Okay.
Let's make sure nothing's ever sharp or uncomfortable. Nothing's ever sharp. This is the largest lipoma that I've ever attempted to remove. It is huge. Look at this lipoma. He's ready to come out. I'm working on Melissa's lipoma, and with my first incision, it actually made me happy. It's like it pushes its way out. You just make one little cut with your scalpel blade, and it's like it's coming out at you. You don't always know whether they're going to behave, but that initial cut can tell you a lot. I just gotta slowly ease it. Are you okay?
Yeah.
What's up?
Oh, it hurts a little bit.
Okay, it hurts because I'm tugging on you.
I can feel Dr. Lee pulling on my insides. It's so uncomfortable.
Let me just back off a little bit. Let me see if I can pull it up this way. When you're numbed locally, we are stopping the pain fibers from firing and going to your brain and telling you that you're experiencing pain. But it's not affecting nerves of vibration, even nerves that are a sense cold or hot. So you can feel that tugging, but you don't feel pain. Sweetie, hold on, I'm getting it. He's just making me work for it. I know I'm pulling on you down deep, but as long as it's not sharp, it should be okay. It's coming. It's like having a baby. Coming, he's coming. I'm trying to get him out of one piece, and he's coming. Just gentle, womanly touch. I might have to take him off in pieces just because I think he's too big. All right, I gotta cut this off. This is too big here. I can't pull the whole thing out one. Yeah, I'm gonna call myself the lipoma whisperer after you. All right, I think it's about half, maybe? Yours is a workout, girl. Okay. And you wouldn't think there was more. So now it's just like the last little tendrils, and if I don't try to get it all, I'm afraid it'll come back, and we don't want to do this again, right?
No.
Okay, we're getting it. Come on. You got it, we got it all.
All right.
I'm gonna weigh this one for sure.
If I can't get it removed, it would be such a heartbreak.
Okay, here we go. We're gonna start with the big one first, okay?
The big guy.
Yes. So let's see. I usually do this very gently at first because in case it's a cyst and I've made it mad by injecting on top of it, and sometimes they'll squirt. I think I know what we have here. I'm gonna give a little squeeze. You got yourself a nice cyst here.
Oh, wow. So what is it coming out like?
Like mashed potatoes.
I love mashed potatoes.
You do?
Was there a lot in there?
Yeah. I think you might have a little bit of a calcified part of the cyst.
Calcified?
Yeah, sometimes they get a little calcified and they're like, they are stiffer. Calcified is when any kind of growth that you have may have a little bit of calcium deposition. It's gonna feel a little bit like stiffer, like almost like little slivers of rock. I gotta remove the sac that contained the mashed potatoes. I think it looks good. We will send it in, but it's definitely an epidermal cyst. They're like butter when they go.
Wow, oh my God, wow.
Taj has steatocystoma multiplex. He's got them all over his body. I just gotta make sure that we take as many of them off as we can with as little irritation and scarring as possible. Get a little pinch, feel it.
Oh. I watched everything that was happening. I had the mirror here, watching stuff come out my skin.
See how they're all different? What's really interesting about steatocystomas is you can have one single person with multiple bumps like this, and out from each of these bumps comes something different.
Oh.
There's another one. You're cute. They range from being really buttery
Oh, man.
to kind of greasier and darker orange in color.
Wow.
I've seen ones that look like the consistency of a rubber band.
Oh, sorry, that one squirted.
They're fun to remove. They're fun to remove, very satisfying to watch.
Ooh.
Sometimes we do a guessing game. What color is it gonna be?
I think this one might be yellow. Ooh, God, and here it comes. Oh, it looks like a ribbon. Oh my God.
It is a ribbon.
You know how a ribbon is set up like flat but long? It was coming out like that. It was epic. Ooh, man, just look at that.
Good stuff.
That is excellent. Look at that. You know what chitlins look like? They look like that a little bit.
Gross.
Yeah.
Taj was a joy. He was a joy for his personality, and he was a joy for his steatocystomas. They were wonderful pops, and he's definitely gonna be less bumpy. So I'm just gonna try to take it off on your ear itself. Make sure nothing ever hurts, okay? Just take as little of your normal skin as possible. Amber's here, and she has 2 pretty big keloids on both of her ears. Trauma causes keloids, but for me to remove a keloid, I have to cause trauma. So I'm trying to cause as little trauma as possible. It's off. That single keloid was pretty straightforward. It wasn't really attached very much at all, and it was in a good part of the ear that had some stretch, so I could just close that wound side to side. The second ear is definitely going to be more complicated. It has 2 keloids, and there's not a lot of skin to move around. Okay. I'm taking that off. Keloids like to ooze like this. I think they just had such a good blood supply, you know, feeding it.
Yeah.
Grab that. This one now, again, make sure I'm not hurting you. Okay, let me see. All right, last one. Okay. We gotta get it. There's something that's oozing a little more right there. There's a little vessel that wants to threaten us. It's like, come on, you don't want me. I want to stay here. We will not let you beat us, keloid. We're getting you.
Are those veins and vessels like attached to my ear or anything?
I mean,
they're
all
just
attached to you,
Right.
but you don't need them. They're the end of the organ, but
Oh,
they're
right.
just making it difficult for us to take it off without getting squirted or anything or making a mess. All right, I'm done with it. This is the biggest cyst that I've ever seen. This is the standing world record of Dr. Pimple Popper's biggest cyst ever. Okay, this might get wet. That's a cyst, did you see that? All right, we're gonna have to squeeze it. All right, you ready? Get this cyst out of your system here.
Oh, God. Oh, my God.
That is a lot of cyst.
Oh, my God.
That's like oatmeal. What is that face for?
I'm just...
What were you doing with a cyst this big? Walking around with this. I'm gonna look at oatmeal differently now.
I never really liked oatmeal to begin with.
All this is skin cells. This is all skin cells that are just shed.
What does that mean, though?
Like maybe you had an injury, maybe something hit this and traumatized it and some of your skin got stuck underneath
Okay.
and it started to shed into the sac, and that's what all this is. It's just wet, dead skin cells that shed from you. You can feel him, he's right on the surface there. All the structures that we're worried about are all deeper. Actually, a lot of them are under muscle. I don't intend to go anywhere under any kind of muscle. But the only issue I have is that if this has been partially removed before, it's sometimes there's scar tissue and it's stuck to you. Bring down to see it. I think it's like a little eyeball of fat. And how are you doing over there?
I'm good. I'm fine.
Are you sure? Don't fool with me here. This is
No,
not
I'm
the
totally
time to
fine.
fool with me. Okay. So I'm just gonna reach around because I want to use my fingers because they're obviously not sharp and I can feel around and try to loosen around it. When I'm probing deeper in the neck area, I am trying to use non-sharp tools. I'm gonna use my fingers, I'm gonna use rounded tip scissors because you don't wanna accidentally cut something that you don't want to cut. No, not yet, he is stuck to you down there. I'm trying to keep it whole. It's one of those fibrous, sticking to you lipomas. Oh my gosh, what a pain it is. It is Tommy's a bigger pain than Paul. But we're only gonna be able to evict one of them. I'm realizing it is a very fibrous lipoma. It is stuck to our skin. It's not something that's gonna easily pop out. We're about to give in and just try to pull them out in pieces.
Okay.
One little piece of Tommy, his leg. Looks much the same, though. He looks much the same. You okay?
Yeah, that was just weird. I could feel like,
You pushing?
no, like my arm.
Or your arm, your
shoulder.
your nerves, right?
Something, yeah, like
Triggered, right?
triggered.
Because I'm pulling on you. See, it's like really close to your
It's
nerves and
touching
things
my,
like that.
Yeah, I could tell.
So me going like this does that?
Yeah, yeah.
Right there?
Like I could feel it in the back of my neck.
Oh my God. He's stuck to down deep where there's important nerves and vessels. Look, he's right there. It just looks so easy.
My shoulder.
See, it's pulling on you, huh?
Yeah.
What does it feel like? It wants to lift your shoulder? Pulling.
Yeah, it feels like a rubber band.
This damn thing. Must be stuck to your nerve down there. This is a bad situation. This lipoma wound around nerves and arteries and veins. I'm closing them up. All right, everybody? To try to remove it entirely is just not a risk that I think we should take. Just take a nice deep breath. You might just fall in the baby.
I'm a little bit worried since it's so close to my eyeball.
All you need to do is just stay still here, and I'm just gonna kind of pull on this, okay?
I'm just ready for this whole thing to be over with.
Okay, ready? It's really essentially hanging over her eye. So I'm very careful. Eyelid skin is the thinnest skin on the body, so you can't go very deep. This is also very, very close to a very important structure that I don't want to damage. There's a lot of things that can go wrong here. We're trying to remove just as little normal skin as possible so we can just get this and pop it out of a little slit here.
And then make sure that like all of it comes out so it won't come out.
Yeah, of course. You really think I'm just gonna take part of it? We gotta keep you looking cute. We're getting it, I see it. Cysts definitely can have funny smells. I mean, I don't react like I smell anything. I definitely don't put my nose down in there and smell it, but they usually smell something along the range of maybe like spoiled cheese or toe jam. I'm trying to keep all your eyelashes too, because I'm a woman too. I know what our eyelashes mean to us.
It's probably hard to do because it looked like it was up against.
Oh, you're
somewhere
right
I
up
would
against
look
your
at.
eyelashes, girl. Almost got it. I think I almost got it in one piece, too. Come on, you're right here, little number.
Wasn't one spared.
Put that up there. Okay, I still don't know for sure what this is, so let's see. Anthony's here today. He's got a bump right smack in the middle of his face. I'm not quite sure what it is exactly, but I'm gonna find out soon because we're gonna try to remove it. I made my little line here. Make sure nothing ever hurts. And it's kind of close to your eyes, so keep your eyes closed in case something drips into it. Sometimes the numbing medicine can drip into there. I do like to take these out whole and clean. I don't know if I can do that with this one because I'm gonna take it out of a smaller area, but I wanna, at least it gives me an idea what it is. You all right?
Yeah, I don't feel anything.
Good, that's the way we like it. All right, so I can see it. It's definitely a cyst, but I can't get it out of this little hole here we made. Let me see if I can wiggle around. And it's a lot bigger than what it looks like on the surface. So what I'm gonna do is I'm gonna squeeze it, okay? Now that I know that this is a cyst, I have to figure out the best way to remove this, creating as small a scar as possible, but also ensuring that I remove it entirely. I'm gonna give it a squeeze. Make sure nothing's ever hurting. Just gonna squeeze a lot of it out.
I don't feel anything.
Good.
I just feel you like
Pushing on you, right? I need to open it up a little bit more. But so far we got a little bit of it. It's this cheesy kind of texture, kind of like paper pulp. So that's what all this is. This is actually not the sac, it's just the contents of it. You're doing awesome.
Thanks.
I can feel it still under there, so. See, it's like a never ending, it keeps going. Now, have you ever gotten a black eye?
I have.
You have? Have you ever gotten a black eye from a 5-foot tall girl, though?
No.
Well, just you wait. You're probably gonna have a little black eye. It's still the internal contents. That's not the sac. I can see a little of the sac wall right here. This is the sac wall here. See that? See the opening there? You can see that? Okay. I've squeezed all the internal contents of the cyst out, so I've essentially deflated that balloon under the skin. Now I need to make sure that I get rid of all the sac wall, because if I don't, there's a chance that it can grow back bigger, it can grow back more complicated, and I am not gonna let a cystic sac knock me down, no way. Just trying to get to the bottom of it. Yeah, that's the sac. There we go, look at that part, hair coming out. It's like excavating. Like I'm in a cave. All right, that is a little space you had. I don't want it to like explode on me here. That's why we wear splash guards. Looks like it is so far though.
You cutting?
I am.
Oh.
Isn't that weird? Wouldn't even know,
sure?
huh? I'm sure I am. It's amazing what you can do under local anesthesia, isn't it?
Yeah, it is.
Just undermining a little with my fingers. It's a much safer way to do it, you know, because you can feel and also you can really loosen something up without using anything sharp. This is literally a deep tissue massage. All right, ready? I think we're gonna get a nice little pop here.
I'm almost a little sad that I'm gonna lose part of them.
Yeah, right.
Oh.
Oops, sorry, splash there.
Oh, dude. Looks like a brain just came out of your back.
Really?
Yeah.
Not a boob? Not a boob anymore?
So that's just fat, or?
It is. I'm gonna show it to you in a little bit. Maybe I'll
Okay.
see it. Do you feel lighter? Oh, I almost dropped him.
She almost dropped her baby.
Yikes.
You dropped my boob?
So had been a 5-second rule I would have gotten, okay? So it looked like we got it pretty much out entirely. Brandy came to visit me today. She's a wonderful young lady who has this big growth above her left breast. Really this kind of third boob. I'm trying to get this out really carefully and efficiently, but also I need to make sure she's comfortable and she's not freaking out. The fact that I'm pulling out this mass from her chest, inches away from her, using a sharp blade, a single glance would be something that you would never forget. You're okay?
Yeah.
Okay, good. I see it. I got my finger on it, so let's try to get it out here. Are you okay? Yeah, make sure you get good oxygen there. You're a woman. That makes you tough. I know you are. I know, that's why I'm stopping. I'm just trying to make sure you remember to breathe and get good oxygen in your lungs. Yes. So I'm gonna squeeze you just because I'm trying to get it out of a small little hole here, okay? You okay?
Yeah.
You're doing awesome. Gonna wiggle you around. People have asked if they can keep it. People definitely ask if they can hold it. People ask how much does that weigh? You haven't done any of those things, huh?
No.
Not necessarily. You have to pay attention to how the patient is feeling. And part of that is talking to them too. If you're thinking about how to answer a question, you're not so thinking about what's going on. Would you say it's a he or she? I don't know. It's really important here that I protect Brandy and her mind, really. That hurts right there? I know, your nerves are getting, but you almost got him.
Good.
I just need to wrestle with him a little bit. I'm sorry about that.
Okay.
But if you can handle me wrestling with him, it'll be better in the long run.
Dr. Lee was comforting me, but I started feeling like I might get sick. I really don't know if I can get through it.
Yeah, I'm sorry. I'm sorry. I'm sorry. Oh, you hate this. You hate this. This lipoma is a bigger problem than I expected. It's not really popping out nice and easily. It's found little nooks and crannies to kind of hide under. And I'm also aware of the fact that my pulling and pushing on her is freaking her out more. But I'm trying to get this out as quick as I can. I'm just using my fingers, nothing sharp.
Okay.
You're doing awesome, girl. You can do this. You can do anything. But he's almost all the way out here. You're doing awesome. I know you're over here on this side. All right, honey. All right. He's just stuck to you a little bit here. We got him, though. We're getting him. Ouch. Okay. 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 That was the last big piece. Okay, let's take a look again. Okay. Just be careful. Even though I think it's a lipoma, it might be a cyst. So I'm gonna block myself. was mistaken. Oh, it's a cyst. Give me a kidney basin, please. You never know when you cut into a bump what is exactly going to be in there. This is a cyst, and it's about to blow. Like oatmeal. Yours is like oatmeal.
Looks exactly like oatmeal.
It does. Just need some brown sugar or something, I don't know.
Some cinnamon.
Some cinnamon. I tried to aspirate some contents from a syringe, and sometimes that works and sometimes it doesn't. The reason that I thought it was a lipoma was because I could not imagine a cyst being that big and being right there on his shoulder. I thought for sure if that was a cyst, he would have popped it by then. Now, the only issue with these cysts is you gotta get the whole sac out
Right,
now.
yeah,
So the sac is very thin-walled, but now it's pretty much flat. That's a good thing. All right, could take that away. Anthony is here to remove this bump on the back of his neck. It's a really tough area to remove a lipoma, but I'm hoping that it's gonna be a really nice pop. Sometimes these lipomas can be a little bit like they grab onto you. He's there, but he's like hanging on. I can already tell he's planted his feet down. He's like, okay, this is gonna be a fight. Let's see if we can do anything about it. Let's hope we can get this one out as a nice pup.
I see it. It's chicken. Yes, it is. Oh, you're popping everywhere.
Yeah.
Pop it, pop.
Yeah, it's not easy, man. He's got this thing stuck on him. Let's see, though. We're gonna get it.
Oh, she'll get it. Oh, Sandra get it.
Anthony's lipoma is wedged in there pretty deep, and that always kind of concerns me because I have to go there blindly and really try to release it from underneath, and I just don't like that idea. I mean, there's a spinal cord there, there's a lot of important structures, so I just don't like to reach under there with anything sharp and try to pull that out. I mean, it's really lodged under there, and that's always concerning to me. I think we're getting him. I think he might come out in one piece. Ooh, I felt a loosening right there.
Get this out in one piece. I told you that's
Awesome. That's the goal, right? That's when you get the
golden nugget.
Yeah. That is. But I hope so. I don't want to say too soon, but I do feel like it's coming now.
I bet.
You okay, sweetie, right?
Mm-hmm.
Push.
Okay. Oh, wow, girl, yes, girl, yes.
Yeah.
Beauty.
I've never had a peanut gallery quite like Anthony and his daughters, but I'm not gonna let them distract me. I'm gonna get this thing out.
Cute one. Oh yeah, we have our own sound effects.
One little plum. Golden nugget. I told you that's what we're going for.
It's like a plum size.
Like a little plum.
You feeling okay? You breathing okay and everything, right? You let me know if you're ever in any distress.
I will.
Gonna carefully look, see when we see it. Just still seeing a little layer of regular fat. Let's take another little peek. This looks like a lipoma. It looks like Belinda has a lipoma here. I just hope that it's not connected to deeper structures underneath. I hope it's not holding on to her and that I could just pop this out nice and easy. I'm just gonna kind of loosen it up with my finger.
You're not bothering me, you're fine.
Good. You're so easygoing. Does everybody in your family tell you that?
Well, the doctors do.
All the doctors do?
Yeah, because I don't complain about nothing.
I don't know if it's gonna completely come out yet, but it is gonna pop. Trying to get it out of a tiny little hole here so we keep you looking cute. We got it. It wanted to come out. It was waiting. Let me put him on this table here a minute. This is a lipoma jackpot. When you get the lipoma out in one piece, it's so exhilarating, it's so exciting, it makes you feel good. This is why I love to remove lipomas. Make sure we're never hurting you. Nicole's other doctors have warned her that this could be migrated breast tissue or extra breast milk, so I don't know what I'm gonna find under here.
So it's kind of like I only see mainly fat here. It's like fat that's herniating out, which can be breast or glandular tissue. But I think we just have to take a lot of this out. See how it just wants to, it's like it wants to bulge out. All right, let me see what we got here. Look how that just wants to come out here.
And it's ready to go, isn't it?
Well, it does want to herniate right here. Like, it just wants to come out, but I don't want to take out too much, you know what I mean?
Yeah.
So I'm just trying to decide, I think this is glandular tissue, but I'm going to try to take out the perfect amount, and that's what I'm taking my time and kind of trimming this, okay?
Herniation means that this tissue, whatever it is pushing outward. The fact that this tissue is herniating does not tell me what type of tissue this is. It doesn't tell me if it's regular fat or breast tissue. I don't know what this is.
See this one sitting up here? It actually might even be a little bit more what we call a warty keratosis. And I just take these, I have these special scissors that have serrations in them, so it grips things really well, like especially skin tags and things.
Oh.
And there we go. There's your little friend.
Wow.
Here he is, gone.
And I didn't feel anything.
Oh, good. Well, that's the way it should be. You can actually, if once you're numb, see that? How you can just kind of scratch it off? See? There you go, gone.
As I'm treating all of her bumps, I'm looking at them and making sure that they're not something that I think is at risk. Because if there is something that I think is suspicious by any means, I'm gonna send that tissue in to have it looked at.
There you go, there's another one. But now look, they're taking good care of you. Let's do a few of the smaller ones with the little laser. Because this is really where I want to do the most, because I feel like this is where you see, you know, when she wears most of her clothes. And these are the ones she's gonna be the most happy with. Everybody, okay, ready? Once, close your eyes.
A KTB laser targets dark tissue. It kind of makes it explode and it makes this popping noise that you can hear.
You see that pop? What does it smell like to you?
Ah, it smells like burned skin.
You're doing okay. It's a little bit hot, I know. Yes. Halfway through there, okay? Oh. All right, almost there, almost there. There we go. 2,473 pulses right there. I'm gonna squeeze it. Okay, I don't know if I can get it. Ah, come on, it's stuck to you. Come on, come on, come on. There we go. We got him. You okay?
Yeah, I'm fine.
Okay, ready? Everybody ready? This is gonna be a pop, I think. Okay. That's the way it should be, this one.
I'm curious, has nobody else tried to do it themselves here?
No.
I'm the first one.
Absolutely not. You have to.
You're so
yes,
really
you absolutely are the first one. That's actually truly my worst fear. I do not want people that watch my videos to find, you know, because I think that sometimes they watch it so much that you almost feel like you could do it because it's like from my perspective. So you're like, wow, I could do that. That doesn't look that hard. It's like slipping away from me. Damn it. God, this lipome was a pain in the butt.
I would say usually in the back, that's probably the thickest skin on our body. A lot of times there's little fibrous bands that kind of hold the lipoma in place. So because of those two things, lipomas in the back are usually a little bit more difficult to remove.
Here we go, here we go. He's coming now. Yeah, you would not be, I mean, didn't think you could do the other one by yourself, but I don't think you could do this one. Oh, see, I got him, but he's not coming. Get out of there, dude.
Sometimes I'll wiggle a lipoma as I'm pulling it out because oftentimes it's just wedged in there. In this case, I gave it a little wiggle, but it didn't fully pop out, and that's because it's stuck to deeper structures.
He's been with me for 8 years, so I don't think he's going anywhere.
He's stuck on you. Here we go, here we go. Man, you got a really, really stubborn one, just like you. Don't want to listen.
I think everyone would agree with that.
We got him. There we go, number 3.
No way.
He was stuck to you.
Wow.
Okay, cutie. You're the most important here. You should always feel comfortable. You might just feel me pushing on you, but you shouldn't feel anything sharp. Make sure I'm never hurting you, okay?
Yeah.
Good, you're doing awesome. We got a lipoma here for sure.
I'm glad I can't see it. If there was like a mirror up there, I wouldn't look at it.
You wouldn't look at it?
No.
Don't need to look at it. I'm just gonna try to get rid of some of the fibrous connections. It's like stuck to you here. I'm just gonna release it a little bit with my fingers, moving it around, see if I can't squeeze it out even. You're doing awesome. You can see there's little connections and fibrous bands, so I'm just trying to break them up here. Your boob is out.
Yay!
It is out.
If you find my car keys in there, let me know.
Come on. I'm not hurting you, right?
No.
Oh, you feel that?
Oh, it's like a brain.
This program examines dermatological conditions and the procedures involved with treating them. Due to the graphic nature, viewer discretion is advised. Well, you heard that one.
I did. I felt it.
You felt a little pop there with this one. One thing that I'm concerned about is certainly the number of scars that I create. Here's your first one.
Wow.
There you go. I'll line them up. So if I can remove some of these bumps out of one slit in the skin, that would be wonderful. Can you look down a little bit? Can you see that? Can you see that?
Uh-huh.
There he goes.
Oh my goodness.
Oh, look, did you see that? That's a cute little double, a little booty. That was like a twerk. Usually I do maybe 1, 2, or even 3 lipomas per patient, but there's no telling how many lipomas are actually under there. Oh my gosh. He's almost there. There we go. Phew. I feel like I've been doing this all day.
That's disgusting.
I've got April in a certain position, and I've removed all the lipomas I can with her arm in that position, but I know that I'm gonna be putting in her multiple new positions, and there are new challenges everywhere that I go. I have to pay attention to the nerves under there, the muscles under there, and make sure that I'm not wading into territory that I don't want to be in. Okay, here's another big one here that I'm not sure what's going on under here.
That was good.
That was a satisfying one, I will say. Messing under anyone's body is no joke, but I'm certainly paying attention to the areas that I know that there are nerves that run more superficial in the skin, maybe run above the muscle, because these are areas that I have to be more cautious of. So I'm really cautious of this area in particular, because there's the ulnar nerve that traverses over your elbow, but in particular this area too, the antecubital area. This is where a lot of nerves that allow us to open and close our hands, and we need to be very careful in those areas. This is all just from your left arm. Phew. Look at all your little gremlins you had. You had a litter. How many have I done on you? 30, 31, 32, 34, 35. No, 6 or 7, 38. 38.
Wow. Oh my goodness.
I've just removed 38 lipomas, 38 from April's left arm. That is crazy, ridiculous. I've never removed that many lipomas, and that was only her left arm. I filled up entire surgical trays, so I've got a whole new tray to try to tackle her right arm next. Alrighty, Missy, here we go. Let's get rid of all the rest of these here. All right, let's start here. Let's turn your head just a little bit in. There you go. You see, there's one. That was a mama. They're just in here like rocks. Oh, carpal tunnel. Okay. Oh, we're so close. See, I'm losing count now. Okay, we have one more up here, and then we're done.
Felt that.
It did, yeah, weird. That was like giving birth right there. Okay, I think that's everything. 9. Oh, there we go, 30. 38 on your left, 30 on your right. There's 68 total. 68 total. This is an absolute record for me. I've never removed this many lipomas from a person in one sitting. My fingers are numb. It seems like the anesthesia has finally taken effect. Genner doesn't seem to be as in much pain. He's not flinching as much. I think I can finish this whole case. You shouldn't feel anything, okay?
Okay.
So turn your head a little this way. I'm gonna start slow, okay? Just one little arrow right here. You okay?
Yeah.
Good. So far, so good. Thankfully, Genner is starting to feel more comfortable in this position, so I need to move really quick. This tool has an electric current that goes through it, and this current allows the wire to heat up so you can cut through tissue very quickly. We use a vacuum to help suck up any of the smoke that's created from burning Genner's skin. You know, we want to remove the smell of burnt skin and also protect all of us in the room from inhaling the skin. It's like making it shrink in front of my face because it's so oily here. Just all oil. It's like you're sculpting out of clay and you see your face emerge. I feel like it's the closest I get to being a sculptor. I've got to unearth this nose and the rounds and the curves of the nose without taking off too much, because once you remove too much, you can't put it back. How thick this is, it's all oil. Getting smaller. There's a chunk of sebum here, see that? Rhinophyma surgery looks maybe a little bit brutal. It's actually kind of fun, especially when you come across these pockets of sebum or oil. Look at this oil here. It's like you're eating salted caramel vanilla ice cream that has little chocolate-covered squares of caramel in it. And you're taking scoops away, and you never know when you're gonna hit one gem of a square of caramel. That's exactly what it's like. That is extremely satisfying. I guess in a sick derm way, you know? I think we're done. Okay, let's take a look. Turn that off again for me for a moment. You're relieved that was that terrible? That was like childbirth, huh?
I feel like the snake shedding for a new skin. I feel much better.
It's okay?
Yeah, I'm okay. Much better than before.
Yeah, and it's gonna be better than this too. How long has it been? Almost 15 years.
Yeah. Not only the skin will heal, my heart will feel.
That's the most important.
Yeah. When I look at the mirror for the first time, I'm very much happy. And to that person in the mirror, I would say, we have already won. We have already overcome this problem.
Oh, my Lord.
Chris has 2 issues today. He's got pretty extensive psoriasis and this pilar cyst on his scalp.
So there was stuff in there?
Well, yeah.
This stuff fascinates me.
Yeah. Yeah, she's stuck to you. All right, one more push. There we go. You had a garlic bulb in there. That's what it looks like.
Yay.
There's our little friend. The consistency of the wall of a pilar cyst is very much like the wall of an olive. You can squeeze it and it kind of bounces back to the same shape. And then it's filled with kind of like when you have a blue cheese stuffed olive. It's like kind of like he's got this shard under here, like this strange sliver, like a piece of bark. Matt came to me because of his neurofibromatosis. He has many skin tumors inside and out. I've decided to help him, if I can, remove some of those painful, deeper-seated tumors. Dab it again. I'm excited to show this to you.
Oh, please do.
What is that?
Literally little worms.
I wonder if the other ones are gonna look like this. Let's see what this one looks like.
Yeah.
This one was a little bit like kind of deeper. Okay, let's see if this one will squeeze out. This one looks like Patrick from SpongeBob. This is another one that I haven't seen before. It looks like a little starfish, and it doesn't really fit into any category in my mind. It doesn't look like a cyst, doesn't look like a lipoma, doesn't look like a neurofibroma. What is it? There we go.
Holy smokes.
Yours are like cartoon characters. That's what they are. As I turned Matt around to really remove the one on his back, I noticed that that one didn't move like that. It really seemed to be stuck to deeper structures. That to me is concerning because that means that this might be an aggressive growth that could be malignant, it could be life-threatening. This is the Papa one. There he is. It's like a little eyeball under there. Come to mama, Papa. Pulling on you, okay? Make sure it's not terrible, because it's stuck to you down below.
Jeez.
Almost got him, almost got him. We're gonna send those out. Find out what the heck they are.
The last time that I was this nervous was maybe when I went on my first date, maybe.
Oh, tell me about this first date. When I have a patient as nervous as Yami, I like to use talkesthesia. I talk to patients and ask them open-ended questions so they are really distracted from what I'm doing. Did you really like it?
No, I mean, not really. You know, I mean, he was a
nerve-wracking?
cool guy, but it's just he looked like a spoon. You know, like
A
it was,
spoon?
Yeah, like a big head and skinny. I don't know.
I just lost my bet. This is not a lipoma, this is a cyst. You have a cyst here. That's good, it's gonna pop out.
It's a cyst.
Yes.
Yes.
It's got little flecks in it, like chives. Are you okay?
I'm good.
Okay.
I'm relieved. I'm relieved.
Good, there's still more coming. I've never seen cyst contents like Yami's. I mean, hers looked like grits with chives. Here's that hard bit. It's stuck right here. Now I have to figure out this hard knot under the skin. I've got to figure out what it is, and I've got to figure out a way to get it out. But let's see if I have to loosen this little bit right here. It's like you've got a little coin under here. You're doing great. You're doing great. That's that hard bit right there. We'll take a look at in a little bit. All right. You got anything you want to put in here, precious in here? No extra change?
No. That's funny.
Pat has a bunch of seborrheic keratoses. She's peppered with them all over her torso, her neck, parts of her face. One of the best ways of treating them is hitting them with a little bit liquid nitrogen. Oh, you're tough. You can handle this, but it's cold.
I am tough.
I'm surprised at the way that Pat is reacting because when that liquid nitrogen first hits your skin, it often makes people jump. It's like a coldness boring deep under your skin, and she's like not even budging at all. Oh, if you can tolerate me, I might be able to do most of them here. That's great.
Tough.
Just cry uncle if you need a break.
Okay.
I gotta get a new one, because see, it's got frostbite on it now. Look at that, it's all frosted, so I gotta use a new one. I don't think I've ever had a patient with the pain tolerance that Pat has. A lot of patients can't tolerate this procedure. I call it the Muhammad Ali syndrome, because when you come at them with that liquid nitrogen, they're like bob and weave, they get out of your way. I'm a Muhammad Ali. I'm the same way. I do the same thing. I float like a butterfly and I sting like a bee. I gotta switch that out, thank you. Imagine if you get frostbite in something, how it aches later. Well, the skin aches when you're treating it, and it aches later. I think she knows that if I sense any discomfort in her, I might pause, and she's not gonna give me an ounce of emotion because she wants them all gone. In my whole career, I've never had anybody withstand me treating more than 40 or 50 of these seborrheic keratoses. I have never treated more than that at one time. She is tough. I know this does not feel good, and she makes it like it's nothing.
Once you get used to that little piercing sting, you know what to expect.
I never get used to that.
I was practicing relaxing, and I did the mind over matter thing. I was comparing that pain to other pain that I've experienced. I had migraines until I was in my 50s. So that's how I was able to get through that.
Looking good. I think I got most of them. I'm not trying to push your head off the chair.
Okay.
So just resist me when I resist me. You get it? That's
Got
my
it.
little one of my little sis jokes.
Resist me.
Resist me.
Resist.
You just got it?
Did, yes.
Jenny has 3 bumps on her head that we're about to remove. The ones on the back of her head are pretty small and not really noticeable. However, the one on the front of her scalp is pretty noticeable. Not only is it important for me to remove this bump completely, but I've got to make sure I don't leave her with a big old bald spot. I have a little theory on my pilar cyst. I usually see them in 3s if they're somewhat small, because I feel like once you get 3, you're like, okay, now there's something wrong here. Like, what is going on? This one looks like a tick, kind of.
It's like name
An engorged tick. Guess what? We're on to number 2.
What?
And so far, your sister behaving, but I don't like to talk so soon because then I jinx it. I'm gonna push against you again, okay?
Okay.
Can you dab that top again? Oh, okay. Got it. Did you feel that little pop?
I heard that.
Yes, I heard it.
That's crazy. I can feel that.
Well, it is your head.
I know.
Okay, I'm gonna lower your head down a little bit.
Okay.
And this is Big Mama.
Oh, yeah.
But you're feeling pretty good right now.
Oh, my gosh, yes.
Okay, good. Good. So are we. I'm gonna give you a little squeeze here. You okay?
Yep.
You just heard it?
I did.
You heard a
It's
pop.
weird.
Right, I know.
Oh, I hear it.
It's like she had gnocchi on her scalp.
Oh,
The little pasta bowls. Mhm. That's what it is, gnocchi. Oh yeah, it did bust. I thought I felt it pop over there. You saw it? Okay. Did he get that? I hope it did. You okay?
Mm-hmm.
Okay, good. All right, looks gorgeous. All the cysts are gone. I am removing a little extra skin on the unicorn bump area. Once I do that, she'll have less of a bald spot. Okay, I'm just gonna go very superficial because I wanna see if I can do this without it getting me. There's a big balloon under here, and usually if I don't get a nick in it, I can take it out whole, but I don't know if I can take this out whole. Come on out. Stuck on her, man. Come on. Sorry about that. If only I could take this out without it. Oh, I popped that side too. All right, well, now I've done it. Now I've made a mess. I've been trying not to, but I think I have to just squeeze it, okay? Oh, let's get some stuff ready here. Maybe right here. There you go. You okay? We're just gonna squeeze some of this out onto, if I can. This just looks like the biggest pilar cyst I've ever seen. Due to the size of Arisa's cyst, I know that there's gonna be a lot of extra skin. So that last bit of cyst is really stuck to some of her scalp skin, so I've decided to snip off part of her scalp with the cyst, because I know that I'm not gonna need it in the end. We just gotta figure out what we're gonna do to make sure this looks pretty here.
Y ahora va a arreglarlo como para que se vea bien.
Araisa's scar is going to be hidden by her hair, and I'm going to remove certain parts of her scalp and place the scar nicely so that the hair grows in the normal direction. You okay?
I'm okay.
Okay, good.
Yep.
You may be a little sore tonight, but I don't think it's anything that even a little Tylenol can help with. Not going below that muscle if we don't have a fight, you know. If we have a fight, it could be something different. Right there, here he is. He's like in its own little capsule. Bada boob. Okay, I'm gonna push against you, okay? Okay, let's see about this little bad boy here. Johnny's pop was really quite beautiful, just like he is. But the bottom of it was a little bit tethered. It's a little stuck to his muscle. I'm just working on that last little bit that's kind of wanting to stay with you, so.
Woo!
Okay.
Woo! Hello.
So for me to pull it a little bit, it elicits a little discomfort from him. So you doing okay?
Well,
just push it on you.
There. A little pain.
Oh, I'm
right there.
sorry, a little pinch? Is it stingy?
The whole area is now starting to ache.
Okay. We've almost got him all the way out. Almost got him out. I think it's just pulling on your muscle underneath, but it's just because it's kind of stuck to you a little bit. You okay?
Well, it's hurting a little bit.
Because I'm pulling on you, but I almost have him. I disengage a tethered lipoma very carefully. You'll see me mainly use my fingers. I'm trying not to use any sharp objects because I want to probe down deeper in any area that I shouldn't be, and certainly I don't want to disturb his muscles or any deeper structures. I think we got him. I think we got him. One last thing to do, just to stitch Johnny up and send him home bada boobless. Okay, you wanna see bada boob? This is bada boob.
Holy mackerel. Man alive. That is crazy.
You okay? Mm-hmm. I hope you don't feel like we're pinning you down. I know we just met.
It's okay.
Amber's here because she's got a bunch of bumps on her face and even some on her armpits. I'm gonna try to remove the biggest bumps and see if I can get her looking and feeling a little better. But then I have a lot of homework to do. Looks better already there. Now let's get this one here. Nothing's hurting you. Okay. So we're gonna send one for biopsy. So I'll put one right here.
Weird not to see that thing out of the corner of my eye now.
Now I'm gonna move on to her armpits. I'm really curious about these because they're under the skin. They're not really raised up on top of the skin. So what are these exactly? Okay, let's see what you got here. You're eager to see it. You got like diamonds in here maybe. Wouldn't that be nice?
Oh.
It's a pearl. See that little thing right there? Solid. Solid. I'm gonna send that in and have that looked at.
I'm stumping you all over the
You
place.
are. So out popped a little pearl from Amber's armpit. I don't know if this is the same thing as the growths on her face. We'll have to send it to the lab to try to figure it out. You okay? Mm-hmm. You are tough. Now I'm gonna remove some of the other bumps that are more noticeable on Amber's face. This area, like especially right around the nostrils or right around the mouth, these probably have the most nerves of sensation coming to them, so they're probably the most sensitive areas on our face. And that presents a challenge because I just want her to be comfortable. So as long as she can withstand what I'm doing, I will do as much as I can. Right, okay, that's looking good. Her nose is definitely looking a little bit flatter. So what I'm gonna do now is we're gonna take a little laser and just try to soften this up a little bit.
Okay.
The thing that's really bothersome for Amber is the bumpiness that she has in her skin. So I wanna smooth that out a little bit using a laser. Now I'm gonna just do one, all right? So you know what I'm talking about here. Got a little bit right here on her cheek. I know. Look how much better that's gonna look though. Actually, I see it. See how nice and flat it is? Let's stop it for a minute. I think that what we really did that was the best was just shaving it down a little bit.
Okay.
But it looks good. I think that Amber's gonna be pleased with the results. It's hard to see right now. She definitely has some charring and some burnt skin, but I hope she sees at this point the potential. You wanna take a look right now? Yeah. Just remember, you're gonna be a little bit kind of charred here.
It's a big difference. Got all the biggest ones off. It feels so different. With the bumps gone, I can actually feel my nose is smooth. She was able to get rid of the biggest areas. I'm very excited about how this is gonna look in a week.
So we made this a little off of your spinal cord. You know, I don't like the idea of going straight down towards your spinal cord, certainly. Antonio has this lump right smack in the middle of his back, right along his spinal cord. You know, all your really important nerves come out from that area to kind of feed the use of your arms. So I've got to be careful when we remove this bump. You don't want to get into any problems. I'm gonna tug on you. It's stuck until I tease it away. It tugs a little bit. Oh my gosh. I'm too weak. You're proud?
Yeah.
Dang it. Oh gosh. It's stuck a little bit, but I think I can get it if I just move her, if I just kind of shimmy around it. So bear with me here. Antonio's lipoma is not being cooperative. It is certainly giving me a little fight. It is fighting back. It's like a workout. I'm panting afterwards. It's really hard for me to predict whether something is gonna pop out or not. And his certainly has stuck its little claws in his back. It doesn't wanna let go. I'm just trying to stay calm to make sure that I can remove this very safely and not really encounter any deeper structures. All right, he's not gonna come out one full piece, but close. He's got like feet, he's got like hands and feet here. That's the problem. Sorry, lovely noises yours makes. You got a definite chicken cutlet here. Ooh, what noises you got here? You okay, right?
Yeah, I'm okay.
Good. This lipoma is a tough one. It is grumpy, it is stubborn, it doesn't want to come out of its hole, and I have to be really careful with working with it. I don't want to force it out too quickly because it is stuck underneath, and you know, right underneath there is the spinal cord, and I don't want to get anywhere close to his spinal cord. So I really don't want to blindly cut with a scissors or a sharp blade under this lipoma. I really got to coax it out very gently.
Breathing kind of hard.
Oh, because I was working out.
Dr. Lee's breathing hard and it's setting off my spider sense. I'm a little nervous and worried about it. My shoulders and my arms are really tense.
You can tell if I'm distressed, if I'm concerned. I know. You see that I'm not, though.
You're good.
More excited. Come on, come on. Oh, this looks good. It was a little bit wrapped in fibrous tissue. That's why it took me a little bit longer.
Are you cutting in my arm?
Maybe.
I feel like I'm watching a YouTube video. It looks like yellow cottage cheese.
You really?
Yeah, you probably wouldn't eat yellow cottage cheese. I don't think that'll sell well in the store.
No.
I'll do one little bit more on the side.
Oh, that made all the difference, didn't it?
Mm-hmm. You're doing great. Yeah. Just let me wiggle you around. Again, just tell me if anything hurts.
This is so cool.
I'm just gonna pull it. I think we're good. Some people are real excited in here. It's like opening a present at Christmas.
Is it totally not squirting out or anything?
Not yet, but it's right there. All right, we ready? There we go, here we go. Let me make it a little bit bigger. It's a cyst for sure. Do you see that, Sissy? Can you see that?
Can't see it. Oh my gosh. Oh, good grief.
Let's put it into the basin too, okay?
So what's the smelly?
That's cyst. It's like old skin cells that are stuck under you for years, for 15 years. I feel like it would smell like toe jam or something, something that's like your skin's been sitting there for a while. That's essentially what the smell is. I'm putting numbing there, okay? because I have to now like evacuate this whole sac. So you're gonna feel more numbing here. I gotta just, let me.
Are you okay?
Yeah.
Don't you think it's cool?
Yeah.
I never thought you'd be able to sit here and watch this.
I think you're turning her into one of us. This is like the sac wall, and we have to get it out, otherwise that's what makes it kind of come back.
It's just so
weird that's part of you. I'm pretty sure that Janice started off hating the stuff. She could not bear to watch it. But then I feel her over my shoulder peering in and watching every step of my removing the rest of Sherry's cyst. So I think I've created a popaholic. Janice, welcome to the dark side.
Oh my gosh.
There's the sac, see it? It's like a little pouch.
Oh my gosh.
Okay, so you shouldn't feel anything other than us touching you. Just make sure you're doing okay?
Yep.
Okay, good. So I think there's a little bit of fat that is herniating outward here. I'm not sure about this lipoma. It's a weird one. This is not what I was expecting. I've started to remove it, and I see fat under there, but it doesn't look like a lipoma kind of fat where it's encapsulated. It just looks like regular fat, as if this fat has herniated out, as if it's just trying to escape from her tush in some way. And so, I gotta get to the bottom of this. Here's the firm part right here. You can see that fatty tissue looks a little bit different. It's like a little firm ball of fat, and it like wants to make it pooch out, I guess. Your booty's ending up being a challenge. I'm just trying to tease it out a little bit. I'm just trying to be careful and gentle here. I think it's a nevus lipomatosis superficialis, a herniation of fat, where you have like fat that just pushes out onto the skin surface, and it's not really like well encapsulated like you normally, would see like a lipoma.
Is this gonna come back?
I mean, I think it has more of a chance to come back than a standard lipoma, because a standard lipoma is like its own little entity that sort of pops out whole, but this is like you don't really know where it starts or where it ends. It's just kind of pooching out from this little area of loosened skin. I think we're done. Everybody's ready? Well, essentially, it's like a hot knife that's cutting through butter. So what I'm gonna try to do is really sculpt this part of your nose. You can see all the whiteheads. I mean, if we squeeze on the squeeze out, that's like whiteheads there. So those little chunks of oil. She's got all the sebum stuck in here, like just stuck in there. See how it is doing with bleeding. It's doing all right now. One of the most interesting parts about rhinophyma is, it's this thickened, really oily skin. So a lot of the times while you are taking some of that down, you will unearth little pockets of oil or fat. It almost looks like little pockets of chipped butter. Got a good amount of oil under there that is wanting to about the they're like little pockets of just oil and sebum, like it's all just been, collecting in there. Yeah. That's not unusual. It's just, I want to make sure I don't confuse that for your actual nose. We want to sculpt it down and still have your nose be nice and smooth contour. Okay? Look at his nostril and how much it's opened already. Like the weight of that. It's already opened up. You could probably breathe a lot better right now. Turn that off for just a moment, please. Thank you. I'm just debating as to what do I do here? You're not really bleeding, but I'm afraid about you bleeding later. Let me do a little on the other side, and then let me see what goes on, okay?
Okay.
At least we can open up those nostrils here. See what that right there? This is real nostril right here. Look, because real nostril has been pushed like this, smushed down. What I'm gonna do to try to keep this symmetric too, because this side is fuller, is I'm gonna try to take down this here and try to release that nostril. I am seeing it all come off. Isn't that amazing? It's like, I don't want to stop with you. I want to do this forever. I want to get it all down, but I just don't think it's safe. Turn that off again. So I've debulked both nostrils at this point, and I've decided to stop now. The numbing medicine temporarily constricts the blood vessels and minimizes bleeding. But if you're on a blood thinner, when the numbing medicine wears off, you may bleed later. And so this is something, I don't want to get a call at 3 a.m. with poor Patrick holding a bloody napkin on his face saying he can't control his bleeding nose. I mean, that's a little bit of a nightmare. See how it drops off from here and here? This is what we took off, this height. The main reason why I'm stopping at this juncture is because of the uncertainty with your medications and whether they're going to promote more bleeding. And I'd rather make sure that you're safe and that you're not going to bleed excessively when we take off the rest of this area.
Okay.
You make sure I'm not hurting you at all, okay? You feel me pushing on you, but you should not feel anything sharp.
Well, my wife, she said it was affecting my thoughts, my brain.
What?
She said, oh, yeah, you need to have it checked out because I think you're thinking irrational.
I think she's just trying to make sure you get this done.
Yeah, she's a good manipulator like that.
Oh, this is going on TV. Don't you forget that. I see something peeking out already. It's right there, ready. Okay, I'm gonna give it a little squeeze, okay?
All righty.
You got some kind of cyst here. Let's see what kind it is. We could kind of tell sometimes by the wall of it. There's no clear-cut reason why cysts happen, but they just do, and they're fairly common. They do occur in the hair-bearing area because they're derived from the hair follicle, so you're only gonna see them in areas that potentially grow hair. I don't wanna squeeze too hard or else this gets on our wall. You okay?
Yeah, I don't feel anything.
Good. I squeezed out all that cheesy content from Joe's cyst, and I've really discarded that because that's not what really counts. What counts is that sac wall. I need to remove that completely, and I'll send that off to pathology to confirm the diagnosis. Almost there. Done. This looks like it's, I don't know if it's an epidermoid or a pilar cyst. I'm just checking that I got the whole thing. It looks like I did. It's like a little lima bean. Joe has a cyst. It's either an epidermoid or a pilar cyst. The shape of the sac actually tells me that this is most likely a pilar cyst because it's thicker and it kind of retains its shape. Epidermoid cysts tend to be a little thinner and more friable and easily torn, but I'm only gonna get confirmation if I send it off to pathology. All right, so you make sure we're not hurting you at all.
There's a little worry in the back of my mind that it could be cancerous.
I'm just gonna pull on this and see, okay? You guys ready? Yeah, one big swift knock from your dog, and I think you would have had this thing on the floor. It's gone. I mean, it looks like pilar cyst contents underneath, but things can mimic that, so I'm just gonna try to take all that off. just need to take that off. And that's the skin we're gonna check to make sure there's no thing that we're like really concerned about. Okay. Sorry, a little tightness there. I am happy to tell you that it looks like we pulled together your skin very nicely there. Okay, you wanna see your little friend here?
I do.
You do. It's like almost like a mitten.
It's crazy.
So that, even if it was a skin cancer or a pilar cyst, this is all like wet skin cells. So as it's emerging out, it was drying up and getting hard like that.
Right.
All right, we're ready to boogie. Here we go.
So I guess it's definitely not a blackhead, right?
It's kind of stuck in you a little bit. Definitely multilobulated. This is a lipoma, but it's a multilobulated lipoma, and that means it has multiple fingers that burrow and get wedged in the skin between normal tissue. I don't think he's gonna come off in one full piece. This is going to be a terror to remove. Come on, I wanna get to the bottom of it before I cut it. Chuck has a Popeye-like lipoma on his upper arm. It's a multilobulated lipoma, and that means it has multiple fingers that burrow and get wedged. It has grown for the last 30 years. It's found every little nook and cranny under the skin, and it's gonna be like arm wrestling with this lipoma. Come on, little tugs is all I need. Phew, that was a good chunk. I got part of it out. I'm just trying to get the rest of it. I'm having to pull out this lipoma piece by small piece. If I could find the secret release here, I would. Come on. I just got it right here. It's right there. I had to be really meticulous when I remove a lipoma like Chuck's. It's sort of like you have to feel with your fingers the different little caverns that are under there, and you just have to do this blindly.
Anything I can do?
No, just think expunging thoughts.
I'm hearing noises and I'm feeling tugs. I try not to think negatively. I try to think positively. I'm just hoping that nothing's getting damaged in the fight.
You got a good one here. Phew, that was a good chunk. That made me feel better. I need to make sure that I get every last piece that I can find, because if I leave any part of this lipoma there, there's a chance that it can grow back. God dang it. Okay, I think we're gonna stitch you up. You shouldn't feel anything like I said, okay? Just me pushing against you. Nothing sharp or uncomfortable. Jonathan and Christian are brothers who both have lipomas on their body. Their mom really wants them to have their lipomas removed. Christian is very interested in doing so. Jonathan, not so much. So maybe Jonathan can watch me do Christian's lipoma removal and see how easy and simple it is, and maybe that might change his mind. Mom and brother, you just make sure nothing's bothering you too. If you're feeling like, I can't look, you look away, or you tell us, okay?
Okay.
This is the closest you're ever gonna have to having a baby. I see the lipoma. I'm just kind of trying to disconnect it from the regular fibrous bands we have in our back. I'm gonna give it a little squeeze out here. Flap would have been. Christian looks like he's got a textbook lipoma on his back. It is a little stuck to him, so I do need to detach these fibrous bands that kind of keep it stuck to his body. You okay over there? I hear some noises.
Yeah, I'm fine.
Just think like it's a video game.
Okay.
You okay?
Yeah.
I gotta squeeze him a little bit. You're doing great. Come on, you're almost done. You're almost out.
Oh, I heard it.
Okay, if I'm pulling on you underneath, you let me know.
That's pretty big.
How about you, Jonathan? I hope it's not turning you off of chicken or anything like that.
Yeah, make it into chicken nuggets and feed it to them later.
Oh my gosh, your mom's
Try it.
sick. Her mom is crazy. You're doing great. Almost got them all. Alrighty, just come in here. Okay. Okay, it's welcome to the world, baby Christian. Christian Jr.
Christian.
Christian's surgery went excellently. I think it's gonna heal really well. And now I'm gonna leave it up to Jonathan. Let's see if he thinks he's able to hack getting his lipoma hacked. Make sure I'm never hurting you, okay?
No, you're fine.
Okay, good. You're doing great.
I can definitely hear it. It kind of feels like you're scratching on paper. That's all it is.
You hear that scratch, yeah, exactly. I'm gonna try to take off a little of this skin overlying this keloid to see whether we can't use it to close this area. That's why I'm making all these like snipping noises here. I make sure to keep some of that skin that's actually on top of the keloid there because I need that skin to be able to cover up the area where the keloid was. I can still feel this is keloidal tissue. It's that tougher, firmer tissue. So I'm gonna try to take out all of that. I really wanna remove all the keloid tissue because it will have less chance of recurring.
Mom, my eye's about to drip. I don't
Your
mess
eye?
up.
What is
on the other side? I'm about to cry.
Well, don't cry.
We can't.
You wanna dab it with something? We can dab it. Here.
It's gonna drip and my makeup is gonna mess up. Mama,
Oh, you worried about your
hurry,
makeup.
hurry. Mama, hurry. No, on the side of my eye. On the side.
my
on the side of
goodness.
my, right there.
Oh, I suppose I can't go on that other side now.
Oh, my gosh. Oh, my eye watering is making my glue come off my eyelash.
I understand. I got glue if you need it.
No, go up some. Go up. Yeah, go right into my eye. There you go. Ooh, okay.
Are you the diva in the family?
Pretty much.
Yes. It's really great when a patient is not stressed about their surgery at all. It makes my life so much easier. Taylor seems more concerned with her makeup. She's so bossy to her mom.
Oh, my mom, wet one more time. Come on.
Oh.
Now it won't be so wet because we're gonna cover you up there. I feel confident that I removed all the scar tissue from Taylor's first ear. Now I'm moving on to the next one. Let me see if I can do the same thing there.
Oh, wait, I gotta, oh my gosh.
What is it?
I gotta sneeze. Oh, okay.
You can sneeze.
Okay, it's gone away.
Oh.
What does it look like? Just chopped off?
Chopped off.
Oh, her ears, they're so small. They like try to dodge me, I feel like. The fact that Taylor has these cute little tiny ears and I'm working in this little nook and cranny, right behind her ear, it's taking me a little longer to put the stitches in. The last little bit now. It looks good. It's just bumpy right now.
No,
I wanna
you're
forewarn
fine.
you. Finally, I finished putting the last stitch on Taylor's ears. They're a little bumpy today because there's a little swelling, but tomorrow they're gonna look fantastic. But it's important to be vigilant after you have a keloid removed. Keep your eye on that area. Make sure that it is not getting more itchy, it's not getting painful, you're not getting a scar that's getting more raised. Those are the first signs that a keloid could be returning. So if Taylor sees any signs, she really should follow up with another dermatologist in her area. Welcome. Let me show her too.
Oh,
she's
wow.
a deciding factor, really.
Guys, the time is now. Oh my gosh, y'all, I haven't had a normal ear in I don't know how long.
So the bumpiness there is just numbing.
Yeah, I know.
It settles down.
Oh my gosh, that is too cute. My whole life has changed now that I'm not held back from certain hairstyles and how I can wear my hair. I'm definitely gonna start modeling now, for sure.
Kind of like pigtails.
You okay?
Yes, I'm okay.
Okay, good. Ken is here with his wife. He has many cysts. He is very nervous, and I want to make sure he's comfortable, but I really want to get off all the ones that are painful for him. I'm gonna push against you. Looks just more like a regular cyst, this one does.
Oh, wow, look at her.
It's like she's just enjoying this so much.
I am. I really am enjoying this. Like every little piece that come out.
Guess what? We're done with that one.
See there?
Get out of town. Well, I'm out of town.
This first cyst that I removed was really small. Ken seems to have calmed down now, so now I think is the time for me to tackle a bigger cyst. Oh, now I see. There's like a threesome here. These are the biggest steatocystomas I've ever seen. You're growing big. Okay, you ready? Looks like you had a rubber band in there.
Oh, look at her.
You okay?
Ice cream machine.
Exactly what
It looks like ice cream. They come out of ice cream machine, vanilla.
She is having the time of her life.
Your hands just about don't put me to sleep.
Oh, that's good. That's the best compliment I can get. I'm so happy that Ken is fully relaxed now because that makes the procedure so much easier. This next one, you got all colors of the rainbow.
Yes.
You do. All right, 2. One more here. The mama.
Oh, look at there.
Come on out of there, man.
Oh, she did.
That was heavy. See, look at this sack. It's like a water carrying jug, like a bladder. You can carry something in it. It's like a purse.
I spell it. Welcome.
I would say a smaller percentage of them have a smell than do not. But a cyst is gonna have a smell if it is infected or inflamed because that's when bacteria is involved. And they smell like old toe jam, like skin that is just wet and has been sitting around for a long time, all mashed in something, and now you're releasing it to the world. What is that gonna smell like? He has a good sense of smell, huh? I'm not smelling anything. The important thing for me as a physician is to not make the patient feel embarrassed. He knows that they smell. Everybody in the room knows that they smell, but I'm not going to talk about it. Patients come to me because of something that they're embarrassed about, and I don't want to make them feel more embarrassed. Righty, part 2. There he is. I see him. One hard push, and sometimes it'll squirt out. It's like you had an egg yolk in your head. Alrighty. I have 2 more bumps to pop on Ken's back, but he has many more bumps than that, and I just want to make sure I'm getting all the ones that are causing him the most pain. Looking good. All right, let's put stitches and you're done. After 7 pops, we're finally done. I just gotta stitch him up and he's good to go.
How you feel?
Wonderful, baby. It wasn't nothing like I was thinking. She do a wonderful job.
I told you.
Words cannot even explain how happy I am. If I can just open my body and let you see all the feelings, you'll probably think it's a fireworks show. I'm so happy. I don't even know this person. I feel a totally different person. But I'm loving him right now. I'm looking in the mirror and I'm still saying to myself, man, you're a nice-looking fella now, man. I'm feeling awesome.
Are you ready to see what we took off of you?
Yes.
You think so? Okay.
Yes.
This is the one on your head. That was the left one on your chest. The middle one. And then this is that bigger one on the chest. I'm so glad that I was able to help Ken. I really think I got the ones that caused him the most pain and distress. So now I'm gonna send those for pathology to just really confirm that he's doing just fine. Okay. I'm gonna turn him a little bit more. There, like that there. Turn a little this way. I know I keep pushing and pulling you.
All right.
There he is, I see him now. I see it. Just trying to see if we can't get this lipoma off of you, if it'll pop out really easily.
Okay.
I know you can feel me pushing you around again, but nothing should hurt, okay? I'm just trying to see if I can loosen this whole lipoma up. It's a very fibrous lipoma. I really wish it would just pop right out. That's what I don't like. Sometimes lipomas pop out nice and pretty. This one was more fibrous. It had more adhesions. It was really kind of stuck to the scalp. This could be much harder than I expected. Come on, just pop out. Step away from the skull. That's just a little bit so far. Come on, just lift up. That's all I want you to do, dude. I'm trying to be safe with this and just use my fingers. This is why I have strong fingers. I know that might look barbaric for me to use my fingers, but it's much safer for me to tease a lipoma away with my fingers than to use something sharp. So we have almost all of it. It's just this bottom part, it's just totally stuck to your scalp here in a flat, like a pancake. So I'm trying to take that out. Come on, little guy, make me happy. Make it worth it. Make this a good day. One lipoma is not like another lipoma. You never really know what to expect. Some can be firm, some can be soft, some can be clumpy, some can have fingers and toes, and some can be just one solid single sphere. They come in all colors and sizes. I'm gonna cut it because I can't get them off there. Alrighty, let's see if I can work this way out here.
So you're already in?
Yeah. Wow. Trying to see if I can get them out whole. That would be the nicest.
Oh, wouldn't that be nice?
Oh, friend, let's see if I can ease them out now. Stuck right here. One side is kind of out almost all the way.
Really?
Yeah.
In one piece?
Yeah, so far it's in one piece. It is stuck. I can tell it's stuck a little bit, so I'm trying to keep it in one piece if I can. I'm always really careful when I'm working around this area close to the spine. You know, I'm burrowing down pretty deep. This could be the most important moment during the surgery. Just takes a little bit of TLC then. Whew. Yeah.
Kind of wrestling it down there.
I am. See, it's like seriously like giving birth.
Push.
It comes, yes. Pull and
Slap it on
push.
the butt and let it cry. Come on.
Here it comes, here it comes, here it comes. Oh, I got it, I felt that release.
Oh, yay. Did you get it?
I think so, but let's take a look at you now. We'll clean you all up here.
Oh my gosh, I already feel like it's flatter, like
It is.
less pressure.
It's flat. It is flat right now. I'm just
That's
cleaning this up.
crazy.
Your upside down part is gone now. I didn't get anywhere near Barbara's spine, and I was able to complete the final step in her full transformation. Here's your friend here.
That's great.
Maybe we can see how it fit in you. It's like a butterfly.
Oh my gosh. So it turned from a butt cheek to a butterfly.
Does this hurt you at all?
No.
Okay, right there. That's a water-filled cyst. See, it has like a milky kind of contents that squeeze out of it. Just squeezing it out, making it nice and flat. You can even see the opening to it right there. Just gonna try to open it a little bit more. A little buzzing noise you're gonna hear. You okay? Did that hurt or just took you by surprise? By surprise?
Yeah.
Okay. It's difficult to work around the eyes for me and for the patient. Obviously, I don't want to nick an eyeball. And for the patient too, can you imagine you're awake and you know somebody is so close to you and has to have such steady hands because they're holding such sharp objects? See, we can see how that milky kind of substance squeeze out and trying to disrupt the sac as much as I can. But it's tough in these little nooks and crannies. And when you have so many and they're all kind of connected. I feel like if we can stay on top of them and get you on a plan where we can kind of keep them in check. Previous doctors who removed these did not destroy the entire sac, and they're really delicate, the sacs that contain these hydrocystomas, so I'm gonna pay special attention to that. I feel like I wanna call them cisterns, or like little caves that you can see that the cyst is in, and they're so thin-walled you can't see the wall. Look, see how that was deflated that, but there's another one. See how there's a bunch of them right here? You have hydrocystomas on top of hydrocystomas. Hilda's case is pretty unique because she has a lot of hydrocystomas. It could be that her previous surgeries have contributed to the fact that they're all now on top of each other. Okay, I think I've tortured you enough. Hilda has some areas that are stretched out because there was a cyst there already. So when we deflate it, there's some extra skin there. that skin will stretch back down, and I don't want to remove too much skin because there is retraction and we don't want to have the skin so tight that she can't close her eyes. You tell me if anything's ever sharp or uncomfortable, okay? All right, so I'm gonna start here. Make sure I'm never hurting you.
Okay.
You're doing great. I see it, I see it. Step here. All right, I'm gonna squeeze it now because I kind of squeezed one edge of it. It's like a steatocystoma almost, more like that. It's like mashed potatoes when you add too much water. It's messy. For a moment there, I thought this could be a steatocystoma because it sort of had that yellowy, buttery look that steatocystomas have, almost like more of an oily kind of consistency. So I'm thinking either steatocystoma or epidermoid cyst. So now really, why did you, if you don't take this off, didn't it like cramp your style though? Like, didn't you not want to go out so much? And
Well, I got like 10 hats.
you have 10 hats.
Yeah. For every day, I wear a hat to hide my bump. It's the first thing I get. Put my clothes on and my hat on. The hat's like a habit, just put on.
People hide their bumps in all kinds of creative ways. They do a nice big comb over. They may have really long hair to hide one on their neck. They might throw a shirt over their shoulder. I've even seen a guy who wasn't religious and he'd wear a yarmulke all the time to cover his bump. Well, now you don't have to wear all those hats. Won't that be good?
Oh, yeah. I can't wait.
Oh, that's good. That's the first time I've heard you say like you were excited about this. Before, you were just kind of like, it is what it is.
A lot of it's nerves.
Yeah, I know. You feeling a little better now?
Yeah.
Good, because we're almost have it all. We're so close.
Hey, take your time.
Yeah, I won over another one. That's my specialty. Let's see what we have. Make sure I'm not hurting you.
If Dr. Lee can't help me, I'm just gonna go home and I'm gonna get an eyeball tattoo on it.
See how thin it is right there? It's like a little egg yolk. It's kind of exciting. It does look like a golf ball.
I told you.
See? Oh, but it's cute. But yeah, it's a cyst. It's an epidermoid cyst. Josh has an epidermoid cyst, but this cyst is a little different because the wall of the cyst seems thicker, probably because of the trauma from the car accident. So it'll be interesting to see how this plays out. Here, look, take a look. Yeah, that's wet skin cells.
That's pretty cool looking.
Okay, you ready for a nice squeeze, everybody? Getting new places.
It's being hateful, ain't it?
Oh, it's warm. It's like warm grits.
Yeah.
See it?
That is nasty looking. That's where the grits went to that I ate the other day. Cheesy grits.
Cheesy. It is like cheesy grits.
Lots of cheese.
Now, because you've had a cyst that has occurred within the area of a scar, there's more of a chance it could recur, I think, with you than like another standard person, because it's scar tissue, and if there's a little bit of cyst tissue under here, it could come back, you know?
I got you.
I am concerned that there's a higher chance of this cyst coming back because the scar tissue sort of distorts the cyst and kind of holds onto some of the cyst sac and makes it difficult for me to ensure that I'm removing it completely. Make sure I'm not hurting you at all, okay?
All right.
You should be just fine. You've been waiting for this for a long time.
Yes, I have.
Brittany is here. She has a lot of unusual bumps on her body. Ideally, she'd like to have all of them gone, but we really can't do that because sometimes when there's bumps really close together, if I remove one, it will distort the skin and make it too tight for me to remove another. So my goal here is to remove as many of the large and painful ones that I can for her to make her feel more normal. Number one down. You get to watch this one.
Oh, yeah.
She's all excited about that.
I want to see that one go. Wow.
I'm so happy that I could remove that really big, painful bump on Brittany's elbow. I know it was the one that bothered her the most, and I think she's gonna be really pleased about it. All right, 2 down, 3 to go.
Oh, yeah.
That one looks good. Okay, 2 more. Brittany's bumps are unusual. They are spongy, they are flexible, they are rubbery. I'm not really sure what Brittany has at this point. I have some ideas, I have some suspicions, but not really sure, and that means they could come back tomorrow for all I know. Last bit. This one has little hairs that come out of it. That's no fun. You know, and you can't hide this. You can't put your hand across your face.
No.
Almost there. Okay. Done. We're gonna send these out and we're gonna have it looked at in the microscope, and that's gonna help us to determine for sure what you have, okay? We're still trying to figure that out, but I'll be calling you back in Memphis, okay?
I am very anxious to figure out what my moles really are. I would be very happy to find out if I can be cured from it as well.
You look beautiful.
Thank you.
All right, let's see if this, just brace yourself, guys, in case this wants to squirt at me. We'll see pretty soon whether it's really a lipoma or not.
I can't even
Or whether we
feel
get cottage
anything,
cheese. I know,
and
isn't
you're
that
already
cool?
cutting, huh?
Yeah, that's a good thing though, right?
I feel 0.
But let's see, that's pretty small what I did.
Looks like a lipoma.
Good.
Oh, I heard something.
Yeah, I know. That's you, not me.
Yeah.
Oh, he's gonna be nice, I think.
Oh, you're excited.
When I feel around this bump, I feel like it's really well contained. It's in its own pseudo capsule. And when that happens and it's not stuck to any regular tissue, it really can slip out. I feel like this could be one of those, I hope. Sorry. Come on. I'm not hurting you, right?
No.
Whoa. Did you feel that?
I felt something.
That was a perfect pop. That was more than a perfect pop. That was a mic drop pop.
Oh, it's like a brain.
Yeah.
It came out in one lump?
It's warm right now, but it's gonna get cold pretty soon.
Oh my God, it's like chicken fat.
Uh-huh.
Look at that. Oh. Look at that, she's beautiful.
It is, it's pretty.
It's actually perfect.
It is, it's perfect. It's pretty much perfect.
It is,
It's like a
huh?
little pizza before you
Did it
pulled
come
it
out
out like
super
dough.
clean?
Gonna push against you, okay?
Did you cut it?
Feel that?
Yeah. Yeah.
You have
did
a
it?
garbanzo bean in your head. I like to compare a lot of the bumps that come out of people to food, and I just feel like it's a really lighthearted way to do this. I mean, it's better than me comparing it to spider eggs or something gross like that. Okay, so there's this one right here. I see him under there. Maybe this one more side. The smaller ones are harder to get because they're like hidden, they're so small. I'm just having trouble finding that one.
Yeah, now it feels flat, actually.
Yeah, see? Now it feels flatter now. When Brandon came in, I counted 7 cysts, but when I go to remove them, there's only 6. I'm not sure what's going on here, whether I've lost the cysts, maybe evading me under his scalp, but I can't find that 7th cyst. Where did you think it was? It wasn't really 2 eyes and a mouth?
I feel like there was one there.
You feel like there's one there where I am?
Mm-hmm.
So there's 5 down here, right?
Yeah, I guess, yeah.
Well, did you say that? Were you counting there were 5 before here, or was that just
I
me?
guess I was miscounting.
I don't feel it anymore. What's really weird here is that I can't find one of these cysts. I mean, it could be scar tissue, it could be a little baby BB cyst, and so sometimes those are hard to remove because they're so teeny tiny. It's almost like finding a needle in a scalp haystack. Feel something there?
Feels like there is.
I don't feel it anymore. Yeah, I don't feel anything. I'm gonna put a stitch there. So initially I thought there were 7 cysts on Brandon, kind of like the 7 little dwarves. But I guess the last one was sleepy because it didn't want to come out. I didn't see anything. So I closed up the area and hopefully there's not really a cyst there that was hiding from me. Okay, next one here. Number 2, beans in your head. Okay, I'm shifting over here. Same thing over here now in this one. Loosen this up so I can squeeze it out. Sorry, it's weird, I know.
Did you get that one out?
Yeah, I did.
Nice.
So far, we got 3 for 3 whole. There was a pop.
Yeah, I
heard that one too.
I felt it, yeah.
Okay, last two. I know, pushing your head deep in there, huh?
Yeah.
Here he comes, like a little trombone. All right, last one. It's actually bigger than it looks. It's like flatter. That was quite a splash there. I mean, it came out like a fire hose. I'm sure when I injected some anesthesia in it, I must have injected a little of that fluid under there, built up more pressure, and it was like a geyser. Sometimes the splash mask is not enough. I think I might need a helmet next time.
What, did it pop?
Yes, it did. It popped on me and us. We gotta take a shower.
Jeez.
Sorry, Valerie. It's okay.
Oh, no.
It's okay, don't worry.
God.
It's all right. It's older. It's more unhappy with us.
Do you want her to clean off your forehead a little
Oh,
bit?
is my forehead messed up?
Well, it's all in your...
It's in my hair?
Yeah.
You could see it. Yeah, why don't you do that?
She got sprayed. Or do you see
I have a
that?
party to go to tonight. Now I'm gonna have to...
You need to shower. It's like, and it's all in the back of her hair, too.
Thank you, darling. Make sure I'm never hurting you, okay? That nothing's ever sharp or uncomfortable. Leonard is here. He's got this huge bump on his arm. I know he's really terrified. He could run out at any minute. I feel like I have to move pretty quickly with him, but also make sure his nerves are calm. It's gonna be an interesting approach that I have here, I think, because I have to remove all that damaged skin and pull out this growth, but still leave him with a nice scar. I'm gonna use my finger to move around here, and that's because that's very safe. It's blunt, this section. Look, here's your lipoma coming out. You know, Chip's pretty cute.
Of course he gets that from me. I could have done this at home.
No, you could not.
Yeah.
Right. Leonard is chatty and joking. I really think that I got him to relax, but I'm always still very careful because I feel like at any moment if I said the wrong thing or did the wrong thing, he could get up and walk out. It's like a flower. I like Chip. Chip is pretty cool.
If any other woman said that to you, I'd be like, okay, Lenny, you gotta let her go.
But I'm okay, though.
Yeah, you're okay.
Your lipoma is gone now.
Oh my God.
See how it's like these globules? These multiple lobules that were tucked in there? You saw it come out. It was like a flower.
Honestly, I am in shock right now. When I seen what come out of Leonard, I ain't got a weak stomach or nothing, but that's just not for me. Seriously, I was sitting there thinking to myself, okay, the bathroom's right around the corner. I know where it's at.
I think I really broke him down a little, but I think I relaxed him a little. Maybe he even likes doctors just a little bit. Maybe not, yeah. Maybe just me. All right, I'm done. How's that look?
A hell of a lot better.
We're getting it. Look, here it comes. You're still doing great, right?
Yeah, I'm fine.
Here you go. Here's your baby.
It's a boy.
This program examines dermatological conditions and the procedures involved with treating them. Due to the graphic nature, viewer discretion is advised.
One of the key considerations for any tumor case is recurrence.
Yes.
So we've got to make sure we get a good margin.
Right.
And we want to contain that tumor in all of the tissue that we excise, that we take out.
When removing this bump, we don't want it to certainly come back, and we don't really even know what this is. So we want to remove it entirely so we can at least ensure that it is all out.
Okay, here we go. You can see the vessels, but it's a pretty vascular tumor, and we're seeing that already.
So you would say that that's pretty rare to get in the hand.
Oh, this is
Yes.
this is the 1 in 20 year kind of a thing. This is very unusual. Okay, start going into the minefield. So if Gerald's tumor is not well encapsulated, that abnormal tissue can spread out throughout the normal tissues of the hand. That means it's tougher to get rid of it. The soft tissues of his hand could suffer if we have to take that out, otherwise it's coming back.
It's just right under there.
Thankfully, it looks like a great capsule. This is really good news.
When Dr. Lilly says there's a good capsule, that's a good thing. It's like a really well-contained ball under the skin. It wasn't something that was going to become a mess.
But I want to make sure we get those nerves identified.
How does a nerve look compared to a vein?
A vein is kind of purple, kind of red, dark blood, blood that's
Nerve
lacks
is really
oxygen.
white, right? Like that.
Yeah, and it's a white, pale yellow, and on the back of the finger, it's super small. And we got to take our time and just kind of protect them as much as we can.
Like glass noodles.
That's right. Okay, so we've got something going on in here. This is the hard part. This is the middle of the minefield. Wow.
What are you saying? Wow, there's a vessel there?
That looks like a nerve.
Nerve right there.
Is it stuck to the base a little bit more? There's
Well,
some massive little vessels there? Maybe
It may wrap around quite a bit.
One of the concerns that Dr. Lilly has is preserving the nerves that Gerald has here. If you sever any of these nerves, you could lose sensation, you could lose movement in the finger.
That nerve seems to provide sensation to this skin. That nerve doesn't matter.
We don't need
This
it.
skin
Yes.
is going bye-bye.
Yes.
Some of these nerves are actually optional. The one to the fingertip is not optional. So let's find that guy before we take this out. It can be nerve-wracking to be taking apart someone's hand and putting it back together, and you worry about accidents happening. It can be like a minefield. It can be like an unexploded bomb. Is it the red wire? Is it the blue wire? So I don't want to interfere or injure the nerve on the palm side of his finger, as that could lead to numbness at the fingertip and his inability to feel things when he pinches or grasps. So this is the nerve to the tumor. Get rid of that. And that really helps that connection.
Almost there.
Okay.
Look at that. That looks
We're
good right
making
there.
good progress.
Blue vessels look threatening, though. They look so like varicosities, you know?
Yep.
Like big veins.
And their source is somewhere in here.
Torturous.
It's
Yeah.
really proximal. It's kind of in the toughest spot to get to. Boy, the last part's going to be the toughest with that artery. Wow. That's crazy. So this is the tricky part. We're down to the final pedicle. And if I cut too much, I'll be cutting into the normal artery, and it's a disaster.
If Dr. Lilly severs some of these nerves around this bump, Gerald could lose movement in his middle finger. He could lose sensation, and that is a tough thing to deal with for the rest of your life.
That's amazing. Take a picture of that.
I should have done it in the office.
I know. With a kitchen knife?
That's pretty. So your vote for this tumor, what are you thinking?
I think it's some type of hamartoma. It's multiple tissue types that don't belong in the finger that have just started growing. There may be some bone. Maybe it's an angioma with fibrous tissue, so maybe a choristoma.
A choristone?
Yeah. We'll see. We'll see.
Neither of us really are sure what this is. We've never really seen anything quite like this, and you need to see what kinds of cells are there to really get a firm diagnosis. You also need to see what cells are there to see whether there are benign or malignant cells there. We really need to depend on pathology to get a diagnosis.
Now you have to trim out the excess and create some good flaps. We need to make it look pretty. And I want to put the division of the glabrous and non-glabrous skin, the sweaty and the palmar skin.
So it looks natural,
hair-bearing
looks real, right?
and non-hair-bearing skin naturally.
Especially in him, he's darker, he has a difference in the color.
Yeah,
so to make sure you don't want it, it's a
match.
little distracting if he had some of his palmar skin on the top of his hand. You would be able to see that.
And make sure we get a good color match. Whenever we take out a tumor this size, we want to make sure we restore that balance. And if we can keep the scar on the very side of his finger, it optimizes his function and minimizes stiffness.
That's good. That looks excellent.
Let's wake him up.
While you're finishing up almost, I'm going to play with this a little bit. I want to see what's in there. That was fascinating.
Have fun.
Looks like portobello mushroom. You see that substance? It's like strawberry jam or something.
Again with the food analogies.
I know, I'm sorry. What else does it look like? Oh, look, that's even, see, this is like almost like a coagulated blood there. That was darker right in there. It's kind of gross sticking my finger in there, actually. It's like very cold and blech. Oops. Thank God I didn't take that stuff out. Look at that. It's very like sticky. So it's like a sack of fibrous tissue, I'd say. That is gross right there, sorry. All right, I'm done with that. I've never seen anything with strawberry jam come out of it. It is so cool that Dr. Lily was able to free this entire mass and not affect any of the important structures of Gerald's hand. Dr. Lily is an amazing orthopedic hand surgeon. I can't thank him enough.
Well, you have a big heart to do this.
Thank you. Juliet is here. She has a bunch of steatocystomas scattered on her neck and her chest. There's sort of like this oily, oil-filled, butter-filled cysts, and they just look ugly to her. She's anxious to get these removed, but there are a lot of veins in the neck, and those scalpels are razor sharp, so I have to be very precise. Okay, first one, I'm gonna put one little nick in it. Here's your little oil too, see it?
Oh.
Julia definitely has steatocystomas, and they are really pretty ones. They look like they're coming out nice and pristine, like you would squeeze out some beautiful hand soap or some moisturizer into the palm of your hand. I know you feel me pulling it. I'm trying to get the sac out. All right, 2 down.
Okay.
Okay, so I'm gonna pierce this one, and then I'm gonna have you hold your mirror up. Ready?
Okay.
Take a look.
Oh!
Are gonna need a rest today. Right here.
Well, it's a big one, huh?
It's bigger than some of the other ones. I was like, rubber band. Isn't it kind of cool?
Yes, that's amazing. So these are called Seattle Tacomas.
They are from you when they come out of you. Right? These are now Seattle Tacomas because you're from Seattle. But they're called Seattle. They're called steatocystomas.
Steatocystomas.
Yes. Okay.
Oh, sorry. My
That's
expressions
good.
are probably like,
Oh, you should see some of the other people that watch it. They're like, oh, that one was amazing.
Yeah.
They're like gushing about them. Getting on a little roll, a little pop and roll.
Yeah.
Wait, look at this one. Hold on.
Oh.
See the birdseed? I speared it.
Oh, yeah.
Okay, I'm moving on to the other side. I've been able to remove many of Juliet's steatocystomas, and I've even been able to tackle a lot of her eruptive vellus hair cysts. It's very satisfying to see them like bloop, pop out of the skin. Okay, one right here. This is a bigger one if you want to watch this one. I can feel it under there.
Oh. Oh,
It
my.
really- you can feel it like just deflate in your hands.
Wow.
Doesn't it look like really good, expensive soap?
Yes.
Like
Maybe we should
expensive?
make that and
Telling you,
market it.
girl. Okay, I got like 3 smaller ones and then that bigger one, and then we're good. Okay, one last one back here before we do that row of them. I finally gotten to the biggest steatocystoma that Juliet has. I really want to avoid this vein, so I need to find a way to get out the steatocystoma by maybe pushing this vein gently aside, just really treating it with a lot of respect and making sure that I don't go anywhere near it with anything sharp. Okay, I'm gonna do this little caterpillar one, okay?
Okay.
Let me raise it up from back here first, okay?
Are there, ooh.
There's one. And then another one here. Not go too deep. Three.
Oh, that's huge.
You missed the veins, that's good. I think I got them all. I got the steatocystoma, I avoided the vein, and I'm gonna just pat myself on the back. She has these little linear scars, and she's gonna be okay with those, I think, because there definitely are an improvement compared to what she had before. I think she's gonna heal well, and she's gonna be really happy. And here are your little bird seeds. Like there's 3 of them that I got intact, right?
Oh, uh-huh.
So I'm gonna go smush them under the slide, okay?
Okay.
Yes, I'm a dork, but one of my favorite things is when I remove one of these eruptive vellus hair cysts, I like to show people what they look like under the microscope because I think it's so cool that somebody had this little piece of birdseed in their body that has all these little coiled up hairs inside. Okay, so you can see it from up here. That's the slide, it's smashed down. You see all those little hairs? And they're kind of wound in here. All right, let's go show her this. I think what happens is that these sac walls are derived from vellus hair cyst cells, so Instead of like an epidermoid cyst that sheds skin cells into it, these shed vellus hairs into them. Okay, you wanna see your little hairy friends?
I do.
See the little hairs under there?
That's me?
Yep, that's you under the slide. We smushed him down. There's even a swirl like right here.
I mean, and they were so small. And look at all that. That's amazing.
I'm glad I could help you, and they already look way better.
Thank you. I know. You've really changed my life. But you have no idea. I had someone telling me for years that nobody would ever accept me because of these. So
that's terrible.
It is, but now they're gone.
Now they're gone.
So
now the world is your oyster.
Yes.
I adore you.
Oh, I feel amazing. It's like a switch just flipped for me. Dr. Lee changed 25 years of my life like that and just made everything so much better. My ex can't hurt me anymore. I'm back. So there's my little dance.
Whoa. Did you hear it talking to us?
Lita's here with a huge lump on her leg. I'm hoping it's a lipoma, and I'm also hoping it's not under her muscle because that means I wouldn't be able to remove it completely. The best thing about her bump is that it's almost singing to me. It's like getting prepared for its removal, like me, 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 me.
I heard something.
It is, it's like talking to us. It's a lipoma.
It is?
Yeah. But he's just talking to us. Because there's like little nooks and crannies that part of it is your regular tissue and part of it's like lipoma, so it's like a talkative one.
Are you serious?
It looks like Lita's lump is a lipoma, and I'm happy to tell her that. Sometimes there are squeaking noises. It's just skin against skin, and there's air involved now that I've opened the area. I think that lipomas talk to me because they know who I am. They know I'm coming to get them. They say, help me! No, don't take me! I'm here in my fibrous band home.
Use these little bands that keep it stuck in there. I'm just gonna tear a little bit of it off. I feel like sometimes when you get these ones that are wedged in here, if I loosen it a little bit, a lot of times they'll ease out then.
I think I see why Lita was concerned that this could be more deeply attached to her, because I think that these fibrous bands sort of tethered the lipoma in place, and so when she moved, it would tug on these bands, and so she'd feel much more movement or discomfort or potential pain.
You okay? Oh, I'm hurting you? That hurt there? Sorry, darling.
As I'm laying here and feeling a lot of fear, anxiety, it's overwhelming.
He's just. Am I hurting you?
Yeah.
What happened? I'm pulling?
I know that Lita is really nervous about her surgery, so I know I need to speak up and draw her into a conversation so she stops thinking about what's going on at the moment. So,
what do you like to do for fun?
I sing.
You do?
Yeah.
Sing something to your lipoma.
Why should I feel discouraged? I love music because it does soothe and it relaxes and it calms everything down. When Jesus is my portion, and I know He watches me.
That was just beautiful. You have a gorgeous voice. And we now know you didn't lose it by losing your lipoma.
Right.
We wouldn't want to blame it on that. And upside down, yes.
Lita has an amazing voice. I know I was initially just trying to get her to speak, to ease her nerves, but to get to be blessed with an amazing song like that, it really makes the surgery more pleasurable, and it just makes us all have a little more fun.
All right, you ready to see it?
Oh my gosh. Wow. I can't believe it's not there anymore. This thing has plagued me daily. I don't even know how to describe it. It's amazing. I was carrying all that around in me.
I know.
Now I can be excited about getting married and walking down the aisle and our wedding night. I wanted it to be perfect, and now it will be. Now it will be.
I want to see wedding pictures. You better.
I will. Goodbye, lipoma. You've gone away.
Okay, you shouldn't feel anything other than us touching you and pushing on you, okay?
Okay. I'm super nervous. The only thing that's stopping me from leaving this office is I really want this lump off of my leg.
Okay, let's see what you've been hiding that's grown to be 10 years old now. So, you have a very pretty lipoma.
Oh my goodness.
I'm just trying to loosen it up, okay?
Okay.
It's kind of adherent to you. It is in these little tunnels stuck. Heather's bump is a lipoma, and that's a good thing because that means it's benign, but it is much deeper than it initially looks. Sort of like an iceberg. It really does project under the surface of the skin. I'm just pulling it out from its little cavities that it's in, but it's slippery. I mean, he's just hanging on for his dear life, and it's almost all the way out. It's heavy. I think that's it, just attached by this. It's like it's attached by the umbilical cord now. Ready to catch it, okay? All right, catch it, catch. It's heavy. It's gone.
Hooray. Thank you.
That is gonna be beautiful. See how it's gonna tuck right into her inner thigh? I don't think it's gonna keloid right there.
Okay, nice.
I really tried to design this closure to keep the skin as loose as possible. I really don't want the stitches to have too much pull or tension on them because I do think that that can help promote the development of a keloid.
Oh my goodness. It looks amazing. I am looking at the mirror and it feels awesome.
It kind of looks like a jellyfish.
Oh my God, that's huge. This morning I was freaking out, but Dr. Lee did put my mind at ease about not forming a keloid.
Let's see how much it weighs here. 2.10.
Wow, that's huge.
This bump was kind of deceiving because it was much bigger than it looked like on the outset. I mean, it was as if this lipoma was wrapped around her entire thigh. It was hiding in there. Thanks for leaving a part of yourself with us.
No problem. I haven't felt this excited in so long. I'm looking forward to going out into the world and showing my children a good role model. I don't have anything to hide anymore.
Okay, here's Big Mama. Make sure nothing's ever hurting you, okay?
We're here with Rhonda. She has 7 big bumps on her scalp. One of them in particular is unusually large. And so that has its own complications that I have to make sure I address. She also has this really interesting horny growth. Could this actually be a skin cancer? I need to take this off and get a good idea or a good feel of what this is. I really have to approach this systematically and just make sure that each one is in good condition before I proceed to the next.
It's like you're deciding whether you want to pop this balloon or not. One little cut too deep and it's gonna spill out.
It's always risky removing a cyst of this size, especially on the scalp. The scalp is extremely vascular, and so if you get a little blood vessel that bleeds, sometimes it's hard to see where it's bleeding and hard to stop the bleeding. So that always complicates things and can slow you down.
Just treating it with some mad respect, let me tell you. This thing is like your old friend. Guess what? He's gone.
Really? Oh
Big
my
Mama's
gosh,
gone.
That's so awesome.
I was able to remove Rhonda's biggest cyst, but I'm not done yet because I need to cauterize the wound edges well and make sure there's no excessive bleeding. And she's still got 6 more cysts for me to remove, including that really unusual one, that horny one that's growing on top of her head.
I'm gonna just shift positions here. Just gonna wiggle you around, okay? Some of these you gotta wrestle with.
I got the big cyst out now, so that's great, but of course, a smaller one is posing a little more of a problem. Sometimes the smallest, most innocuous looking cyst can cause you the most problems.
All right.
That one made a little kissy sound when it came
Yeah,
out.
it did. Little suction.
Yep. This one looks like it might have been a little banged up itself. It's kind of a little bit bumpy.
One of Rhonda's cysts is a little more on the bumpy side, and I think it has to do with the fact that the cyst wall on one side might be a little weaker, a little thinner, so when you blow the area up or you fill it up more, that weaker edge sort of herniates out and it creates a little knob.
That was so close. I almost dropped it on her arm, her real arm. Now I think I lost a little trust in her.
The trust is still intact.
Yes, oh good.
It's such a relief to finally have an obedient cyst, and now I can finally tackle the last bump on her head. It's the one that looks like a horse's hoof. It definitely looks different than the rest, and it might be my biggest obstacle yet.
You okay here?
Yeah.
Okay, just let me know if anything hurts. I think I numbed it up well now. It's wedged in there.
When I remove this cyst, the things that I don't want to see, which could mean something bad, if the skin was really mushy or broken down, if there's a lot of bleeding easily, if the skin looks more cancerous, it looks more injected with blood vessels and just angry and ugly. So I'm really interested in seeing what happens when I knock this horn off.
All right, how am I gonna get this thing out of there, huh? This thing is like wedged in there. What the heck? Yeah, it's like it's stuck to your head. Can't be stuck to your brain because there's a skull in the way. Calling it a horse hoof because what the heck? This thing is rock hard. This one is like, maybe we'll just keep this one on you.
Oh, no.
Just kidding. Are you okay?
Yes.
Okay, I almost have it off. Oh my gosh, he's almost there. You're gonna have to change your height on your driver's license now.
I know, right?
That's a hoof. That's it.
Yay.
This surgery was certainly risky and difficult, and I was able to remove the horn completely, but I'm still not convinced that this is not a skin cancer. So I'm taking a portion of tissue and sending it for pathology to get a formal diagnosis, and I should have the results for Rhonda in a couple weeks.
Here, you stay like that, and I'm gonna give you a mirror. We put numbing and there's swelling around it, but they should flatten up. They look very bumpy right now. They're not gonna be that bumpy, okay?
Oh my goodness.
Top of your head too, that one's more bumpy. We're gonna have to pull that one tight.
Wow, that looks
See the sides
so
too?
awesome. This looks so great.
It looks really good.
Yes, it does.
And it's not there yet either. It's just
You are
too
amazing. I was so excited that she didn't have to shave my head, so I won't have any bald spots. I'm excited about that. Oh my gosh. Oh, okay. Wow. That is so crazy. It feels so weird. The bump on the top of my head, she sent off to get tested. I hope that it comes back good, but I am still nervous about that.
All right, let's see what you got under here.
Let's reveal the secret.
Paul came in to see me because he has this giant bump on his back. He's pretty sure that it's due to his sciatic nerve injections. I'm not really convinced about that. But I don't know whether this is a buffalo hump or a lipoma. I'm always hoping for a lipoma that pops up nicely. Okay, it is a lipoma for sure.
Good deal.
But I'm just trying to get it out of its little
Pocket.
The little pockets, exactly. I can now tell this is a lipoma because I can see that there is this fat pocket area that looks like it's separate from the rest of the body. If this was a dorsocervical fat pad, you would just see regular fat. I feel some fibrous bands keeping it in place.
Being stubborn?
You gotta romance it a little bit, you know?
Yeah, you gotta wine and dine it.
Yes! The lipoma, I had to wine and dine.
There you go.
This lipoma's been there for 10 years, so it's really made itself a nice little cozy home, and it doesn't want to leave. It has really found all these nooks and crannies. There's a lot of fibrous tissue keeping it bound in place, so I have to really massage this lipoma out. Thankfully, Paul is really good-natured, and so he makes my job a lot easier. I can't even grab it because it tears. I feel like I'm scooping his out. Where's my big serving spoon when I need it? Look at your hand, you got little pieces everywhere.
I've been catching it. This is definitely the messiest.
And we're gonna have to check our clothes after this, make sure we don't tuck any lipoma in my pocket or something. Well, it's official, the messiest lipoma ever. You know, have you ever pulled the cheese off the top of pizza?
Yep.
That's what it looks like. We're taking the mozzarella out now.
You know, every day we find new foods to compare.
Can we have pizza for lunch? I often can't help but make food comparisons during surgery because it's all organic. It all reminds us of food. It just becomes like second nature. It doesn't bother you. I can talk about something like egg salad and then I can eat an egg salad sandwich right after too, no problem. What kind of work do you do?
I deliver campers, RVs, motorhomes.
Really? You know what? I want an RV that's a Dr. Pimple Popper pop-up. And I want it when we roll around to have a pimple on top that bops up and down and has like stuff shooting out of it.
There you go.
Yeah, and then I drive around the country and have a Pimple Popper pop-up. Okay, done. And look, his neck is back.
I got a neck?
You do. All right, let's fix you up. Even though the lipoma itself is a little complicated, we conquered it, and now you're left with a little smile.
Well, got a smile on my heart also.
Aww. Although his lipoma was a total mess, I couldn't ask for a more wonderful and good-natured patient. So it was really nice to be able to put a little smile on his back instead of a heavy weight. Here, you want to look at yourself?
Oh my gosh. Totally gone. I'm ecstatic. I've actually got something removed that's been a burden for years. And I'm gonna be a lot safer on the road. Look at the flexibility. I couldn't do this before. Took a hump and turned it into a smile. The scar Dr. Lee left me with, she made a smile out of it. And she made a smile in my heart.
You're awesome.
Thank you, Dr. Lee. I'm so grateful to her. It's like I'm reborn again. I've got my Paul Duke back that I lost years ago.
Okay, put a little numbing right there.
Needles are not my friend.
Okay, one little baby pincher, just a baby pinch. That's it. So what do you like to do in your spare time?
I like to cosplay.
Sounds like fun.
I can be a chatterbox. I like to talk to my patients and get to know them. And in this case, I use it to my advantage because it helps to calm the nerves of my patients if you get them thinking and talking about other things and what's going on. And I think in this case, it's working.
Okay. You should not feel anything other than us touching you, okay?
All right.
Just taking this little friend of yours off and keep as much of your normal ear as I can here. So.
I can hear it scraping.
Yes, I
That's
know.
so crazy.
Whenever I work on people's head, their scalp, or their ears in particular, the sound is amplified. You know, even if you kind of scratch your ear, you can hear yourself doing that inside too. You can hear that in your head, and sometimes that can freak people out. I don't want this to come back, but I also don't want to increase the trauma here. There's a lot of factors I'm thinking about here.
Guess what? He's gone.
I removed the largest of the 4 keloids. It was probably the largest that I've ever removed. And I was surprised at how much it was actually attached to her ear. So I unfortunately had to take off more of the normal ear than I expected.
The key is like to have them not own you. You own them. And now there's time to go. Rent is up. Guess what? It's out of you.
Both of the keloids on Jennifer's left ear are now gone, but that was actually the easy part. I realize now that I've had to traumatize a good surface area of Jennifer's ears, and so what am I gonna do to try to fix this up? Because keloids are created by trauma, and the more that I traumatize
the skin, the higher the risk is of a keloid growing back. All right, let's hope this one's nicer to me.
This one is my oldest one.
Yeah. Better not be the grumpy one. These are really more attached than I imagined. In fact, this one on her right ear may be going all the way through to the other side. I mean, it's affecting the helical rim, it's affecting the antihelix, and I'm afraid that it's gonna go clear through the ear from one side to the other. And that would be trouble if she had a big hole in her ear. I have no normal skin to patch that up. We gotta take out some of this tissue under here. See, because we normally have cartilage there anyway, so that is what we know is normally there, but sometimes it's hard to discern. That is ready. Tuck something under there. That looks good, actually. Luckily, this keloid did not go through her ear. Because it was two separate ones, I could remove it and still maintain this general shape of her ear, but now she's left with the area that has to heal by secondary intent, meaning letting it heal from the underside and from the sides, and slowly these new skin cells are gonna grow and cover that area. It's gonna take a few months, but it will get there. This is the issue that I have right here. I might need to do like a little graft right there of tissue from this tissue that I removed on you. I gotta just recreate your ear here. Sometimes when you want to successfully close a wound, you need to do a graft. A graft is when you take tissue from somewhere else in the body, completely detach it, but then use it to patch up another area. And in this case, that's what we're doing. And I think that's really important in Jennifer's case on her left ear, because we wanna maintain the shape of her normal earlobe. If I somehow distort her helical rim, which is that outside edge of her earlobe, it's much more noticeable. Let's show it to you. Let me tilt you up a little bit more. Okay. This was a really complicated, very challenging and intricate surgery, and I'm still worried about the amount of trauma that I've created on her ear, but I know she's gonna be really pleased with the results. All right, we're gonna give you a mirror here, okay?
Oh my God.
They're gone though. That makes a huge difference, girlfriend.
I feel like half my face is missing.
It took up half your face. You look amazing. But you're okay with that? See how that ear's a little smaller?
Yeah, I see it.
It's actually really cute.
I
kind of
like it, yeah.
Yes, I agree. I think if anyone's gonna like it, you're gonna accept it.
Just seeing myself without the keloids just made me... I forgot what I looked like. I forgot that I could feel so good about myself. I can't believe it's gone. It's so crazy. I probably haven't been this happy in like probably 15 years. I actually feel like I'm really confident. Like I feel like I could take on the world.
Let's see how much they weigh. 14 ounces, pretty much.
Jeez. I love it. I actually do. I really like it.
Yes. I'm really happy with how Jennifer's ears look now, but I do know that the more trauma that I've created on her ears, the more chance of a keloid returning. But I think I have an idea of what I can do to help minimize the recurrence of a keloid. There's a device that we have here that we use it to apply superficial radiation therapy to the area, okay?
Okay.
And we're gonna submit the focused areas to radiation, and that can help to really keep these away. Radiation therapy is one of the ways we can help prevent keloids from returning. But there is a 24-hour period I have to wait before administering the first dose, so we'll send her home and we'll see her tomorrow.
I really don't want him to come back.
I don't want him to come back either, and this is the best way to do that. So I'm gonna put a little numbing here, okay? So you might feel just a little initial pinch here. What Margarita has could be an epidermal nevus. It could also be something called a sebaceous nevus. These both look pretty similar. These are growths that are conditions of the hair follicle, and they often occur on the scalp, and so hair doesn't grow in that area, so you have this bald patch of this cauliflower floret-like growth on the scalp, so they can be ugly and a source of embarrassment. Okay. She's gonna tape your ear forward a little bit. Mm-hmm. Okay, you ready for this to be gone?
I am so
ready. So ready, huh?
Mm-hmm. Get him.
Yep, go get him, right. I'm just marveling at the fact that you have spent so much time anguishing over this.
One little grape cluster. Okay, next one. This hangs on like from a little stalk here, this one. This is number 2. You feeling a little lighter? I've almost got it all. I'm gonna take off this little bottom portion that's a little more raised. I do my best to try to get under this growth and remove it completely so it doesn't have a chance of coming back. Done.
Can't believe you're done.
Margarita's been dealing with this growth that has caused her so much embarrassment, so much distress in her life. So it was really nice that I could get rid of it within minutes. Can I show it to you?
Definitely. Oh my God. I can't even describe the feeling. Not having that anymore, I just went speechless. It was overwhelming. Is it really gone?
Yeah, you want to see? It's here.
Oh my God. Thank you.
Look at all that wasted time you had stressing about this.
Wow. I can't believe it. I had this nevus behind my ear for 46 years, all my life. And in 20 minutes, Dr. Lee took it off. It's gone. Before I had sad tears, now they're happy tears. I'm so happy.
Okay, let's see if this is what I think it is. I think it's a lipoma, but you never know. Kevin is here. He has a pretty big bump on his hip. I really think it's a lipoma, which is benign, but I think that he's a perfect example of somebody who has a benign growth that really affects his life. He stopped working out, it affects his work, and it clearly affects him emotionally. And it's a lipoma. Now I'm just gonna woman handle it, okay?
Oh.
Weird?
Yeah, weird.
Am I hurting you? Just pulling like,
yeah.
You know what that feels like? You'll never feel it. It's like a C-section. When someone's delivering a baby and it feels like you're tugging, but you can't feel anything painful. Yeah. I know, I've been there, done that. We're getting it. Look, here it comes. You're still doing great, right?
Yeah, I'm fine.
You sure?
Mm-hmm.
Everything looks awesome. You're almost done. Look, there he is. There he goes. Here he comes. This is the fun. You okay?
Mm-hmm.
You sure?
A little pain, but I'm fine.
Oh, you're in pain? Tell me.
Just a little bit, just a little bit. I'm fine.
This is it. This is it. You're done. We got it.
All right, so that's it?
See?
It was huge.
It's pretty big. Think of all the new outfits you're gonna have to buy. You probably looked at things and tried on things and just said, because of this, I can't wear this.
Wear them, yeah. Shopping in the big and tall section.
Oh, really? Now that Kevin has his bump removed, he can get healthy, he can get his confidence back. It's definitely a high friction area, pulling up and down your pants. So I really need to make sure this is stitched up nice and tight and there's no bulge there in his pants. There you go.
You all stitched up?
Mm-hmm. It's just looser there. It's gonna tighten up, you can see. It's gonna be good. All right, nice and flat. Looks good.
Feels awesome to get this thing finally removed. I feel like 1,000 pounds have been lifted off my shoulders, or off my hip.
2 pounds, 6 ounces.
2 pounds, 6 ounces. Losing 2.5 pounds and I didn't even have to work out for it. It was awesome.
Here you go, here's your baby.
It's a boy. Very excited because I won't be stuck behind the desk at work anymore. I'll be able to go out back in the field and drive the tow trucks, be more active, get back working out, doing a lot of things I used to do before I had this lipoma. No more sitting inside, no more, you know, just being a bump on the log, be a whole lot happier. I'm about to hit the streets hard again.
Stuff there. You're now a popaholic. I can see it. You got it in you.
You turned me into a popaholic.
I'm going to in a second.
This program examines dermatological conditions and the procedures involved with treating them. Due to the graphic nature, viewer discretion is advised.
All right. Let's see what we got here. What have you collected in here?
I don't know.
Oh my gosh. It's a lipoma. It's official. It is an absolutely world record-breaking lipoma for me. Now, I still gotta get it out of there. All right, maybe if I push it this way. I need to work out more.
Lipomas can be easy, lipomas can be hard. Usually they're easy because they have a pseudo-encapsulation, which allows them to pop out really easily. And so Tim's, he does have a lipoma that is pseudo-encapsulated. Problem is that it's just stuck and tethered down on the bottom, and it's very hard to get to it because it's so big.
Wants to be stubborn.
He does. It's probably like you. Arg. Just carpal tunnel asking to happen.
Do most of them come out in one
I'm
set?
hoping.
I really want to keep this in one piece because it's always really nice when something pops out whole. But can I pop this out of this small hole?
I'm done.
I wouldn't be surprised if this one broke the record for the biggest lipoma that I've ever removed. I think the last biggest one was maybe around 11 and a half pounds. So let's see what happens here.
It's right here. Oh my God. All right, I found your brain.
Finally come out.
It's literally a brain. All right, let's go home.
I was finally able to remove this big melon-sized lipoma from Tim, but it's still attached by these little connections on the undersurface, so I'm gonna have to carefully, delicately snip those away. But at the same time, I'm also concerned about not dropping this thing.
Hold on to it. It's gonna be slippery, sucker. Like a greased pig. All right. I'm holding it with my chest so it doesn't fall. Guess what? It's out of you.
All right.
Do you feel lighter?
Mm-hmm.
I have given birth to 2 baby boys myself, and neither of them was the size or the weight of this that I took out of Tim's body.
Do you have a guess as to how much this weighs?
7 and a half.
If you win the lipoma.
Okay.
Don't move. 12 pounds, 9 ounces. You broke the internet lipoma record.
This was the heaviest mass that I've ever removed on somebody's body. That was the biggest, that weighed the most. That was definitely on the upper edges of a healthy baby. I mean, that was like a big baby.
Look at where that was. Now is like the challenging part for me is trying to get this closed.
Removing a big mass like this is difficult in itself, but equally it's difficult to close this area. There's a lot of time involved. In fact, there's probably more time involved in me closing this area than actually removing the lipoma in the first place.
What's really important right now is compression. You know, you just had something big taken off. I don't want to have you move around a lot, and you know, getting up can make you lightheaded. I don't want you falling on me.
Okay.
That's really, really important.
I'm trying to close this up as quickly as I can so I can get compression on him because I don't want him to move a lot. If you move really quickly and move around, you could disrupt something.
You got a really strong compression on. Don't let anyone pat you in the back or hug you or run around or jump around right now. You got to take it easy right now.
I think Dr. Lee, she's a very nice doctor, awesome lady. And I have to be patient while I'm healing. I know I got to take it easy, which I'll do that so I can go back to work.
Shouldn't have kept it that long, but...
You shouldn't have, no.
I'd really be excited to get back to my friends and let them see how my back has changed. Maybe I could start being more social. And I can move around easier on the farm. Work every day is going to be a lot simpler. Certainly is.
Okay, I'm gonna put a little numbing right here, okay? Just a little baby pinch.
Eso es lo que menos importa. Lo importante es que se lo va a quitar.
No,
Una aguja no es nada, un punzoncillo.
You shouldn't feel anything, like I said, other than us touching you. You just make sure we're never hurting you, okay? I see it. It's a cyst, but I think we're okay. In other words, I popped it and it didn't explode in my face. That's what I care about right now. Do you want to see Mama now too? You want to see?
Oh my God, que ya que no lo vio Gloria.
Looks like what? Is there a dish in Costa Rica that's like this?
Algo que se parece como la arena.
Like sand.
Comida como frijoles molidos.
What? What is she saying? What kind of food is it?
She said like ground beans.
Oh yes, yes, yeah, frijoles. With cysts in general, there is a wide range of colors that it can appear. There can be snow white, it can be as dark as oil, it can be green, it can be yellow, almost all colors of the rainbow. I've never seen neon though, never seen glow in the dark. But I think this has a lot to do with the skin coloring, because remember, it is just wet skin cells. So the darker complected a person is, the more chance that they can have a darker colored cyst contents.
Beans, good in your cyst. The more you pop, the less you can resist. Mas frijoles. Oh my God. So what I want to do now is remove that entire sac, dissect it off from you. It's like stuck to you a little bit.
Oh, okay.
So I'm just gonna put more numbing underneath. Is it hurting you at all?
No.
Okay, good. Just try to tease it away delicately.
Gloriana was really nervous before we started the surgery, but I think all this talk about ground beans and ground beef has really taken her mind off of the task at hand, and she seems really nice and relaxed and comfortable now.
Almost there. Just make sure again I'm not hurting you.
No, it didn't hurt me. It feels like a little cold.
A little tug. Okay, well, he's gone now.
Yeah.
Clean everything up here. Bye. Okay, I'm kind of interested in showing you what it looks like and see if it looks like what you imagine it to be right now.
I don't think so. Now you said black and beans and who knows what else. I was like, now I'm not hungry, thanks.
Oh, okay.
Gloriana is a beautiful young woman with such a fun personality. Now she's gonna have this gorgeous shoulder to go along with it. I know she's gonna be really pleased with the results.
Looks good. Okay, you wanna see?
Oh my goodness.
Frijoles.
Oh, that looks like ground beef. As I'm looking at it, I think, oh my God, I never expected it for it to look like that. So I was like, ugh.
She can hold it now. Hold this one behind her. Okay, you can see that now here?
Oh yeah.
Yeah.
There it is.
Okay.
I feel happy. I did not feel a pinch. I was expecting at least like a pinch. She has angel hands.
See, we can still see that it's a different texture underneath there. I can see it. It's under that skin there. That's what's infuriating about them.
I'm here with Tracy, who has a multitude of bumps on her face that are called trichoepitheliomas. I'm in the process of trying to remove them with minimal scarring, but the problem is if you take too much, you can leave permanent indentations in the skin. With experience, you do understand how to remove these well. When an area is convex, if it's rounded out, like your forehead or the tip of your nose, you don't want to shave off that much or remove that much because any kind of indent that you make is more noticeable. But for example, an area that is concave, like the groove between your nose and your cheek, you can be a little more aggressive because that's a normal dip in your skin.
It does kind of make your eyebrows go a little crazy right here.
Mm-hmm. That big one right there, if that's the one I'm thinking you're working on, that one bugs me quite a bit.
Yeah, because it makes your hair go up like a cowlick.
Mm-hmm.
All right, let's get our little laser here ready.
I'm now at the point, if I were to continue using a surgical blade, I'm probably going to remove too much skin because it's very thin. Some of these bumps are really, really just slight. So I'm gonna switch to the laser now because this allows me to do a more controlled, precise, small amount of tissue removal, really measured more in microns.
So just one right here. We're gonna do one right up here, okay? Ready? You okay?
Yes.
You can even see how it shrivels the tissue a little bit. And like sucks it up.
We're using the CO2 laser, which is a laser that targets water, actually, under the skin. And so it helps to really decrease the bulkiness. CO2 laser can be very effective. We normally use it to help improve acne scars, dyspigmentation, deeper fine lines and wrinkles. So it can help to kind of smooth the surface of the skin. The laser is painful. It's like a beam of heat, that's boring a hole into you, but 100 of them drilling into you at one time. I mean, it's not comfortable.
Okay, you did awesome. Let me tell you, I'll treat you anytime because you could handle that like a champ, Missy, and I know that's not so easy.
So Tracy's all finished, and you know, it must be hard for Tracy because she's been dealing with this for so long, and to know that she came to see me to see improvement, but actually she's leaving looking worse at this point. But as this mends, we will hopefully see a wonderful result. I wanted to show you what you have here so you can see what's going on here.
That is already a night and day difference. Thank you so much.
I think this is gonna look nice. That's where I really tried to hit you.
Yeah, that one drove me nuts.
Yeah, and you handled it so well that you allowed me to be a little bit more aggressive with you, which is good.
Wow.
I feel amazing already. I feel like I'm finally gonna be able to get out from behind that mask that I've been wearing for so long. I feel like I've been set free in essence. That's the best way I can explain it. Just wanted to say thank you for helping me with this, you know, because it's rocked my confidence dealing with that my entire life.
We see this a lot in dermatology in general, and these are the steps we can do to try to change those emotions around.
Get that healing process done.
Right, you're darling. If anyone deserves it, you do, for sure.
Thank you, ma'am.
Oh, you're so welcome. I'm gonna see you again, though. Okay?
Thanks, ma'am.
We're gonna keep doing
Thank
this.
you so much.
Okay?
I really appreciate it.
Of course, I adore you.
I can't even express how grateful I am for what she was willing to do to help me. And I think finally I'm at a point that I can let the past be in the past and start fresh and new.
This is my first surgery, so it's like having me on edge right now. It's like a haunted house. You're excited, but you're scared at the same time.
All right, so we make sure nothing ever hurts, okay?
Having sharp objects near my genital area, that's kind of nerve-wracking. It's kind of like a horror movie. I just think, what if I jerk or something and it cuts somewhere else that it's not supposed to?
What's going on under here? I think you got a lipoma under here. A little extra bit of fat, and I think yours just popped out. Lipomas usually occur in the subcutaneous space, which is the fat space of our body, but you know, there can be fat more superficially on some of us, so the skin sort of pooches out and accommodates it, and now you can have a pedunculated growth.
Sometimes, like, I stand up, it'll be stuck in between my thighs, and I had to squat and do all kind of extra stuff.
Detach it?
Yes, ma'am.
Stuff like a wedgie, it's kind of like that. You gotta like make some move or something without reaching down, huh?
Yes, ma'am.
Yeah, you still okay?
Yes, ma'am.
Good. All right, we got your friend there. He's off.
Yay.
Putting our stitches in. I was able to successfully remove Ravon's growth, and I was able to stitch it up properly. It's a very high tension area. If he were to squat down and the area was too tight, he could split the sutures. But I do think I removed the minimum amount of tissue needed to really help prevent stretching of the scar.
That's it?
What do you mean that's it? That's what she said. Sorry.
As I was holding it in my hand, it weighed about 3 to 4 pounds, but now that little small lump feels like thousands and thousands of pounds that's been lifted up off of me. Wow. I'm looking in the mirror where the bump was, and it's a relief. I can't wait to show my girl. I know she's gonna be super happy that it's gone, and
We're gonna numb this whole area of your nose. It's gonna feel like it's running. I've numbed up David's nose, and I'm gonna try to remove as much of this rhinophyma that I can and really unearth that handsome, debonair limo driver that I know is in there. I really hope this goes smoothly.
I'm ready to have this taken care of, and the doctor seems like she's ready to go, so we can do this.
Just don't wanna take off too much. I need people to be calm when I'm doing this sort of procedure, and so I don't really wanna bring up the eye yet. I need to work on making sure his nose looks beautiful first. I'm starting with the scalpel first on David because I really need to debulk the area. We know that there's a huge chunk of rhinophyma tissue that I don't need to slowly carve away with a butter knife. We just need to cut that off from as close to the bottom as we can. Okay, there's this piece off.
There's that other piece. Now that I've removed that large piece from David's nose, you can automatically see that he's going to be able to breathe so much better. Now it's time for the fine touch. I'm going to use a little loop electrocautery, and this is when I can really surgically and precisely melt a lot of this rhinophymatous skin and really resculpt his nose. So let me just try to trim this down a little bit now. This is an electrical cautery device. You have electricity and heat being transferred through this handpiece, so it's going to seal off blood vessels as well as cut through tissue at the same time. You can cut straight through a body with it if you wanted to, so you've got to be very careful with it. I mean, there's a certain depth you've got to place. You don't want to take off too much. You can definitely leave scarring. I think that the thing that is always a concern when you do a loop electrocautery on a person's nose for rhinophyma is you got to remember that everybody's nose is different. I'm not trying to give him his neighbor's nose. I'm trying to give him his nose. And so you really got to imagine what his nose looked like before and try to follow those lines because I want him to be proud of it again. All right, let's take that camera up. Let's take a look and see. Yeah, good. That looks good. My work on David's nose is done, and I am so excited to show him the results. He looks like a whole new man.
Oh, yeah.
Oh, yeah, huh?
Oh, yeah.
You look good. All of a sudden, you lost like a decade at least.
Well, I feel real good. It's looking better. You know, it's kind of back to where it was. I'm glad to get it gone, and so I can feel a little better at work and breathe a little better.
I'm glad we got this done, and I can see that it's just brightened up, you know, your life, really.
Oh,
you know,
yeah.
this is gonna change your
Definitely.
life. Now, I wanna address something. This bump that you have here, that area, I suspect, is a type of skin cancer. And you said that it was there for 6 months. Maybe you just didn't notice it, but I'm gonna say more like 6 years. They grow slow, and they just kind of keep growing on you.
There was just a little teeny bump.
Like a
with
pimple?
like
Right.
a whitehead on
That
it,
was
you
it.
know?
That was it.
And then
It just kept growing.
Yeah. When she was looking at my eye, too, you know, it kind of concerns me a little bit. I'm a little surprised that the eye is cancerous, because it just started out as a little whitehead. It's a little worrisome. I thought this was okay, and this was the problem. This is okay, and this is the problem.
So I'm not gonna let you leave here. I'm gonna numb the area and take a little sample of it, and we're gonna check that in the lab, okay? David, under his right eye, I do think that that is a type of skin cancer. So we're gonna do a shave biopsy today, take a little sample of that tissue, send it to pathology, and get a diagnosis. I'm gonna have David come back and we can decide whether I can proceed and remove that myself. If it is a skin cancer, which I'm pretty sure it is, this is something that I think is very important to take off.
The big C word, and nobody likes to hear that, because there's so many different kinds, and some are really, really bad, and some are just bad.
So this is called a shave biopsy, because we take just a little part of it, enough to make a diagnosis.
I'm going to tell my daughter, Rochelle, that it's cancerous. I put my finger crossed that it's not a real big problem.
You should not feel anything other than us touching you. I'm now going to remove the visible part of the skin cancer and take my first layer, meaning that I'm going to take as little as I can to help minimize the size of this surgical defect and minimize the potential scar. You're doing awesome.
When they took it off, it was about the size of a nickel. It was kind of big. I wasn't expecting it to be that big. It was kind of unnerving. Don't want to see inside your dad, you know?
All right, it's a little hurry up and wait now. We're gonna check this tissue while you wait, okay? Once I remove this cancerous tissue, I make a map of this tissue and how I removed it from his face so that if there is a positive margin, I know where that is on the patient so I can go back to that specific area and take a little bit more if I need to. Take that and I'll be back. Let me know when it's ready. Thank you. Rachel places the tissue really carefully on a glass slide.
Then the tissue is placed into a cryostat so that she can slice it really thinly. It's sort of like a really high-tech version of the meat slicer that you find in your deli counter. So instead of slicing smoked turkey, you're slicing tissue. So I look at all the edges and down underneath to see if I can see any residual. Ooh. He's clear on the edges, but down deeper, there's a little bit of a deep component right in the center here. So David's first Mohs layer looks pretty good. There is one little edge there that looks like there's still skin cancer there. So I am gonna have to take a little bit more for him. And that is a little concerning to me because anytime you take a little bit more tissue, there's a risk for more nerves or vessels to be cut. All right, let me just mark that out and have her process this, and then hopefully that'll be it, okay? If this cancer goes deep, that could lead to severe disfigurement here, and I don't want that. I mean, we just got his nose looking good. If I wasn't successful, then likely the skin cancer would recur, and it could lead to a big disaster. I hope it's negative. I am looking for darker blue cells that are really close together. There's palisading of the cells where they're all kind of lined up along the edges. Got all my skin edge good. I see a little bit of muscle there. It looks clear, all right. Thank goodness that David's case cleared in 2 layers. I mean, if we have to progress and do many more layers of Mohs surgery, it could really become a much bigger deal than the rhinophyma case that he initially came in for. Well, the good news is second time was a charm. You're all clear now.
He's out of the woods. He's cancer-free. I'm pretty excited.
We're going to fix that up now. You don't want to walk out with this little kind of coin-shaped little area there.
I just can't stitch up this hole on David's face because that hole is too close to his eye. If I pull that side to side, it's gonna pull on his eye and you won't be able to close it. What I've decided to do here is a Burroughs graft. I extended a triangle more laterally on his face and really taking that tissue and pulling it to close that initial hole so that that area is not pulled together, but we're actually hiding this little scar line in his smile line. You're a very good patient, considering that I just found you on the street. All right, it's all bumpy today. Tomorrow it's gonna look a little flatter, but it takes a little while for this to fully heal up. I mean, I see the potential, but usually, you know, I gotta make sure the patient knows that. It looks really good.
Yeah. Oh, yeah.
Looking good.
Way better.
Yep. Give me a smile. I'm so glad that I was able to get rid of David's rhinophyma and also get rid of this skin cancer that he has. He's gonna look so much better once all of this heals. Thanks for letting me work on you there and dragging you back in, and I'm glad I could give you good news about it. And I think we got it. We have 98% success rate with Mohs surgery, so we probably got it.
I feel like Dr. Lee is a genie, and she popped up and granted all my wishes.
Thank you so very much.
Welcome. It was nice to meet you.
And I'm very thankful that she just happened to end up in his card. If it wasn't for that, I don't know what he would have done.
All right. Okay, let's say goodbye to these. So my first one here is on your neck here. Shouldn't feel anything, okay, other than my touching you. Nothing should be sharp. You okay? Mm-hmm. Slowly. Looks like a steatocystoma to me. And the sac here is actually really thin, but can usually kind of get it intact, and that's when we know we got it all there. Oh, sorry. Did I hurt you? I'm sorry.
It hurt. It surprised me it hurt this much.
You okay? You feeling okay? You're feeling a little tired of me now.
No.
I'm trying to read you, make sure you're feeling okay, because there's a lot to go through. I don't usually do this many steatocystomas on a patient on a single sitting. And in fact, I think it's turning out to be harder on Nicole than she thought it would be.
Make sure that nothing hurts, okay?
Oh, wait a minute. Sorry. There's a lot of these to do, let me tell you. You're a trooper.
Right now, I'm really uncomfortable, and I just try to be a good patient.
I think you're done with me, huh? You need a little break from me. You okay?
Yeah, that just hurt.
pulling you like that. Oh! You scare me more than anything when I do that, but I don't want to hurt you.
That hurt. I felt that. Whatever that was, that hurt.
I pinched you there.
Okay.
Hold on.
That hurt.
Take a little break. Let me up right there. I won't do that anymore. I'm here with Nicole, and she has a large collection of steatocystomas really scattered around her neck. I'm trying to remove as many of them as I can, but Nicole is actually having a hard time with me doing this because there are just so many. Do you want me to keep going, or you want me to give you a little break and we can work on these another day?
Keep it going. You can be here all day. I don't care.
You have been here all day. Nicole is uncomfortable, but she is pretty determined to get as many of these off as she can. And I can understand that because when people are looking at us, they're going to draw their attention to our neck. And so I think Nicole is willing to put up with a little bit of discomfort to really have the results that she's looking for. This neck looks good here. You sure you're okay? It's a lot out of you to do all this today. This is a lot of stuff here, a lot of bumpies.
More than anything, just wanted to be over. Temptation's there to take a break, but you know, I'm a trooper. I want to keep going.
They're hiding under there. They're so, tough to locate. At this point, I've probably removed at least 20 steatocystomas from Nicole, and I know how tough this is for her to go through this, but I also know how important it is for her to do this and feel better about herself. I gotta make sure she's okay. You're all right though, right? You're feeling good? Mm-hmm. Okay. That was the last stitch to Nicole's neck. We are finally done. Good morning, princess. Want to take a look? Hold this mirror for you. It's just a little swollen because you put numbing there, but a lot of those are all smushed back in, and this one too. You're gonna have a nice defined jawline there. There was actually a cluster and then another one under here we took off.
It's over. It's sore. It's a little burning. It's nothing I can't live through.
All right, I'm gonna just put a little piece of gauze over here, and I'm just gonna put one little baby pinch here.
Okay.
Pinch here, just like that.
I'm gonna kind of miss the bump.
You might miss it.
It's kind of grown on me too.
I kind of use it to think once in a while, actually.
You do? So you shouldn't feel anything other than us touching you, okay?
Yep.
And it's a lipoma.
No backing out now.
The buzzing noise you're gonna hear, just a cautery that stops little baby blood vessels. The head is famous for bleeding, essentially. It is an area that we really know there's a lot of blood vessels in, and so I need to cauterize the blood vessels so I can see what I'm doing. Just gonna squeeze you here, okay?
Okay.
All right, he doesn't want to pop out. I'm gonna take him out in a piece here first.
I'm always hoping for a clean pop, but this is a lipoma on the forehead, and so it's very unlikely that I'm gonna be able to pop it out whole. And in this case, yes, I'm finding myself having to take it out in pieces.
It's like an egg yolk lipoma. It makes us hungry for some eggs.
Oh, God, I could not.
Scrambled eggs.
Scrambled eggs with some ketchup.
Mm-hmm.
It just makes me feel sick to my stomach because that's what we had for breakfast this morning.
I'm piling it high, like the pieces of lipoma that I take out, I'm piling it. They're like scalloped potatoes. I'm slicing them. Scalloped lipoma.
I'll never eat those again.
I bet not. I bet she's gonna cook it up for you, and you're gonna be hungry, and you're gonna eat some.
Was it really big?
I'll show it to you. You're gonna see it all in a scalloped pile. Aren't you getting hungry? What are you gonna have for dinner?
We probably won't eat for a while now.
What?
All joking aside, I finally got Steve's lipoma out piece by piece without any excessive bleeding, and I think with a few stitches, he's gonna look as good as new.
Here, take a look.
Holy crap.
Look at that, honey.
Wow, it's even everywhere.
Who are you?
Cute little hairline. Your stock just went
crazy.
up.
Oh, man.
Watch out.
Yeah. I feel great with no bump right now. It's awesome. I went from a bump to this hideous looking headband and looks like another egg on my head, but this one gets to go away in a day.
Okay, you shouldn't feel anything like I said, okay? Stop your sighing. You're doing fantastic.
Just stuff that looks like chicken, basically, coming out of his arm. It's adorable.
You doing all right?
Oh, yeah.
Alan seems to have relaxed
a bit. But I want to move pretty quickly because I don't want to give him too much time to think about what's happening.
Yeah, I should have done this years ago. It just stupid of me.
Well, I can see why you didn't do it now, because you don't like us.
No.
Nothing personally. I know you like me. Out of anybody, you like me the most, but in general, you don't like us.
Last time I had a medical procedure, funny, is I had a vasectomy.
Uh-huh. How is that?
The doctor, he was like, you're not gonna make it. I'm like, no, we're gonna do this.
What do you mean? He didn't think you didn't
No,
know
he
how to
didn't,
have
it was the same way. I didn't think I was
Same
gonna
way
make
with
it
you?
through.
Like, you gonna do this. Okay.
Make it.
Yeah, you gotta let me know that beforehand. Yeah. How was it recovering from that? Wasn't too bad? It was a little testy?
Yeah, it was a little testy. Exactly.
Almost there. We almost have the whole thing out. Just trying to ease it out. All right, we got it all out. But I'm just gonna stitch it, and then you're out of here.
I knew you could do it.
I knew, I had doubts you could do it.
I worked really hard to remove Alan's lipoma, and I need to put these stitches in quickly because I know he wants to get out from under my grasp.
There's just fluid there a little. Actually, you can see the definition of your deltoid now, huh?
Wow. It's amazing. You know, I'm glad that I was able to stick through and get through the procedure and not cop out like I have in the past. Awesome.
It looks good.
Yeah, it does. Really good. Thank you.
You're gonna see. It'll be like that. It'll be flatter tomorrow.
Yeah.
You want me to weigh it?
Yeah.
Oh, it's 3 pounds.
Wow. Alan is 3 pounds lighter, but I did spot a little skin tag, so I thought I'd give him a little extra oomph, like a little skin tag bonus, and take that off for him.
Now that I'm not coming at you with anything sharp, now you're all calm, so that's great.
Thank you.
Take care. We'll see ya. Thank you.
Appreciated.
Thank you, sweetie. You take good care. Keep taking good care of him. Keep giving him hell.
Oh, I will.
I know.
Every day for the rest of his life.
Yeah, I needed pretty much everything other than a stuffed animal to get me through the procedure, but I made it. It kind of renewed my confidence in doctors. In hindsight, I wish I would have got it done sooner. I'm very grateful to Dr. Lee. She has honestly changed my life.
Okay, this area is gonna get more full because we're putting numbing solution under there, and it actually is more comfortable that way. Okay, you shouldn't feel anything other than my touching you, okay?
Okay. My family's face is right in front of me right now. Even though they're miles away, they're with me in prayers.
Make sure this is a lipoma first. You doing all right?
Yeah.
It looks like a lipoma. Just trying to use my fingers, which is very safe, to move things around and just check areas, make sure nothing's ever hurting you. Like I said a million times, I'm a broken record, I know. You okay?
Yeah, I'm good.
Okay. Just gonna pull on you.
This lipoma is really cooperating with me. That's a good thing. But the larger an area that you remove under the body, the more you are in contact with other blood vessels, other nerves, and other issues there. So I don't want to shear blood vessels and cause a problem.
And just make sure we catch something if anything falls. So maybe after we do this, maybe I could convince you to show us a little dance, or teach us a little moves. Oh my gosh, he's almost there, but I feel like he's gonna fall if I make one swift move. So close. You got it all right, you got it.
Yeah.
That was a satisfying one. There you go. I think that's one of the first times we filled that tray and it's like overflowing it. Look, it's like peeking out the top.
I would say definitely more than what I had originally thought.
Had it for 10 years, out in maybe a little over 10 minutes.
Thank you so much.
Not finished yet.
After removing some extra skin so I can make this lay really nice and flat, I really do an extra check underneath, making sure there's no little blood vessels that need to be tied off or cauterized, because this is a really mobile area. The shoulder, you move it up and down, and if there was a bleed under there, this area would swell up again with blood, and that is a big mess.
Gotta make you look pretty. Okay, get ready to take a look.
I feel way lighter. My arm feels amazing.
I'm trying to contain myself right now.
Oh, you got the award. 9 pounds, 2 ounces. Congratulations.
Thank you so much.
That is a baby. That's a big baby.
I'm excited to get back home and just dance like I was meant to.
Now you're gonna be able to dance.
You'd like me to show you,
I would
teach
love
you how to
to.
dance? Fijians are known for their fierce warrior dances.
Yes.
But I don't want to do it because I might break something in here right now. So what I will do, Fijian folk dance.
Okay.
You and I, while we sing. So bula is greeting in Fijian.
Bula, okay.
Bula malea. Bula malea ke vitita lega. I feel overwhelmed with joy and blessed and grateful.
Bula! Bula! Bula to you.
Bula.
Thank you. Okay, you shouldn't feel anything other than us touching you. Wait, I won't. You don't have to look yet, but in a little bit you can look. Reed is here, and he has hundreds of steatocystomas and eruptive vellus hair cysts. I want to get as many of them out as I can, but I know that there's a limiting step. It's my hands. My hands get really tired because I've got to squeeze these really hard, and I need to get as many of them out before my hands give out. Stuff there. You're now a popaholic. I can see it. You got it in you.
You turned me into a popaholic.
I'm going to in a second. Yours are gonna be nice. Yours popped out. See that little sac? That's a steatocystoma. 2 more little squeezes. Here you go. At least it doesn't smell, right? Isn't that cool, Jocelyn? They're pretty cool, huh? Okay, 5 down, 50 more to go.
Can you raise my head up just a little so I can see it?
Actually, yes, we can. Reed, I could see the obsession right there. It's growing. Now it's starting. This is like a pivotal moment in his life.
There we go, yeah.
Oh, now look at you. Now you really got a
now
front
I'm
row
interested.
seat. All right. This is gonna be a good day for Reed because I'm just getting started. He's got a lot of steatocystomas to see and revel in.
I can't believe that came out of me.
I know. That's like butter or something for your toast.
You just ruined toast for me.
Sorry.
You're just going to town on these.
Trying before my hand gives out. You like them, huh? They're growing on you now.
Now I want them back.
You do? No, I doubt it. I think my hand is done. I just removed a whole stick of butter from Reed's chest. I mean, that was how many steatocystomas I squeezed out. And my hands, my fingers, they're exhausted. Imagine if you're typing on your keyboard and instead of typing on it, you had to squeeze each key hard over and over again. It messes with your fingers, it messes with your head. That's gonna look a lot better. It doesn't look that great right now.
It will, though.
Yes, you see the potential, right?
Definitely. I've had these since I was 17 years old, so just watching them disappear like that, it really helps my self-confidence, and it's making me smile. When they heal up, is there gonna be a lot of scarring?
And I think with your light complexion, they'll heal in really well. You may always know something's there, but I think that most people are not gonna be able to see them.
So I was really thankful that Dr. Lee got almost all of these bumps out, so I know that they're not gonna leave craters in my chest.
All right, you're all set,
right.
ready to go. I think you're gonna feel a lot better. You're gonna look a lot better once these all certainly heal up. Give me a hug. Nice to meet you, sweetie. I'm glad I converted another popaholic. Have a good one, okay?
You too.
Bye-bye.
Bye.
Close those eyes. We do the vacuum because it creates a little smoke. Tony is here, and he has a really severe case of rhinophyma. I mean, he essentially has 2 grape-like balls hanging down from his nostrils, so it really makes it difficult for him to breathe. And it's my job to help him out. I'm using a loop cautery tool to essentially burn away all this extra skin. And this is why Val is holding a smoke evacuator to vacuum away all this smoke that's created when we burn the skin. Sorry, hold on.
Normally I use a loop during the entire process, but in this case, he's got this huge growth there and I don't need to really sculpt that, I just need to debulk it. So I'm gonna change my loop tip to a different tip this time. It's called a spatula tip or a knife-like tip.
You know what? Can you do something for me, Valerie? Can you get me a blade and like a blade holder?
Okay.
I feel like I want to shape this more, and I feel like that's the straight blade. I can control it more here.
It turns out that it's a little frustrating to use the spatula tool because it cuts in a different way, and I just want to be done with it. So I'm gonna just switch to the scalpel, to cold, hard steel.
All right. See, you can already look down and see your nose is different shape, right?
The first scrape was successfully plucked from the nose. The scalpel was really the best tool to do this, but I need to be really careful that I just remove extra skin. And you can kind of see where the normal nose is because it's almost like someone took Play-Doh and just like pushed it onto the nose.
Look how big his nostrils are now. See all your deepest thoughts.
Oh. There's already a huge, dramatic improvement in Tony's nose, but this is just the beginning. I mean, I've just taken off those big chunks of skin. Now's the time to change back to the loop cautery tool and really sculpt this area. This is my favorite part.
You can see it.
When I'm doing this type of surgery, I do feel like I'm unearthing the real nose that has been trapped there, just like a fossil. And here I am, an archaeologist, just trying to like brush away and preserve what's really supposed to be there and get rid of all the extra.
Sometimes I have a problem quitting once I start. I'm like, okay, I could keep going forever.
I can't wait to see the grapes.
Yes, I'll show you the grapes. First look at his nose like this for what, 5 years, I think it is. They're cute nostrils too.
Tony's nose is certainly unique, and I had to work in a more unorthodox way. My previous experience with rhinophyma really came in handy here. I'm very pleased with the results.
Ready?
Uh-huh. Oh my goodness. Just amazing. There's my nose.
Yeah, your nostrils. Look at those nostrils.
When I look in the mirror, I see this normal guy and not this freakish blob of a troll-like nose. It's an amazing transformation. I cannot believe how good this looks. Yeah, look at that. Oh my goodness.
That's the underside of it. All that, I bet if I squeezed, would be some oil in there. So it would probably snap, crackle, and pop if you put it on something. Not that we'd ever put it on anything to cook.
It was shocking at how big those things were. When I would flare my nostrils in the past, there was all of this weight, there was all of this movement. Now, man, they're gone.
Good.
Thank you.
Thank you. Give me a hug.
Oh, Shirley. It's such a relief to be transformed, and there's, I don't think, anything that's gonna hold me back now. Whatever public thing I need to do, I'm ready. I want to shout hallelujah, so hallelujah.
You're gonna do just great. Let's see what we got under here.
I'm here with Marie and her girlfriend, Heather. I'm really interested in seeing what is growing on her forehead. She thinks that it's a lipoma, but I am betting that it's a cyst.
Changed my mind. I think you have a little lipoma here. I think you were right. You can see it right there, probably. Oh, yeah. You okay?
I think I just want to cover my ears.
I know, but you hear it through your head.
Oh.
You know what I mean? Because you hear it, like, at the area.
Yeah.
I know when I'm working on the scalp or on the forehead that the patient can hear the surgery, these scratching noises, almost like a little mouse in the corner. If you tap on your forehead, you can hear something. So imagine if you're numb there, you can't feel that, but you would hear that sound.
So what do you guys like to do for fun? How are you gonna celebrate this?
We have an 06 Harley.
You're just gonna be wild and free, lipomaless?
It's gonna be awesome to feel the wind in my hair.
Do you like to go helmetless?
Yes, I do.
Blowing it away and not worry about that?
Yeah.
Looks pretty clear, huh?
Yeah, it looks good.
So how is she as a rider?
I'd rather be on the back of the motorcycle than in the car with her because she's a better rider than she is
really?
a driver.
That's funny. Done.
Holy cow. Seeing myself with the flat forehead is just amazing.
You look younger.
She does. Yeah, you do look younger.
I numbed your brow. You can see you can't raise your brow that way easily.
No, I can't. I've always
You don't
wanted
go away.
to do the one eyebrow.
Yes, now you can do it.
Like,
only for a couple hours. Only for a couple hours.
I'm gonna keep flirting.
Thank you so much. You're so welcome. Take care of yourself.
Thank you.
Heather and I are gonna rock that bike, for sure.
Ride your Harley for me, okay? I'm scared, but you can ride it for me. I'll stick with my
send you a
scooter.
picture.
I would love that. Let's see what you got under here, huh? And it's a lipoma. Look, that is ready.
Tommy is here with this lump on his anterior thigh. I'm surprised that this is a lipoma and not a nevus lipomatosis superficialis, which means that I have to approach this whole surgery a little differently. Because it's a lipoma, this will mean that I can hopefully pop this out whole.
Okay, I'm gonna give a little squeeze.
That's just crazy.
You know, sometimes you'll see them pop right out because they're not in these bands, but yours has a little bit of something. You feel it kind of pushing out, releasing,
Yeah.
huh? You know, if you look at it right now, how do you tell the difference between this and your regular fat? It's kind of hard.
To people watching this surgery, it looks like this fat is like any other kind of fat, but it feels different. You could feel this foreign object under the skin, and if you give it enough good pressure around all sides, it usually can squeeze out entirely.
See, he's in this little sack right here, and I gotta find a way to ease him out of there, or else we stuck to you. But I'm gonna just take him off and then just take a look and see what might be still left. You can put that on the table for me. This, I think, is still a little bit of it. Remember that part that was herniating out? It's right there. But what do I do there? Because I think that this is stuck to the surface of your skin almost. If I try to just take it off, your skin's gonna be really thin there. And that's gonna affect the healing, like the appearance of it.
I'm almost done with Tommy's surgery, but there's a little bit of lipoma left, and it's kind of stuck on the undersurface of the skin that is going to be so tough to separate from his normal tissue. If I leave any of it there, there's a risk that it can grow back. So do I go after this last little sliver and maybe make the area not look as good, not heal as well, or do I leave it there and hope that it doesn't grow back? This is a tough decision for me to make.
I actually think I'm gonna cut that skin off. Actually remove that entirely. Now, because I took out a little extra skin, there's a little more tightness there. You know, it's not a lot. You stretched out anyways because of the lipoma.
The best solution was just cut that tissue off because I know that this lipoma stretched the skin in the area, so why not just remove that extra tissue anyway and make this area nice and flat? I made a decision that has a lot to just do with your experience and how you know the skin moves and the skin heals. Doing this for years, it becomes second nature.
You ready to see?
Yeah. God, see,
There's
that's...
your leg again. There's just swelling there right now because of the numbing. See, there's
Oh,
nothing there.
God.
There's nothing there. Looks good.
It does.
Yeah, very good.
Thank you so much.
Oh, you're so welcome.
I feel a tremendous amount of relief, just like a ton's been lifted off of me.
Oh, wow.
Yeah.
That's way heavier than I thought it was.
I think everything's gonna change now. My self-esteem. It was here, and bam, I already feel it. It's there.
You're amazing.
We'll see you, okay?
You really are.
Bye-bye.
Thank you.
Take care, okay?
All right. Let me know if anything hurts. Look, that is ready. Just gonna use my finger to move around because it's safer. Not gonna affect any little blood vessels there then.
I have 2 small children and my wife, and I would hate for anything to happen to me.
I'm just trying to minimize trauma to you as much as possible.
As I'm doing surgery on Gerard, I'm really making sure that bleeding is at a minimum because I don't want his blood to clot.
That I felt.
Oh, I'm sorry. Oh, are you hurting right now?
That felt a little painful.
I'm sorry. Okay, so I want to remind you again, I know you already know, pain, swelling, increased warmth, redness, those are all potential signs of a blood clot. In terms of pulmonary embolism, shortness of breath, your heart beating really rapidly, you know, heaviness on your chest. Look.
Wow.
That was 1.
I didn't see any problems removing the first lipoma, so I feel slightly more comfortable moving on to the other ones.
Yours make these cute little sucking noises. Just trying to get this thing out, and it's
I thought that was a pop.
Kind of. We'll see that noise? This is a fibrous tissue spreading. Okay, was it number 2? Number 3. That's 4. So 4 total. You help me with that running tally there.
We're up to 4.
Look at that one. That's cute. What number is that?
5.
Good job.
How's the bleeding? Not too bad, right?
Right now, everything's good, too, but, you know, you clot. Okay, 6.
Wow.
I'm about halfway through removing Gerard's lipomas, and I feel pretty good because there's not that much bleeding. There don't seem to be any complications, but I'm not gonna get my hopes up yet. I still have more lipomas to go, and you never know when one of them is gonna prove to be a problem.
Okay, how do I get to this one here? There's another one on the side, though. So just don't move around too much while I'm here with sharp stuff. I don't want it to go into the wrong place. Look.
Wow.
That's 7. Shouldn't feel anything.
Oh, no, I'm just kidding.
Don't you start playing with me now.
I didn't think that I'd be able to remove this many lipomas on Gerard, but everything's going really well. So let's see how many of these I can get done.
Here's their little pop there. That's 8.
Ocho. A little
Okay,
alien.
9. Like General Tso's, right?
Yeah.
It just needs the breading at least be fried a little more.
Wow. 10.
Made a
Look
nice
at that
noise.
sucker.
12?
I think that's
Or 11.
11? Mm-hmm. Double counting. There's 12.
It's like gnocchi.
That's 13. What else we got in here?
The gift that keeps on giving.
Right down.
Just amazing.
14? 15?
What was that, 14?
You're the one that's supposed to count for me.
All right, well, let's just call it 15. We're at 15. I'm getting tired.
Yes, you are. Me too. Do you mind if I let Christy do a little squeeze here in this one?
Not at all.
Christy, get them out of there.
My girl Christy is about to pop herself. She's about to have a baby. So I really thought that it would be a nice little goodbye gesture to let her have one of these pops.
Wow. That's a good one.
Jackpot with that one. That was a good one, yeah. 16. Sweet 16, that'll be it. Sweet 16, I like that.
The surgery so far has been a great success, but I can tell that Gerard is getting tired, and I don't want to run the risk of having a problem here.
And you sew it up nice and tight, so when I do go on that dinner, nothing's gonna come out.
That's right. Nothing better come out. That's right. Last stitch. I think that looks good. Look at that definition, man. That looks dang good, I'll say.
Am I disappointed she can't rid me of all of them? Well, yeah, of course. But to look down at my arms now without some of these lipomas, it feels amazing. I feel like a new man. I feel like it's a new start. It's a new beginning.
Yes, okay, but no flexing. Take it easy. Take it easy.
Don't get nuts.
Don't get nuts.
Don't get nuts.
Here are your nuts. These the nuts.
I'm feeling great. I feel awesome. Everything went so smoothly. I just can't get over it. It's such an amazing feeling to be able to get them out. Sick. What an experience.
We took off a good amount right there, but I'm concerned about you because you're not out of the woods with your factor 5. Today, I just want you to chill, just taking it easy with your arms. and so that they don't bleed, but we'll probably start you on your blood thinner again, okay?
All right.
Take it easy, capiche?
Okay. Dr. Lee has changed my life in a matter of hours. Something that I had to deal with for 20 plus years has now been reversed. It's a new beginning. It's a step in the right direction, however you want to phrase it.
All right. Eric is here today. He has a bump on his scalp that I think is a pilar cyst. He does tell me that there's been trauma to the area, so that does make me wonder maybe it's a lipoma. We're only gonna figure this out once I start removing it.
Watch out. It might be a little bit under tension, just to warn you. Come to mama. Oh!
Oh, good Lord.
On my arm.
Oh, my God, I'm sorry.
It's okay. But I have to stop for a minute to take the acid off my arm.
Oh, jeez.
It missed your scrubs?
Yeah, it did.
Pilar cysts are probably the type of cysts that get me the most, and that's because it has a thicker walled sac, and it's particularly satisfying to squeeze it and get it out whole, but sometimes I get a little too aggressive and squeeze too hard, and then it pops.
I'm giving everybody hugs after this.
You're welcome, I suppose.
I don't commonly get it on my arm like that.
Yeah. What kind of distance are we talking here?
Oh, we had a good trajectory. Had some good projection.
Nice arc.
Yes, there was
Outstanding.
definitely an arc.
So much for splash guards, but my most important goal here right now is to remove this sac completely so that this cyst does not come back.
And after you take this out, my IQ is not going to go down or anything like that, right?
No.
Okay.
Don't blame, it's not my fault.
Okay.
Okay.
Everything look all good in there, at least as good as it can?
I can't see through the other side or anything. There's no echo. At least there's no one talking back.
Yeah, no joke on that one. Oh, my God.
I got all of the sac wall out, so that means that it's not gonna come back. It is time to stitch him up and show him his results.
Oh, my God. I can't believe it. Looking in the mirror, it's almost like surreal. I've had this thing for a decade, and just suddenly it's gone. One less thing to worry about.
This is what got on me.
Oh, wow. Sorry about that.
It's okay.
That's cool. It's
gone
only
now,
it's just
yes,
a new
yes.
shirt.
Back at
That's
ya.
fine. Yeah, apparently we had a jumper, so I caught the doctor. Sorry about that again. I would have never guessed that it was under that much pressure.
It's like a nest with no egg.
Well, the baby bird's got to leave every
Yeah.
once in a while, you know? I'm looking forward to doing more firsts with my daughter. Now I don't have a reason to say, oh, no, Daddy can't. Now Daddy can, so. Thank you so much.
Nice to meet you.
The on-off switch for Dr. Lee to be the one to retire it, I'm honored.
Ooh, wanted you again. You really want to get Christy. This program examines dermatological conditions and the procedures involved with treating them. Due to the graphic nature, viewer discretion is advised. You feel something sharp?
No.
No? Good, it's numb. You did really well. And now we can get rid of this nevus sebaceous. This should not hurt at all. I'm just gonna get rid of this here, okay? Because I've numbed you. Monica's biggest concern is pain, so I've given her as much numbing as I can. And to minimize scarring, the first thing I'm gonna do is use my serrated scissor that can really grip the tissue well, and I'm trying to get this as flush as I can to the skin surface. Are you okay? Mm-hmm. That one's gone. I know you didn't like that one. You okay there?
I kind of feel it.
I'm sorry. God, no.
It wasn't
It
bad.
wasn't terrible. Okay, sorry.
No.
I'm sorry. Done with that. Sorry about that one. Okay, so we got those. So I'm gonna start with this one up here. I'm gonna do slow. There's a loud noise that we're gonna have here, okay? Monica had some moments of discomfort, but I really talked her through it, and I think she did really well. Now I'm gonna move on to the next step. I'm gonna use an electric loop cautery, which does two things at the same time. It cuts tissue, but it also cauterizes it. You okay?
I hate pain, and I got to zen out and just like focus on not feeling the pain. Okay.
No? Out? No good?
I felt it.
Okay, no bueno? Hey, stop that for just a minute again.
Sorry.
No, you're okay. I gotta keep numbing you up. That's what I gotta do. There are people that are certainly very fearful of pain. They're like waiting for the pain to happen. So it's almost like they anticipate it. Potential pain is their kryptonite. I know that Monica is feeling pain, but I also know that I've taken a long time and been very careful about properly numbing her. A lot of this is in her mind, but I just want to make sure she's comfortable, and I'm giving her plenty of numbing, and I'm trying to get as much of this treated as I can.
How about here, this one?
Ow, ow,
Okay,
ow,
okay, okay. Okay, okay, I'm putting more numbing. Okay.
Damn.
Okay? Oh, I'm sorry. Okay.
Ow, 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 ow.
I've given her a lot of numbing medication, but she's still saying she's feeling pain. Sometimes a patient's emotions get in the way, and some patients are perhaps just better suited for general anesthesia. I think that her mind could be just playing tricks on her, telling her she's experiencing a lot of pain and discomfort, and she's scared. Yet she wants to get this done so bad, so I really hope that I can complete the surgery for her.
I did get the most warty kind of looking areas, but I can't get that raised area without your complaining on me, like that more like wider plateau raised area.
Just leave it then, don't do it. I've been to doctors my whole life, but I'm still not used to pain. It still scares me a lot.
I feel like the other one is better for you, huh? When I was just snipping them off?
A little bit.
Okay, let me try to get some of these real raised ones here. Is that okay with you? Okay.
I think I need to shift gears here with her. I feel like the electrosurgery device is not ideal for Monica. And the reason is it does generate some heat. And I suspect that the heat is making her think that she's experiencing pain. So I think that I need to switch back to a scissor to debulk as much of this as I can. I'm still trying to help Monica, but there's certainly a delicate balance. I never want to make somebody feel like I forced them into doing something and they had unnecessary pain.
Okay, I'm gonna just do this bigger one right here.
Ow, ow.
I'm sorry. Done with that. All right, I think you need a break from me. What do you think?
Like, are you almost done right now?
Well, I'm gonna show you right now and see what you think.
Or at least right now.
Well, like you tell me, like I'm ready to quit if you want to quit. Do you know what I mean?
Yeah.
All right, so you shouldn't feel anything other than my touching you. Oh, let me. And it's a lipoma. So far, this looks good.
Now that's what I like to hear.
There are these septations, though. They are these little nets that it's in, so I shouldn't get it too ahead of myself. There's definitely, I can feel all these like little nets. Things that I should have spoken too soon, girl. He's just tethered in there. Can't wring my hands around it easily.
In the back of my head, I'm like, Lord, please, I really need this to go my way. I don't want to hear these words. Please make sure that she can get this out.
Well, you got a little bit of a fight, but maybe I can start to squeeze it. But it does tear easily. It's not so solid.
I was right, this lipoma is definitely going to be a fight. There are a lot of septations. There's a lot of firm scar-like tissue just holding this lipoma in place. And it's not just like it holds it like this, it holds it like this and this. It's just in 3 dimensions. So you really want to try to get all this lipoma out because if you leave a little part of it, there's a chance it can come back.
Can't I just squeeze it and it pops out?
Well, see, it's an annoying tumor, so therefore it's going to have annoying inside parts.
Yes.
There's a room filled with laser beams, but now it's septations, and I'm trying to pull this lipoma out without cutting anything that I'm not supposed to. It's like lipoma impossible.
So far, yours is a little bit of a pain, but you are so agreeable, it makes it enjoyable. Make sure you tell me again if anything ever hurts, okay? Because I'm getting lower, deeper into it.
Well, I mean, I feel the tugging, but nothing.
Nothing sharp. All right, we're getting there.
Okay, you know what? I just felt so light.
But yes, it is definitely lighter right now.
Holy moly, that's crazy.
Okay, we're close.
I got your back, okay? Or your head.
So we're now making the incision.
You're doing awesome.
You want to actually use a knife or some type of laser?
What he's using is a device that really kind of cuts the tissue, but also buzzes, like cauterizes it too, so it won't want to ooze. Dr. Umar is using a tool that cauterizes and cuts tissue. It's really similar to the cautery device that I use to remove rhinophyma. I use a loop tip, and in this case, we're using a spatula or like a butter knife tip. We're just starting from one side and going to the other. So it's like kind of peeling it back.
The things you would not want to see once you get into someone's scalp will be, a gusher, as we call it.
This is an area that bleeds. It's very famous for bleeding very easily, and it's hard to control a bleed there, and that can be very problematic.
You bleed a lot?
Well, I'm a little worried about the multiple bleeders right now, and I hope that I can get it under control.
It looks really good.
The baby is about to be delivered.
Oh, yeah?
It's going to feel a little bit lighter very soon.
Yeah.
You ready for this?
Yeah.
There you go. So this is
Yeah.
it.
It just came off.
It just came off.
I felt that.
I was like, wow. And he got it off in one piece. Man, that was cool.
Yeah. You felt lighter?
Yeah.
That's a lot of skin that we removed. That's a big hole, too, that it's left. So really, this is the tough part. Because in the past, we know that when we've closed areas like this, that people actually have big complications. This is where Dr. Umar's special technique, his tension suture that he invented, is going to come into play. And I'm really excited to see it.
Sandra, do you see that? You see that shape?
Yep.
This should close. When I remove the lesion, we will be left with a wide wound. And my goal is to bring those wound edges as close together as possible without actually having them touch each other. So let's have the suture kit. Yes. Bring it up. We have developed an implement to assist with that process.
Special invention, the Umar tension suture.
If we use anything ordinary, the suture will just cut right through the tissue.
We're almost there.
Yep. Okay.
Y'all kidding me. He done the whole thing.
Yes. Now we're closing it up. Your wife did tell us to put that GPS device in here, so we're putting that in right now.
You know what?
GPS device.
Instead of Find My iPhone, it's Find My Reggie.
She already does that very well without the GPS.
All right, Reggie. Almost there. With the tension suture kit holding that wound just slightly apart, what happens is the wound now will try to do the rest of the work. I want Reggie to come out with the back of a head that he will not be ashamed to show to the world. Now you're all set. Looks awesome. Now you can sit up comfortably.
It's probably shocking to a lot of people to see that Dr. Umar has not closed the wound completely, but this is actually on purpose. It's almost as if letting this heal a little bit open is a signal to your body to really send more resources in there and help to fix that wound. Okay, so keep your eyes closed. I don't want anything to squirt on you. It's not even necessary that the poke does it. It's more like when I'm squeezing it. Yep, you got a cyst. I don't know if you can tell I'm squeezing it out. Sometimes people say they feel like a relief almost.
It smells bad though.
Oh, well, that's okay. We all have masks and, imagine what skin smells like when it's been sitting under your body for years. There are worse smells, let me tell you. Why I'm not a proctologist. Ah, the smells of cysts. Sometimes they smell very little, sometimes they're more odoriferous. It's like body odor mixed with toe jam that's you tucked into like a little pocket and saved and collected over the year. And then you open that up 10 years later. That's what it smells like. Trying to tease away the sack wall and get it in one as close to one piece as I can. Ah. Just trying to clean it up a little more now. Almost time to celebrate. I'm really happy about how short I've kept this incision line. There is a little bit of extra dark tissue that I think I can remove and it won't sacrifice the length of this scar. That darkening that you had there, we took some of that off, but that should fade just like it does with our little acne bumps. Just takes a little while. You see? Thank goodness you can see.
I can't.
Can you not see it either?
No, I cannot. Oh, God.
That's the big difference, huh? Because you can't see it. Nothing should be hurting you. Cysts are predictable yet unpredictable. Is it liquid? Is it solid? I don't know if it's going to take an hour or if it's going to take 10 minutes. You all right, right?
Yes. I can feel it coming up.
This one's mashed potatoes. Ooh, it's going to drip down the sides. Okay?
Yes.
You can feel the relief?
Yes.
Some more. There's another little cyst or something on there in that corner. Did I get you?
Yep.
Where?
Right in my face.
Okay, stop for a minute. You can go wash yourself off. It's never fun to get splashed, but it's not dangerous. I mean, just close your eyes and don't open your mouth.
Sorry.
It's okay.
Val, Dr. Lee aimed a cyst right in my face. I knew it was gonna happen too.
Don't worry, she'll remind me all the time about this one. I don't know if I can get this whole thing. It's just scarred here. It's just very hard to see what is cyst wall and what is the scar tissue. It's like it's been squeezed multiple times. I think it's gotten inflamed multiple times. That's what happens too when you have one that has partially healed too. It kind of creates like little tracks, like little tunnels.
Oh, okay.
You know, and so then you gotta like follow it a little bit.
Find the root.
Yeah, I gotta find it all, because if I don't, it'll come back. This surgery is particularly challenging because of all the scar tissue that Juan has there. And scar tissue is very tough and unyielding and also causes cysts that grow to really grow more misshapen and make them more difficult to remove completely, make them evade, surgery. I'm trying to be as thorough as I can. And by doing so, that's gonna best ensure that this does not come back. I think I got this all cleared out.
First one's over.
Okay.
Oh, that one was a bear. All right, one more. I have finally drained and removed Juan's entire cysts, which actually ended up being 2. So now I'm gonna move on to the next one, and hopefully there's not as much scarring, and there's not as much difficulty, and there's not another hidden cyst under there. 2 down, 1 to go. Ooh, wanted you again. You really want to get Christy. Okay, the relief should be coming soon.
I feel it. It feels great.
You okay? Good. All right, let's see if I can take this out. Almost. That was it. the easiest of the bunch. Thank goodness. I can't imagine the tension that must have built up in this area and the pain that he experienced with this. I was able to remove the 2 big ones, which actually ended up being 3, and I really think this is going to make him feel a lot better. This is the back of your neck here, so there's that one flat one.
Oh, yes.
There was 2 there. That's the one that shot her. That one you're gonna call Little Christy.
Thank you all.
You okay? You see, you don't feel anything, right?
No.
Good. Like, I feel like you still don't trust me yet. You're like, not yet. I think it's a cyst, but I think it's a water balloon cyst.
A water balloon
It's like filled with liquid. That's why they're soft like that.
Okay.
Wow, how does a cyst not pop? Just takes a little delicate movements here for me to do this. What are you gonna do with that? How it's stuck to him like that, huh? It's a pilar cyst. They kind of break down over time, the larger that they get, and that kind of thing is just waiting to pop. It's almost like it's a ticking time bomb. I have to really be careful. If I puncture it, a big water bomb under there can make a big old mess. Plus, if there's bleeding involved, then I'm in big trouble. I'm essentially trying to de-scalp your cyst. Sometimes it doesn't get it.
You must be sopping it up. I don't feel anything
It's
wrong.
not, I'm heading it off of the pass. If I have a bunch of those, then it's a problem.
Just trying to be.
I know you are. I might get it open, and then that would mean game over, like in terms of me keeping this whole. Okay, let's see if we can't detach this whole thing.
It's not hooked to my brain, is it?
So the galea, which is like the one last little attachment to the scalp or below it, sometimes likes to ooze on us, so. On the scalp, on the cranium, there is another special layer of skin. It's called the galea aponeurosis, and it's really the layer that is closest to the skull. And in Dennis's case, when I'm lifting this big tumor really off of his scalp, I'm seeing a lot more bleeding there. So I'm really trying to be very meticulous and cauterizing areas and even tying off blood vessels as I see them.
You guys doing all right?
I just tied off a little baby blood vessel under there because it was oozing. Let's see if I can tie that off a little bit here. I gotta take my time here with this because it's so big under here. I gotta make sure I get these little vessels here. It's not gonna be easy.
Oh my gosh.
I'm here with Dennis. He's got 4 big bumps, the biggest of which I'm removing first. It's like a water balloon cyst. I have to be very meticulous here. There's a lot of bleeding going on underneath and actually requiring me to tie off some vessels. This is a really kind of laborious process, a very slow process, but it is very necessary because I don't want him to have bleeding under here. That'll cause a lot of problems. I am still pulling, but I do think that we've gotten far here. We're almost there. Just don't bleed on me or anything, okay? We've been so close and you're behaving so well. I can feel it's like just a little bit left. Done. I was able to remove the entire cyst, and I'm really pretty proud of myself that I removed it in one piece without rupturing it. Hi, Donna.
I still see one left.
Yes, we did this one on its own.
Wow. I got back there and I could still see lumps, and I didn't know what to think. But one of my biggest prayers was to have the big one gone.
You want to see what came out?
Yeah. Wow.
Oh, there he goes. Okay, you want to see your friend that came off?
No.
For real.
Honest to gosh.
Look, it's like gold. Look at it.
Oh my God.
Ooh, good thing you got that out whole.
Yes, can you imagine what a mess it would have made?
All the years that I told him he had a big water balloon back there, I was right.
It's still filling it up. Now it's just a little sack. Dennis was here just the other day and I removed this giant pilar cyst on his head. I was really concerned about the bleeding and how he would really heal. But I do see that he has tolerated it fairly well, so I think I can try to remove those other bumps today. All righty. Now, these can get wet.
Oh, you think they're gonna pop?
It's when I start talking about it that
This
I
is
get
my
into trouble,
favorite
so I'm
shirt.
trying to give it respect. Why do yours have to be stuck to you like this?
Which one are you working on?
I'm working on this one that I can't see very well, and I'm trying to get it out of this area, and it wants to ooze a
Okay.
little bit, so I'm just trying to get it out so I can buzz that oozing. Right away, I can tell that we're not off to a great start. Dennis has this cyst that is completely stuck to his head, and I'm afraid this is not gonna be the simple procedure that I was hoping for. I know it's not easy to get to that, but these are stuck to him. That's the issue here. It's very hard to blindly look at where it is. How am I gonna get this out?
Yeah, you doing anything?
Yeah, there you go. Tough guy now. Okay, let's be done with this one. Sorry, that one was a little awkward. Now that I know what I'm doing, though, usually, hopefully, I'll be faster here. In most cases, the first one usually takes me a little longer because I kind of have to get the lay of the land. And in his case, his cysts all tend to be really stuck to him. That makes it more labor intensive. But now that I know that, I feel like I can get a hold of them. All right, I'm gonna squeeze this one. I kind of popped it a little bit. What are you gonna call this? Old egg salad?
That one's a new one.
You okay?
Yeah,
What's that one?
feels like you're going faster.
Usually I start to get the hang of it a little bit. We might need some more gauze.
It's like honey mustard.
Well, that's the oldest one.
Yeah. So close to getting this thing off. Jeez, that was a tough one. All right, let's see what we got here. Yeah, close those eyes. I don't want anything to squirt on you. It has leaked pretty recently. You can see the opening right there that it leaks out of, so I'm gonna cut that out. It's like a pore. I'm here with Juan, who has tuberous sclerosis, which is a condition that you're born with, and you really get a lot of different types of skin growths. I'm about to remove the one over his brow, which I think could be a cyst, but it could be something that's related to his tuberous sclerosis. I am about to find out. I'm just trying to be gentle here, just in case it's something else. Looks like it's right there. You're doing great. Looks like a regular cyst. You okay?
Yeah.
Just have a little baby, a little oozing right there. That's all. I'm just buzzing it, just so I can see what I'm doing. I think that bottom edge is still the sac wall, so let me just make sure I get it all. Buzz that again. This cyst has been a pain to remove. There was a lot of bleeding that I had to control, and I'm gonna stitch him up now and move on with the rest of the procedure. Next, for Juan's nose, I'm going to use the electrocautery tool, which is specifically good for angiofibromas since there's a lot of blood there. So it's nice to be able to cauterize something, stop the bleeding, and cut it off at the same time. Okay, so I'm just gonna do one. Hurt? Pinch?
No,
oh,
there's
smells.
nothing wrong.
I know, I'm sorry. At least it doesn't make you hungry, right? You're okay? You know what? I'm gonna uncover your mouth so you can breathe through your mouth a little bit, okay?
Yeah, it's just a smell.
I know, I understand. Make sure to tell me if anything hurts though, okay? Yeah, sorry, right under your nose. You okay? Breathe through your mouth if you need to. Okay, sorry. As I'm cauterizing tissue, it creates a little smoke, and that's really vaporized tissue. The smell of burning skin is the same smell you get when you blow dry your hair, but the hair gets stuck in the back of the blow dryer. So it's really not something that you want to smell. Okay. Okay. Considering Audrey's medical history, I should commit to doing 1 or 2 of these bumps. And I have to be very meticulous. You know, these cysts are in this subcutaneous space, which is the space that most of the fat is contained. It's below the epidermis and the dermis. I'm gonna try to not leave any cyst contents behind because that definitely increases the risk of infection. And I know how much this bothers her. I'd really love to be able to remove more than just a couple. I think they're pretty superficial. Don't splash me. It's like, I'm gonna get you. It did pop on us, but it didn't get us. But she jumped.
This reminds me of the cheese fondue my mother-in-law makes.
Look how much was off there. Look at her neck being defined right here. I just removed a really big, great steatocystoma, and it came out relatively easily. So that makes me feel a little bit better about trying to pursue a couple more here. I need to always remind myself that she certainly has a higher risk of infection than the average person. So every time I do this, I'm thinking, you know, is this the one that's going to cause her problems? This is a mama one. That.
Was it a good one?
Yes, it was.
Oh, I wish I would have watched it.
I want to get that sac out.
Yes, please.
It's always important to remove the sac that contained the steatocystoma to help ensure that it doesn't grow back, but especially in Audrey's case, because that can certainly increase her risk for infection. We got 4 in this little cluster at least. That one's more oily. See, no smell. That's good, right? There's nothing that I'm seeing to indicate to me that Audrey's not tolerating this procedure. It really has so much to do with how she recuperates from this. So I'm trying my best to do this in as clean and as sterile technique as I can. Oh, there's another big one right here. Ah, this is my favorite kind, the butter kind.
Mine too.
So obviously, if I could just like make a million incisions on your neck, it'd probably make these more visible. Just want to get that sac out. But in your case, the more incisions, the more trauma I cause to you, the more risk of potentially having issues. But I think we did a good number of them. I was able to remove a good amount of steatocystomas. I felt really good about the amount we were removing on her neck, and I really wanted to target the ones that were really uncomfortable for her and the ones that I thought were the most physically noticeable. The most responsible thing for me to do is to just sit back now and see how she tolerates this and make sure she doesn't have any negative effects from it. Now, as you know, I told you there's no way I could get all of them on one side. With your personal medical history, I think they were probably not going to do more. There. Doing okay?
Yeah, I'm fine.
Again, you shouldn't feel anything other than us touching you.
Okay.
Nothing should be sharp or uncomfortable. My goal always on the face is to remove as little normal skin as possible, leaving you with the smallest scar. In Felicia's case, she's got this large darkened area on her skin. I'm trying to remove as much of that as I can, but there's still gonna be dark skin remaining. The only way that this darkened skin is gonna lighten up is with time. And so she's gotta keep her hands off of it. Bring that little bit in. So initially one can see how thickened this scar is. Right here, the skin is very thick because it's been kind of just scratched, rubbed on all the time. Let's just see if I can get to it now. Still, because the skin, like I said, is thick, so I still don't see the lipoma under there. I don't know how I'm gonna get this thing out, guys. Do I have to make a wider incision? Will I be able to stitch this up? Maybe it's a cyst, so keep your eyes open. Nope, lipoma. It's a lipoma, yeah. I finally reached the lump, and it does turn out to be a lipoma, but it was hard to get to because the skin on top was so thick. She has really picked at this area. It is the thickest forehead skin I've ever seen. See, imaging right there? Oh, he's a cute one. You got a cute one under there.
Oh, wow.
You okay? That's a pretty one, actually.
I'm gonna have to tell you. Came out. It doesn't often come out in one piece, but that one did, I do believe. Okay, little baby pinch here, okay? Just a baby pinch. You okay? Mm-hmm. Good, not too bad. Okay, so I do think this is a lipoma because it feels really nice and mobile, like it's poppable. So I kind of do it in a regular, natural forehead crease. You okay, right? Mm-hmm. Good. I see it. I'm at the top of it, and I'm just taking a look at it carefully. All right, let me see whether this won't pop out of this smaller little opening. I'm just gonna squeeze you a little because I want to see if I can't pop this thing out. If I can pop it out of a smaller hole, it'll make all of us really happy. Just take it out in pieces here.
Well, I was right. This is a lipoma. It is a different kind of lipoma. It's more fibrous or more dense as opposed to other lipomas that are more really loose and blobby and kind of easily tear. This one was stiffer and more fibrous, so I could really grip it and get a handle of it and leave the scar line smaller because I can see it really well.
What are your guinea pigs' names?
Brownie and Oreo.
Oh. I name mine after food, too. One of my cats' name is Dim Sum, and my other one's Taquito.
Oh, I love taquitos.
Yeah. I feel like even like as you speak now, your personality's coming out here, because I think in the beginning, you know, it's stressful to do this, but I can see you relaxed and are now just excited.
Yeah.
I'm really pretty pleased at the size of this little incision line we made. Okay, make sure I'm not hurting you, right?
Nope.
Okay, good. You're doing great.
I'm here with John, who has a pretty big lump on the front of his neck. Even though technically I am under a muscle now, I do think that I'm just working around it so that I can really try to convince this bump to come out easily.
I see it under there. I think I see something. I hope I see something. Okay, I see the lipoma.
It is.
That's good. It's right in the front.
Good.
But let's see if I can fish it out of this tiny little area and say, hey, come on out.
John's lipoma is visible just under the surface, which is a great relief. I can at least see part of it. The main problem is I just don't know how deep this is going, and I don't know what it's attached to.
What's this going on here now? Why is he stuck to you? Just tugging just to see whether I can tug it out.
Oh, I can feel it.
You feel me tugging?
It was on this side.
Okay, did it hurt? Just like a tug?
Pulling on it.
But it's gonna pull on you because I'm trying to pull it out.
Okay.
It's stuck to your muscle, I do believe, underneath. That's why you're feeling that. So I'm gonna try to trim it as close as I can.
Okay.
This lipoma is definitely stuck. It is not just one simple ball that pops out so nice and easily. It's never that easy. It is definitely tangled up in this area, and I'm just really careful. I don't want to snip something that I'm not supposed to, so the best really mode of action is to try to take it off in pieces and really take my time and make sure that every piece is the bump and not something else.
I'm trying to see if it'll just tear away from that deeper part. Do you know what I mean? I do think I feel the bottom of it. I'm just trying to pull it up. I would just dream about you over and over again if this just popped out. But I try to pull it out far enough so that I can kind of safely see around it and then trim it a little bit. So if it's gonna take me little by little, that's so fine. Be it. So be it. So far, so excellent. So if I can trim this as much as I can this way, it's gonna work, okay?
Okay.
That's what I'm concerned about, that I do that and then it disappears on me. It wants to suck back in.
I'm trying to remove John's lipoma, but the bottom part is still stuck to something deeper. And so every time I snip a little bit of it, the part that I don't snip off gets pulled back in by vacuum or retraction. And obviously it gets harder to find it again. If I can't get all of this out, John is still gonna be left with some kind of bump.
I feel it. I feel the edges right here. Just come this way. It's like tangled in a little net. So even if I squeeze it this way, if it's caught up in it, it won't come out. That was a pretty good piece. That was satisfying. Look at this. That was a hidden gem. I think it's the last bit. You okay?
I'm good.
Come on, little one. I do feel like at the end, the final piece broke free, and I do feel pretty confident that I got the last of this lipoma. Yes, that was a nice piece. Okay. I'm here with Matt, who has this pretty large and recurring growth in his armpit. I really need to be careful in this area. There are really important nerves and structures underneath this. So I need to go really slowly and very safely to make sure I get it all out so it doesn't come back. Okay, so I do think this is a lipoma. So if I can ease this out here with you in comfort, that would be the ideal kind of thing. Just trying to get him out of his little casing here. He's just smushed in there, wedged in there. So when I pull him, he tries to pull the casing with it. There is a casing or pseudomembrane around a lipoma, and it's stuck to his muscle. So I need to be really careful when I remove this not to disturb the muscle or deeper structures. I'm trying to get it out of that little membrane.
It's like his little business suit, right?
Yeah, trying to get him out of his suit. Like when you take your underwear off over your head or whatever. You need to...
Ooh.
Oh, sorry.
Yeah. That one was a little bit of a pinch, yeah.
Probably pulls on you underneath, and you have scar tissue there, so I'm not actually using anything sharp, so that's all great. So the brachial plexus is sort of a danger zone. If you damage that at all, it can cause decreased sensation in any part of your arm. It changes in ability to move things. So I'm always really careful in this area. I would say we have like 3/4 of it out.
Yep.
It's a kind I have to be patient with, because if I try to go too fast, you won't like it, and it's just gonna tear.
Ah, yes.
Part of it, not all of it, but more this
But I tell you what, that feels much better.
Does it?
Mm-hmm.
I was able to remove a majority of the lipoma, but there is still something there left, and I can see it. It's just evading me. It's down deep. You have a double right here. There's a deeper component to this lipoma, and maybe that's the part that they missed the first time because it was so deep and harder to see. And I can see why this part was difficult to get to and could potentially be missed. As I try to pull it out, it really wants to suck back in. So I've got to just pull on this without tugging on deeper, more delicate and important structures. I actually have a lot of it. He's almost there. I can't say for sure that I got it all, but if there is anything left, it's a tiny little bit. Are you excited about this?
I'm very excited.
Okay, you shouldn't feel anything other than us touching you.
Yes, ma'am.
Good. Oh, it wants to come out a little bit already.
Oh, that looks like mustard. Dijon.
Oh, nice though. Make sure I'm not hurting you, okay? Just kind of tugging on you. Make sure it doesn't hurt. It's like she had a little grape in there. There's one little grape. Okay, number one down.
Oh, wow. That was the whole thing? It came out in one piece?
I just think that these are soft, so they're kind of liquidy, I think. Do you notice my girls, they only protect themselves. They like really don't
Well, look
protect
how you did to Christy today.
I'm all scared. Just got oatmeal on that one.
Hey. Hey. Did I get you?
Yeah.
Yes. Oh, I'm
Hold on a
sorry.
minute. It's okay, it's not your fault. Applying local anesthetic is like adding more water to a water balloon, essentially. When you inject a cyst and you increase the pressure in the area and then you cut into it, this can sometimes happen. Doing great.
You're like cutting the sack out?
Yep. Sometimes they're stuck to you a little bit. That was satisfying. All right, there's that one.
And here comes the cream of the crop.
Mm-hmm.
Brace yourself for impact.
Okay.
No impact. If I get hit, I'll know she did it on purpose.
No way.
Houston, we
I
have a
would
problem.
never do that on purpose.
Ooh.
I'm going slowly because it's liquid.
Ah.
That's like oil.
Yeah, like 30
got
weight
that?
oil. Tracy, it looks like one of those plums Alexi got.
That was more like it.
I'm so happy for you, Tracy. Thank you.
I'm happy
happy for both of you. And now I'm ready to see what Stacy's cysts have in store for me. I promised these sisters that I would send them both home bumpless. All right. Okay, part deux. I really hope I can live up to that promise. Okay, you shouldn't feel anything other than us touching you.
I'm ready.
It's jammed in here. Yeah, this one's like it's just stuck to her. You know why it is? It's because it's been scarred and, gotten inflamed. I just got started with Stacy's cysts, and I can already see that there's a problem. I think that there's a lot of scar tissue here. Pilar cysts are very similar, yet very different. Some of them are more liquidy, some of them are more chalky or thicker, are ones that have been manipulated a lot, but that does make it more difficult usually to remove. I don't know how I'm gonna get this thing out, guys. I don't know if I can get this one all the way out. It's like stuck to the skin. A lot of it could just be scar tissue, but okay, I think I almost got it. Take a look, sister. I don't see anything else inside there.
That looks clear to me.
Oh, so you want to put anything in here? You made 2 carat, 3 carat?
Hold on.
Yeah, okay. She'll put her keys in there. I am 1/3 of the way through my second case, and I'm really hoping that the remaining 2 are not as stuck as that first one. You okay?
Yep.
Oh, this thing is wedged in there.
Oh, yeah.
They're all smushed like you took your thumb and just jabbed on them, like to keep them, pushed them down.
See, yours didn't squirt.
Hers is a little more like putty.
Stacey, I don't know if you're going to be as smart when she gets done with you.
Yeah. Do you think this is where brain cells?
Your brains are coming out.
Yeah, it's coming out. There you go. The consistency of cysts can be different. I think that the ones that are really stuck to the skin are ones that have been manipulated a lot. The fact that Stacy has really squeezed stuff out of them before is the reason why hers are so stuck to her. Okay.
Here's a big one now. Let's see how much brain comes out with this one. Oh!
It is that kind of day.
It is.
Did it squirt?
Did I get him?
You missed it.
I'm still
It's on the wall.
Oh!
Hey, that was like all yours. Almost there, everybody, almost there. Well, I kept my promise. I was able to remove 3 cysts in each sister, and we also got to keep things interesting. If you haven't been sprayed in here, then you haven't lived. Not only can they bond about being twins and having bumps, they can both boast that they've squirted cyst contents on me. Okay. Just gonna put a little numbing here. What'll feel like is just pressure, like tightness here. Let's do it. Shouldn't feel anything other than us touching you. I know it's gonna make sure I'm never hurting you, okay? Nothing should be sharp.
I just feel you.
Really great. Let's see, it would be nice if this thing would just pop out so pretty and clean. We'll see. I'm cutting around Joanne's lipoma and really trying to free it up from the muscle at the base. So I'm hoping this is gonna squeeze out really nicely from the small incision that I made. If it doesn't, it's gonna mean that I'm gonna have to widen the incision and widen the scar. It's ready to pop out here. I'm gonna push on you, just pushing against you, just to see if this will kind of pop out, which is always nice. Okay. But it never really does. It's nice if you can get them out whole, but I can't really do that with these on the head. This lipoma does not want to pop out, so I have to extend the excision just a little bit. I'm trying not to overdo it because I certainly don't want to leave her with a scar that she hates as much as the lipoma. I made it wider, but I don't try to make a big old excision. You're doing great. Now, just trying to push around and try to ease it out nicely. Noises sometimes.
Lots of fun noises.
Yep. Like I can't pull it and then the whole thing doesn't come out with it, which would be nice. This bump is really becoming an issue. I can't pop it out, I can't pull it out, so I'm really gonna have to use my tissue scissors and cut it piece by piece. So just kind of trying to, it's oftentimes stuck at the base, which is what we're just working on.
Sometimes they're like more fibrous or like dense. Yours is kind of not as dense, so it doesn't come out in one full piece. I made it wider, but have to really take it out slowly. So the scar line's gonna be a little bit longer. Sometimes they squirt at me, so I'm trying to be a little bit...
Well, hopefully I won't squirt at you.
He might be a squirter, and then I was like, I better not say that.
I'll try and hold it in.
Okay.
I'm here with Mike, who has a golf ball-sized bump on his head. I have to be careful here because these can squirt at me, and sometimes I don't know what I'm dealing with until it's too late.
It looks like a little smile. It's like an evil smile it's giving me.
It's smiling at you?
It is. It's giving me an evil...
It likes you.
Well, it's spitting at me now a little bit.
It wants you to hold it.
It does. I think it does. It's not brains coming out, thank goodness.
I'm starting to feel stupid. What was your name again?
Hey, don't worry us. Just gonna tug on you, make sure I'm not hurting you again.
Mm-hmm.
It's talking to us, do you hear it? It's talking to us. This one is a little bit stuck to him. All right, now I'm gonna just figure out what we're gonna do to close him up here. He actually is not too far. We can see him again.
See who again?
You. I get to see you again.
Nah.
Yeah. Next time you're gonna have bells on. You're gonna come prancing in here.
I'll take the stitches out myself.
Yeah, right.
I took my own braces off. I'm sure I could take out my own stitches.
Why did you do that? Because you didn't want them anymore?
Nope.
What did you? How do you take them off?
With the pliers.
What?
I don't even want to imagine what that felt like. I do not recommend that a patient take out their own stitches. It's always best to see a professional.
It's not unusual to have a little touch-up because, you know, it's better to take off a little bit too little than too much because you can't put it back.
I'm here with Dania, who has rhinophyma on her nose. I'm using an electrocautery tool to really reshape this nose. It's like being a sculptor. You really have to think in 3 dimensions. And the most important is that I want to take off too much. I don't want to change the shape of her nose forever.
Now, the one thing is I just want to make sure it's down enough. It always looks like you don't take it out as much as you thought you would, but this also shrinks the tissue while you're treating it.
You really see contraction of the tissue as you're moving it. So essentially, it's like shrinking before your eyes. You just have to be really careful with that, and that's something that you need to take into account. If I take off too much or I take off too little, it can really affect her self-esteem.
I don't know. Am I done? Let me just take a look at this. Don't look at the swelling. Look at the contour here. I know I already shaved this nice and down and it's just swollen here. Done.
I think Dania's nose looks really good. We've really been able to minimize that shelf that she had. And I know that it's healing right now and it's really charred up, so it's kind of hard to look beyond that. But once the swelling goes down, we reassess this.
If you could see the contour, like from the sides, that's really kind of where you usually notice it. Okay. And the swelling go down over the next week.
Oh boy.
But do you see that bulbous? You don't have that there anymore, right? This little boop.
Wow.
Like a clown nose on
Yeah.
stuck on. Looks good from the side.
Yeah.
The profile looks nice. Something clogged it.
I'm here with James, who has this large bump on his forehead. And just from the way that it feels, I'm concerned that this might be something I can't remove. Now I'm drawing out a sample with a syringe, and the contents are so thick that it is clogging up the needle. Hopefully, we're finally gonna figure out what's inside this bump.
Let's see what comes out initially. Oh, look at that. Cyst. See that little bit right there?
Oh, yeah.
We got a cyst in there. So that's good. It's not brain.
Yeah. It is such a relief to know we're moving on from here and we're going to remove this today.
Let's see if you can squeeze it out. What do we think is inside this little friend of yours?
I now know that this bump is a cyst and it's not fluid from the brain, so that's a good thing, but it's still a weird cyst. It has this very weird texture. You push on it and your imprint of your finger stays there and it slowly creeps back, and I've never seen that before.
Because of this, I really have to keep my eyes open for anything else that's strange about this unusual cyst. Was that a hair in there, maybe? Oh, look, these little hairs in there. Hold on, let me see. Yeah, little hairs trapped in there. Keeps coming. There's more hairs in there. Oh, maybe you could have a little dermoid cyst here. Dermoid cyst is something that you're kind of born with more so, but we'll see. I'm squeezing out this cyst, and the first thing I notice is it's filled with hair. So it made me start to think, could it be a dermoid cyst? Dermoid cysts really develop during fetal development. A dermoid cyst can contain hair, it can contain skin, it can contain teeth or bone even. Or could this just be a cyst that has a lot of hair trapped in it because the hair grew the wrong direction into this cyst? It just looks like mashed up banana from your drain in your bathroom. Because it's got hairs in it. You got like a whole serving for your whole family here. This is the container it's in. That sac wall is like a stronger sac wall. If I don't get all this out, then it's gonna come back. You can see here's the sac here. This could be the end of it. Yes. All right, we're stitching this one up. I was really worried that this was gonna be something more serious, but it was a cyst. Okay, so let's take a look here. Doing okay? Mm-hmm. Good. So are we. So this is usually the time where I can kind of figure out how difficult this is to remove. I do feel there's some little split right here. Whenever I remove a bump on the shoulder, I'm always aware that this is near a joint. It could be bound down, so I want to always be very careful. It's just stuck right here.
Oh, wow, the thing is big.
It's pretty cute, huh? It actually came out in a nice little bloop. Okay, I'm gonna just try to remove that whole area, as straight as we can. Get you all primed up for romance, it sounds like.
Yeah.
Uh-huh, see, there's something. Still more stuff in there. All right. It looks like a cyst, though. Thank goodness that's not intestines.
Yeah.
See that whole sac wall? We just need to take that out. Look at that, it's really stuck to him. When a cyst has been popped, that really kind of changes the rules. And the fact that this could be somewhere within his abdominal cavity, it could be diving more deeply, means that I need to proceed really carefully, yet still try to remove the entire sac wall so that it doesn't return. Man, this thing had been growing there, I'm telling you.
Yeah, it's been there a while.
This is the issue. How am I gonna get this off? Now I just have to dissect out the sac wall. And I have to be very careful here because when a cyst has been inflamed, it's really more adherent to deeper structures. But he really wants to get rid of it before his girlfriend gets released from prison. So how do you have a romance like that? That's difficult. It's not that easy, huh?
No, it's a lot of writing.
Do you know when she's coming out?
By the end of the year.
Oh, okay. Do you see her every week?
Well, up till COVID, I would go every week, but when that started, then it was.
That.
I haven't seen her since March.
Can you guys like FaceTime or anything? Like.
She has a tablet, so we can email back and forth.
That's fascinating. It's like kind of tucked back here in this part. What am I gonna get right here? Is this thing still it? Done. You shouldn't feel anything other than my touching you, okay? So I'm gonna try removing less in the beginning, so I have the option of keeping some of that instead of like having too little and then going, well, now what are we gonna do? So I'm just gonna debulk it first. And then we'll see what we have left to try to trim it, make it look nice. There are a few things that I need to be cautious about when I do this procedure. One is knowing that if I take off too much skin, I can't really go back and put some back. And the other is the blood supply. JD has a pretty good blood supply feeding this growth, so I need to be very cautious and make sure he doesn't get too many bleeders. Bye! Oh, I knew it. Oh my gosh. You know, when I was walking out the door today, I was like, should I bring another chain to scrubs? It's when I think those things that I probably should just turn around and do it. I'm here with JD, who has a very interesting keloid on his earlobe. I need to remove skin conservatively, make sure that I have enough skin to rebuild his earlobe so it looks normal. And also, I need to head off blood vessels at the pass. I really want to zap them when I see them and prevent a lot of bleeding. Okay, look, that is ready. Okay, you got it off. Let's see if this thing will pop out. We'll see. Hopefully we can just take it out very simply. I'm excited for you, and I'm excited for this lipoma. I have a feeling I'm gonna like it as much as I like you.
I'm excited to see what comes out of there.
Yeah. So, okay, yeah, yours is like stuck in these little bands. I just have to give a little elbow grease here. Okay? Yes. All right, we're getting it. Julie is just this tiniest little thing, but she's definitely a tough cookie. I mean, this thing is stuck on her, and I really have to grapple with it. I can barely get a grip on it. It's sort of like that soap that drops in the shower, and you can't grab it. And she is taking this like a champ. Let me hear about your stories. You must have some stories from the cruise ship. Stories you gotta take with you to the grave kind of thing.
There's a few of those. I always smuggled things out of Russia when it was still communist.
Oh my gosh, you smuggled things out?
Well, because you had to buy things from the government store and show a receipt.
Okay.
And I collected the Russian lacquer boxes. If you went to the Artist Square in Leningrad, you could buy them for next to nothing, where in the stores they started at $300–400.
Jeez.
So I would stick them up my jacket and, you know, places.
Wow. The things we do when we're young. Whoa, Julie's got some crazy stories. I mean, smuggling stuff through Russian customs? I mean, I like to keep my patients talking during a procedure to really distract them from the nervousness. But in this case with Julie, I really hope the KGB doesn't come after us. Okay, we're getting there now. We're almost there. I'm gonna come from this side and then we'll be good, I think. Just take this off first. Okay. Yours was probably like a little troublemaker like you got to keep an eye on you. You can just clean that off there. Okay, then put some stitches in, then we're good. I'm really pleased at how Julie's procedure has turned out, and I'm telling you that lipoma was just as tough as she is. Hopefully this is gonna give her a whole new lease on life. She's already blocking. Yes, we're all blocking ourselves.
I got you, don't worry.
Whenever I cut into a cyst, I'm always concerned about getting that squirt of cyst juice in my face. In this case, on the neck, I'm really hoping that I don't get squirt with other things, such as blood from some of these large, important blood vessels. So I'm always really careful in this area. You okay?
Yes?
Make sure I'm never hurting you.
I don't feel anything.
Okay, I'm just trying to see. I think I see the top of this beautiful cyst here. It's egg salad.
Oh.
We'll show it to you. Let me take a little of this off. Give you a break for a second. Take some of that egg salad off. I'm just squeezing you. It definitely looks like a hard-boiled egg. Don't you think?
Yeah.
So close, but he's stuck at the whole base. You okay? Yeah?
Yeah. Nope.
Okay, good. Everything looks really great and very safe, obviously, but also
Good.
I just want to make sure you're not feeling anything. There's no need to torture you.
Okay.
Having a cyst stuck in the neck area is certainly tricky business. I want to make sure that I really take this off very delicately because there's really important structures under there. I'm always checking in with David too to make sure he's not feeling anything, no discomfort, nothing I'm doing is really making a nerve sort of twitch, because those kinds of signs are indications to me that I might be in an area that I don't want to be.
That guy was a mean one. Oh, your days as a neck model are about to begin. Get ready. So I'm assuming this is the same thing. Let's see. It's
Little nutty.
a little nuts. These nuts. It's these nuts.
These nuts.
Do you want to give it a little squeeze? Can I get my girl give it a squeeze? Do not spray it on me.
No, it's my chance.
Yes. Yeah, it's like mashed potatoes.
Mashed potatoes? Homemade or instant?
Yeah, it was instant, like instant ones. You okay? Just trying to get the I have to get the sack out now, so. Just checking all the edges, seeing if I see anything that looks like cyst.
Okay, I got rid of all the cyst contents as well as this little sack. Now I just need to stitch them up.
Okay, let's see what you got under here, huh?
This is like excavating cyst henge on Adam's head. The first one was blue. The second one was really a pretty round and pink one. Who knows what we're gonna get next? It's just such an exciting mystery.
I'm just trying to make it a little bit wider so I can squeeze it out. Don't get me, please, don't get me. Did you miss me? Darn it.
This program examines dermatological conditions and the procedures involved with treating them. Due to the graphic nature, viewer discretion is advised.
Nothing should hurt.
Okay.
I'm gonna start with Sandra's growths behind her ears because they are the largest, and I know they really bother her a lot. But they're also sticking out of the skin, and I use both a really sharp scissor and a blade to try to remove them and try to keep that area as flat as possible.
So I do think the things that are on the inside or the opening of your ear there are the same as what's behind your ear. So that'll help us determine what that is and how to best remove them.
When I'm working around the ears, there's an increased risk for keloiding in this area. So there's a couple different things that I do to try to minimize this risk. One would be trying to keep the incisions as short as possible. If you have a longer scar, a keloid can grow in that entire length of that scar. And also, I try to minimize the tension on the wound edges when we close that area. I'm really trying to preserve as much skin as I can, because if I leave a lot of that loose skin, there's a lower risk, potentially, of getting a keloid.
Did you hear that?
Ooh.
Sorry, I'm pinching you. Does it hurt?
Yeah,
Did it make you
kinda
cough?
like, I think it did, yeah. A little bit.
This is like a puppet master, this thing.
Oh my goodness. It's out.
It looks like popcorn.
It's out. Get out of here. What it doing? Look like a brain or?
It does. I think I got rid of part of your brain.
That last growth, it was really bumpy and self-contained, and it might be really different than what these other growths are in this area. No matter what, I'm really trying to minimize the scar line and minimize the incision, minimize the tension on that wound.
How are you doing, Jessie?
That was actually interesting to watch.
Make sure I'm not hurting you, okay?
Okay.
Turn a little towards me there, sweetie. Thank you.
I'm using a scalpel on Sandra's forehead, very flush to the skin. I think the very best course here is to shave some of these off. Let's see how they heal. Let's see whether they stay flat or whether they raise up, and go from there.
So this one, I do see a little bit of it underneath. I'm wondering whether I just leave that, or, because it'll just come back probably. Maybe if I buzz it, actually, I'll shrivel it down. Let's see if that'll help it. Sorry.
I decided to use my cautery tool to shrink these growths down a little bit more. It's because I do see a component there that I'm leaving underneath the skin. It's almost like using a little sandpaper and kind of smoothing the area down as much as I can.
If you don't mind, Jessie, can you pass that mirror to us?
Crap, let's see. Are you kidding me right now? Oh my God, they gone. Yes, yes, they gone. That looks good.
She wants to ooze, huh?
That looks great.
All the blood's rushing to her head.
You couldn't tell it was there.
All right, let's do it.
The first bump I'm gonna start with on Jessie is on her glabellar area, which is the area between her eyebrows, because that one bothers her the most.
Whenever we take out a circle, you sew it all.
I've decided to address this area with an incision. there's still gonna be a deeper component there, and it will probably bulge out again in the future. So by excising it, there's a better chance that I'm gonna remove the area completely and just leave her with a slight curvilinear scar there.
I don't feel nothing.
Yeah, that's the point. You're doing good, baby.
I was able to successfully remove the bump on Jessie's eyes, but I'm gonna move on to her ear now. She's got a growth very similar to her sister Sandra's, and I'm gonna remove them in a similar way.
Girl, you look good, Woo.
So make sure I'm not hurting you again, because I feel like these can pop out of in there. Let's see if it looks like popcorn too, this one. You wanna see? Stand up?
Yes.
Stand right there, okay, ready?
Oh, yeah. Oh, wait. Oh, yeah, look like mine.
Yeah, like a little nut or something. You're not trying to cough or anything, right?
No. Oh, wait.
Yeah, he's cute. Everything seemed to go really smoothly with Sandra and Jessie. Not only was I able to remove the worst offenders on them, but now we're on the way to finding out what the diagnosis actually is. Once we know this, treatment is gonna be easier, and they're also gonna have a good handle on what works best for them.
All right, let's get started.
Vision 33.
You could lose so much blood in a matter of minutes. It would be nothing for him to be in cardiac arrest if someone were just to try to lop this off. There'd be no way you would stop that bleeding.
I'm here with Roger at Dr. Osborne's Head and Neck Foundation. Dr. Osborne has just made his very first incision into Roger's rhinophyma, and bleeding is a major concern.
So we've got a circumferential skin cut without too much blood loss. That's nice. But I can already see a big vein right there. Bipolar. Bipolar.
Dr. Osborne is using a bipolar electrocautery tool, which really allows you to seal the blood vessels as well as cut it at the same time. And sometimes there's some bleeding despite that because the blood vessels are so large. And that's why Dr. Hamilton's coming in with a little vacuum and pulling up that fluid, because if there's too much fluid in the area, the cauteries don't work.
So I have my finger inside the nostril just to delineate it.
Yeah.
Last little piece now. Here it comes. There we go.
Wow, they removed that entire huge piece with very little bleeding. So that is in itself a huge victory. Even if nothing else happens today, we've really improved Roger's breathing, removing that first big lump. But these doctors are just gearing up to tackle that second larger growth. There's tape placed over Roger's eyes, and this helps because he's under general anesthesia. Sometimes if you're laying back, maybe your eyes might open, and we want to protect his eyeballs, certainly.
The biggest challenge here, I think you're just gonna go straight across something, like I'm just gonna lop it off. You're gonna end up lopping off part of his normal nose. This is not just a take it off procedure. This is an unroofing of the nose beneath the mountain of tumor. And you've got to be careful not to remove the normal parts of the nose. It's pretty easy to take something away. It takes an act of God to put it back. If I were to remove too much of this tissue, we could turn one deformity into another deformity.
I mean, that looks like a
Portobello mushroom coming off.
You say portobello, I say potato. There we go. It's just the skin could accommodate so much there. Dr. Osborne was able to successfully remove the superior tumor as well. Most importantly, he allowed there to be extra tissue there to really aid in proper reconstruction of the nose.
All right, well, we're not done, but
Clean goes, Murphy.
I know whose job it is now. You're gonna pass it on soon.
we're able to get it off pretty well without losing a lot of blood. But this is not really a nose under here. This is really just almost like hamburger meat.
Dr. Osborne removing the bulk of these two gigantic masses on Roger's nose was really a feat in itself. However, there's still a lot of work to be done. Dr. Hamilton is a plastic surgeon who works really closely with Dr. Osborne at the Osborne Head and Neck Institute. He's one of the best plastic surgeons around, but reconstructing Roger's nose to become a fully functional nose may be his greatest challenge yet.
So what's going on here more specifically?
Now we're just trying to create contours, just trying to get rid of the rhinophyma and recreate some normalcy. Some of this was the rhinophyma, but some of it's the normal ala, which you can see here on the inside, is just stretched out to maybe, 4 or 5 times its normal size.
Okay.
So we want to kind of fold this down to
and then that will be
get rid
nice
of it.
too, because the scar will be hidden along that natural crease. Okay.
Yeah.
So this one's not in the textbook.
Yeah. A lot of things you got to make up on the fly, right?
Yeah.
You see it and then you decide what you're going to do.
We're going to make a smaller nostril by making an incision inferiorly in the nostril, removing a small piece, and then sewing it together.
That looks great. Fantastic.
The many, many years of having weight sitting on that cartilage made the cartilage soft like putty. The nose needs to function. If Roger were to take a deep breath in through his nose, all of that tissue will just collapse in almost like a vacuum.
So we're putting an external nasal cast on to kind of give it some shape from the outside.
So it's like a cast that's molded?
Yeah, we're actually a hard cast.
Okay.
Like a taco shell, you know, so it
I've
can
seen
form.
that, like it, yeah.
We're just going to do a splinting system, which would almost act like a cast, almost as if you broke your arm. We cast his nose and allow things to sort of strengthen on their own, and they will with time.
It really is already.
It looks very impressive right now.
Kind of contracting on the table. Yeah, it looks like it's gonna do well.
I'm so relieved that Roger's doing so well and he's really come out on the other side of this surgery looking so good and so promising. I think this is the world's record holder for the largest rhinophyma ever seen. And it's gonna be equally interesting for me to see what's inside this growth that has been weighing him down for 10 plus years.
So these are the two specimens that you removed. This is your portobello mushroom, and that was my Idaho russet.
That's right. Got a lot of fibrous tissue to this one.
It looks like a big hunk of skin.
A little bit like whitefish,
Yeah.
I suppose.
I think you're enjoying this. You're gonna cut through all your tissue and stuff off now.
It sort of looks like when you cut through a scallop, actually. It's got that kind of whitish look, and it's sort of that rubbery texture when you feel it, but it's not a scallop, it's rhinophyma.
Make sure I'm not hurting you at all, okay?
Yeah, I'm good, thank you.
Christina's come to me with a lipoma on the back of her arm, and when she flexes, it does tighten, which concerns me that this could be below the muscle.
Aha, well, I like what I see so far. I see a little lipoma eye peeking out at me.
Sweet.
So that's a good sign. I'm just trying to really release it, so I actually do this in a really safe way. I use my fingers.
Christine's lipoma is indeed above the muscle. But this is not the end of it, because this lipoma is still pretty big, and there's probably a tangle of nerves and blood vessels under there. I really hope that it comes out whole, because that means that this is a much quicker and less invasive surgery, and hopefully there's less bleeding.
And you're doing just great. I love that you're so calm, and that helps us to really get this.
This is how I envision it too. I picture it just to come out in one piece.
Okay. Well, that puts pressure on me, huh?
I'm a little superstitious, and I really hope that Christine's not jinxing me with her premonition for success. Now I'm worried that this thing's gonna fight me and I'm gonna have to take it out piece by piece, so fingers crossed that this is gonna be easier.
All right. You okay?
Yeah, it's just, wow. It's
Weird,
so
feel weird?
Wild.
Well, I think we got it all.
Despite my superstitions, this was a very successful and satisfying removal. I do think that now Christine's gonna heal up really well with her stitches, and she can leave this lipoma behind her and get on with her life.
Close your eye just so I don't put my finger in it.
Tiffany is really nervous about this procedure, and that's understandable. And this is a really delicate area here. And I need to really make sure she's calm during this process, especially in the eye area. Any kind of quick, significant movement from her, I'm holding a sharp object over her eye.
Okay, a little baby pinch here. I see it like a little, because it's so superficial.
Eyelid skin is really thin, and there's a lot of important muscles right under here. One slight movement one way or another may make you cut something else. Okay, all numb.
Make sure I'm not hurting you. So there it is, nice and flat, like as if you had it lanced.
Already?
Yeah, well, we have it flat, but let's see if we can't find what's the container it's in. See, this is the inside of it, but the cyst, but it's so thin.
The skin on the eyelid is the thinnest skin on the body. The entire surgery has to be done at the depth of a credit card, so I hope that no one sneezes.
Almost got the whole thing here. Are you okay? Not really? I know I'm pulling on you. That's a weird, weird sensation. All right, so close. We're so at the very end, You're doing so good. It's out.
The cyst is out, thank goodness. Now I'm down to the stitches, and these sutures are so small, they're smaller than a strand of hair. All right.
Can you open your eye? You okay? Mm-hmm. You see okay? Mm-hmm. Okay. Do you want to see it?
Yes.
That looks good.
Oh, yeah.
You're back.
Yes. If I could do the happy dance out here, I would. I'm so happy. I'm really grateful that Dr. Lee is committed to my surgery. And I hold her in the highest esteem. She's just a great human being.
See, the liquid's like a yellowish gel. That was what was in there, but this whole area, too, is more liquefied. Oh, looks good. Looks good, girl. Am I hurting you, by the way?
No, not at all.
Okay, good.
I'm here with Brittany, who has neurofibromatosis type 1. I'm going to start tackling the bigger bumps on her first, because those are the ones that bother her the most. These can be really stubborn, so I need to be on my game to make sure I get them all out and they don't come back.
Oh, yeah, we've gotten some big ones, I'll tell you that. Okay, good. All right, there's one. Looks nice.
It already feels different.
Yeah.
I can feel you touching my skull and not a bump.
Yes. Okay, so this one is like this top part, and then like it's a deeper part under there. So
I'm curious.
You know, there's like vessels and nerves under here we don't want to go to, but I want to just get this bump here and see.
These neurofibromas are really interesting because they go pretty deep under the skin. But I was successful in removing the ones around her forehead and on her temples, so now I'm gonna move to her mouth and her chin and see whether I can remove this one that is really pretty noticeable.
This cute little nubbin here.
Mm-hmm.
See how they herniate out? They're like under there too.
Even with thousands of bumps, it's really interesting how people with NF have specific bumps that they would really like to have removed. It's interesting how some of them bother people more than others.
It's like iceberg.
Mm-hmm. So far, things are going pretty smooth. I am now about to tackle her shoulder. That's where Big Mama resides. And then I'm gonna try to treat some of the ones around her nose and on her mouth.
Alrighty, here. Make sure nothing hurts. Same thing.
I didn't feel that.
Good. This one like pulls together really well again too. They're nice and well behaved because they're all just right under there and they kind of pop out. Let's do this. There's your friend though.
Oh,
it's
wow.
An iceberg. It's like a little Portuguese man of war.
I like that. My shoulder hasn't been flat since I was like
Really? You've had this
10.
forever?
I got rid of Brittany's biggest bump, and so now I'm gonna stitch her up and move back to her face. I really wanna smooth this area up around her nose and her mouth. These are actually very complicated because there could be a lot of growth underneath the skin and they can herniate outwards. So that is always a risk, but I need to give it a try.
I'm just gonna put one little bit right here, so close your eyes. She's got a little suction to help with the smell too.
I'm using my electrocautery tool in this case to remove these smaller bumps around Brittany's nose and her mouth. I can kind of sculpt the areas and melt the skin really around to try to keep this as flat as possible and also have to deal with less bleeding.
I think the smell bothered me the most.
Brittany really is such a trooper. I think that multiple treatments she's certainly going to benefit from. So I really look forward to seeing her again. But I think she's gonna be really pleased with what we've done, certainly so far.
Here you go, take a look at what we did here. Oh, careful. What do you think?
I feel like my whole life has been about this moment. It's finally happened. Can I hug you?
Oh, of course you can. Oh my gosh.
Okay.
You're doing awesome. I know you can hear these weed sounds, okay?
Well, you're doing fine.
Good. You are too. I think you're doing great. Your sister would be so proud of you. We're just taking our time to tease this off of you.
Ooh,
Am I hurting? Okay, I'm sorry. I'll make sure you have numbing right there. I'm so sorry. Sorry, sweetie.
Yeah, well, I mean, I felt it.
Careful. Don't reach up here.
So
Don't reach
sorry.
up here. It's okay.
So sorry.
I know you're just trying to be helpful and show us, so don't worry.
One of the drawbacks to having a patient under local anesthesia and being awake is they will instinctively reach back to touch an area. And I'm trying to keep this area as sterile as possible. So for the rest of the surgery, I think I'm gonna have to take on the role of a sister and keep him in check.
You're a precious person. We gotta treat you extra precious. Feeling okay?
I'm feeling okay.
Okay. I think that stuff works.
Yeah, I think it is. Relax completely. How's it look?
It's actually very cute. You okay?
Mm-hmm.
Okay.
Just close my eyes a little bit.
Oh, good. I will leave mine open.
I hope so.
So close now. You okay?
Yes.
Pinch?
No.
Okay.
No.
Okay, it might squirt. I hope it doesn't. Oh,
Okay.
you want to block yourself? How about blocking me? I'm aiming at
You're
you.
used to it. Ooh, there it comes.
All of that is just
Touch that. It's just, it's like skin, yeah, that's just been flaking here for years and some of it's liquefied. It's like custard. It's just so packed in there, I think. You had cream frosting in there.
So I'm so proud that he went through with it, and I know he looks really happy. He's relieved to have it out. He's kind of like being himself again.
So nice to see you.
Thank you.
You're so welcome. You shouldn't feel anything other than my just kind of touching you, okay? Okay, you just make sure nothing ever hurts, okay?
I'm here with Monica, who has a large birthmark on her face. I've tried to remove this before, but was not very successful. I'm using a different method for removal of this growth and also pain management.
You're doing awesome. Let me know if anything hurts.
My neck is really sore. Can you push down any harder on my face?
You're so high maintenance.
I am, thank you. See, she recognizes all this.
I think Monica is doing so much better this time around.
Oh, sorry.
No.
I'm sorry.
Ow, ow, ow,
Okay,
ow.
okay.
Ow, 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 ow.
Okay, okay.
That was the worst one.
Oh, I'm sorry. I'm so sorry.
Maybe she's more familiar with the surroundings, more familiar with me. But I also think she feels a little bit more in control of this situation. And I think that is really key in her getting this done.
You can tell I'm not feeling this because I would not be talking.
Yes, I know.
I'm a giver, though. That's my problem.
Give people a hard time, you mean?
Bam, bam, yep, you got it.
Monica's a different person this time around. She's a little more brazen, and I'm going with that because I think that that's helping her. And if I have to take a little lip during that, I'll take it.
All right.
Right now, I'm not feeling any pain whatsoever. Like, I can't even feel my whole face.
Okay, let me put some stitches right there.
The tough part is over, and I couldn't be happier. I removed a pretty large growth on Monica's cheek, and no pain from her. She handled this like a champ.
It's looking good, though. Looking good. You're in a considerably better mood than when you first were here.
I don't feel anything.
Now I'm gonna finish stitching her up. I cannot wait to show her her results. I really think this is gonna make a big difference in her life.
Okay, let me just take this down for me a minute. Now, how are you with soreness? Can you sit still for longer?
Yeah.
Yeah, you think so? I can take off that little bump right there.
Okay.
And also the one along your lip here, okay? Let me just put a little numbing there, okay?
I'm gonna move on to her lip and remove part of the growth there. And I think if I can finish this up, she's gonna be so happy with this.
Keep those eyes closed. I'm just gonna reach up here and take a little bit from around this lip here. You okay? Nothing hurts, right? Okay, almost done. Almost done, almost done. You okay, huh? Okay. Okay, this is a little awkward here because you have sutures that are like right over your lip, like they're gonna poke, you know, when you're eating kind of thing. So just be reminded of me, I suppose. 7 days. I know. Hey, I'm not making them real long like goat hairs or anything, okay? So be happy about that. Can you pass me the mirror? Okay, you ready to see what we did? And hopefully tell me what you think about what we did, and here you go.
Am I still shaking?
Oh, no.
Oh, yeah, that looks a lot better.
So look at it straight on, like, you know how you kind of feel like you have like sticking out?
It looks
That's gonna be a little line, right,
smoother.
instead?
Yeah. What about?
I can't take off the whole thing because that would be too much stretch, right?
Okay.
See, you're always like, what about this?
No, it's just, I'm wondering, like,
Yeah, I know.
geez. It's a real confidence booster in me. Looking at myself in the mirror this time, damn, she really smoothed it out and took a huge chunk out of my face.
Okay, let's see what's under here. Don't want this to get on us first thing in the morning, so I'm gonna block it a little bit. I'm feeling it's gonna try to squirt us. I'm gonna just push this one here. This one is liquefied. You definitely manhandle these things. So I see the sac here, which is nice because it's coming off of you pretty well. To ooze, careful, keep an eye on that. Okay, that one is off of you.
One down, and that really wasn't terribly difficult. If I can keep at this pace, I will be able to remove all of his cysts. However, right now I'm about to tackle the cysts that he admits he has poked and pushed on the most, and I really don't even know where exactly to start.
Okay, this one's a little bit thicker, and there's a little one on the side here hiding out, so. I feel like if I can get this out under here, I can take it out whole, but it's a weird shape. I mean, there's maybe a triple here, actually. Triple, not a double. And then actually it might be a quadruple. Sometimes you can get what's called a proliferating pilar cyst that's a bunch of little ones connected together.
Proliferating pilar cysts are pretty rare, and partially removing it with this trauma has probably caused another cyst to grow in the area, and that's why you sort of get these bubbles of cysts. When I see that, I know that there's just a big old mess here.
Jeez Louise. Not the biggest we've ever removed, but kind of like the most complicated here. Now, if I squeeze that, I might just be able to pull it out. Yeah, you got some scar tissue in here, I do think. Guy, man, he's a bugger, let me tell you.
Guess what? He's gone.
Yeah, I just want to get this last little bit here. Well, like a little lima bean in here. I don't like lima beans.
Ken literally has cysts on top of cysts. However, I'm keeping up a pretty good pace, so I'm gonna see if I can knock out a couple more.
This is bigger than it looks. All right, I'm gonna squeeze it, guys. Ooh, sorry, I'm so excited. Yours are all pretty liquidy. This one, would you smush that a little bit?
Yeah.
Yeah, your old ones, man, they got legs. There's still something else here. Hold on, there's still something there, I think. It looks like a nut he's got over here. Oops, a lot. It's like a macadamia nut.
I removed 3 of the largest cysts on Ken's scalp, but it seemed more to me like 7 cysts. There's one more that I think I can take care of before sending him home.
Here we go. Yeah. Way easier than earlier. Well, this one, I don't think you mashed this one as much. You were occupied with the other ones.
This is one of the most complicated pilar cyst removals I've ever done, but I successfully removed the biggest and most bothersome cyst from Ken's scalp. And I think that Ken is gonna be pretty pleased with the results.
Okay, so a little bit of pinch here, okay?
Okay.
It's like it's very thin, the part that connects the two, but if you let it fall, it will actually be wider. You know what I mean?
Yeah.
Like it stretches.
I need to make the incision at the thinnest part of the stalk, and that is a little bit elevated from the surface of his tush. So that means there's a little bit of it sticking up. That's important because I wanna have a little extra skin just so that I know that I have less tension on the wound edges so that he doesn't squat down and this whole thing splits open. But on the other hand, I also don't wanna leave too much so that there's a little horn sticking out. I mean, this is like Goldilocks right here. I don't wanna have it too bumpy, I don't wanna have it too horny. I want it just right.
All right, you ready to get this thing off of you? Make sure I'm not hurting you, okay? Right? Nothing sharp?
Nope. It's definitely a sigh of relief to know that something that I felt like held me back for so long can finally just be gone.
I'm sure it interfered with your outfits.
Yes.
Your costumes.
Let me see now. Is this a little lipoma that's attached to like the edge of it? I think so. Okay. There's a little friend there. I'm just trying to close this little area here.
Okay.
So that it sits flat.
Corey's growth is a lipoma, after all, which is a good thing because this is a benign growth. The thing is that I still have a little bit of a stalk left, so now I really have to try to flatten that. And so I need to try to remove a lot of the fat inside that's propping up these sides of skin and really try to flatten this down, but not take out too much either that there's not enough skin to close this tight.
It's hard to pull it. It's tight, man. He's got a tight tush. Probably all those heels.
Yeah.
Almost there. Aw, that looks cute.
His butt is beautifully rounded and it matches the other side. I just want this area to be able to flex really easily while he's on stage dancing in those heels.
You will start on this little one. So one little pinch here, okay? Just like that. You okay?
Mm-hmm.
Good.
The last time Adam had one of his cysts removed, it was an extremely traumatic experience for him. So I decided that the first one that I would try to remove is the smallest one. I think that that will be really good to gauge his tolerance level because this is a cyst circle of trust. I really need to gain his trust so he can let me remove these.
Let's take a look and see. You okay? I'm doing a little tug. I know you can kind of hear it.
Dr. Lee's working on my head. It's like someone's inside your skin and pulling up from above. There's squelching and squishing and bursting noises.
This one is just a little bluish color. I kind of squeezed some of it out so that I can grab that little sac around it.
This is actually like a cool archaeological dig. I mean, I removed this first one and it's blue. Blue is weird. I've never seen blue before, but there's something called the Tyndall effect, which is when you have color that is deeper under the skin and on the surface, it looks blue to you. If it's more of a hot pink or something with glitter or sprinkles, yeah, that's not legit. Adam's tolerated this removal really well. So let's move on to the next one and see what other kind of artifact I find.
I'm trying to squeeze it out of this hole. This one, it's super cute. 2 down.
Okay, let's see what you got under here, huh?
This is like excavating cyst henge on Adam's head. The first one was blue, The second one was really a pretty round and pink one. Who knows what we're gonna get next? It's just such an exciting mystery.
I'm just trying to make it a little bit wider so I can squeeze it out. Don't get me, please, don't get me. Did you miss me? Darn it.
Adam has a whole semicircle of cysts atop his head. He did have quite a horrible experience the first time he had one removed. I'm hoping today is gonna be a better experience for him, but it could get messy.
Sorry, little tug. That's number 3. It's not too bad though, is it? Or else you just have a good poker face? You're not like jumping up off the chair. So.
No, that's not too bad.
So Adam doesn't seem to be in any pain, so I'm gonna slowly work my way around this semicircle of cyst trust.
Ready. Yours are quite wet. I'm gonna pull a little bit on it. You've got like dried up prunes up here.
So far, I've unearthed about half of cyst henge, and this is going on way longer than I expected.
Okay, moving right along. This is slow going. These are not easy to take out. My back feels like it's gonna break.
Have to make you work for it.
Yeah, you're making me work for it.
Compared to what the last doctor was doing, Dr. Lee's having a more gentle touch, and she's conveying more of what's going on to me.
Oh, you're so close to being detached. 2 more.
I know that both Adam and I are really tired, but we've got 2 cysts left, and I really want to try to take out one of these whole.
Okay, last one. This could be liquid. Right in the crosshairs right now, potentially. Don't squirt me, don't squirt me. Totally standing right in line of it. I think we might get it out whole. All right, we got it out, and we got it out whole. We're done.
Cyst henge is no longer. It was the 8th marvel of the dermatology world, but I think that Adam's gonna be really happy because he's gonna much prefer a beautiful, smooth dome.
All right, so I'm gonna put some numbing here. It's a little baby pinch here, okay?
Luckily for Kiki, it's only her neck that you really see these steatocystomas, so that's where I'm gonna start. If all goes well, I'll be able to move on to less visible areas of her body, but at least now I know her neck will be smooth.
So I'll start over here. Just turn your head a little bit that way. Great. Let's see how the first one goes.
Oh, wow, look at that.
So it's like butter, right?
Wow.
Oh, that looked good.
I didn't know what to expect. And it was watery and oily and yellowy. Oh, you just squeezing it. It's nasty, but it's like, I'm so excited, like, to see it come out.
I know, it's like butter, right?
Yes.
So there's a sac under there.
You have to take that out?
Yeah, otherwise it'll come back.
There's an important balance here for me, trying to leave as small an incision as possible, but also trying to remove the entire sac. If I leave part of it in there, there could still be some of that oil or butter in there, and that can actually promote an infection. 3 down and probably 20 or 30 more left on the neck here. This is gonna be a long day.
Well, let's see how long I last. That's the thing.
Oh, wow, look at that. Oh, look at that. Let's hope your hand don't start.
I decided to start at her neck and move down to her groin area, time permitting, and most importantly, hand strength permitting.
Try to go quick on you, I know, so I can get as many as we can.
Yeah. Oh, wow.
It's like butter, right?
Oh,
you could oil
goodness.
something. Human butter.
Huh.
I think we got most of them there,
You can
right?
tell the
Except for those
difference.
I'm gonna lower your head a little bit. Okay, so let me see your tummy. Okay, so, shall we try to do some of the big ones?
My hand is beginning to cramp up. Imagine taking a stress ball and really squeezing it hard over and over and over again. That's what it feels like. Your hand's gonna be sore. I'm really glad, though, that we got rid of a lot of the large ones on her neck, but I do see her stomach. These are much larger than the ones on her neck, and I know they must cause her a lot of discomfort. Let's do it. We're running out of time.
I'm just nervous for you.
Nervous for me?
Yeah.
Why?
I don't know what you
Do I need a
want.
splash mask?
I don't
Splash
know what
guard?
you're going to get
What
out
are
of
you
these.
Smell like oil there.
Well, I thought it'd be pussy. Yeah, that's freaky.
I feel like the farther we go down on Kiki's body, the more stickier the steatocystomas get. I do think that there are a few big bumps on her stomach left, though, that I would really like to get, and I'm sure Kiki would like that, too.
Christy, can you help me with this one here first? You okay?
Told you.
Oh my God, I'm so sorry.
I told
Wait. I got it on her. Oh my gosh, here, my
Yeah.
dear. It was part lemming medicine.
You can never quite tell when a cyst is gonna be a squirter. It's like gambling. You never know when you're gonna hit it big, and here we go. We hit it big, and it hit Christy.
Yeah, I definitely didn't aim at you, Christy. I'm sure she's not that happy with me right now. Thank you. Sorry, Christy. All right. And let's see what we got here. Ooh. Ooh. That is ready.
It's like a waterfall.
Can I get like a chair or something? I think I need to sit down.
It's been 3 hours in surgery, Christy's been splashed, and my hands are dying. But Kiki has the most positive attitude. I really want to try to get these last big bumps off, and it will really change her life for the better.
Thank you. Do you want me to take a look at the groin area and see what you have going on there? Well, let me look at it.
I know,
I'm
I
not
know.
saying, like, yeah, let
If
me...
you would look, that'd be...
Yeah, of course I can.
Kiki has more cysts in her pubic area than her neck and her stomach combined. I really want her to leave here feeling more confident about her body and more comfortable with her husband.
Oh, wow.
The hair's in there.
Jeez. Embedded hair.
Something else under there.
Oh, there it is.
Look. Yeah,
You
there's
got it.
something else under there. Where are you? Where's another tweezer?
It's a lot of hair. Oh, my God. Oh, that's nasty. I had all that in there?
Up until now, I've been pulling out little short vellus hairs, which is expected in these type of cysts, but these are pubic hairs. They are actually really fun to remove. You're like, what could be in this one? And all of a sudden, this like thing emerges.
Cute, Christy.
That's cute. All that was in
That
there.
was tucked in this one. A little hairball.
That was a big chunk of
Yeah, that was. I didn't expect that either. I'm gonna see how long my back here lasts.
It's a bust of hair under here, I bet. See, I told you. What? Oh, my gosh. Oh, look at that. I told you. That's 2 hairs. Oh, like that's been in there forever. I wanted to take it home, but nah, I'll leave the hair. Ugh.
That's just your hairs stuck into there.
Like, why?
Because they got trapped. They grew the wrong way.
So many.
That's it, 3 hours and 62 steatocystomas later. I'm tired. Christy really took one for the team, though, and I have to thank her for that. And I especially have to thank Kiki, because we couldn't have done this without her. And I really hope that she leaves with much more confidence.
Okay, let's see what you got under here, huh?
But you're gonna feel it getting real kind of tight.
Oh, it is. Ooh.
You feeling okay?
I'm gonna use the tumescent technique, which is when we dilute the anesthesia so we can numb up more areas of the body. The technique that I use in numbing also reduces the incidence of bleeding, and that's really important because he's got 2 areas here. I'm gonna tackle the one on his leg first to really ensure that there's less bleeding there, because certainly if there's increase in bleeding, there's increase in complications, there's increase in risk, then I may not be able to proceed and tackle his neck bump as well.
Okay. Make sure nothing ever hurts, okay?
Okay.
I see the lipoma here. It's a lipoma. So I use my finger a little bit, just because it's nice, it's not sharp. Trim my nails just for this. It's actually pretty free on this side, so I'm gonna just give you a squeeze. You okay? Okay, I'll show them to you in just a second here. You're doing awesome. So, oh, it's making noises now. It does remind you of chicken a lot, doesn't it?
My wife used to love chicken broth.
Chicken broth, that's yummy. Almost gone.
Oh, wow. Oh, geez.
A lot of bumps to them. Nice and flat now.
Yeah.
Well, that was an interesting looking lipoma. It almost had little tentacles. And sometimes those are a bear to remove because all those little fingers are really stuck in there, almost like vacuum sealed in there, and they're really hard to pull out. But his just popped right out.
How did you meet your wife?
We were a grocery store romance, actually.
That's kind of cool.
I was a night stalker, and she was up in where the registers was. She would go home at like 11 o'clock, and each one of us stalkers would always walk the ladies to their car. And so I picked her, and we just hit it off.
Oh, that's lovely. Okay, so like I said, you shouldn't feel anything other than us touching you. I see the lipoma here. It's crowning right now. Are you okay?
I am.
Okay, I feel the little pockets this one has found its way into. Sometimes when I put a lot of fluid in there, it just makes it tighter too, so I just try to like loosen a little bit.
I'm here with James, who has 2 lipomas. I've already removed the one on his thigh, but the one on his neck is proving to be very difficult because they come out in little pieces. You have to pull them out, and you're never really fully satisfied that you got them all. They're just really aggravating.
It's like it's found this space, and it's been trying to grow in this tight space for a while. I don't know what's going on right here. Let me see again. I'm trying to keep this thing whole, and it's kind of not letting me. It's telling me I think I need to, if I took it out in a piece, like cut it in half, I bet you then it'll be like, it'll just slip out then. Is that to you too? I'm gonna just kind of remove this in pieces here. I'm gonna cut it pieces.
I'm gonna cut his lipoma in half because it's gonna let me see what's going on underneath there, and it will probably ensure that I have a better chance of removing this.
I'm sorry I couldn't keep this in one full piece. It wouldn't let me. It's part of it. Okay, closing it up now. You're gonna do just great, I know it. All right, so I don't know if this is like a liquidy cyst, so I'm going pretty superficial because it could get me. Yeah, this is like an eye on top of your head here. That can't be that fun.
It's definitely annoying.
It looks like Corey has a cyst. So in this case, I'm gonna puncture the cyst sac wall, squeeze out the contents, and really be able to pull that sac wall out and check the bottom of it, make sure it's not stuck to his skull.
I think we got a cyst here. Let me just cover it while I pop it. Okay. We already know how things act. We're like, okay. We only have so many changes in clothes. So you got a cyst up here, a cute cyst. I'm just squeezing it.
So at least I'm not gonna be called no devil worshiper anymore.
What?
Oh yeah, plenty of people said it was that I was a devil worshiper for having it because we're in the Bible Belt of North Carolina, so everybody's like, oh, look at this guy, he's a devil worshiper. And like older people, they were the worst.
Oh, I see. So they judged you.
Yeah.
Really by this, and also just thought you were something that you're absolutely not.
Exactly. And if you see on the internet now, a lot of people actually get that stuff done, not me.
Yeah, that body mod.
Yeah.
Let's put a little suture there and then we'll be out of here.
Despite the trauma that Corey inflicted on this cyst, it was pretty easy to remove, actually. I was able to squeeze the contents out nicely and remove the sac wall. The scar is gonna tuck really nicely in his hairline, and I think he's gonna feel really great.
You shouldn't feel anything other
Okay.
than us touching you, okay? Nothing should be sharp, nothing should be uncomfortable. You make sure to let me know if anything ever bothers you,
I sure will.
obviously, okay?
I'm smiling underneath my
Are you?
mask.
Yes, you can't even tell these days. I have to do the face scrunch.
Yes.
Because otherwise people won't know I'm smiling. It's resting face like magnified. All right, let's see what this one's gonna be like here.
It looks promising.
Well, it does. But I did feel there's a little dimple right here. There's a little band right there. I use my fingers because it's very safe that way. I kind of push around and see if I can't loosen this friend of yours that way. Oh, it looks vegan, whatever it is. Doesn't look like any bacon got a hold of.
Okay, that's fine. Guacamole, that's fine.
Yes. Okay, let's see here. Where are you connected? Just trying to pull it away from your fibrous tissue stuck to you. It's like kind of a netting that's keeping it in place.
I use my fingers to really kind of loosen around the edges and feel whether there are any fibrous bands on the undersurface or the posterior surface of this lipoma and try to free them up in some way. I can't really see under there, but my finger is helping me to see where those fibrous bands are.
I'm curious why it grew so fast, so quickly.
I almost sometimes feel like once people have an appointment here, then this thing decides to take off. That's like my answer. What the heck? Why are you growing right before I'm about to get you? If I do remove this, it's gonna fall down because it's heavy.
Okay.
Oh, I'm telling my girl here.
Oh.
So she catches
Oh,
it.
okay.
Catch it. I have to tell her because she's gonna catch it. The 5-second rule does apply here, though. We're okay if it hits the ground.
Catcher's mitt down here.
Because it's not like we're putting it back.
No way.
It's like a ketchup bottle, a fresh ketchup bottle, where you can't get the ketchup out in the beginning because there's no air under there.
Right.
That's what we're trying to get their air like introduced into there, because then it should just kind of fall off of you.
I'm here with Stacy, who has this big old lipoma on the front of her shoulder. It looks like it's gonna come out in one piece, but I never celebrate too early because there could always be some kind of last-minute issue.
Almost there, we're so close. So now it's up to me not to drop it. I'm holding on to it. Thank you. All right, it's gone.
I was a little concerned when I saw the dimpling of Stacy's lipoma before I started the removal, but luckily this thing was in one giant piece and we could slip it out really easily and I got it all out whole.
These are not tears of I'm in pain.
Are you crying?
It's tears of joy.
Oh, I didn't even know you were crying. Just don't get your tears over here.
Okay.
Okay, I'm just kidding. You know, that's so sweet. Oh, I'm so happy for you.
I can tell that Stacy is one strong woman, but I do see as well that this lipoma was certainly holding her down. And it's really nice to be a part of this transformation with her and really any patient, you know, to be able to be a part of something that I know is going to change her life for the better, both physically and emotionally.
I'm gonna pull a numbing here, that's all, okay?
I'm really excited about this procedure. It's going to be fun to do, but it is not so cut and dry as it may seem. When you lift something and you pull it up from the skin and then you snip it off, it'll leave an indentation because you're pulling it up off the skin. So I want to leave it as flat as possible and shave that area as flat as I can, which is why I'm going to use a dermablade. A dermablade is a wider blade that I can use more of a sawing motion back and forth and get really the entire surface of this growth that is attached to him and try to get it off in one smooth stroke here and get it off completely.
Okay, but you shouldn't feel anything other than me touching you. You doing okay?
Yeah. Good. Absolutely.
Maybe just come on that side if you can in case it wants to.
I have the cautery here as well.
Okay.
I'll do this for you.
Yeah, jumping around on you, is he?
No, not yet. You want to see your friend?
Oh, man.
You never seen them up that close?
No.
Seborrheic keratoses can grow back if you leave some little part of it. So any little bits and pieces that look like they may be left, I'm gonna scrape them off with a curette. A curette is a semi-sharp spoon with a hole in it. This area can bleed a little bit. Luckily, this one isn't bleeding very much, but the cautery is also going to help to destroy any little bits of seborrheic keratosis that might still be there. There's no need to put stitches in this area because that is the top of the skin edge. This is going to be his new surface of the skin.
So you shouldn't feel anything other than us touching you. We want to take that little opening out because it can grow back, especially from that area. You okay still?
Yep.
I'm here with Sharon, who has this stinky squirting cyst under her breast. She's had it removed a couple times in the past, so I really hope that there's not a lot of scar tissue here and that I can remove the cyst in its entirety so that it never comes back again.
You're doing great. Make sure nothing ever hurts. I'm just removing that little piece of skin.
I'm scared when she opens it up, it's just gonna just send everybody running for the hills. It's just nasty.
See what we got under there, okay? See it.
You see it?
Mm-hmm. I see where you're storing it. It's a little bank, a little cyst bank.
Why do they smell?
Well, it's skin cells that are wet. It's trapped under there. Mixed with sweat and dirt and, debris, that kind of thing. Every time you squeeze it out, you squeeze out a little bit, but then it fill up again. All right, so there's the little cyst bank that she's got right there. There's not much underneath there. See how it dives under, how it's a different shape because it's been removed before? Just seeing where the end of this, bottom of this cyst is here.
Yeah, the top is like a peanut. Maybe there's more underneath.
Yeah,
but...
let me just try to see if I can't take this off gently from you because there's a little scar tissue under there.
This cyst is proving to be more difficult because if you don't remove it well the first time, it's harder to remove it the second time. Sometimes it grows away from where you initially think it is on the surface of the skin.
See how it's stuck on her?
I felt that.
Okay.
Okay, I think I got 99% of the cyst out, but there's this one little edge I can see really down deep, but it seems to be hooking around some scar tissue there, and I really need to be very meticulous about trying to get the entire sac out, because if I don't, it's gonna come back again. It could be even worse.
There's scar tissue there. They make that noise though, too. That's what kept giving you stuff. It was still filling in. It was like kind of tucked in one angle. That part was just opened up a little bit, but I got the whole thing.
Just to see that it wasn't that deep at all and caused all that trouble, it was shocking that it wasn't as bad as I thought it was. And I'm grateful it wasn't as bad as I thought it was.
We're pulling up a little bit just to make it a little smaller. You okay?
Yep.
Good. Okay, you shouldn't feel anything other than my touching you, as I said. Nothing should be ever uncomfortable. You let me know if anything bothers you, okay?
All right.
See if I can tease this out even in one fell swoop. Just trying to find it here because I kind of deflated it a little bit. But it's right, I see it. I'm just right on top of it. Now I know where the sac is. It's on the underside. See if I can't rustle it out here. Make sure we're stopping it, so I'm gonna tie it off. Now, the issue is that it's right where the sac wall is. So that actually complicates things here a little bit. Again, why you gotta be so complicated?
I don't know. It's just me.
So how am I gonna get this out without, maybe it isn't attached or right next to it. But then there's this like little landmine of a vessel near me trying to block my way. So I just have to take my time. That's all I can do. I mean, that's the best I think I can do, is really to do that. Just this piece I want to get. Okay, I got half of it. Just a little nubbin right here, right next to that vessel. Right here, it kind of like dove a little bit, I feel like, and right there, that's where that depression is.
This cyst is really frustrating. The cyst sac is really stuck to the base and it's deeper in this well. And every time I pick up the cyst edges and let it go, it really sinks into that area.
So this is why you always need to respect the cysts. I'm a little concerned that I'm gonna go right where that vessel is.
Right.
Okay, it's like landmines or something. It is, okay. I feel a lot better now. Hold on a second. Let me just relax for a minute here.
The cyst is out, thank goodness. It's been a really stressful journey for Latice, but I really think this has changed her life.
Okay. Might be able to do it all today, or we might have you come back again.
Just do whatever you need to do.
There's only so much numbing that you can give any patient at any given day. Certainly at high levels, that can really affect your heart. That can actually cause toxicity to your heart. Let me numb up one side first, and let's see how well we can do this, how quickly and how efficiently with as little bleeding as possible and with the most comfort as possible.
It comes out of the little pores. Oh, sorry. That's just the numbing medicine coming out of the pores. That's why I wear all my gear, too.
Today, I'm using the surgical electrocautery loop. It cuts through tissue, but at the same time, it's going to help to seal little blood vessels there so you have less bleeding.
So she's gonna turn on this vacuum here. Make sure nothing ever hurts you. Cut that off.
Rhinophyma is really a thickening of oily skin. You get these enlarged pores that oil can store in, right? Oil and keratin, or dead skin cells. Interestingly, a lot of the size of his nose doesn't have so much to do with actual skin there. There are big pockets of butter in there. There's big pockets of oil in there. These are some of the biggest butter pockets I've ever seen.
It's doing well. It's like it's so dense in there, it gets harder to cut. Okay, so now I'm looking at his nose. See, that's where it's gonna end. So I actually don't want to go too far there. There's like little pieces of skin that I take off, and it's like bacon bits. You can feel the heat coming off of this thing. Look at all the oil coming off of it. Like there's so much oil here, it just disables this tip. It doesn't cut as well.
I am getting a lot of moisture collecting on my electrocautery tool. And this is slowing me down because it's not getting hot enough to cut through the tissue. It's not as efficient as it usually is.
Feels better already.
It does? Oh, good. I like that. It feels better. You feel like lighter, maybe. Solid tissue here. Oh, sorry. Sorry.
I can feel a little bit of pain, but I want her to keep going because I wanted her to finish it up.
Hold on, blood vessel there. We might get some more of those as we get closer down to the bottom here.
Stopping to cauterize these oozing blood vessels is certainly slowing me down, and that is something that I'm also considering because taking longer here will mean that the numbing will wear off.
I'm sorry. Damn it.
I'm trying to really efficiently shave off this extra skin from his nose. But he has a lot of oozing. He's got a lot of little pockets of butter, so to speak, and that's very much slowing me down. And these are things that I'm considering because the numbing's only gonna last so long.
It's getting smaller. You probably can see that a little out of the corner of your eye, though. You probably just want to keep your eyes closed anyways. Sorry, a little bit. Sorry. This is really oily up here.
The deeper I get, the larger pockets of oil I find.
Sometimes I think if I squeeze out more of it, maybe it'll get smaller and then I won't have to do as much.
And the bigger the blood vessels.
We're gonna put one little baby oozer there. I want it to get us.
I feel like I'm on this rhinophyma battlefield. It's like I'm hitting all these landmines of pocket butter, and I'm getting these blood vessels that want to ooze. And we have Terry who's feeling some discomfort here. So now my goal is really focused on finishing the right side of his nose as much as I can. You know, I'm going to just trudge on through and get to the end, though. I've got to get to the flag. I got to capture it.
Look at that. It's like a little treasure here, in a way. Not sure how to get this down completely. Sorry. Oh, sorry. Let me put some numbing right there. Hold on. I'm sorry, making him cry. This is hurting you, huh? A little bit? Or a lot more? When you say a little, I know it means a lot.
It's not bad.
Oh, it is. Yes, it is. This little thing here. I'm just trying to squeeze out as much of this, of the extra little stuff you got in here, because I think that's gonna lead to it being smaller too in itself.
Yeah.
Terry is such a trooper. He really sat there so patiently as we took a good amount of time, really, to remove the larger portion of rhinophyma on his nose. I think that it's unsafe for me to fully proceed here because we're really reaching the limit of a safe level of numbing that he can really receive within a 24-hour period. So I would really like to see how he heals and to come back another day and to remove the rest of it. At least now, this should improve his breathing tremendously.
You are definitely a two-timer, but we're getting it. I've definitely made a difference here, for sure. Okay, I'm gonna sit you up for a second, let you take off the little piece of skin on you. Just gonna show you though, what you have so far. Oh, let's take that out of your nose.
Oh, yeah. Yeah, it's a lot better.
Yeah, a lot better.
Unbelievable.
Right, it looks good on that side.
I feel happier about myself when I look in the mirror now. It's a big difference. Big improvement. Can surely breathe better already.
I'd love to see you like in about a month, because it's gonna take a couple weeks for it to heal.
Feel great. Feel great. I can breathe better already. I was wanting it all to get done in one day, but whatever it takes.
Just one little baby pinch, okay? Are you okay? I know, I'm getting close to your eyelid edge.
I'm here with Austin, and he has a birthmark really close to his eye. The skin around the eyelid is the most thinnest skin on the body. It is very delicate there, and you only have so much of it. There's no margin for error here.
The issue with it is that it's so close to the edge of your eye. As it constricts, as it heals, it kind of can pull a little on your eye. So I'm trying to take this off flush without pulling on this.
I'm creating a really taut surface in order to remove this as flat as possible. I'm alternating between using a scalpel and a scissor, really depending on the shape of the tissue that I'm trying to remove. If something is really flat, a scalpel is better for me to get it nice and flat. And if something's more raised up, I can really grip it with a scissor and grab it and take it off flush.
Now let's do the part that's on the edge of your eye. Same thing, but I'm gonna pull on you a little bit more even.
The last remaining section of Austin's birthmark is really the most riskiest to remove. I want to make sure I remove the perfect amount. I don't want to go to a depth that causes a little poorer wound healing, and not too little that I leave him with a brown mark that is more visible. So you have to have steady hands in this instance.
I think I got this all cleared out.
Thankfully, I was able to remove the entire birthmark here and try to leave as little trauma to the skin as possible. He may always know that there's a scar there, but my whole goal here is to try to make it that other people don't see it.
It looks good.
The neck is always a delicate area. I mean, I try to minimize any sharp instruments. And I think that this really necessitates me squeezing this out and then slowly and delicately try to tease it away.
Nothing should be sharp or uncomfortable or anything. I have a feeling this is pretty thin here. It's always nice to get them out whole because it's kind of a challenge, number one, and number two, then we know we got it all. The one thing that I was more concerned with, there was like a pulse right here. There's a blood vessel, a pretty big one underneath here. So obviously I'm just being very careful trying to remove this and staying well above that. It is kind of stuck to her muscles there a little because when she sniffs, it kind of moves a little bit.
Oh, really?
I'm getting more and more concerned about this pulsating artery that's right next to Mary Jo's cyst.
Okay, sorry.
That's all right.
Yeah, I might need to just pop him. Okay, everybody, you ready? I'm gonna snip in and squeeze it. I think it's not gonna squirt at us because I think it's just like pure mashed potatoes. Okay. Just pushing on it shouldn't hurt again, just weird pipe squeezing. Let's take a look and see what I see here first. Okay, that makes it easier to see. Work on, see, this is where her little vessel is there. I'm just trying to look at it and not go close to it.
Now that I've deflated the cyst, I need to slowly and still carefully remove the sac wall, and it's really adherent to fascia or muscle below. If I don't, there's a chance that it can recur again.
Just regrouping for a second. You can pull that off for just a second. Let me look at all over the place again. You can see that angle of her vessel pulsing. Good, looks good. That's it there. Thank you. We got it.
All right. Thank goodness that this was intact and it was pristine, because I was expecting there to be a lot of scar tissue, and I was very worried that it was going to be wrapped around these important arteries. I'm very confident that this is not going to grow back because I saw the entire cyst removed.
It was 2 months ago that Dr. Lee treated me the first time. I was anxious to go back, and a month ago she did the left side.
You did great the last time, so I know you're gonna do great this time.
She finished the job, and she just did great. Now they're both done, and everything about my life has gotten better. It looks like my old nose. Now when I sleep, I don't have to hold my nose up. Just great to feel normal, be able to go out in public and not feel like people are staring at me. I'm just real happy.
I'm gonna put some numbing here and then just let it get nice and numb.
Is this like gonna be a needle or?
Like, what do you mean? Like
Is it a needle? Like,
yeah, it's a little baby needle.
I'm not a big fan of needles. I'm a person that's never had stitches. I've never broken a bone. I've never had major surgery beyond a root canal.
Just gonna put a little gauze right against here. You might feel just a little baby pinch. You okay? You hate needles? Is this gonna be terrible for you?
I hate needles.
Great, just fine. Let's see if we can see your little friend here.
Okay.
You're gonna hear a buzzing noise. Can you come just hold the edges there? Buzzing. You okay? Just got scared by the sound?
Yeah.
What's that?
I can feel that a little bit.
You felt what? A sharpness? Or you can feel me pushing on you, okay? You shouldn't feel anything sharp though, but you can feel me pushing you on here.
Yeah, I'm okay.
So everything's going great. I see it, okay? I'm just moving it around. Hard to get one to pop out whole in the head.
Anytime I have a patient that is really afraid of going through a procedure, I'd make a smaller incision here, try to pull this out in pieces, because I think the more that I incise, the more you hear that cutting, it's really gonna freak her out.
Sorry, all these lovely noises you're hearing. I think, see, a lot of times for people, once we start doing it, they realize this is it, that you know, it's not so bad. Yeah, of course, let us know along the way, okay?
Okay.
Just plugging away at this. It's like a never-ending lipoma. It's still there. It just comes out in pieces because it's like stuck kind of at the base. It's like a mochi ball, or you can't just pull it and tug it out because it's like it'll tear, you know?
Yeah.
Taking this out piece by piece seems to have calmed Jacqueline a little bit, but there's still some in there, and I'm finding that I have to really progress a little bit more widely, a little more deeply to get this out fully, and I really hope that Jacqueline can tolerate this.
It's like never ending. I keep getting more of it. It's like in these tunnels right here.
I can feel my head getting lighter and the pressure relieving. All that tension that was there for so long is just releasing.
Oh, sorry. Okay.
Sorry, that scared me.
We're getting there.
I hate that Jacqueline is this uncomfortable, but this lipoma was really deceiving. It is much wider with these sort of like octopus tentacles. So that just takes a little more time, a little more tugging, because I don't want to leave any of those little arms in there or any of those little fingers.
Oh, it's right there. It's tangled in this. Come this way. Ow. Oh, sorry. Oh, I can see it right here. Yes, I got it. All right, you did great there.
I think Jacqueline's fear of pain almost psyched her out, but she really ended up being a trooper. So I'm proud of her for that. I feel pretty confident that I got rid of it completely and that she can leave California with a lot less on her mind. You should not feel anything other than us touching you.
Okay.
I have Shane with me now, and he has a cyst right in the corner of his eye. It looks pretty superficial, but the fact that it's in this area that we call the triangle of death, it's not that it has a higher risk of getting an infection here, but if you do get one, there are potentially worse consequences.
Okay, so the cyst here is pretty tight, so it's going to probably be right under the skin here. I see it. It almost looks like an eyeball you got next to your eyeball. What should I do? Should I poke, squeeze it out, or? This is always the point where I'm like, okay, which one should I do?
I like getting cysts out whole, but in this case, Shane's cyst wall was really thin and it was going to break anyways. So it's better that I make an incision and squeeze out the contents first and then try to make sure I get all the cyst sac out.
Just gonna push.
Okay.
You okay?
Mm-hmm.
Good. I'm sorry I'm pushing into your eyeball, I almost feel like, but
fine.
I got half of it out.
All right.
Clear up this stuff. It's like mashed potatoes that need a little more milk.
Delicious.
Just trying to get underneath this to pull it out all the way. It's stuck me down there.
Of course, the cyst is really stubborn, but luckily it is not growing in the direction of his eyeball, so I can still be aggressive enough to try to remove the entire sac wall and feel safe that we're not really going into any major danger zones.
Okay, let that go. Let me just make sure I got it all. I'm gonna just do a little double check. Let me look with that.
I'm happy that the cyst came out completely. And I do know that this area is much easier to hide a scar because it's sort of sunken in. So it should really heal very well in this area.
Normally you could see it out of the corner of your eye, right?
Usually I see the little black spot, and I can't see that. Oh, wow. I feel like a completely different person.
You're so handsome.
Thank you.
Hold on, I'm gonna poke one little. Don't spray us. Might be that part. Yeah, it's gonna come out. It's like egg yolk. Oh, yeah.
I have noticed that Angela's cysts are pretty liquefied, so I'm gonna try to see if I can aspirate some of the fluid first, deflate it a little bit to make it more manageable and less messy.
You okay?
We're okay, yes. Oh, we're okay.
I think she was asking me.
It looks like orange juice.
Oh, no way.
It's a mimosa.
It's a mimosa.
This program examines dermatological conditions and the procedures involved with treating them. Due to the graphic nature, viewer discretion is advised.
Okay, you ready to get this thing out of here? I feel like you are.
Yeah, let's get it out.
I'm just kind of feeling around with my fingers just to see, explore like where this bump is. I think it's just still just right under here.
I'm here with Gabe, who is an extremely nervous patient, so I'm trying to talk him through this, making sure he stays nice and calm. I think that this is probably a nice, perfect, just ball of a lipoma. Hopefully I can just pop it out in one nice, simple pop.
I'm just trying to be very gentle here because there's just cute little veins that want to look at me and say, you really want to mess with me? I'm not trying to play with them.
Yeah, it's like cellophane wrapped.
Yeah.
Every lipoma looks different, so really when I take a peek at this one, it's got some very interesting features. It is intertwined in this sort of cellophane wrap. It's really kind of keeping that lipoma intact, But there's also this really big blood vessel there. And those always give me a little pause, and I try my best not to sever them when I can.
So I'm trying to slowly peel away these layers of cellophane. He likes you. You're a good guy, though. I could see why.
It's very impressive.
Yes, it is.
It is impressive looking.
Have you ever bought a product that is shrink wrapped? And so it's wrapped in this sort of cellophane. That's like what this lipoma is like, because once you kind of cut into it, then you see it expand. It really got big. This was a lot bigger lipoma than it first appeared.
You know what it's like? Have you ever bought those bean bags that are from like China and they're all stuffed really tight in this airtight bag?
Yeah.
And then you open it and it's like, oh, it's expanding, it's getting bigger. Yeah. And then I feel like I could twist it and it will come off. It's like a bolt or something. Come on now, dude. Just come to mama here. Just like that. He's off of you.
Yeah?
Yeah, he's off of you. We got it. That was bigger than I originally thought. It's a football.
Really?
Yeah, it's a football. I'm so proud of you. You ready to see what it looks like?
Yeah. Wow. That's so awesome.
I look in the mirror and I just see a flat spot. I see symmetrical shoulders. It's just a great vision right now. My shoulder's like this. It's been so long.
This was the top of it, right?
Holy smokes.
See that? This is like 3 or 4 layers right here.
Any side effects, you think? Or
Of us removing this?
Yeah, what possible side effects? It won't go back or anything.
There's a chance if there's some deeper component to it, there's probably gonna still be a little bit of it left.
Okay.
That there's like a deeper component sometimes, but I'm trying to keep this pretty superficial here.
Okay.
I'm here with lovable Lorne, and he's got these neurofibromas on his face that I know that he hates. This one here on his neck is a plexiform neurofibroma, and it's almost like an iceberg on the surface, and what could be going on underneath, I'm not quite so sure. And Lorne is really smart to ask me about this.
There's still neurofibroma tissue here. I can see it. And I'm sure, like, if we sliced into you like a loaf of bread, there'd be quite a lot more than average neurofibroma tissue in you. So, you could also be just going into another one,
I trust your judgment.
Well, you're gonna be able to see the results in just a bit here, so. Okay, that's one down.
Lorne's concerned about side effects, but he doesn't have to worry because I think we removed it enough to really make it nice and flat in the area, and it didn't look like I encountered any big, important vessels. Now I'm gonna remove the other one, the cute one. You're doing great, but everything looks good. You doing okay? Okay, good. Good, good, good. You're doing awesome.
That was very painless, thank you.
Oh, that's good. A little buzzing sound you're gonna hear. Nothing should hurt, okay? It just stops little baby blood vessels if they're oozing. Sorry, it smells like bacon or something.
Getting hungry, actually.
What?
Yeah.
Are you about to ask us out to dinner?
Okay.
He's pretty sharp. He made us feel like we're asking him out to dinner.
I was able to remove Lorne's super cute little chin baby bottom, and I think he's gonna look fabulous. I can't wait to see the results.
All right, you ready to take a look?
Yes, I am.
And hold your mirror up there.
Oh my God.
A little easy right here on the bottom.
They're both gone.
Yeah, so this is swollen, that's all, okay? Just swollen, a little line there that will take out the sutures, and you just have a fine line there.
Okay. I am so happy right now. I mean, seeing myself in the mirror for the first time is taking all my control not to start crying. Wow. I am the happiest I've been in a long time.
It's the last time you see your dad with this, hopefully. You okay, right, sweetie?
I'm good.
Mr. Rubin, okay. Good. You're gonna hear a little buzzing noise because I'm just gonna stop little baby blood vessels.
I'm here with Reuben, who is a big, tough, scaredy cat, and Bella, his daughter, who is so sweet but really keeps him in check. I'm about to tackle this lipoma on the back of Ruben's head. I am anticipating a lot of bleeding, but I'm going to zap every blood vessel that I see to help to minimize this.
So it's totally visible now, right?
Yeah. Right? Does it look like what you thought it would?
Mm-hmm.
Yeah.
Uncooked chicken?
Does it make you hungry?
No, not really.
Good, good. I'm gonna squeeze you here, Daddy. See if it's ready to pop. This lipoma is looking good. I mean, I've never had a lipoma pop out whole on the scalp before, though, so I don't have a lot of faith that this lipoma does not have something up its sleeve. Sometimes they're like solid, and they would come out whole, but I think this one's maybe a little bit, maybe. Ooh, he talked to us, too.
Those are some weird noises.
Yeah. You okay? That's mainly bumpy. See him?
Kind of cute, isn't he? Yeah.
This lipoma was awesome because it popped out whole, it wasn't super messy, and I got to leave this incision line short. I think Bella was really good luck. Now it's swollen because we put numbing still under there, so it's still under there. So Ruben may look like the superhero, but Bella is the true hero here. Because of her, he got his lipoma removed. Good job, Bella. Very proud of you.
Probably what makes me happy about today is being able to share it with my daughter. You know, she's been through it the whole time, and she is the driving force behind me getting this done. It was a great experience.
That's crazy. You're right about that raw chicken, though.
I told you.
Can you see it normally when you look in the mirror?
Oh, yeah.
It's just a little bit bumpy on the edges. That'll flatten down because it's just filled with numbing fluid there.
My life's totally gonna change in terms of physically, professionally, emotionally, you know, and that's a big part of what I plan to do with her. She's missed out, I've missed out. I feel like I'm gonna be back to me again, you know?
You can wear this the rest of the day if you want to. It's yours. Bye.
I'm definitely proud of my dad, and I'm happy that he feels like he's in control of his life, not just the bump is.
Okay, so I'm gonna put one little baby pinch in here, okay? I just wanted to avoid the vein, see if I can pull it out of this socket that it's in, and then decide how we're going to fix you up. I'm really planning out my surgery beforehand, paying attention to where this vein is. The armpit's pretty dark and almost like a little cave, and I don't want to nick something that I can't see, so it's much better to use my fingers and to use rounded tip instruments. Okay, and you shouldn't feel anything other than us touching you. Nothing should be sharp, okay? That's the main point. And it's a lipoma. I'm gonna squeeze it here. Oh, I thought it was gonna give me a nice pop. Not yet. I'm just taking my time and making sure that we're not hurting you at all. The lipoma does not contain the vein. It's the skin that has the vein in it. And so when I'm removing this lipoma, I'm really dissecting very carefully the skin from the lipoma. It's a lot like peeling the rind off a lime. And this means getting your fingers under there and really kind of pushing gently and really trying to not damage the lipoma, but also not damage the skin. It's like attached right here. So Margarita has a lipoma that is pedunculated. It's hanging from a small stalk, which is great, but it really is positioned in one of the worst possible places. It is very close to her brachial plexus. It's like a really choice lime on a tree, and you want to cut it, but right next to there is a beehive. Just wants to hold on. Almost got it all out. It's gone. It's gone. So I can see the vein right here, underneath there. I removed the lipoma safely, but that big vein is still attached to the skin. So I'm going to tie off the ends and really promote sealing or closing down of this vein. And because it's closed and it's not patent anymore, your body just absorbs it.
Okay. So it looks like we tied it off successfully. Just taking off that extra skin here.
I really need to manage removing some of that extra skin so you can keep this as neat and as normal looking as possible.
Well, let's put some stitches in there first and see, and then we'll trim the edges. The nice thing about this is it does do a natural tuck in this area because it's your armpit, you know, it tucks in there.
This is a really tough area to stitch and make it look good, but I really wanted to fashion an L-shaped stitch that will tuck really well into the dip of her armpit. And I think she's gonna be really happy with this.
So take a look here, okay?
I am amazed. When I first saw my arm, I just said, wow, I feel great. I'm just happy. It's gone. It's 100% better.
And look at this.
I can't believe it.
You want to hold it? Put gloves on you.
No,
Put gloves.
No, no, no.
It's just like getting a chicken. You're cooking chicken.
No.
Pollo asada.
Pollo loco.
I'm so excited for the
Thank
fun
you,
that you're going to have.
Thank you.
Oh, you're so
from the
welcome.
bottom of my heart.
Oh, you're so welcome. So what I'm going to do is I'm going to put a little numbing in and let it sit for a couple minutes here, okay?
Because of the nature of this lesion, although it is large, I don't like that on him. It's just important to get something like that looks like that off as quickly as possible. If you take off an entire area that you strongly suspect is a skin cancer, you're gonna get a more accurate idea of what is involved.
Okay. You shouldn't feel anything other than us touching you, as you know, okay? Well, this is not a very pretty thing. You're pretty, but this thing's not that pretty.
Yeah, I told people before it was a welding accident at work.
Now you can say you were attacked by a 5-foot-tall woman.
That's right. It is pretty gross.
Just trying to be very gentle.
Yes. I'm so thrilled.
So see, there's still some substance right here. I'm gonna take that off too.
The main part of Bradley's mushroom growth has been removed, but as I do that, I can see grossly that this growth is diving down deeper below the surface of the skin. And I do really want to tackle that and remove that as best as I can. But on the other hand, too, that also is an indicator that this is more involved and it's really not the greatest sign to see.
Let me just take a look and feel this for a second. See, it's still underneath there. Let me try to take that a little bit more there. I'm just trying to... That looks better. That looks better. All right, so I'm gonna just put some stitches like this way. Good, you did great.
Thank you. So did you.
Why, thank you. I took out whatever I could see from Brad safely, and my job here is done. Now I pass the job on to the dermatopathologist who's gonna analyze this tissue so that we can move forward here and give Brad more information.
Now you're not gonna have that hamburger meat right there, right?
That's right.
So we're gonna send that tissue in. The thing is, I feel like there's a chance there's gonna be something else done here.
Okay.
You know, it depends what the diagnosis is.
Yeah. I'm ecstatic. Having this removed is a weight off my shoulders. I can do things that I couldn't because I was always afraid of banging this thing open. And I'll be glad not to be oozing and bleeding. And I'm happy that I'll be able to go back to swimming and socializing and not worrying that I'm gonna be grossing people out.
So I'll be giving you a call soon, once we find out the results and everything. This is not the end of it. We gotta just figure out what this is first and then decide what we're gonna do from then on, okay?
Okay.
You shouldn't feel anything other than us touching you, okay?
I'm here with Jeremy, our friendly Texas minister. He has a bump that is just on his upper leg. There is a stalk of skin that's connecting this bump to the rest of his body, and I'm sure that is chock full of blood vessels. So I hope the Lord is with me on this one.
Oh, look at that cute lipoma under there, just wanting to come out. Okay, let's see if I can't get this thing off of here. I'm gonna make a little buzzing noise here. Buzz that bottom there. You okay there, right?
Right away, of course, I see some oozing blood vessels, so I want to make sure I use my cautery tool and really get them before they get out of control. You hit a little arterial, it becomes a lot more complicated. You can't seal a vessel if there's too much liquid around it.
Still doesn't want to detach from you.
Say it's hard to say goodbye to friends, right?
Maybe you should have a different mantra, a different saying. I got it off. Okay, I'm gonna take a little bit extra because I know that this area will tend to want to open up. I'm concerned about your bending, and the more you bend, the more the scar can like spread too.
You don't have to be too pretty. Nobody's gonna see it. So.
No, we want it to be pretty.
This area that we're suturing up is probably one of the areas that are under the most significant tension. Imagine the crease of your tush. If you were to squat down, obviously that area stretches a lot. My goal is to leave a little bit of extra skin there so that there is just a little extra flex and we minimize the risk of suture splitting.
There's a little smile.
I always try to walk away with a smile.
Well, now you are literally gonna walk away with a smile.
I left him with a grin on his face and a smile on his tush. Amen to that.
Is it weird to sit down? It's the first time you sat down and not have to adjust
About 4
anything.
years, yeah.
That's nice, isn't it? It's
Yes,
nice to
thank
do
you.
that.
Well, I'm feeling good. I think Dr. Lee may have very well found her calling as a doctor. My family and my friends, they've been praying that God would heal me, and he sent me Dr. Lee.
You want to see your little friend here? There's your friend. He's like a hermit crab.
Kind of does look like a crab, doesn't
Doesn't
it? So it was, in fact, the lipoma then, wasn't it?
Yeah, looks like a lipoma. This would kind of like
right
herniate out. You see that? And then you could stick it back in like a purse. It's on this little pouch here. You did awesome.
Thank you. Can I pray with you before you leave?
Oh, yes.
Heavenly Father God, I thank you today for Dr. Lee. I thank you for the talent and the skill you've given her. Amen.
Thank you. Can I give you a hug too?
Yes.
Thank you so much.
Thank you.
I'm psyched and relieved that my bump is gone. I know that without my friend, I can be the best pastor that I can be. Leave people with a smile and joy in their hearts, just like she did me today.
Let's see what we got here. Yeah, this looks like a pilar cyst.
Okay.
So I'm gonna just start to try to remove this here. I try to take it out whole usually, but sometimes these ones that are bigger, they're harder to get out whole.
Okay.
So the nice thing is that you're in control. Remember again, if you feel any little pinches, just let me know. Just trying to relax you.
I know.
Todd's bump is indeed a cyst, a pilar cyst to be specific, versus an epidermoid cyst, which really makes sense because it's thicker walled and it was able to maintain this sort of oblong shape, as it grew. This thing really is as hard as a rock. I think I'm able to get it out whole, but I also need to be conscious of preserving enough skin so that I can close this properly.
Looking pretty good so far.
Not a lot of bleeding?
No, nothing crazy. It looks like it's separating really well and behaving for us, so that's what I like to see. It's kind of like going to the spa and getting a massage, huh?
Never been to one.
Just kidding. Oh, then it is. It's just like that.
Okay. Now, how many have you seen of these? Look, I got.
Everybody's unique. Yours got one that really likes to stick up. I mean, you're like got tough skin, I guess. Yours was resilient. It didn't really want to break through. This tells me you're a tough one. You're a tough guy. Otherwise, everything's looking really good.
I'm actually a little more relaxed now.
Yeah, right?
I'm still worried, but Dr. Lee talked to me, and that's making me feel comfortable. Just conversing with her.
Almost got it all.
Done. I was able to remove Todd's cyst hole, and he really handled it so well. Now that I've removed the cyst, my next big task is to make sure I evaluate this preserved tissue and choose the right tissue to close this so that it looks its best.
Pretty much over. I'm just trying to keep it looking pretty here now. We've kind of taken what we call a flap, like we've moved tissue from the top, you know, into like a little smile shape. We're gonna make you a little smile scar.
I want to leave Todd with as pretty a scar as possible, especially because this is a really prominent area of his face. You can't miss it. So I really want to create a curvilinear scar in a smile shape because that really allowed me to preserve much more of the thicker non-red tissue.
So when I show you your forehead,
oh boy.
It's going to be puffy because I put numbing, a lot of numbing there.
Well, I kind of figured it would be something like that, yeah. But the thing is, it's not there. Holy crap.
We put a little smile on you.
Oh, wow, here it's gone. Holy crap.
That's a big deal.
25 years.
Yeah, that's a long time. Can't believe it, huh? Oh.
Sorry.
It's okay. I'm so happy for you. I'm really happy for you.
It's surreal. 25 years, it's gone. So, I don't know, it's just, it's gone. That's all I can say, it's gone. I'm happy, it's gone.
So I'm going to put some numbing here. So just a little baby pinch on the surface.
This is lancing, squeezing, draining, sac removal, repeat. It's like your job was to remove staples from all these reams of paper, and you had to use the little staple remover and squeeze and squeeze and squeeze hundreds of times. Your hand would not feel very good. And so I just need to pace myself so that my hands don't get too tired.
Make sure I'm never hurting you as always, okay? Got one of them.
I don't feel nothing.
Good. Why don't you look down right now and you can see? Can you see that?
I don't want to.
Okay.
Oh, wow. Yeah, that's it.
So that's one of them. We squeezed it out, and you can see how much flatter those two are. But there's a couple under there still, below that, so.
Steatocystomas can often feel like the seeds you see when you see kelp that washes up from the beach. It's like these little pods that hang off this vine. And sometimes it's very confounding because you will remove a couple good ones and you're like, oh, I got this area. But then there's like two underneath disguised by the other ones.
I just pierce it.
Get it, girl.
Yeah. What makes it hard is that's actually sometimes hard to grasp this sac wall.
Removing the cyst sac means it's less likely to come back because you took it out. But it's very slippery and thin. You have to grab it really tightly and just try to snuggle it or wiggle it. It is very hard on my hands.
Oh, wow, look at that. Oh, my goodness.
You see? Sexy flat armpits.
Right?
See? See that sac?
Oh, there, get it.
There's a second one there. Or maybe it's part of it and was attached. See, look, there's another one, right? See?
Whoa. So
See that? There was another little one under there. You okay?
Oh, yeah, I'm good.
Look, another little.
Oh, wow.
They're like all connected.
Wow.
I feel like I've been doing this for hours and I haven't finished one arm. My hands are really cramping up. They're killing me and it's really worrying me because I'm not sure how many more I can do of this.
Like my hand freezes sometimes when I'm doing this because I squeeze so hard. Oh my God, my hand just froze up. Okay. Oh my gosh.
All right, you shall we move to your chest?
Yeah.
Let's do it.
Oh, yes. Get it, girl. Just get it. This is...
It's cathartic.
Yeah.
My hands are almost numb, but I just have one more and that's it.
Oh, that's a...
You just made it happen.
Wow, that's like a donut.
The cream-filled donut. Woo, okay. Done. Your chest.
Yeah,
Good
look at that
chest,
definition.
man. Yes. Okay, people, we're on the last little bit here. Okay.
Oh my goodness, the one on the neck.
Yes, I know, we gotta get that.
The
Before you
fake
go. The fake Adam's apple. That'll be a nice one. This has just been a steatocystoma storm. I feel like I need to take a hand nap. But we have this one more really prominent on his Adam's apple, and I know it's gonna make him really happy for me to take care of that. So I'm just gonna not listen to my hands screaming and just do this last one. Almost got it all out.
Yeah.
Done.
Wow, that's my Adam's apple?
Can you swallow?
Oh my goodness.
I think these are gonna heal spectacularly. Not only is he gonna look physically better, he's gonna feel so much better mentally. And it's really gonna up his drag performing game. Look at how fabulous you look. I'm just so happy for you.
I'm like 2 chest sizes smaller. I just got a reduction.
Yes.
I am so excited. I haven't seen my chest since freshman year in high school. I can live with the scar, but I just could not live with these cysts anymore.
I really feel honored to know you and just like how much you're giving to the world. So I'm really happy that I get to participate in your life, really.
Now that I've gotten this procedure done, all those limits that I was telling myself I can't do based off of my skin, I no longer have that. It's gonna build confidence, not just within myself, but is in the characters that I portray, because I'm not gonna have to hide everything.
Trying to decide which one I want gone worst. I think that one.
I would think so. This one is like out there. Almost got him. It's almost gone. All right, we got our little friend here. That's a pilar cyst too, I think. You're doing great.
Feel better already.
Oh, good. The one that we removed on her elbow, it's a pilar cyst, just like I said. Now let me move on to the more pronounced bumps on the top of her head. Just pushing on you. Okay, I'm gonna turn your head to the side. Yeah, exactly.
Did that one come out in one piece?
Mm-hmm. They look like cute mushrooms, and they come out pretty easily. And that gives me the time to be able to work on the ones on the back of her scalp. And they're really in a cluster. I think they're gonna be a lot harder to remove. Okay, let me see now. Okay, there's one down. Got these in some nooks. That was a little booger.
Ow.
Oh, sorry.
Ow, ow.
Oh.
Yeah.
Are you okay?
Not really. I feel that.
Okay, I'm sorry. Right there?
Mm-hmm.
I only have 2 more cysts to go, but they are mashed down. They're holding on to Amy's scalp for their dear life. They are stuck. Sorry, you hear that sound more so. Is it hurting you though?
No, yeah, it hurt.
Do you want me to not do them? You okay?
Do them. I'm willing to put up with any kind of discomfort just to get them off my head.
It's just like he's stuck at the base and I'm trying to get to him. That was the biggest one. Okay. This is the last one.
Hallelujah.
It's like at the crux of your neck where it bends. So I think it's tucked in there, you know? I do my little suspension sutures.
There is one lone cyst that is really proving to be difficult. It is wedged in there. So I like to use a technique that I call a suspension suture. If I take a needle and thread, essentially, a suture, and I pierce through it, I can use the suture as a pivot point. So I can lift it up so I can use my tissue scissors to really tease out underneath it. I am on a mission and no cyst can resist me.
Okay, got him. There you go. Woo, okay.
The triangle or quadrant, as it turned out, we got it all out, and I'm pretty pleased with the results, and I hope Amy will be.
This is the one on your arm. What do you think's inside? It's skin. Just skin that has shed into this. See how thick the walls are?
Yeah.
That's the elbow. This is the other one that was a little bit older too, right, on the head. It's a little bit darker. It's a little green. 35 years of wet skin cells tucked in there. You can take a look. I know it's hard to see in the back, but at least you can kind of see in the front.
Beautiful. I feel fabulous. Each one that came off represents something that I'm releasing. Insecurities, judgments, and now I can learn to let them go, and I'm gonna show the world who I am.
Make sure nothing ever hurts, like I said.
I'm here with Jason, who has this pretty big growth on the back of his neck, which is a lipoma that does extend down the side of his neck, and I'm not really sure whether I'm going to be able to successfully remove that portion because it's in a very dangerous area. So we'll see.
Yeah, you got like little finger projections in here. Let's see how well they want to come out of these little areas here.
Right away, I see the lipoma peeking out, which is great news because I know it's superficial. However, this lipoma is in little pieces, so it's really like a laborious process to pick this out.
It's coming, it's just, man, it's like peeling wallpaper. Just try to use a little gentle tug on these because I don't try to use anything sharp because I'm trying to just not shear anything, but trying to ease it out. I mean, this is just like a pain in the butt is what this is right here. A little tug on the higher part because I see a little piece here that's wedged in here.
I'm seeing this piece that looks like it's intact. I can see that it projects down into this posterior triangle, the side of his neck, which is an area that I'm trying to avoid, but I'm seeing one little edge of it, and I really am going to try to tug at it lightly and see if the entire thing will release. It's like you feel it kind of coming out, and you're like, please don't break, please don't break. You gotta just let it slide out in its own time.
Have you ever heard that song, Wiggle Wiggle? That's what we're doing right now. Look at that piece. That was, I think that piece right there was in your posterior triangle. Look at how flat he is right there. Wait, before you do it, that was where it was right there. I think that's good. Feel that, you don't feel anything in there. I think we eased that out, which was like the most important to me, like in terms of like danger. So now that that feels good, we're like rejoicing. I think we got it all. And fixing you up.
Okay.
All right.
It really was miraculous that the part that I was the most worried about slipped out so beautifully and easily. To me, that was a home run.
But you can hold this.
That's a huge difference. I'm happy, excited. I mean, it's just such a relief, you know, and I'm just so grateful. And, you know, my cheeks are gonna be hurting from all the smiling.
I'm here with Chanel, who has a lot of cylindromas on her scalp, which are a more rare tumor that we see here. She's got many of them, and they're all a little bit different, so I'm really gonna have to figure out what to do in each case as I go along.
Just wanting to see whether I or scoop it out. It's just that this one's not gonna be in a complete piece. So I'm trying to preserve some of that skin on top. I wanna make the scar as small as possible, but I wanna get it all.
I think I cleared that out. One down. I wanted to keep the incision small because it's a noticeable area, so I had to pick out the cylindroma in pieces. Now let's move to the right side of your head.
I think that some of these are run a little, you know, they're under the skin too. It's like iceberg, you know, not a big iceberg, not a big thing that's underneath. Right, that's it too. So let's see if we can get all that out. Looks like regular fat, which is good. So my whole goal here is to obviously take these off completely, but also leave you with as nice of a scar, you know, as least visible of a scar as possible.
2 down and 4 to go. Next, I'm gonna tackle the 2 on the top of her scalp.
Let's do the little one first. I don't know if you've also been kind of holding off doing this because you felt like, you know, someone may have said you had to shave your head or whatnot. That's what some people get scared off of, you know?
Yeah.
So. Still okay, right?
Mm-hmm.
Okay, now. Doing awesome. Maybe I can somewhat pull it together.
The smaller growth, I'm gonna leave open because it doesn't go down too deep, so it should heal rather quickly. But this big mama, I don't want to just let a big wound like that heal on its own, but the skin is too tight there. I can't close it all the way side to side. So I choose to close it partially, but at least it's a smaller area.
But you also have to be careful on the scalp when you move, shift tissue around, because it actually will shift around the direction of your hair growth. I don't want to give you cowlick where you don't really have one. Feels tight, huh?
Yeah.
So I think that makes it smaller at least. That's better. Let's move to this one right here.
This one is the furthest back on your scalp.
I'm gonna make this like a little split thickness skin flap. I'm trying to just take off the actual cylindroma pieces and leave some of the tissue on top.
So for this one, I took off what I believe is all of the cylindroma underneath the skin, and then I used that top layer of tissue to just flap right back onto this area that we removed.
Okay, guys, we're on the final stretches. What is this here again, guys? It's like the frontal here. Is that it?
Mm-hmm. Yeah.
Oh, okay, good. Okay, last one here. You're okay, right?
Yeah.
If you feel anything here, just let me know. That heal on its own. How you feeling, okay?
Yep.
All right. I am going to let this one heal on its own because I think if I were to close it, it's gonna leave a much longer scar, and I think it's gonna heal in really well. And it's gonna, you know, you're gonna have a tiny little bit of a hair loss there, but it's not. It's gonna be like smaller than it was.
I've decided to let this heal as an open wound. A lot of these areas that heal, they kind of constrict and shrink down to maybe 75% of their size. But obviously, the bigger the area that you have that you let heal secondarily, the more chance you have of a larger area of hair loss. So I think that what you have is Brooke Spiegler. Part of the things that we see are cylindromas.
Okay.
Working with Shaw now makes me actually suspect that she might have a congenital condition. It's called Brooke Spiegler. I have seen that before, and these people typically have growths in the scalp, on their nose, and various other skin conditions.
So this area right here, it's a little swollen. That's all, but it should hide really well. It's gonna shrink into 3/4 of the size it is now, okay?
Seeing myself for the first time, like, I'm so excited. It's humbling. It's motivation, it's gratitude, it's all the above.
The first one without that bump on your forehead.
That's good. I'll see that.
It makes me feel really good that I no longer will have to Photoshop any of my pictures, especially my unicorn. It was the longest one to take care of, and it's gone.
So just have you close your eyes just because I don't want anything to fall into yours. This is like hot little pieces, almost they look like prosciutto.
Prosciutto.
Pancetta. Some of the butter that's in there. Right now I'm doing really what we call debulking more. Like we're just trying to take off the bulk of it.
Right.
And then we'll do some fine tuning here.
When we're doing the loop cautery, we're taking some of the weight of this rhinophyma, this extra tissue of his nose off, but also it's almost like it's frying the skin. It's causing it to shrink a little bit. It's kind of like when you put a slice of bacon on the pan and it shrivels up. It's gonna cause the skin to tighten up and it's gonna open up his nose.
Just sometimes wants to ooze a little, so I try to like stop that oozing. Trying to get this anterior projection right, but I don't want it to start oozing all over you.
My main concern here is I need to keep an eye out for blood vessels because if I get a lot of blood vessels that are slowly oozing, it can make it a mess. And I really can't see what's going on as well.
Just trying to stop it from oozing. We don't want that. I think I need to stop. I feel like I'm just dripping right into his nose here.
I'm having a lot of issues with just oozing in general. So I have to stop for a minute and really get some of the bleeding under control so I can really proceed and see what I'm doing.
Trying to get that anterior projection just right. I still think it's too much, and I've got to take it down a little bit. I have to wrestle with the fact that I know it's swollen.
I don't know what a car feels like when it goes to the mechanic.
Oh.
There's swelling from just me doing this procedure and just his skin reacting to it, and also because I put a lot of anesthesia into the area. And this swelling really can distort the skin and make it more difficult for me to ascertain how much I've removed and how much more I need to remove.
Get very focused at the end because I can see it now, and I'm just trying to do the last little bit, and then sometimes it's hard for me to stop. That's the problem. What? Oh, sorry, I've had it. Sorry, look, this is your skin. This is not my skin. I'm sorry. I'm sorry. Close that mouth.
Salty.
Is it salty?
Then he can't breathe if he closes his mouth.
Oh, yeah, you're right.
He's got cotton balls.
Sorry about that.
At least it's your own skin.
One of the weirdest moments is when I ate one of the pieces of extra skin. Man, really bizarre.
Yeah, I think I need to stop. Done. It really is looking good.
I did warn Jim that the skin particles would look like pancetta, but I didn't expect him to actually accidentally eat one. He was really a good sport about that, though. I think I've done a pretty good job at addressing the projection of his nose. There's a lot of swelling right now, which is to be expected, but it's gonna look great. The most important thing is that he can breathe a lot better now, and that definitely makes this all worth it.
Remember, it's swollen.
Oh my God.
And now it's swollen. Looks crazy.
Ugh.
It looks crazy. Still looks crazy, but you see it. You see the potential.
Oh, absolutely. It already feels better, to tell you the truth. As I'm looking in the mirror, it's fantastic. I can already see the change, and I can feel the change, more importantly. All of a sudden, I can breathe so much better on that side. Who knows? I can be a runner now.
It's stuck.
Okay.
That's not good. I'm here with Roger, who has this really big growth on his shoulder. I think it could be a lipoma. I've already kind of pushed around on it, but I don't know whether it is stuck to muscle or not, and that might make me have to throw in the towel.
I don't see a muscle here. I mean, it's close to it.
I feel better about this now. I think I can sneak him out.
Sweet.
Come on, little friend. I know you want to come out.
You don't want to let go?
It's like it's caught in this little net right here.
Do you fish? You know when you have like a knot in your fishing line and you're
Yeah.
trying to figure out which direction?
Yeah.
Because all tangled, that's what we're trying to do. Because if you pull too tight, then you're done. You just have to like
Go
release
back the
that
other
whole
way.
line. Yeah.
Yeah.
You okay?
Actually, I was thinking, I wish I'd gone to the bathroom before I did
Oh. Right now is like a very hard time for me to get you up and go to the bathroom.
this. Yeah. I understand.
It's getting slippery too. It's a little slippery sucker. All right, it's coming out.
Guess what? We took it out. You gotta pee?
Yeah.
DEFCON 3, DEFCON. Can they dump out a drink like out there? Can we get something, guys?
I gotta
I'm
go.
serious. I get it. He has to go to the bathroom, but this is probably the worst time for him to really need to pee. So I really need to bring the restroom to him. Good, thank you. Gonna cover you, keep you covered. I'm gonna do, you know in Japan, when you go pee and you don't want people to hear you, they play music. I'm looking away, don't worry. Happy birthday to you. Happy birthday, dear lipoma. Happy birthday to you and many more.
This is close to being the weirdest thing ever.
La 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 la.
The worst thing would have been if I'd missed the bottle and went all over the floor.
No,
but-
that would be terrible.
Okay.
You can grab it with that, yes.
There you go.
There you go.
Look
There
at
you
that. Oh, I feel so much
yes.
better. Mercy.
I tell you, some of the best peas people have are around me. Crisis over. They don't teach you this in medical school. I mean, you had to go and we had to figure something out. Now I can finally stitch up a much more relaxed Roger, and I can't wait to show him the results. So take a look here, okay?
Ooh, doggy. Love it. Looking at my shoulder, I just can't believe what a difference it is and how nice it looks now that it's not there.
You wanna lift that off?
Yeah. Mother. Oh. I cannot believe that that thing came out of me. It looks like a heart of someone who ate too much greasy food and they died of a heart attack.
Okay, so let's see how many of these we can do. All right, I'm ready. I'm gonna put a little baby pinch here, okay? Just a baby pinch, pinch. I know that these neurofibromas are under the skin as well, so I purposely want to take a little bit of a deeper shave. So that's why this time I'm gonna pull up before I shave, because if I pull up, I'm kind of pulling the tissue away from the skin, and that will naturally give a deeper shave. Okay, so you shouldn't feel anything other than my touching you, okay?
Yep, I'm
Make
fine.
sure she's not touching metal, okay. Just to check to make sure you're okay first.
Yeah,
You look great.
I'm okay.
Okay. The nice thing about this is that it cauterizes the tissue at the same time so that it doesn't want to ooze so much. I think this is faster, right, than if I were to do shave, because it would ooze a lot and I have to go back. It might be. So far, I'm really pleased at how well the loop cautery is doing. It is allowing me to remove these completely, but also helping to control any bleeding. So really the question is, how much can Susan tolerate? Okay, so this one, this is a little mitten. So I try not to pull up too much on this, because if you do, while I remove it, it could actually take out too much, or like if you lift it up too high.
Okay.
Here's your little mitten.
Oh, wow, that looks bigger too then.
All right, let's see how many we can do around your face. I know those bug you the most. I was able to remove the most bothersome and painful neurofibromas that Susan had on her back. As long as she's comfortable, I'm gonna do as many as I can on her face. Chin. Close your eyes, I'm gonna one right between your eyes. That's okay with you.
What that's bothering me now is my leg won't stop shaking.
What is it? Do you want to
It's probably the adrenaline.
numbing? Oh, okay.
Adrenaline.
Sometimes that does happen.
Oh, okay.
I didn't put a ton in, but
It just kept on shaking, so I just think it's the adrenaline the whole time.
yes, it is. Well, this has adrenaline in it.
Yeah.
Epinephrine is a natural hormone in our body. It is adrenaline. It's like what's in EpiPen to get your heart moving again. And in people who are more sensitive, it can actually make them feel really jittery. So I've already finished all of the numbing. I can't remove the epinephrine. So at this point, I just want to try to take these off effectively and efficiently and make sure she's not shaking when I come at her with this loop cautery tool. I'm doing a lot of delicate work around her face, so I really need to make sure she sits
still, and she doesn't have as many jitters. You want to turn that off for just a moment? I'm gonna just try to snip these off here, and then I'll buzz them. The buzzers, they're working, okay? Just keep your eyes closed. Turn your head a little this way, good.
You're doing really good.
And for the last one, let's get rid of this one on your head that bothers you when you brush your hair. Okay?
No, it feels a lot better now. All right.
How are you feeling?
I feel good.
I like that. I like to hear that. Okay, hold on. Let me sit you up for a minute. Let me take this stuff off of here. Susan did great. I think that with her little reaction that we had to the numbing, we should quit here. I mean, we got rid of all the ones that really bother her, and that was the point of it. And I think this will make her really happy. So you can look beyond there.
Oh my.
You're not gonna have those bumpies so much anymore.
No, I'm not. Wow.
Flat there?
Yes.
Seeing myself in the mirror for the first time after the procedures, I feel amazed at how great I looked. I realize that I do have some neurofibromas left on my face, but they are minimal. I feel better looking because I'm no longer looking in the mirror at the bumps. I'm looking at myself back when I was younger. I feel like I'm young again.
Okay, first one. You can see it. Pilar cyst. I'm here with Angela, who has 4 bumps on her head. I think that they're pilar cysts, but they're different sizes and different shapes. So, I mean, maybe they're not. I'm gonna start with the smallest one and take it from there. It will make things a lot more complicated if there's one pilar cyst and the other things are other things. You okay? I'm just pulling on you.
Yeah, it's fine.
Okay, good. Yeah, see, this is like a little baby one, actually. It's pilar cyst. Okay, one down. Let's do the one on the side of your head next. Sometimes some people's just pop out, but yours have been a little more stubborn. You okay?
Yeah, I'm good.
She's sitting back now. Grosses you out?
She would always be like, look, touch it. And I'm like, no, I'm okay.
You don't want to necessarily touch it.
I just like to observe.
Okay, got it. Okay, it's another pilar cyst. This one was a little mushy. Okay, I'm moving right along. There's 2 down and 2 to go. Because the 2 first growths were pilar cysts, it's a pretty good chance that the other 2 are the same. But this one on the top has been really smushed down. It's kind of flattened, so it could be a little bit of a challenge. This one, I think it deflated just a few months ago, so I think it's halfway liquefied and might be kind of gone too. More orange juice up here. So now I'm just trying to get all the sac wall, but it's in pieces right now. This is more complicated in the fact that it's stuck to you. It's another pilar cyst though. Okay. This cyst was certainly something that was a little more complicated. I think I did manage to scrape all the contents of this cyst out, but all of this was really just the preamble to the big one. Okay. Make sure nothing hurts either.
Okay.
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 You can see the little egg here underneath here. And I'm trying to see if I can take out whole. Back up a little bit. I'm more nervous that I don't want this to pop on me. That's what I want to.
I know.
Should I squeeze it? What do you think?
You could try it.
Okay, so hold on. I'm gonna poke one little. Don't spray us. Might be that quiet. Yeah, it's gonna come out. It's like egg yolk. Oh, yeah. Sorry. I have noticed that Angela's cysts are pretty liquefied, so I'm gonna try to see if I can aspirate some of the fluid first, deflate it a little bit to make it more manageable and less messy.
You okay?
We're okay, yes. Oh, we're okay.
I think she was asking me.
Oh, sorry. It looks like orange juice.
Oh, no way.
It's a mimosa.
It's a mimosa. I'm just trying to pull it out now. At least it's smaller.
I could see it was probably liquefied, so I had to pull out some of the fluid. The big one is gone.
I feel like I can breathe.
Oh, you couldn't breathe before? Was it stressful?
A little bit.
That was a very orange, juicy cyst. I'm very happy that I aspirated some of the contents because that thing was under pressure. And so I'm really happy that we kept the area nice and clean so that I could really ensure that I removed this cyst and its sac wall in its entirety. Can you see over here?
Oh my God.
See what came out? It looks like orange
God.
juice. See, this was filled with orange juice. Look,
The
watch.
orange juice is
Inside here.
Oh, my Lord.
Seeing what came out of my mom's head, it's fascinating and kind of gross.
You did so great. Let me show you what you look like here. There's gonna be no more unicorn though.
Yeah.
Okay? Oh, you did so good. I'm so proud of you.
I'm proud of you. I'm so happy, and I can't describe it in my words. Today is my very, very best day. I'm so happy.
I'm just gonna put a little baby numbing here, okay? Baby numbing. I know Mike would love all his lipomas to be removed. Mike's a big guy, so he's probably used to getting what he wants, but he just met his 5-foot-tall match. I can only do what's safe, and so let's just take one area at a time and see how it goes. So you shouldn't feel anything other than us touching you, okay?
Okay. If I do, I'll say something.
Oh, I'm sure you will.
I guess.
Replica of this.
My dad gave me a nickname, Bab, because I was always babbling.
Oh, you were? That's cute.
Did you already take one out?
I did.
Really?
Mm-hmm.
They're not giving no problems?
Well, I only did one.
Oh, what you been doing down there, Dr. Lee?
All right, I'm done. Forget it. I'm out of here.
You gotta be nice to Dr. Lee. Remember, she had the knife, you don't.
Still working on that same one?
Hey, you know what? I think he should be knocked out the next time.
Did it go? Yeah, I've been known to talk too much.
Look at his sexy leg coming out, though. He's got a lot of lipomas on his legs, and I don't want to leave him with as many scars as he has lipomas there. So I'm trying to sort of hunt for some of the lipomas when they're close together. I mean, the difficulty about that is that I have to push and pull and dig a little bit for these lipomas.
Oh, yeah. Ooh.
All right, there we go.
It came out?
I had it.
Oh, my Lord.
All right, we're good on that side. One leg is done. Now I just need to stitch up all these incisions I made and move on to the next.
This right side is going to be the challenge.
Oh, great.
Yeah, maybe you should have did this one first. Told you the side was going to be the problem.
And he thought I was going to do his arms and his legs and his back and his tummy.
You come down here to challenge you, Dr. Lee.
Looks like a brain.
He's stubborn.
Get out of here.
Don't look.
I looked at it. I didn't mean to.
And this is the last one. Done. I removed a good amount of really big lipomas from both of Mike's legs. I need to stitch him up now, and I think he's gonna be really happy with the results.
Wow.
Look at those sexy legs coming back.
Yeah, coming back.
Let me
Wow.
stitch you back up here.
Okay, well, thank you. What about the side cluster? And I got the ones around the ribs and maybe arms.
Oh my God. You are persistent. Because there's a lot of issues with your stomach, and I don't want to. I don't even want to go too close to that. You know what I mean? That there's just you need to address that first. But you know what? You're charming. I like you. I don't know why. Against my better judgment.
Like you too, Dr. Lee. Thank you.
So we're gonna do arms, okay?
Okay, thank you. Appreciate it.
I admire Mike's persistence, so I'm willing to try to take off more for him because he's just such a sweetheart. Okay, here we go again.
they're spitting at us. They are spitting at us, like, ooh.
That was a little pop.
Yeah, it was a little hop. That looks pretty good.
I'm gonna move on to the left arm, and the lipomas are spaced out a little bit different. They're a little farther apart, and hopefully I can get through this one.
If you can hold like that just for a little bit here, let's try that, okay? The thing that behaves more than anything else is his lipomas. This is the last one. You wanna watch this last one popped up?
Yeah, why not? Yeah.
Why not?
Oh my God.
There's your friend.
Oh, God. Ooh.
There's your friend.
Pop goes the
Looks
lipoma.
like a little bear.
As much as Mike pushed and pushed, he was an absolute pleasure, a delight. And I do hope that he's happy with the results because I am not doing another lipoma today.
What is 9 plus 11 is 20, plus another 11 is 31, plus another 6 is 37. Yeah, so look at all these things you left with us here.
Dr. Lee removed a total of 37 lipomas. I was wanting to be the record breaker, but I'll take it, and I'm happy, and I'm grateful for it.
But look at all the stuff that Dr. Lee have removed. It's
Yeah, that
just
was
amazing.
a lot of work. I gotta take a nap after this.
Get that hernia taken care of, okay? Because once you do that, then you can address the ones on your torso.
Okay.
See how that one's like encapsulated? It's got its own, like, yeah, it's like a little patty.
Some of my lipomas, they look like chicken breasts. Some of them even look like little gummy bears. Probably not a gummy bear I should be eating. And so it just feels so weird that this was in my arm and in my body. And I'm just thankful that it's out of my body now.
The first thing I'm gonna do is put some numbing there, making sure you're nice and comfortable, of course.
So first I'm gonna use the loop cautery to melt some of this seborrheic keratosis off as flush to the skin as I can. It's a really big SK, so it's going to be difficult to manage, but I'm trying to really kind of debulk a lot of this growth. I don't want to make an indentation there because that's knowing that I could be destroying a lot of the hair follicles and she won't have hair growth there.
Just a little bit here first. That's a vacuum. Sometimes it gets a little smoky. Okay. You okay, right?
Yeah.
Okay.
Yeah.
When I melt seborrheic keratosis, it really kind of gets sticky and sticks to the loop. And it looks kind of like roast beef, but it definitely doesn't smell like roast beef.
It's got a bunch of hair gel and stuff stuck in the crack. I've actually never done it quite this way.
Yeah.
I hope that didn't worry you, but I figured because it's so big here, it would be like using a spoon to dig a pool or something. I was dreaming that I could maybe take it off in one piece. No way. That can't happen. I gotta take it off in pieces. Almost all the top of it off. Okay. You still have to fine tune it though. Let me just see if I can get some of this off of this without it being too much of a problem.
After I've used the loop cautery to really debulk a lot of this lesion, I'm gonna use this device that's called a curette. It's essentially like a spoon with a hole in it that has some sharp edges so I can really kind of scrape and smooth out this area.
This is actually how we commonly do some bigger ones on the body with this kind of tool that's like a spoon, but it can kind of help us to fine tune it. So I'm just trying to use a certain level of pressure to scratch it that I feel like is pressure enough that real skin won't come off, but that seborrheic keratosis will come off.
Yeah.
I guess it's like using a coin to scratch off the numbers on your lottery ticket. You know, if you don't put a certain amount of pressure, you're not gonna be able to see your numbers, but if you put too much pressure, you could really scratch off the numbers itself and you won't even know if you won.
And maybe I can help find somebody that, like, if you feel like it's starting to come back, we could like have them freeze a little of it or something, because it's easier to try to prevent it from growing back if you see a little something starting.
Yeah.
It's gonna look really good.
We see that the seborrheic keratosis is gone there, and I know that I didn't go deep enough to destroy her hair follicles.
but seborrheic keratosis cells can dive down within your hair follicles, and it is more likely to come back in those areas. It is possible that she might need some little touch-up procedures here.
First, let me show you, I guess, some of the fragments.
Yeah, let me see that ugly thing.
It all came off in pieces.
Ugh. Looks like a bug.
Like a mohawk. Oh, yeah, like a caterpillar.
Yeah. Ugh.
See the hairs? Hair follicle? Wow. All right. Now we can go out on the town. Okay?
Yes. I've been dealing with this thing since 1998. It's been a constant cause of anxiety for me, and in 1 hour, it's gone.
Have a safe trip back, and I'll try to connect you with somebody up there.
Thank you so much.
You're so welcome. That's a great hug.
It's really gonna enable me to start dating again. It's going to change how I interact with people, my confidence level, just so many things.
We're gonna get ready, because it might want to ooze on us.
I've got Ramiro here, who has a large cyst on his jaw. It's been removed before from the inside of the mouth, but it came back. So this time we're gonna try from the skin side to remove it.
So that does mean that I might get a little wet here. We're all prepared in case this wants to leak on us. The cyst is intact. It's just that we're trying to tease it away now. You have a big cyst here. There's like a big balloon under there. And we're trying to delicately...
Es como un globo de agua.
Oh, sí.
Ajá.
How am I gonna take it out like that? We're going to go ahead and squeeze some of it into here because it's too big for me. So I have like a little basin under here.
I always like to get it out whole, but when a cyst is pretty deep, I can't really see what's going on under there. So there's a point where I have to decide, okay, I think I'm gonna pop this, clean up that little mess that is made from popping, and now I'll have just the cyst sac wall to deal with, and I can see around it really well.
Ready? Do you like to eat oatmeal? How do you say it? Oatmealito?
Si le gusta comer avena.
Casi no.
Porque eso es lo que le está saliendo ahorita.
Sí.
Es como un globo de agua que está lleno de avena. Lo rompió, sí. Decidió mejor romperlo para que saliera el contenido adentro.
All right. I mean, our Pop's cool. They're never the same. He's got a pretty good one here. The challenge will be removing this cyst sac wall, especially because I know that this cyst was attempted to be removed from the inside, so the bottom part, maybe the part that has the most scarring, might be the most difficult to remove.
What happened is last time when they removed it, they likely didn't remove this entire sac. Probably because it was on the inside and it's hard to see. You okay, right? No dolor?
Yeah, no dolor, nada.
Good, everything looks good. We're almost got it. It's getting close. I think we got the whole thing under there.
I think it was the best decision for me to really squeeze out the contents first, because I know that this was attempted from the inside of the mouth before and they weren't really successful. So being able to see really well underneath it gave me a lot of confidence that it's not gonna come back this time.
So take a look here, okay?
A new face.
Good.
Yeah, Dr. Lee. Thank you.
Oh, you're
Thank
so
you.
welcome.
Pues que se acabó la bolita que traía. La primera fue de no mirar más esa pelotita y que ahora sí como si tuviera una nueva cara y me ganó la emoción, simplemente.
I know it's a little annoying in the beginning when I first start numbing it. Gets a little tight.
In order to numb up this part of Eric's butt, I'm gonna use a tumescent technique. And this is when I really bathe the area in fluid that is going to anesthetize it. But it will make this area look even bigger. It's gonna make it look like the Haleakala volcano ready to pop.
All right, let's see what we got here. Yeah, it's your little lipoma, and he's talking to me a little bit. Buzzing noise you're gonna hear, you shouldn't feel anything. It's a cautery that stops the little baby blood vessels from oozing, just so we can see things better.
As I go, I'm gonna be really cognizant of any bleeding and try to really target any blood vessels that I see oozing. So I'm always very careful, and in the beginning, I move pretty slow.
You saw that it's kind of bumpy. There's like a lot of little areas that are tethering it in place, so I'm just trying to break up those bands.
Eric's lipoma is pretty attached to him. It doesn't want to leave, so this is gonna be quite a challenge.
I feel where he's like stuck in these little tendrils here. He's like tethered in there.
There's a lot of fibrous bands that are keeping that lipoma intact. But I really need to get out every little piece of this lipoma. So patience is key here.
Let's see if we can't squeeze some of it. Are you okay?
Yeah.
Just pulling on you maybe, but nothing should be sharp.
This is going to take a long time, but I gotta hang loose. I gotta shaka and just chill out and get this lipoma all out.
All right, I'm gonna get ready to squeeze. It's just stuck. Just gotta take you out in pieces, but that's okay. We can do that. Sometimes it takes a little more work.
I was really hoping that this would be a nice, beautiful Hawaiian island, perfect lipoma, but it really is ending up being kind of a mess. And I'm thinking I'm gonna have to take this out in pieces. So I really have to switch into meticulous mode.
Okay, sorry. Thank you for telling me. Sorry, we're pulling on you a little bit. It's because it's like kind of tugging on your muscle there, okay? This is getting out of there now. It is coming. Well, I didn't think this was going to be this involved in terms of the time here.
Yeah.
But that's what they do to us sometimes. All right, I am very pleased right now.
He is saying aloha to that lipoma, but now I am presented with the next challenge.
What are we gonna do with this little pouch you got here?
There's really a delicate balance as to how much skin to save and how much skin to remove here. And it's because it's one of the more stretchable areas of the body. If I remove too much skin, the scar will stretch, it will look terrible. He won't even be able to bend down and touch his toes. The solution is leaving a little extra skin so he's got some give, he's got some movement there.
There's a lot of movement in our tush, obviously. Like when you bend down and squat onto the ground, like you stretch it. So I'm gonna try to arrange the scar so there's the least tension on it, which means it's kind of vertical, like along your crack, you know?
Okay, yeah.
So that when you stretch, it's not gonna pull on it. Okay, let's see. Look at that. Back to a flat booty.
Aloha lipoma, aloha lipoma, aloha lipoma.
Look at that tush. Now you're back to just a crack in your back. Okay, let me take a picture of it. Okay. Here it is from the side. It's easier to see. Like, Kyle, look at that.
Wow, crazy, yeah.
Looking at my butt for the first time after the surgery, I feel relieved. Before, when I had the big bump on my butt, I felt like a monster. Now my self-esteem is gonna go up. I'm looking forward to dating, and my parents definitely want grandkids. Now that my lump is removed, it could happen. I've been waiting for this day for 5 years now, and it's great. I feel great. I'm happy this is over.
Make sure I'm not hurting you. Try to see if we can get it all. Oh, sorry, Pinchy.
I'm here with a very nervous but very sweet guy, Michael, who has this giant cyst on his head, and I just don't want a big splash to be part of its final performance.
Okay, it's just I can feel it. I just
Yes, no, I'm glad you're telling me.
This bump has really stretched the skin there, and I know that I'm gonna have to take a lot of extra skin there anyway, so why not make a bigger incision, because I know I have to remove that anyway, and try to get this out whole.
It's not so easy, this thing. Because it's so round, I can't see all the way around it. So I have to like change position of you. Can I squeeze it out of that wedge? I thought maybe I could. Sorry, I'm almost done. I almost got the whole thing. I gotta get underneath it.
Did you get it all?
Almost. I have to get the under part of it that's stuck to you. It's right at my eye level. I do like them when we get them out solid. You got it off. Don't you feel lighter?
Yes, I do.
Okay, so now I'm gonna close it so that...
There's not a hole there?
There's a hole here, yeah.
Is there a dent there where I hit my head?
I didn't notice an indentation. No, I didn't.
We did it. We finally kicked Michael's cyst off the stage, but now the hard task really begins. This is me trying to close the area nicely, and I want to reorient the skin. I need to keep the rotation of the hair the same, but certainly also remove any kind of bumps that are noticeable.
Does it look good?
I mean, it's gonna look bumpy to you right now, but it's gonna look good. Are you excited?
Yes.
Now, Michael might be down a comedy prop, but he should be smiling and laughing a lot more now that his cyst is retired from the spotlight.
Just bumpy.
Oh, wow, it's totally not bumpy. That is awesome. Wow. Wow, I don't even see a dent. I don't see a bump. I don't see nothing, you know, just smooth head. That's cool.
Here's your friend.
What the hell?
He's got his tongue sticking out.
And his little nose. Oh my God, that is crazier than you don't know what. I totally didn't expect it to look like that.
Do you think there's gonna be some gold coins?
Wow, that's crazy. Yeah, that's enough.
Look what you were holding in your head.
That is so wild.
You know, that hat is retired, right? 'Cause
Yes, it's
the
done.
cyst is done.
Without the bump, it's gonna be a little different. We can still be funny, I guess. I'll try.
The first thing I'm gonna do is really pay very close attention to the concentration of numbing that I'm giving. Robert is on blood thinners due to his heart condition, and so because he has a higher propensity to bleed easily, I have to really have a more dilute concentration of lidocaine and epinephrine in the solution. The epinephrine is gonna help to temporarily constrict some of the local blood vessels, but too much of that can really be toxic to the heart. So there's a really delicate balance here. I think what I'm gonna do is, because this one's numb, I'm gonna get set up with the cautery.
No problem.
If that one does okay, I'm gonna do the cluster of them. It's certainly safe for me to start with a few of them. I mean, if they start shooting blood, then I'm just going to cauterize the heck out of it, and we'll see how that goes, and I'll know not to proceed. Okay, so I've numbed this one. You shouldn't feel anything. You let me know if anything hurts, okay? I decided to use my loop cautery tool. It really kind of burns the area but seals it closed. I really have to determine the best technique, and it sometimes takes a few tries. How deep are these going to go? Are they gonna just kind of easily shell out, or do I have to really dig for them?
You can see how that cuts and cauterizes at the same time.
Yeah. Wow.
So take a look at that. That looks all right. It'll heal. Well, it's not looking like it's oozing. The first one kind of went even better than I expected. So I'm just want to take these off and take a look at what the whole area looks like and then watch it for like a couple minutes.
So the first removal was uneventful, not a lot of bleeding. I got the area pretty flat. So I'm gonna move and extend to a larger patch, and let's see how that goes.
You can turn that off for just a moment.
Oh, wow.
So good thing is I don't see it bleeding, so that's good. The question is, imagine if you have the little orange spots like that. Do you think that that's better than what? I didn't even get to answering.
Tell you that right
Okay,
away.
yeah, I just want to make sure you know that.
This is way better than any of this.
All right, and let's just start going up the arm here.
Robert is not bleeding, and that is great, but I've never removed this many xanthomas at any sitting. I need to do this very efficiently because I want to remove as many of these as I can, but I don't want to leave him looking worse.
Turn your arm out a little bit here. I'm gonna do this bigger one that we numbed.
Yes, those ones.
Yeah, I don't like these. I'm gonna stretch it a little because
Good.
How many years have you had that and just watching them kind of come off right in front of your eyes? That must be pretty trippy.
It's a crazy feeling.
Is it?
Ooh, look at that one.
Did it hurt?
No.
Okay, your arms are looking a little different, aren't they? Starting to look a little different. So far, so good.
Okay, I feel like I'm getting a good handle on this.
So I'm gonna just take this crop off here. It's really like a crop of them.
Now I'm gonna move on to the underside of his forearm. I just have to continue with caution with the amount of numbing that I use because this is a really dense area filled with xanthomas, and it's also really sensitive there. All right, let's see, stop for a second. Looks pretty darn good.
From what it was to what it is now, that is a big difference.
Yes, it is.
I look at the pile of bumps that Dr. Lee has removed. I think I see about 100, maybe a little more. I think to myself, I'm shedding myself of all this negative energy that I've held back for so long.
That is crazy.
It's just a wave of relief coming over me that this is actually happening. This actually happened. I feel amazing. I feel like a new person right now because just seeing where Dr. Lee took them off, I couldn't believe that they were gone already.
Dr. Lee surprised me by bringing me out 3 more times to finish the procedures on the rest of my arms. That's a large one. Each treatment took a couple of hours, and she removed as many xanthomas as she could.
Moving right along.
Dr. Lee made me feel so relaxed that I didn't have any anxiety.
All right, looks pretty good right now. Areas that you let heal open, or what we call secondarily, will take longer, but time should continue to heal them. I think I'm done.
It's been 8 weeks since I've seen Dr. Lee for my last procedure. My arms look incredible. They're smooth, and I feel like a brand new man. Dr. Lee removed hundreds of bumps off my arms. I don't bleed when I bump into stuff. There's no more pain. It's a great feeling.
Ready to get this thing off?
Yes, ma'am.
Did numb you, but if you feel anything, you let me know, okay? I'm really aware that Alexis experienced a lot of pain during her last procedure when they tried to really aspirate this cyst. So I have to be extra careful and really make sure she feels like she's in control. It was pierced before. I'm gonna just try to remove that little scar line there, that little puncture that they had. Let me know if anything's ever uncomfortable.
You know I haven't told anyone in my family that I'm here.
You haven't?
Nope. I'm gonna have a party at my house. I'm going to say I have a secret that I've been keeping and I want to tell everybody what it is.
Cysts can come in various shades. I think it has to do with the melanin in our skin. I think that the darker complected you are, the more range and shades your cyst contents can have. You should have a potluck and bring in things that they thought your cyst reminded them of or something. Meatballs or something, I don't know.
Yeah.
Like little appetizers.
Maybe some dip.
Yeah, like a dip that say, this could be what the contents looked like.
I have this chicken queso dip that I do.
Oh, okay. Well, I'm gonna show you what the contents look like, then you can see if you can make something
See if
out of it.
if I can get close to it.
Yes. So you're just gonna feel me pushing around here. I'm just trying to tease the sac wall from your skin. It's always kind of fun to make food analogies during surgery, but boy, Alexis is gonna be pretty surprised when I show her this, because it doesn't look like queso dip. But it did come out nice and smooth, so it's got that going for it. Now my most important job is to carefully remove the cyst sac wall from the surrounding connective tissue. I'm trying to get this sac in one piece, because if I take it out in one piece, and I'm pretty sure I got it all. You okay, right?
Yes,
Can you please tell me? Almost have it, and it's coming out like a little swim cap under there. Got it off? You did awesome. I checked, and it looks like there's nothing left, so now I can sew up Alexis' cheek really nicely, and I can't wait to show her the results. So, you said that you were gonna make something for this pimple potluck that looks like the cyst contents.
Let me see what I can
I don't know what you're gonna make with that.
Oh my God.
You can see why it was that color, huh? It's almost like tar. So that's all just dead skin. Look at that. Skin cells that are smushed in there. Here's the sac. See, we got to tease it. Yeah, that was what was. Oh my God. That's good, because we definitely got the sac this time.
I'm just really excited. Now that the sac is gone, it's not gonna grow back.
Now I'm gonna show you your cheek here.
Oh my God.
Here's your cheek back. Don't cry. Oh, I hope those are tears of joy.
I feel just a complete overall sense of relief. Having the bump changed who I was. And to have Dr. Lee remove it, it just gives me everything that I wanted.
Shouldn't feel anything other than us touching you. I'm sad to see these go. Can't tell you because they felt so nice.
Bye-bye, baby.
Good. That's gonna be okay. You okay over there?
I'm sorry. I'm just always emotional. Watching the procedure, it just made me so emotional that finally there was an answer, and Dr. Lee just made me feel so at ease.
How did you guys meet?
Roller skating.
Roller skating!
He was trying to help me learn how to skate.
Yeah, I kept teaching her. She got better at it, and she had more fun.
Oh, that's nice. I think I've been pretty meticulous about this. That looks good.
Oh my gosh, that's amazing.
I'll also get the results just to confirm with you that I know it's nothing to worry about, but don't lose any sleep over it.
Okay.
Although I'm sad that I'm not gonna be able to stroke Stuart's back anymore, I think that Stuart's gonna heal well and really only have some light scarring, but this is really gonna make Donna happy.
Oh, we got it all, I think.
So much better. I was amazed. My back is smooth. I'm very happy. I'm just ecstatic from the high I feel.
That was exciting and fun.
Yes, it
Actually,
was.
yes.
Yes. Now, if people see my back, it doesn't matter.
And now you're not gonna have those. I'm a little sad about it. That's okay.
Yes, well.
I'm just so happy I can, well, I can't touch it now, but it's gonna be nice.
I'll have to fight her from putting her hands on me.
All right, we think this is a lipoma. Make sure nothing ever hurts. I'm just gonna take a little peek at it. Ooh. Oh, I'm sorry, that pinches. I'm sorry.
I'm here with Elaine, who has this big growth on her left side, and I do see veins there in a really threatening position, so I wanna make sure I minimize bleeding, and she does have a lot of sensitivity in the area, so really making sure she's nice and comfortably numb is really important.
It's all tucked around it, which is a good sign, which means it might be solid and pop out. Come on. Okay, let's squeeze it, might squirt at us. Ready? All right, that's a pretty one. You're gonna be excited to see this cute friend of yours. We're cutting you off, lipoma. Don't get all excited about oozing on us.
That was a very smooth pop, but there are a lot of blood vessels here that I need to cauterize really meticulously so that she does not have a bleed.
See, what I'm trying to decide to do is take off part of it first. You can see it's like almost older here. Just hold on that. Oh, this is heavy.
This lipoma came out initially really pretty, but it's very stuck at the base, and that's why I really had to lop the beautiful top young part off so that I could take a better look at what's going on down underneath.
We got most of him off.
It's giving you a tough time, huh?
It is diving down towards your abdomen. Maybe is it split in your abdominal wall? Is it like occupied with your muscles? Because I got the whole top of it. I think part of it might dive down underneath, but I don't think I can pursue that because I think it's going down straight towards your insides, and I don't go that way. It doesn't mean that something's going to come back. I think it looks great right now, and I just got to take off this extra skin. Like I said, you don't want a pocket here.
Okay.
A pretty good piece of skin here. It's almost like you're having a little side plasty, an abdominoplasty. All right, now I'm gonna get ready to put in stitches and then we're done.
It looks so good.
It's possible that there's a little piece of lipoma that escaped my grips and is tucked in behind her tummy muscles and hiding from us. But never fear, if this thing shows its face again, I'll be right there just ready to snatch it away from her. Time to stitch Elaine up and send her home with one less boob.
All right, you ready for that?
Oh,
okay.
Yeah.
Okay.
Because obviously you're
And
sitting
it'll-
down, so everything's bunched up and it's swollen right now. So all
Okay,
this will
so all
settle
of that'll
down.
settle
Yeah.
down.
You won't get that chafing anymore,
That's right. Oh, yes.
But right here, it really dived down, like I think beyond your abdominal muscles. That's why I was pulling on you.
This is the moment that I have been waiting for, to finally put my arm down and it's not sitting up. I feel amazing, I feel refreshed, and I just feel brand new.
That what was inside of me, oh my God.
This is the part that was stuck down deep. I had to take it out in pieces. Gave you a little tuck, right?
Look at all of that fat. Wow.
I am going to be so excited and so confident to hit the red carpet, work events, work more in TV and film. I'm just ready to show off the new me.
I'm going to address this lesion conservatively in the beginning. I'm concerned because of the redness there. Is that because it's a little inflamed, or could this even in fact be a vascular growth? I think Jessica is so eager to remove this that she's not really grasping how dangerous this procedure really is. Okay. Just gonna see what we might want to ooze here a little, so we're prepared for that. Does look like a cyst, the regular kind of cyst that we deal with.
Thank God.
Thank goodness this is just an epidermoid cyst, but that does not take away from the fact that she could still lose some movement in the eye here. So I have to still proceed very carefully. What do you think it looks like?
I think it looks like a marshmallow.
A marshmallow? This is one crazy marshmallow.
Ooh.
Good. We're squeezing some of it out. It's definitely a cyst.
Oh my God, I can already feel a difference.
Really?
Yeah.
That's good. You can feel the tension has gone away a little bit?
Yes.
Just trying to squeeze as much of it out as I can. It's not like it's...
Oh.
I'm just squeezing. Oh. Don't you get too upset on me. I'm too close to your eye. I don't want to have to deal with tearing or anything like that.
Yes, ma'am.
Now, I would like you to open your eye for a moment. You don't
It's
see
not
it
there.
anymore. Yeah. But you can still see, right?
Yeah.
Good.
Yep.
Good. Your eyes are so beautiful and blue. We're going to see more of them now. So close your eye again, and I'm going to try to tease the sac out here. I'm going to put a little more numbing around it just so that it's more comfortable. The good news is that Jessica still has full control of her eye muscles, which is fantastic. The not so good news is that I'm not done yet. I still have to remove the rest of this sac entirely, and that takes a lot of precision and a lot of care and a lot of time. I don't want to affect any important nerves under there, but deflating it has really made it easier for me to see what's going on underneath. You're doing great. You're a tough cookie, I can tell, so. Trying to stay as far away from your eye as possible. Just trying to really delicately remove this from the upper edge, closer to your eye. Okay, that looks pretty good. But I do believe that 100% of the cyst is gone. Now, I'm gonna put some stitches right there, okay?
Yes, ma'am.
Jessica did an incredible job. She stayed really still, she stayed really calm, and now I'm designing this scar to be hidden in a natural transition area between her nose skin and her cheek skin. That's gonna help to pull the scar away from her eye, but also make it less perceptible. I'm excited to show you. Okay, ready to take a look?
Oh my God. It's beautiful.
The profile.
It's great.
Yeah, you see the potential.
Yeah, that's crazy. Thank you so much.
Seeing my face in the reflection for the first time with no bump makes me feel elated and grateful and shocked. I haven't seen my face flat like that in a long time. I feel like the monster is gone, for sure.
Here's your marshmallow.
Oh, my goodness. That is gross.
Yeah.
With the decisions that I've made throughout life and the lifestyle that I lived, my goals and my aspirations are just to move on and experience life like I should. I feel like Dr. Lee has given me the opportunity to show that I can be better and I can do better. And I'm already feeling the new beginnings. Thank you very much. Keep changing lives.
Oh, thank you.
Yeah.
You're so sweet. Oh. He's in shock a little bit. I'm I'm here with Dwayne, who has bumps around his nose. This is called multiple trichoepitheliomas. Dwayne is sensitive to needles, but you know, I really have to numb up this last bit here, and he's gotta let me do that, otherwise I can't proceed.
Okay. Okay?
Mm-hmm.
You feel like a pincushion?
Dwayne was able to push through and let me anesthetize him completely. Now the hard part comes though. I need to use my loop cautery tool to really re-sculpt this nose and mouth area.
So, I'm gonna do just a little bit of one here first, just so you know what it's about. You good?
Mm-hmm. I wanna make this area look as natural as possible and bring his cute nose back. This is a delicate surgery. I'm trying to go deep enough, removing all of the trichoepithelioma, but not so deep that I leave him with dips in his skin.
You're comfortable, right?
Mm-hmm. Other than the smell.
Yeah, I know. I'm trying to suction it as much as I can. All right, done on that side.
Good deal.
It's halfway done and it's looking good. Now I need to tackle the other side and make sure that it matches the first side. I need to be really precise. If I do too little, he'll be left with some bumpiness there. If I do too much, it could draw just the same amount of attention as it does now because he'll have a big, noticeable indented scar. It's like Goldilocks. You don't want it too much or too little. You want it to be just right.
You got that big piece off. I'm just trimming it down now. So close. Now we're just doing the cleaning up part. Okay. So I'm gonna have you take a look. Right now it looks a little bit bumpy. It'll smooth down. Even tomorrow you're gonna see a difference. What do you think?
Looks good. I feel amazing. The last time that I had seen my nose smooth was when I was 20 years old. I am confident in myself again, and I'm ready to get back out in the world. Dr. Lee got the job done.
See your little friends there? Or you don't want to feed that to the fish? I bet you catch some fish.
No.
Well, they'll like bait the hook with these. You got a good-looking nose.
Thank you.
You're welcome. All right, you take care, okay?
Yes, ma'am. My life has been shut down because of this. Now, I don't feel like the beast no more. I feel great. I'm ready to show my girlfriend we can start a new chapter in our lives. It's a great feeling.
Ow, ow.
Sorry.
Yeah, that one hurt.
You could not have a baby.
No, I couldn't.
I'm here with Madison, who is a delightful reptile hunter. He is a little squeamish about the needles, so I have to treat him with a little extra TLC. This always happens to the tough guys.
Have you ever seen an iguana hatch?
I have caught freshly newborn babies.
Oh, are they cute?
Oh, they're adorable.
So I'm gonna put stitches right there and we're done with that one.
Wait, what?
Yeah, the big one.
Madison's first cyst popped out like a perfect iguana egg, if that's what iguana eggs look like. He handled it pretty well, but I know he's a sensitive guy, so I still need to continue to distract him so that I can get out the rest.
Christy, do you want to guess what he does for a living?
I don't have any clues.
Yeah, okay, good.
Do you work outside?
Yes.
Do you have to wear a helmet?
No.
I don't know.
Do you want to know what it is?
Yeah.
So I do invasive reptile removal.
Oh, so
that's-
if they're like stuck in a house or somewhere they're not supposed to be, you come in and take them out?
Yeah.
That's so cool.
All right, we're getting there.
I'm glad that my girls are just as intrigued with Madison's job as I am. 2 eggs hatched and 2 to go.
Ow. How long does that numbing stuff last?
Does that really hurt there? Sorry.
It's like a tearing.
I was expecting these squished down bumps to really create scarred up, difficult bumps to remove, but it was like 3 perfect iguana hatches. I hope the last one behaves.
These up here, I think you smushed them down. You know, wearing things on your head like hats.
Well, so I hit my head a lot, so branches and...
Got it. You got very compact pilar cysts here. Oh, sorry, Valerie.
I don't know.
It
What...
didn't get you.
No, it fell on my shoe. I just had to tap it off.
Almost have it all. It's coming, but definitely deceiving me a little bit. The heck, though? This one's got like a cluster.
Yeah.
Take it off, put it here.
I knew there was gonna be one at least smushed in there, but this one actually had 3 of them. They were misbehaving and they really had their direct aim at Val. So in total, there were 6 cysts actually on Madison's head, and I came out clean at least.
Do you want to see what your head looks like? Hold the mirror for you. It's just a little bumpy because there's stitches. They'll flatten down, okay? And now, are you okay? Did I make you cry? What happened? The iguana wrangler is crying.
Nah, big strong man.
They must have really bugged you. Aww.
I'm seeing my smooth head, and it's amazing. It's last time I saw my head look anything near like it does even now was high school. It's awesome.
I just never thought this would happen.
You did great. I'm so proud of you.
I'm looking forward to not being riddled with anxiety every time I leave the house if I forget my hat, or people making fun of me, or can I touch it? It's like a huge weight's been lifted.
So, like I said, I think we shouldn't target this bigger one right here. But I do think we'll get rid of this little bridge you got right here, like this kind of thing, right? There's like a connection.
Yeah, that's a tunnel there.
Chanel's HS is more extensive on her right armpit, but on both sides she has a lot of scarring and a lot of bridges and adhesions on the surface of the skin. So what I'm gonna do is first tackle a lot of the scarring and really kind of open those up so they don't pull on her arm and restrict her movement. But I'm also gonna tackle the smaller pocket on her left side. Let's see how she tolerates the healing process, and if she does really well from this today and it looks great, let's do the bigger one the next time.
So we're gonna turn on that. Wow, this makes it look better already. Looks a lot better. It cleans it up. It makes it more comfortable for you.
I removed all the little skin bridges from Chanel's right armpit. So now I'm gonna remove one of the smaller tunnels from Chanel's left armpit.
Just make sure nothing hurts again. Okay?
Yeah.
Pus is really collected under the skin in this tunnel, and that pressure is what causes the pain. So for me, using this loop cautery and really opening this area up, it releases that pressure, it releases that pain, and the goal is to prevent that tunnel from reforming again.
Take a little break from that. You're doing awesome. I like it.
So what I've done is successfully de-roofed this tunnel that's on her left armpit. As you can see, I'm not stitching this up because you want it to heal in an open position because then the tunnel won't be there.
So let me show you. Took off this cute little, that'll look much nicer. And then over here, we got rid of these. That'll heal really nicely. And this is where it's gonna be the main drain, probably right here.
Okay.
So that looks nicer already, you know? Baby steps, right?
I'm really happy right now that I got some type of treatment, and I'm really confident that it's gonna work. And I'm happy that Dr. Lee was so nice to me, her and the nurses. I just couldn't believe how nice they were.
See how we open that? So by doing this, we're taking that whole top part off and exposing it so there's no tunnel. So if that heals from the underside and the edges, it should heal pretty flat there.
The scars will be way better than, having pus and fluid coming out of my body all the time. So scarring to me is nothing.
You did really great. I think you're gonna see that it's gonna do really well. In the meantime, we'll get you started potentially on a biologic medication that can help this more heal you from the inside.
It's nice to finally have a doctor like Dr. Lee to give me a procedure that's hopefully gonna work, and she believes in it, so I'm confident that I believe in it too.
Okay, I'm gonna start like kind of small. Really try not to disrupt stuff underneath and cause anything to bleed unnecessarily.
I'm here with Virginia, who has this lipoma on the back of her neck. She's had bad reactions to epinephrine, which has been added to numbing medication before. So I'm using the tumescent technique to numb the area, but it is without epinephrine. So I have to be extra careful and extra diligent to control bleeding.
Oh, I see our little friend. A little buzzing sound you're gonna hear. I just wanna be extra cautious with you. Gonna see if it'll squeeze out. Sorry, I might have to buzz you just a little more. I need to keep control of a little oozing here.
This lipoma is not coming out easy, and it is bleeding more. I find myself using a lot more gauze. I can't remember the last time that I've done a surgery without using epinephrine, and this makes me appreciate it so much more.
We're really close now. I feel like we're taking out as many pieces of lipoma as you have foster kids. All right, that feels good. Feels pretty good. Putting some stitches in.
I was able to get out all of Virginia's lipoma and zap all the blood vessels that were oozing along the way. Now I'm gonna stitch her up and send her home so she can focus on her really busy life fostering all those teenagers. I'm so glad that Virginia was able to overcome her fears and come back for a second visit, because second visit is a charm.
See your friend here? You can feel these, see the bumps on top?
As I'm feeling the lipomas, I'm so happy that I'm touching them outside of the body and not inside. This whole process has been a roller coaster ride for me, but because of Dr. Lee, having the surgery was safe and comfortable.
So you can see.
Ooh, that's it.
Hopefully the stress went away with your stress ball.
I'm very excited that the bump is gone after 20 years, and now I can live a normal life. I won't need a stress ball anymore. I plan to enjoy life into the fullest with my foster children. Thank you, Dr. Lee.
All right, so I'm gonna be a little bit more conservative right now. I just wanna see, because if I feel this is connected to any muscle underneath, I mean, we're gonna have to just stitch you right back up here.
I'm here with Steven, who has a very large lipoma on his back, and I'm not quite sure whether it is attached to the muscle at the base. And if it is, that's not something that I really want to mess with.
All right. Still can't feel how connected it is underneath here. Let's see now. I can ease him out of here. Just gonna feel me pushing and pulling on you. Nothing, again, should feel sharp. But let me know if anything is unusual to you. Makes a lot of noises. You know what I liken it to? It's a lot like the ketchup bottle when you can't get that first ketchup out because there's suction, you know, like if there's no air in there. Lipoma is noisy. You might be able to get this out whole. You okay?
Mm-hmm. Just trying to stay awake.
Oh, you can fall asleep. Oh my gosh, you can totally fall asleep. If I can get someone to snore in here, that's awesome.
I'm really happy that this lipoma has this really nice pseudomembrane. It's really well encapsulated, but the deeper base of it is really bound down, and I'm worried it's sort of like this octopus with all these arms, and where are these arms going? Like, where did these arms end? I don't know how long they are, and I don't know how deeply they spread.
He's definitely planted his roots. A third of him out, and he's just looking at us, going, what are you trying to do? I can kind of tell like where the older lipoma is because it's like a different color. It's like darker. Like it looks older. I think we see the old grandpa of this lipoma right now.
The older part, it looks a little more gristled, a little more older and yellow. I feel like that's where I'm coming to ground zero of the lipoma. Possibly the part that has been there the longest. Maybe it's the most attached to his body.
Doing okay, Steven?
You okay? What's up? You sleeping? Are you sleeping? Yeah, okay, I woke him up. Dang it.
Yeah. Sorry.
No, I'm glad you are. I was just making sure you're, breathing. Pretty much all the sides are out, but he's pretty tangled. He's like at that edge where you're like, that fishing line, do I just toss out the whole fishing line or do I try to untangle it?
This lipoma is really frustrating because it is still stuck at a pretty wide base, and I can't see what's going on there because a lot of the lipoma that I've pulled out is now obscuring the vision here because it's really wide and spread out. The good news is the lipoma does not appear to be under the muscle, but it's sort of like I need to cut the head off of this octopus to be able to see where all the fingers are projecting. And I think he's got more than 8 legs.
Sure he doesn't pull on you. That's your goal. Because I'm about to detach him now. Okay, why don't you carefully lift him into that tray. And then leave everything in there, because don't touch it, because it's not sterile right there. But it says here 3 pounds.
Always felt heavier.
Yeah?
You got something fighting you back there?
Yeah, he's fighting us.
It's like when your jewelry gets tied. You're untangling
That's a good
it.
example, yes. Okay, we got it all. Yay, you should have told me you were a tough one.
It turns out that it was very helpful that I cut the head off of this octopus so that I could see what was going on underneath. There is a lot of bleeding down deep at the base, and I have to be really meticulous about cauterizing any blood vessel that bleeds to help control bleeding. And pair this with some really strong sutures to keep this nice and tight. In case a hematoma forms, I don't want the stretching of that to rake open this area. So really firm stitches and good compression is really important.
It looks good. You want to take a look? It's a little bit depressed there because there's numbing all around the outside.
Oh, man.
Yeah, it looks good.
I'm just relieved. I'm happy. Definitely a great feeling.
Yeah, as Dr. Lee was working on me, I was feeling some tugging, but she made me comfortable enough to where I could actually just fall asleep. I mean, it was smooth sailing. She was awesome.
It looks really flat. Now you can say it's like a shark bite or something. Okay, she's gonna put a bandage on you.
It's definitely a life-changing moment for me. Can't be any happier than I am right now. And now, I mean, I might just run around the block with just a tank top on, man.
All right, so you shouldn't feel anything other than us touching you. You don't have to look or anything. We'll look. Okay?
Oh, I don't intend to.
Little baby
Not
pinches
at
here.
all.
Little pinch.
I can
Sorry,
feel
pinch.
that it's numb, but I'm also getting scared.
You doing all right?
Yeah, I feel it.
Feel sharp? I mean, does it hurt though?
No, I just feel that it's cutting.
Okay, good. I want to make sure I'm not hurting you. That's the whole point.
Oh,
so.
no, I probably would have jumped.
Yeah, you would jump probably.
Or the leg would have gone up. That's usually my thing at the dentist, when the leg goes up.
Just gets wet, that's all, because we bathed it in a lovely little bath of saline, of cold saline.
Well, thank goodness. If I didn't know it was water, I would be, oh my God.
It does make your mind go a little crazy. That's why we definitely tell you about those things.
Nobody likes the sight of blood. When I was a kid, I had a nosebleed. And it was a horrible nosebleed because a blood vessel broke.
Oh.
So I couldn't put my head back because I was choking on the clots.
Oh, that's scary.
I hope I'm not talking too much.
No, we want you to talk, because then you know that you're doing all right, right?
And I'm still here.
That you're still breathing.
Yeah.
I love that Catherine is distracted, but I don't think uncontrolled bleeding is the best topic of conversation right now. The good news is that I've been able to tackle a lot of the underside of this lipoma while Catherine's been chatting away. I don't want to be yanking anything besides the lipoma out of here.
You're doing awesome. We almost have it out. I'm just being very, very gentle because you're so thin. You don't have a lot of buffer here. It's almost all teased away.
But you're right, you don't feel it at all.
That's good. That's what I like to hear. Just trying to ease out the last little bit that's tucked under here.
I'm not going to believe this.
You're not going to believe it? You're here. You should believe it. Looks like the shape of Kentucky.
Oh, thank you so much. My joke was I'd lose 5 pounds if this came off, but I don't think it was a 5 pound.
I think it's going to be more like you're going to lose 5 ounces.
5 ounces?
Yeah, I don't think it's...
It was so, you could play with it. It was so pliable.
You can play with something that's 5 ounces.
Yeah,
you know,
5
it's probably
ounces.
like these guys. It's always bigger than they think it is. You know what I mean? Sorry.
Catherine is such a champ. I was able to successfully kick out this Kentucky-shaped lipoma without a hitch.
You want to see what we took? Take a look at your arm.
Oh my goodness.
So you hit that underneath there, right? You got that sexy arm back.
Oh my God, I'm looking at my arm. And it's, where the heck did that go, that big lump? It's like, it's almost completely flat. My arm is almost completely matching my other arm. It's gonna be a pleasure to wear my short sleeve clothes again. I'm excited to dress like summer in the summer.
That looks good, huh? It's gonna...
Oh, thank you.
You look really great.
Now, I can just go out wherever I want. It's gonna feel great, not having to think twice about where I am and what's on my arms.
It was so nice to meet you. You're an absolute pleasure. You're not nervous anymore, right?
No. Dr. Lee is so patient, so gentle. She has a wonderful way of just helping the patient totally relax. My arm is back to normal. This is life-changing.
Let me see what you got here. I'm here today with John, who is the most lovely blind gentleman. He has a history of retinoblastoma. Now, because of his history of retinoblastoma, this may mean that these bumps are more than just a benign growth. So today, I decided that it would be best for me to really tackle one of the bigger ones and see what's under there, see what's going on, if this looks like something really dangerous or suspicious, and also just see how he handles the surgery.
Let's be a regular fat here. Let's see if we have a lipoma.
This is not so bad. This looks like a very typical lipoma. It's not super firm or hard. It doesn't appear to have scarring, no funny textures or colors. But the thing is that it is tough in the sense that it is really caught up in here. It's really tethered in this fine, fibrous netting.
It definitely is not one like full sac, actually. It is kind of wound in with other regular fat. So as you can see, it's like in these little fibrous like net. It's like in this like netting, you know?
Right.
So I'm just trying to free it from there, and I'm also double checking, making sure none of that netting is anything that I, make sure I want to cut. A little bit of pulling and stuff here. You okay?
Yeah.
I'm just pushing. I just don't want to push on your chest too hard.
I'll let you know.
Okay,
Don't worry, Doc.
please do.
Oh, this is good. This is good stuff. That thing is awesome.
There you go.
John,
So your heart is on your chest now, for real.
Is it
Look
really?
at
The size of that thing.
John might have a pretty hairy chest, but he also has this netting of almost hair underneath his skin. So I was able to free this lipoma from this like fibers that were holding it in.
You know, it's had a lot of years to make it its home,
Yeah,
so.
you're gonna be sad a little bit about it, I'm sure.
No.
No.
It's gone, John.
Yeah,
It's gone.
Let's take a look at
Yes.
that. I mean, look how small we made that opening, too.
Oh my goodness.
All right, that made me feel good about this.
It took a little work to get this big bump off of his chest. It was stubborn. It was tough to remove, but I was able to get it off and give his chest a nice, flat, normal contour. So it's really nice that I can take this huge insecurity off his chest.
Almost there.
Goodbye.
The tissue from this growth on his chest, I'm gonna send to the dermatopathologist to have them read it. Let me see whether this is benign or whether it is not, and that will really help me to decide how to proceed properly.
I'm gonna lay a piece of gauze over there to block it if you want to feel.
Holy
Schnikes.
Nike.
That's his
Holy
word.
rainbow
Oh my
cookies.
God.
It's
gone.
It's unbelievable now to feel the difference in not having this lipoma in me, just taking up so much space. I haven't touched my body being flat like this in forever.
Oh my God, John, this thing is so funky looking.
I mean, I thought I had an idea of just how large it is, but now being able to touch it, it's unbelievable. I can't believe this came out of my body.
I wanna do anything that I can to help John, so I think I'm gonna tackle these other lipomas, and the first one I'm gonna do is this giant one on his shoulder.
Make sure I'm never hurting you, right?
Nope.
Good. Oh, here he comes. You okay?
The first and largest lipoma has been removed. Now I'm gonna tackle the one that's really wrapped around his neck.
It's like a lobster. A piece of like a lobster tail.
God, it really, yes.
Thankfully, the second lipoma kind of slipped out like a beautiful little lobster tail. And now I'm gonna tackle the third and final lipoma for today on John's forearm.
Oh, there he is.
So now that I've removed 3 more pretty big lipomas, John can go home feeling a little lighter. I adore you.
Thank you.
You're so much fun. I can't wait to visit you.
The boost that it's going to give me for self-confidence and my self-image can't be spoken, enough.
I'll be talking to you. So nice to see you again. Can I give you a hug?
I'm certainly happy to have had the lipomas removed by Dr. Lee. Am I disappointed that I couldn't get the ones removed from the neck? Yes. But the story's not over, I don't quit.
So I'm gonna do one here first, just to see. You okay?
Even though it's on me, I still don't want it to start squirting everywhere.
I don't want it to squirt either. You've got butter in there. But we're gonna get that little sack out there too. Because they're so oily though, they kind of get like slippery for me. One down.
I would like to see one of them.
Sure, I will show you.
Ew, look like a snake coming out.
Yeah, it's like a little ribbon.
Oh. That
like
was
your reaction.
liquidy. It looks like lotion.
Mm-hmm. Lotion or like some vanilla pudding. Oh, that was a good one. This one's more like linguine. So far, so good. Lynette is actually enjoying a little bit of what we're doing. I'm removing so many of them so far, and she's kind of maybe enjoying how we're likening them to all different kinds of food. But I still have a lot more to go. I've got a lot of snipping, a lot of undermining, a lot of pulling, and let's hope that I can get all of these popped before I get too pooped. That's gonna be okay here. Take a look. Obviously, then we're gonna let those little lines heal. Oh, it's good, right?
It looks awesome.
We're gonna move to the upper part, okay?
Okay.
Ew. That was a cute one.
Mm-hmm.
It's like a dressing on a cake. You wanna watch this last bit? This is the last bit here, okay?
Oh my. That's a lot in there.
I know. It's like interesting how much is trapped under there. Okay. Everything looks great. Okay, I'm finally finished. I was able to tackle pretty much all of the ones on her abdomen and on her chest. I removed all the sacs. They're not gonna come back, so I'm really pleased about that. Most importantly, I'm so happy that I can give Lynette the confidence back that she was lacking because of these steatocystomas. Now you can wear that low cut all the way down to your tummy.
Yes, it's awesome.
I've had these bumps on my skin for 10 or more years, and to be able to look at my body and see them gone, it's a sense of relief.
See you later. Thank you.
Thank you, Dr. Lee. I can live a normal life again.
This is exciting.
When I get home, I'm gonna do a shopping spree. I'm gonna wear a 2-piece, little halter top, little shorts, and most definitely gonna have this stomach sitting out.
Okay, so I'm gonna put a little numbing here. I just wanna take a peek and see what goes on here on top. I don't know whether this is a cyst or a lipoma as I begin. And it's in a really delicate area. There's not a lot of room for error. So I'm gonna take a little peek and see if I can discern this early on to help me decide how I'm gonna proceed. Okay, it's a cyst. How did you have a 30-year cyst here? My goodness, it didn't really change. I know enough not to bet money on these things. This one is porridge.
Cream of wheat, huh? There's a reason I never ate cream of wheat.
Oh, really? I kind of keep everything as pulled far away from your neck as possible. I think it's real close to your important stuff there, and I'm just trying to keep it away while I tease it. I've drained all the porridge-like contents out of this cyst, and so now I'm just left with an empty sac. So I have to gently tease this really thin, adherent sac away from all of his structures that I want to leave there. Okay. Looks like I detached it and I can see the muscles of your neck, but I don't see your windpipe, nor do I want to.
I haven't been able to hit a high G in a while. Did you find it in there?
Jerry's cyst and the sac are out completely. So now I'm gonna stitch him up, and I think he's gonna be really pleased with these results. In fact, I'm hoping he's gonna be so pleased that he's gonna give me a little show outside. You look like 10 years younger. Ready, look at that, I see you do, look.
Wow, that's crazy. It feels like 30 years of weight has just been removed. It's just a pretty incredible feeling. This is something that is not only visually, but definitely emotionally life-changing. The next time I go on stage, I will hold my head up high.
My plan today is to attack from the front and move to the back. In the meantime, I want to keep the mood really nice and light for Amy. I know she's anxious, and we've got a few cysts here to tackle. I think that to remove this one on the front of her forehead would be a great way to start, because I feel like if we built up to that, it would make her even more nervous. That's a nice little pilar cyst. How long have you had this one?
Maybe 6 years? 5 or 6 years?
Well, you had your first baby there. Oh, well, that first baby cyst came out so easily. I love when that happens, when it just goes bloop. Let's hope this big one here, Donald Jr., the one that I named after her boyfriend, Donald, let's hope it's as nice as this little one was. Okay, now we're working on the big one, Donald. Let's see if I should squeeze this a little bit. Look, that is ready. Sorry. Okay. Sometimes I like it when cysts pop out whole, but I equally love it when you can pop and squeeze those contents out. You get to see the fruits of your labor, I suppose. Now I just have to make sure that the entire sac wall is removed in its entirety to make sure that this does not come back. Come on, Donald, let's go. Go, Donald. There's Donald. Well, that one was nice because Donald was well behaved and he came out whole.
Yay.
Right there. Okay. You must be really happy to have these gone. You've been thinking about them. They've been literally on your mind for a while.
Yeah, I've had these forever.
Good, looks good. Okay, now we're going to that last one that was the troublesome one, though. See, there's like another part over here, though.
Underneath again.
And there's like scar tissue right here. So I've tackled the first 3 cysts. Everything's come along smashingly well. But now I'm tackling the 4th cyst, and this is the one that has a little bit of a history. It has been damaged before, it has ruptured under the skin, so I'm suspecting that this one's gonna be the troublemaker. Oof. Oh, I'm sorry.
Yeah, that hurt.
I'm so sorry, it's the edge of it. Let me put some more numbing right there. Oof. Oh, I'm sorry, that's numbing. It's like I think it got damaged and it sort of grew back in pieces. You have a litter over here. It's like buckshot here. Opening up this last cyst for Amy is like opening Amy's Pandora's box. I mean, there are multiple little cysts balled in there, like quintuplets or sextuplets. That one was a little harder to navigate. There was like a litter. But it is really nice to stitch up this last cyst because her scalp is gonna be nice and smooth. Even mini Donald is gone, so now she can be left with her lovely, sweet Donald by her side. The Donald. All right, you wanna reach up and feel those back ones? Just make sure they're gone. It's like a magic trick.
Oh my gosh, it's so flat.
Yes, he took an inch off of you.
That's crazy.
You're gonna be a little shorter.
touching my head for the first time and the bumps aren't there. It's life-changing. So weird.
We took off a little extra skin, that curly skin, and here it
That's
is.
huge.
Right?
Dr. Lee has helped change my life today by just helping free me, honestly, of all this worry and fear, and I feel like I can pretty much do anything now.
We kind of did a little funny thing. Because that one looks so much like your hair.
My doppelganger.
So one little pinch here, okay?
Cylindromas are dome-shaped tumors. It may look a lot like a cyst that you would see me remove commonly, but there's nothing to pop. It's just solid mass.
I need to make sure I can control the bleeding, so I might try to do this one first.
I really want to get this area flush to Elizabeth's scalp, but they're right on top of each other. I have to really delineate each individual stalk and try to remove each stalk one by one. The scalp is very vascular. It likes to bleed very easily, so the foremost thing in my mind is controlling the bleeding.
Okay, let me know if anything hurts. Okay?
Okay.
Yeah, it's so thick right here. Super dense. I can't see under there to be able to get to the whole thing.
The first cylindroma that I want to tackle is right on top of her ear. It really is tightly stuck to her. Like, it's so stuck I can't lift up and see under it.
I'm just gonna try to debulk this a little bit because I won't be able to see what's going on under there.
It's as if Elizabeth has a whole head of cauliflower stuck to her scalp. And so the first thing I'm gonna do is debulk it to be able to see what's going on underneath.
It's very vascular here. The nice thing about using this tool is that it cauterizes at the same time to help minimize bleeding, but it does like to ooze still. Wonder hand.
Oh, did you have wonder hands?
I'm gonna try to shave this down as flush to the skin as possible, but I'm really concerned about the bleeding, and that could really cause some problems.
What I'll do is let me get around here and take this part off here. Let me try to pull down myself here. Bring down here. Quite a production though, this one.
Removing that first cylindroma was definitely not easy, and if all of these cylindromas are going to be like this, this is gonna certainly take more than one visit.
But could I just cut this whole thing off with one quick thing? Because I do see that it's not attached too fiercely to the base here, or too widely to the base. I'm gonna try to lift this up, but I'm gonna try to go from this way, I think. Okay, so. Okay. Make sure nothing hurts.
The next one appears to be more pedunculated, meaning it's attached by a smaller stalk. It hopefully will make it easier to remove.
Going for a bigger one here. I'm gonna try to do it quick. It's so hard to get under there. I did not mess around with that one, I'll tell you that. Let's see. All right, hold that pressure. Do you think if I took that away, it's gonna ooze, maybe?
Yeah, when you move this gauze, it starts to want to bleed again.
Yeah, let me buzz it a little more. Yeah, I agree. I agree. All right, just a cute little nubbin left. I think we need to see how these two do here, because they wanted to bleed a lot. The second one was better. That I didn't take all of it off because it really started to bleed, and I can see some of these they're bluish, so they're filled with some blood vessels.
I think I'm gonna stop for now, but I am really proud of how well Elizabeth has endured this. The next 24 hours is actually where it's the most important. When some of this numbing medication wears off, it's not uncommon for people to really start bleeding.
I want to show you, actually.
Ay, doctora Lee, gracias.
Yeah, a lot of it is better, huh? Because that's going to hide in the back.
Ay, gracias.
That's gonna be much better.
Yes. Cuando la vi que terminó la cirugía, no podía creer que me hubiera quitado tanto. Quería que me hubiera quitado más porque me sentía muy bien. Pero si ella dice que no, pues se respeta. Thank you, Dr. Lee. Thank you so much.
Mucho gracias. No, that's not what I say. De nada. Yes, I said the right thing. Okay.
After a few months, Elizabeth's initial wounds healed up really nicely and didn't bleed too much. So I brought her back to the office to remove more of those big cylindromas.
Are there?
Okay, how about the next one? The second procedure went really smoothly, and I think when these spots heal, Elizabeth is gonna have a really nice improvement.
Uno, dos, tres. Much better.
Thank you.
A little baby pinch here, okay?
Because I'm not really sure exactly what's going on Jamal's tush, I'm going to use the tumescent anesthesia technique. This is where I inject a dilute numbing solution under there, and that's gonna help create a cushion or a little space potentially between this growth and any of the other deeper important structures so that I can separate it from his real tush. I hope that when I make my first incision, it looks like a standard lipoma. I don't want it to be any strange colors. I don't want it to be any strange textures.
All right, let's take this booty off your booty.
Yeah.
Let me just take a little peek first, just to see what you got here. Well, it is definitely fat. Looks like a lipoma, looks like a pretty normal lipoma. Just a very septated lipoma. As you saw, you know, how it had these little dimples in it. Can you squeeze that and just pop it out?
I wish.
Right? It's almost. Mm-hmm. It's not gonna budge, yeah. It's like a sea anemone. Anemone. You got a beautiful butt flower going on right here.
My butt's very romantic.
Yeah, yes, your butt is romantic. I don't say that very often, you know, that's a compliment. You can take it. Why don't you take it from me? Thank you. Well, the bulk of it is gone.
Okay, well, this does look like a good typical lipoma, so that's the great news. But I do not want this thing to grow back. He doesn't want this thing to grow back. I'm trying to clear out the whole lipoma so I don't leave anything behind in Jamal's behind.
I think that it came out really well. It just was really tethered in there, but we got it. I don't know why the 9-year-old thing happened. I feel like it might be independent of what this is, but maybe.
It looks like I was able to successfully remove this lipoma. I'm certainly gonna send a sample of this to confirm that it's a lipoma and that it's not something more concerning, but I can't wait to show him his new booty.
All right, it's looking good. Okay.
Oh, wow. Never been so happy to have a flat butt.
Oh my God. I feel amazing. I feel like a huge weight has been taken off of me.
Here's a little bit of skin we took off.
Whoa.
Your booty has never been this close to your face.
I don't know, after 24 years of dealing with this, I feel like a piece of me is now missing, but like a piece that I don't mind is missing.
Ooh.
Yeah, you feel good.
I like that.
Yeah.
I actually
How we take things for granted. We can't just sit normally, huh?
I actually feel like my back
It's already straighter. You're gonna stand a little taller no matter what. It was really a pleasure. I adore you, okay? And take care of that booty, okay?
Yes,
it's a good looking booty.
Thank you. Dr. Lee, she has an amazing spirit. She made me feel really comfortable. And I'm really grateful for her that she was able to remove the lipoma. Now that this lump is gone, we're gonna be able to be in the studio all the time, sitting all day, making music comfortably. Thank you very much.
Okay, let's see what you got here. Make sure I'm never hurting you, like I said. You okay?
I'm fine.
Good. It's probably a lipoma, I think. Omar's growth feels a little more soft and jelly-like, so I'm gonna go with a lipoma. Maybe not. Maybe it's a cyst.
I think we got ourselves a cyst. I was wrong. Your wife was right. You know what? I bet she's gonna say that I'm always right.
She definitely is.
Does look like a snowball under there. Okay, let's do this. There's snow in there. Take all that from you. Look at this, you did it. You were waiting for over a decade with this. I will just take out the little sack so it won't come back. You okay? Yeah. Just hear me up here. Like a little mouse. I'm like that mouse from that 'Twas a Night Before Christmas. Not a creature was stirring except Dr. Lee like a mouse. Thankfully, that was a nice, obedient little cyst, not a mean lipoma. And I'm gonna leave him with a flat little scar hidden in his forehead lines. Omar's gonna look fantastic from here on out, not just at Christmas. Don't people wanna look great all year long?
That's crazy.
You're gonna look good. Watch out.
That's crazy.
It's looking good.
Thank you.
Oh, you're so welcome. It's a pleasure.
When I looked in the mirror, that was the first time I had seen my head flat in over a decade. I was shocked. Since the bump's gone, I will be a lot more personable, and I feel like I'd be a little more willing to celebrate Christmas with my family.
Yay! It's right next to the scar. I think it was tugging on you down deeper. I can see why that made that sore, actually, after the last ones. Okay, I'm sorry. I'm here with James, and I'm tackling this cyst on his jaw. This is a really delicate area, so I've decided to make a little nick in the surface and really squeeze out some of the contents first. I just want to make this as small and as quick of a procedure as possible. Feeling okay?
No, I know, I was just breathing.
Good, keep breathing. We almost got it all.
That's good.
Yeah, we do. And it's in a nice intact sac. That's what I want to see. I was concerned that because of recent inflammation that the sac wall may be breaking down, but the fact that it's intact makes me feel much more confident that we're going to be able to remove this entirely. The cyst is out.
Good deal, thank you.
It's all gone under there. Okay, we're just gonna put some stitches right here. Fortunately, I was able to remove this sac wall in one entire piece, which is always wonderful. And now I'm just gonna hide this little scar right in his natural smile lines. It's like that.
Oh, it looks great, yeah.
See, we try to hide it in there, but we got it all nice and flat there.
Yeah. I think she's done a good job. I don't think I'm gonna have much of a scar there. It looks really good, better than I was expecting it to look. Thank you,
Take care, okay? This is Dr. Song, by the way, Ricky. Big bumps like this don't usually come out very easily. So it's really nice that Dr. Song is here. She's the future of dermatology. I get a little extra help. She gets a little extra training. It's win-win. And of course, you know you're the boss, right, girl? Let me know if anything ever hurts, okay?
All right.
Okay, so I think this is a lipoma. The way that I saw it, like how it kind of hung down a little bit, was a clue to me, and it was pretty mobile. Right now it's a little stiffer because we did tumescence.
Dr. Lee moves fast, and I try to soak in as much as I possibly can.
You can actually push around, and you could see how we like undermine with our fingers, right?
Yeah, pretty well circumscribed. This is great.
So I'm just pushing around, make sure I'm not hurting you. The tumescent allows me to really be able to take off the little adherent. Yeah, so it looks like a lipoma. How do you feel about that? Are you excited?
I am excited.
Okay, why don't you give it a little squeeze gently there.
Okay.
Oh, yeah, that's fine. There we go, isn't that cute? It's like a baby. Betty here just had twins.
So I'm pretty good at catching babies right now.
It's so heavy here. Get your hold on to it too, thank you.
Working with Dr. Lee is really exciting. There's things here that I've learned that I never got to do in training before. And so to have her teach me along the way is just a complete blessing.
Have that little area underneath you. That thing's heavy, isn't it?
Right.
Dr. Song just got to experience one of the most beautiful, smoothest pops ever. It was so pretty and shiny. It was marbled like a bowling ball that was just recently buffed. I just hope she doesn't think they all pop out this easily.
It's really heavy. Wow. Yeah, right? That took off some weight off your shoulder, making you walk a little crooked.
It was almost the size of my child's head when he was born.
1 pound, 1 ounce here.
I feel relieved, I feel grateful, and I feel a pound lighter.
Looks good, huh?
Oh, wow. When I got to see my shoulder, I just felt so much relief. I'm really excited about this Christmas this year because I'm gonna be able to put the decorations on the house. I'm gonna be able to help decorate the tree. I'm just gonna be more involved than I've been able to be in the past.
You did awesome. Take care, okay? Happy holidays. Merry
You as
Christmas.
well. Merry Christmas to you guys. It's gonna be a great Christmas this year. My excitement alone is going to make everybody around me excited, and that day is just gonna be a really great day.
Oh my gosh. That's nuts. That's huge.
Make sure I'm not hurting you. Try to see if we can get it all. Oh, sorry, Pinchy.
I'm here with a very nervous but very sweet guy, Michael, who has this giant cyst on his head, and I just don't want a big splash to be part of its final performance.
Hey, it's just I can feel it. I just
Yes, no, I'm glad you're telling me.
This bump has really stretched the skin there, and I know that I'm gonna have to take a lot of extra skin there anyway, so why not make a bigger incision, because I know I have to remove that anyway, and try to get this out whole.
It's not so easy, this thing. Because it's so round, I can't see all the way around it. So I have to like change position of you. Can I squeeze it out of that wedge? I thought maybe I could. Sorry, I'm almost done. I almost got the whole thing. I gotta get underneath it.
Did you get it all?
Almost. I have to get the under part of it that's stuck to you. It's right at my eye level. I do like them when we get them out solid. You got it off. Don't you feel lighter?
Yes, I do.
Okay, so now I'm gonna close it so that...
There's not a hole there?
There's a hole here, yeah.
Is there a dent there where I hit my head?
I didn't notice an indention. No, I didn't.
We did it. We finally kicked Michael's cyst off the stage, but now the hard task really begins. This is me trying to close the area nicely, and I want to reorient the skin. I need to keep the rotation of the hair the same, but certainly also remove any kind of bumps that are noticeable.
Does it look good?
I mean, it's gonna look bumpy to you right now, but it's gonna look good. Are you excited?
Yes.
Now, Michael might be down a comedy prop, but he should be smiling and laughing a lot more now that his cyst is retired from the spotlight.
Just bumpy.
Oh, wow, it's totally not bumpy. That is awesome. Wow. Wow, I don't even see a dent. I don't see a bump. I don't see nothing, you know, just smooth head. That's cool.
Here's your friend.
What the hell?
He's got his tongue sticking out.
And his little nose. Oh my God, that is crazier than you don't know what. I totally didn't expect it to look like that.
Do you think there's gonna be some gold coins?
Wow, that's crazy. Yeah, that's enough.
Look what you were holding in your head.
That is so wild.
You know, that hat is retired, right? 'Cause
Yes, it's
this
done.
cyst is done.
Without the bump, it's gonna be a little different. We can still be funny, I guess. I'll try.
The first thing I'm gonna do is really pay very close attention to the concentration of numbing that I'm giving. Robert is on blood thinners due to his heart condition, and so because he has a higher propensity to bleed easily, I have to really have a more dilute concentration of lidocaine and epinephrine in the solution. The epinephrine is gonna help to temporarily constrict some of the local blood vessels, but too much of that can really be toxic to the heart. So there's a really delicate balance here.
I think what I'm gonna do is, because this one's numb, I'm gonna get set up with the cautery.
No problem.
If that one does okay, I'm gonna do the cluster of them.
It's certainly safe for me to start with a few of them. I mean, if they start shooting blood, then I'm just going to cauterize the heck out of it, and we'll see how that goes, and I'll know not to proceed.
Okay, so I numbed this one. You shouldn't feel anything. You let me know if anything hurts, okay?
I decided to use my loop cautery tool. It really kind of burns the area but seals it closed. I really have to determine the best technique, and it sometimes takes a few tries. How deep are these going to go? Are they gonna just kind of easily shell out, or do I have to really dig for them?
You can see how that cuts and cauterizes at the same time.
Yeah. Wow.
So take a look at that. That looks all right. It'll heal. Well, it's not looking like it's oozing. The first one kind of went even better than I expected. So I'm just want to take these off and take a look at what the whole area looks like and then watch it for like a couple minutes.
So the first removal was uneventful, not a lot of bleeding. I got the area pretty flat. So I'm gonna move and extend to a larger patch, and let's see how that goes.
You can turn that off for just a moment.
Oh, wow.
So good thing is I don't see it bleeding, so that's good. The question is, imagine if you have the little orange spots like that. Do you think that that's better than what? I didn't even get to answering.
Tell you that right away.
Yeah, I just want to make sure you know that.
This is way better than any of this.
All right, and let's just start going up the arm here.
Robert is not bleeding, and that is great, but I've never removed this many xanthomas at any sitting. I need to do this very efficiently because I want to remove as many of these as I can, but I don't want to leave him looking worse.
Turn your arm out a little bit here. I'm gonna do this bigger one that we numbed.
Yes, those ones.
Yeah, you don't like these. I'm gonna stretch it a little.
Good.
How many years have you had that, and just watching them kind of come off right in front of your eyes? That must be pretty trippy.
It's a crazy feeling.
Is it?
Ooh, look at that one.
Did it hurt?
No.
Okay, your arms are looking a little different, aren't they? It's starting to look a little different. So far, so good.
Okay, I feel like I'm getting a good handle on this.
So I'm gonna just take this crop off here. It's really like a crop of them.
Now I'm gonna move on to the underside of his forearm. I just have to continue with caution with the amount of numbing that I use because this is a really dense area filled with xanthomas, and it's also really sensitive there.
All right, let's see. Stop for a second. Looks pretty darn good.
From what it was to what it is now, that is a big difference.
Yes, it is.
I look at the pile of bumps that Dr. Lee has removed. I think I see about 100, maybe a little more. I think to myself, I'm shedding myself of all this negative energy that I've held back for so long.
That is crazy.
It's just a wave of relief coming over me that this is actually happening. This actually happened. I feel amazing. I feel like a new person right now because just seeing where Dr. Lee took them off, I couldn't believe that they were gone already.
Dr. Lee surprised me by bringing me out 3 more times to finish the procedures on the rest of my arms. That's a large one. Each treatment took a couple hours, and she removed as many xanthomas as she could.
Moving right along.
Dr. Lee made me feel so relaxed that I didn't have any anxiety.
All right, looks pretty good right now.
Areas that you let heal open, or what we call secondarily, will take longer, but time should continue to heal them.
I think I'm done.
It's been 8 weeks since I've seen Dr. Lee for my last procedure. My arms look incredible. They're smooth, and I feel like a brand new man. Dr. Lee removed hundreds of bumps off my arms. I don't bleed when I bump into stuff. There's no more pain. It's a great feeling.
Ready to get this thing off?
Yes, ma'am.
Did numb you, but if you feel anything, you let me know, okay?
I'm really aware that Alexis experienced a lot of pain during her last procedure when they tried to really aspirate this cyst. So I have to be extra careful and really make sure she feels like she's in control.
It was pierced before. I'm gonna just try to remove that little scar line there, that little puncture that they had. Let me know if anything's ever uncomfortable.
You know I haven't told anyone in my family that I'm here.
You haven't?
Nope. I'm gonna have a party at my house. I'm going to say I have a secret that I've been keeping and I want to tell everybody what it is.
Cysts can come in various shades. I think it has to do with the melanin in our skin. I think that the darker complected you are, the more range and shades your cyst contents can have. You should have a potluck and bring in things that they thought your cyst reminded them of or something. Meatballs or something, I don't know.
Yeah.
Like little appetizers.
Maybe some dip.
Yeah, like a dip that say, this could be what the contents looked like.
I have this chicken queso dip that I do.
Oh, okay. Well, I'm gonna show you what the contents look like, then you can see if you can make something
See
out
if I
of
can,
it.
yeah, if I can get close to it.
Yes. So I'm just gonna feel me pushing around here. I'm just trying to tease the sac wall from your skin. It's always kind of fun to make food analogies during surgery, but boy, Alexis is gonna be pretty surprised when I show her this, because it doesn't look like queso dip. But it did come out nice and smooth, so it's got that going for it. Now my most important job is to carefully remove the cyst sac wall from the surrounding connective tissue. I'm trying to get this sac in one piece, because if I take it out in one piece, and I'm pretty sure I got it all. You okay, right?
Yes,
Can you please tell me? Almost have it, and it's coming out like a little swim cap under there. Got it off? You did awesome. I checked, and it looks like there's nothing left, so now I can sew up Alexa's cheek really nicely, and I can't wait to show her the results. So, you said that you were gonna make something for this pimple potluck that looks like the cyst contents.
Let me see what I can
I don't know what you're gonna make with that.
Oh my God.
You can see why it was that color, huh? It's almost like tar. So that's all just dead skin. Look at that. Skin cells that are smushed in there. Here's the sac. See, we got to tease it. Yeah, that was what was. Oh my God. That's good, because we definitely got the sac this time.
I'm just really excited. Now that the sac is gone, it's not gonna grow back.
Now I'm gonna show you your cheek here.
Oh my God.
Here's your cheek back. Don't cry. Oh, I hope those are tears of joy.
I feel just a complete overall sense of relief. Having the bump changed who I was. And to have Dr. Lee remove it, it just gives me everything that I wanted.
Shouldn't feel anything other than us touching you. I'm sad to see these go. Can't tell you because they felt so nice.
Bye-bye, baby.
Good. That's gonna be okay. You okay over there?
I'm sorry. I'm just always emotional. Watching the procedure, it just made me so emotional that finally there was an answer, and Dr. Lee just made me feel so at ease.
How did you guys meet?
Roller skating.
Roller skating!
He was trying to help me learn how to skate.
Yeah, I kept teaching her. She got better at it, and she had more fun.
Oh, that's nice. I think I've been pretty meticulous about this. That looks good.
Oh my gosh, that's amazing.
I'll also get the results just to confirm with you that I know it's nothing to worry about, but don't lose any sleep over it.
Okay.
Although I'm sad that I'm not gonna be able to stroke Stuart's back anymore, I think that Stuart's gonna heal well and really only have some light scarring, but this is really gonna make Donna happy. Oh, we got it all, I think.
So much better. I was amazed. My back is smooth. I'm very happy. I'm just ecstatic from the high I feel.
That was exciting and fun.
Yes, it
Actually,
was.
yes.
Yes. Now, if people see my back, it doesn't matter.
And now you're not gonna have those. I'm a little sad about it. That's okay.
Yes, well.
I'm just so happy I can, well, I can't touch it now, but it's gonna be nice.
I'll have to fight her from putting her hands on me.
All
All right, we think this is a lipoma. Make sure nothing ever hurts. I'm just gonna take a little peek at it.
Ooh.
Oh, I'm sorry, that pinches. I'm sorry.
I'm here with Elaine, who has this big growth on her left side, and I do see veins there in a really threatening position, so I want to make sure I minimize bleeding. And she does have a lot of sensitivity in the area, so really making sure she's nice and comfortably numb is really important.
It's all tucked around it, which is a good sign, which means it might be solid and pop out. Come on. Okay, let's squeeze it. It might squirt at us. Ready? All right, that's a pretty one. You're gonna be excited to see this cute friend of yours. We're cutting you off, lipoma. Don't get all excited about oozing on us.
That was a very smooth pop, but there are a lot of blood vessels here that I need to cauterize really meticulously so that she does not have a bleed.
See, what I'm trying to decide to do is take off part of it first. You can see it's like almost older here. Just hold it. Oh, this is heavy.
This lipoma came out initially really pretty, but it's very stuck at the base, and that's why I really had to lop the beautiful top young part off so that I could take a better look at what's going on down underneath.
We got most of him off.
It's giving you a tough time, huh?
It is diving down towards your abdomen. Maybe is it split in your abdominal wall? Is it like occupied with your muscles? Because I got the whole top of it. I think part of it might dive down underneath, but I don't think I can pursue that because I think it's going down straight towards your insides, and I don't go that way. It doesn't mean that something's going to come back. I think it looks great right now, and I just got to take off this extra skin. Like I said, you don't want a pocket here.
Okay.
A pretty good piece of skin here. It's almost like you're having a little side plasty, an abdominal plasty. Give that to you. All right, now I'm gonna get ready to put in stitches, and then we're done.
It looks so good.
It's possible that there's a little piece of lipoma that escaped my grips and is tucked in behind her tummy muscles and hiding from us. But never fear, if this thing shows its face again, I'll be right there just ready to snatch it away from her. Time to stitch Elaine up and send her home with one less boob.
All right, you ready for that? Okay.
Yeah, okay.
Because obviously you're sitting down, so everything's bunched up and it's swollen right now. So all this will settle down. You won't get that chafing anymore,
That's
right?
Oh, yes.
Okay. But right here, it really dived down, like I think beyond your abdominal muscles. That's why I was pulling on you.
This is the moment that I have been waiting for, to finally put my arm down and it's not sitting up. I feel amazing, I feel refreshed, and I just feel brand new.
That what was inside of me, oh my God.
This is the part that was stuck down deep. I had to take it out in pieces, give you a little tuck, right?
Look at all of that fat. Wow.
I am going to be so excited and so confident to hit the red carpet, work events, work more in TV and film. I'm just ready to show off the new me.
I'm going to address this lesion conservatively in the beginning. I'm concerned because of the redness there. Is that because it's a little inflamed, or could this even in fact be a vascular growth? I think Jessica is so eager to remove this that she's not really grasping how dangerous this procedure really is.
Okay. Just gonna see what we might want to ooze here a little, so we're prepared for that. Does look like a cyst, the regular kind of cyst that we deal with.
Thank God.
Thank goodness this is just an epidermoid cyst, but that does not take away from the fact that she could still lose some movement in the eye here. So I have to still proceed very carefully.
What do you think it looks like?
I think it looks like a marshmallow.
A marshmallow? This is one crazy marshmallow.
Ooh.
Good. We're squeezing some of it out. It's definitely a cyst.
Oh my God, I can already feel a difference.
Really?
Yeah.
That's good. You can feel the tension has gone away a little bit?
Yes.
Just trying to squeeze as much of it out as I can. It's not like it's... I'm just squeezing. Oh. Don't you get too upset on me. I'm too close to your eye. I don't want to have to deal with tearing or anything like that.
Yes, ma'am.
Now, I would like you to open your eye for a moment. You don't
It's
see
not
it
there.
anymore. Yeah. But you can still see, right?
Yeah.
Good.
Yep.
Good. Your eyes are so beautiful and blue. We're going to see more of them now. So close your eye again, and now I'm going to try to tease the sac out here. I'm going to put a little more numbing around it just so that it's more comfortable.
The good news is that Jessica still has full control of her eye muscles, which is fantastic. The not so good news is that I'm not done yet. I still have to remove the rest of this sac entirely, and that takes a lot of precision and a lot of care and a lot of time. I don't want to affect any important nerves under there, but deflating it has really made it easier for me to see what's going on underneath.
You're doing great. You're a tough cookie, I can tell, so. Trying to stay as far away from your eye as possible. Just trying to really delicately remove this from the upper edge, closer to your eye. Okay, that looks pretty good. But I do believe that 100% of the cyst is gone. Now, I'm gonna put some stitches right there, okay?
Yes, ma'am.
Jessica did an incredible job. She stayed really still, she stayed really calm, and now I'm designing this scar to be hidden in a natural transition area between her nose skin and her cheek skin. That's gonna help to pull the scar away from her eye, but also make it less perceptible.
I'm excited to show you. Okay, ready to take a look?
Oh my God. It's beautiful.
The profile.
It's great.
Yeah, you see the potential.
Yeah, that's crazy. Thank you so much. Seeing my face in the reflection for the first time with no bump makes me feel elated and grateful and shocked. I haven't seen my face flat like that in a long time. I feel like the monster is gone, for sure.
Here's your marshmallow.
Oh, my goodness. That is gross.
Yeah.
With the decisions that I've made throughout life and the lifestyle that I lived, my goals and my aspirations are just to move on and experience life like I should. I feel like Dr. Lee has given me the opportunity to show that I can be better and I can do better. And I'm already feeling the new beginnings. Thank you very much. Keep changing lives.
Oh, thank you.
Yeah.
You're so sweet. Oh. He's in shock a little bit.
I'm here with Dwayne, who has bumps around his nose. This is called multiple trichoepitheliomas. Dwayne is sensitive to needles, but you know, I really have to numb up this last bit here, and he's gotta let me do that, otherwise I can't proceed.
Okay. Okay?
Mm-hmm.
You feel like a pincushion?
Dwayne was able to push through and let me anesthetize him completely. Now the hard part comes though. I need to use my loop cautery tool to really re-sculpt this nose and mouth area.
So, I'm gonna do just a little bit of one here first, just so you know what it's about. You good?
Mm-hmm. I wanna make this area look as natural as possible and bring his cute nose back. This is a delicate surgery. I'm trying to go deep enough, removing all of the trichoepithelioma, but not so deep that I leave him with dips in his skin.
You're comfortable, right?
Mm-hmm. Other than the smell.
Yeah, I know. I'm trying to suction it as much as I can. All right, done on that side.
Good deal.
It's halfway done and it's looking good. Now I need to tackle the other side and make sure that it matches the first side. I need to be really precise. If I do too little, he'll be left with some bumpiness there. If I do too much, it could draw just the same amount of attention as it does now because he'll have a big, noticeable indented scar. It's like Goldilocks. You don't want it too much or too little. You want it to be just right.
You got that big piece off. I'm just trimming it down now. So close. Now we're just doing the cleaning up part. Okay. So I'm gonna have you take a look. Right now it looks a little bit bumpy. It'll smooth down. Even tomorrow you're gonna see a difference. What do you think?
Looks good. I feel amazing. The last time that I had seen my nose smooth was when I was 20 years old. I am confident in myself again, and I'm ready to get back out in the world. Dr. Lee got the job done.
See your little friends there? Or you don't want to feed that to the fish? I bet you catch some fish with this.
No.
No?
feel like bait the hook with these. You got a good-looking nose.
Thank you.
You're welcome. All right, you take care, okay?
Yes, ma'am. My life has been shut down because of this. Now, I don't feel like the beast no more. I feel great. I'm ready to show my girlfriend we can start a new chapter in our lives. It's a great feeling.
Ow, ow.
Sorry.
Yeah, that one hurt.
You could not have a baby.
No, I couldn't.
I'm here with Madison, who is a delightful reptile hunter. He is a little squeamish about the needles, so I have to treat him with a little extra TLC. This always happens to the tough guys.
Have you ever seen an iguana hatch?
I have caught freshly newborn babies.
Oh, are they cute?
Oh, they're adorable.
So I'm gonna put stitches right there and we're done with that one.
Wait, what?
Yeah, the big one.
Madison's first cyst popped out like a perfect iguana egg, if that's what iguana eggs look like. He handled it pretty well, but I know he's a sensitive guy, so I still need to continue to distract him so that I can get out the rest. Christy, do you want to guess what he does for a living?
I don't have any clues.
Yeah, okay, good.
Do you work outside?
Yes.
Do you have to wear a helmet?
No.
I don't know.
Do you want to know what it is?
Yeah.
So I do invasive reptile removal.
Oh, so
that's-
if they're like stuck in a house or somewhere they're not supposed to be, you come in and take them out?
Yeah.
That's so cool.
All right, we're getting there.
I'm glad that my girls are just as intrigued with Madison's job as I am. 2 eggs hatched and 2 to go.
Ow. How long does that numbing stuff last?
Does that really hurt there? Sorry.
It's like a tearing.
I was expecting these squished down bumps to really create scarred up, difficult bumps to remove, but it was like 3 perfect iguana hatches. I hope the last one behaves.
These up here, I think you smushed them down. You know, wearing things on your head like hats.
Well, so I hit my head a lot, so branches and...
Got it. You got very compact pilar cysts here. Oh, sorry, Valerie.
I don't know
It
what...
didn't get you.
No, it fell on my shoe. I just had to tap it off.
Almost have it all. It's coming, but definitely deceiving me a little bit. The heck, though? This one's got like a cluster.
Yeah.
Take it off, put it here.
I knew there was gonna be 1 at least smushed in there, but this one actually had 3 of them. They were misbehaving and they really had their direct aim at Val. So in total, there were 6 cysts actually on Madison's head, and I came out clean at least.
Do you want to see what your head looks like? Hold the mirror for you. It's just a little bumpy because there's stitches. They'll flatten down, okay? And now, are you okay? Did I make you cry? What happened? The iguana wrangler is crying.
Nah, big strong man.
They must have really bugged you. Oh.
I'm seeing my smooth head, and it's amazing. It's... Last time I saw my head look anything near like it does even now was high school. It's awesome.
I just never thought this would happen.
You did great. I'm so proud of you.
I'm looking forward to not being riddled with anxiety every time I leave the house if I forget my hat, or people making fun of me, or can I touch it? It's like a huge weight's been lifted.
So, like I said, I think we shouldn't target this bigger one right here. But I do think we'll get rid of this little bridge you got right here, like this kind of thing, right? There's like a
that's
connection.
a tunnel there.
Chanel's HS is more extensive on her right armpit, but on both sides she has a lot of scarring and a lot of bridges and adhesions on the surface of the skin. So what I'm gonna do is first tackle a lot of the scarring and really kind of open those up so they don't pull on her arm and restrict her movement. But I'm also gonna tackle the smaller pocket on her left side. Let's see how she tolerates the healing process, and if she does really well from this today and it looks great, let's do the bigger one the next time.
So, we're gonna turn on that. Oh, this makes it look better already.
looks a lot better. It cleans it up. It makes it more comfortable for you.
I removed all the little skin bridges from Chanel's right armpit, so now I'm gonna remove one of the smaller tunnels from Chanel's left armpit.
Just make sure nothing hurts again. Okay?
Yeah.
Pus is really collected under the skin in this tunnel, and that pressure is what causes the pain. So for me, using this loop cautery and really opening this area up, it releases that pressure, it releases that pain, and the goal is to prevent that tunnel from reforming again.
Take a little break from that. You're doing awesome. I like it.
So what I've done is successfully de-roofed this tunnel that's on her left armpit. As you can see, I'm not stitching this up because you want it to heal in an open position because then the tunnel won't be there.
So let me show you. Took off this cute little, that'll look much nicer. And then over here, we got rid of these. That'll heal really nicely. And this is where it's gonna be the main drain, probably right here. Okay. So that looks nicer already, you know? Baby steps, right?
I'm really happy right now that I got some type of treatment, and I'm really confident that it's gonna work. And I'm happy that Dr. Lee was so nice to me, her and the nurses. I just couldn't believe how nice they were.
See how we open that? So by doing this, we're taking that whole top part off and exposing it so there's no tunnel. So if that heals from the underside and the edges, it should heal pretty flat there.
The scars will be way better than, having pus and fluid coming out of my body all the time. So scarring to me is nothing.
You did really great. I think you're gonna see that it's gonna do really well. In the meantime, we'll get you started potentially on a biologic medication that can help this more heal you from the inside.
It's nice to finally have a doctor like Dr. Lee to give me a procedure that's hopefully gonna work, and she believes in it, so I'm confident that I believe in it too.
Okay, I'm gonna start like kind of small. Really try not to disrupt stuff underneath and cause anything to bleed unnecessarily.
I'm here with Virginia, who has this lipoma on the back of her neck. She's had bad reactions to epinephrine, which has been added to numbing medication before. So I'm using the tumescent technique to numb the area, but it is without epinephrine. So I have to be extra careful and extra diligent to control bleeding.
Oh, I see our little friend. Little buzzing sound you're gonna hear. I just wanna be extra cautious with you. Gonna see if it'll squeeze out. Sorry, I might have to buzz you just a little more. I need to keep control of the little oozing here.
This lipoma is not coming out easy, and it is bleeding more. I find myself using a lot more gauze. I can't remember the last time that I've done a surgery without using epinephrine, and this makes me appreciate it so much more.
We're really close now. I feel like we're taking out as many pieces of lipoma as you have foster kids. All right, that feels good. Feels pretty good. Putting some stitches in.
I was able to get out all of Virginia's lipoma and zap all the blood vessels that were oozing along the way. Now I'm gonna stitch her up and send her home so she can focus on her really busy life fostering all those teenagers. I'm so glad that Virginia was able to overcome her fears and come back for a second visit, because second visit is a charm.
See your friend here? You can feel these, see the bumps on top?
As I'm feeling the lipomas, I'm so happy that I'm touching them outside of the body and not inside. This whole process has been a roller coaster ride for me, but because of Dr. Lee, having the surgery was safe and comfortable.
So you can see.
Ooh, that's it.
Hopefully the stress went away with your stress ball.
I'm very excited that the bump is gone after 20 years, and now I can live a normal life. I won't need a stress ball anymore. I plan to enjoy life into the fullest with my foster children. Thank you, Dr. Lee.
All right, so I'm gonna be a little bit more conservative right now. I just wanna see, because if I feel this is connected to any muscle underneath, I mean, we're gonna have to just stitch you right back up here.
I'm here with Steven, who has a very large lipoma on his back, and I'm not quite sure whether it is attached to the muscle at the base. And if it is, that's not something that I really wanna mess with.
Still can't feel how connected it is underneath here. Let's see now if I can ease them out of here. Just gonna feel me pushing and pulling on you. Nothing, again, should feel sharp. But let me know if anything is unusual to you. Makes a lot of noises. You know what I liken it to? It's a lot like the ketchup bottle when you can't get that first ketchup out because there's suction, you know, like if there's no air in there. Lipoma is noisy. You might be able to get this out whole. You okay?
Mm-hmm. Just trying to stay awake.
Oh, you can fall asleep. Oh my gosh, you can totally fall asleep. If I can get someone to snore in here, that's awesome.
I'm really happy that this lipoma has this really nice pseudomembrane. It's really well encapsulated, but the deeper base of it is really bound down, and I'm worried it's sort of like this octopus with all these arms, and where are these arms going? Like, where did these arms end? I don't know how long they are, and I don't know how deeply they spread.
He's definitely planted his roots. A third of him out, and he's just looking at us, going, what are you trying to do? I can kind of tell, like, where the older lipoma is because it's like a different color. It's like darker. Like, it looks older. I think we see the old grandpa of this lipoma right now.
The older part, it looks a little more gristled, a little more older and yellow. I feel like that's where I'm coming to ground zero of the lipoma. Possibly the part that has been there the longest. Maybe it's the most attached to his body.
Doing okay, Steven?
You okay? What's up? You sleeping? Are you sleeping? Yeah, okay, I woke him up. Dang it.
Yeah. Sorry.
No, I'm glad you are. I was just making sure you're, you know, breathing. Pretty much all the sides are out, but he's pretty tangled. He's like at that edge where you're like, that fishing line, do I just toss out the whole fishing line or do I try to untangle it?
This lipoma is really frustrating because it is still stuck at a pretty wide base, and I can't see what's going on there because a lot of the lipoma that I've pulled out is now obscuring the vision here because it's really wide and spread out. The good news is the lipoma does not appear to be under the muscle, but it's sort of like I need to cut the head off of this octopus to be able to see where all the fingers are projecting. And I think he's got more than 8 legs.
Sure he doesn't fall on you. That's your goal. Because I'm about to detach him now. Okay, why don't you carefully lift him into that tray. And then leave everything in there, because don't touch it, because it's not sterile right there. But it says here 3 pounds.
Always felt heavier.
Yeah?
You got something fighting you back there?
Yeah, he's fighting us.
It's like when your jewelry gets tied. You're untangling
That's a
it.
good example, yes. Okay, we got it all. Yay, you should have told me you were a tough one.
It turns out that it was very helpful that I cut the head off of this octopus so that I could see what was going on underneath. There is a lot of bleeding down deep at the base, and I have to be really meticulous about cauterizing any blood vessel that bleeds to help control bleeding. And pair this with some really strong sutures to keep this nice and tight. In case a hematoma forms, I don't want the stretching of that to rake open this area. So really firm stitches and good compression is really important.
It looks good. You want to take a look? It's a little bit depressed there because there's numbing all around the outside.
Oh, man.
Yeah, it looks good.
I'm just relieved. I'm happy. Definitely a great feeling.
Yeah, as Dr. Lee was working on me, I was feeling some tugging, but she made me comfortable enough to where I could actually just fall asleep. I mean, it was smooth sailing. She was awesome.
It looks really flat. Now you can say it's like a shark bite or something. Okay, she's gonna put a bandage on you.
It's definitely a life-changing moment for me. Can't be any happier than I am right now. And now, I mean, I might just run around the block with just a tank top on, man.
All right, so you shouldn't feel anything other than us touching you. You don't have to look or anything. We'll look. Okay?
Oh, I don't intend to.
Little baby
Not
pinches
at
here.
all.
Little pinch.
I can
Sorry,
feel
pinch.
that it's numb, but I'm also getting scared.
You doing all right?
Yeah, I feel it.
Feel sharp? I mean, does it hurt though?
No, I just feel that it's cutting.
Okay, good. I want to make sure I'm not hurting you. That's the whole point.
Oh,
so.
no, I probably would have.
Yeah, you would jump probably.
Or the leg would have gone up. That's usually my thing at the dentist, when the leg goes up.
Just gets wet, that's all, because we bathed it in a lovely little bath of saline, of cold saline.
Well, thank goodness.
Do you
I
feel?
didn't know it was water,
yeah,
I would be,
that's
oh
the
my
thing.
God.
It does make your mind go a little crazy. That's why we definitely tell you about those things.
Nobody likes the sight of blood. When I was a kid, I had a nosebleed. And it was a horrible nosebleed because a blood vessel broke.
Oh.
So I couldn't put my head back because I was choking on the clots.
Oh, that's scary.
I hope I'm not talking too much.
No, we want you to talk, because then you know that you're doing all right, right?
And I'm still here.
That you're still breathing.
Yeah.
I love that Catherine is distracted, but I don't think uncontrolled bleeding is the best topic of conversation right now. The good news is that I've been able to tackle a lot of the underside of this lipoma while Catherine's been chatting away. I don't want to be yanking anything besides the lipoma out of here.
You're doing awesome. We almost have it out. I'm just being very, very gentle because you're so thin. You don't have a lot of buffer here. It's almost all teased away.
But you're right, you don't feel it at all.
That's good. That's what I like to hear. Just trying to ease out the last little bit that's tucked under here.
I'm not going to believe this.
You're not going to believe it? You're here. You should believe it. Looks like the shape of Kentucky.
Oh, thank you so much. And my joke was I'd lose 5 pounds if this came off, but I don't think it was a 5 pound.
I think it's going to be more like you're going to lose 5 ounces.
5 ounces?
Yeah, I don't think it's...
It was so, you could play with it. It was so pliable.
You can play with something that's 5 ounces.
Yeah,
you know,
5
it's
ounces.
probably like these guys. It's always bigger than they think it is. You know what I mean? Sorry.
Catherine is such a champ. I was able to successfully kick out this Kentucky-shaped lipoma without a hitch.
You want to see what we took? Take a look at your arm.
Oh, my goodness.
So you hit that underneath there, right? You got that sexy arm back.
Oh my God, I'm looking at my arm. And it's, where the heck did that go, that big, big lump? It's like, it's almost completely flat. My arm is almost completely matching my other arm. It's gonna be a pleasure to wear my short sleeve clothes again. I'm excited to dress like summer in the summer.
That looks good, huh? It's gonna...
Oh, thank you.
You look really great.
Now, I can just go out wherever I want. It's gonna feel great not having to think twice about where I am and what's on my arms.
It was so nice to meet you. You're an absolute pleasure. You're not nervous anymore, right?
No. Dr. Lee is so patient, so gentle. She has a wonderful way of just helping the patient totally relax. My arm is back to normal. This is life-changing.
Let me see what you got here. I'm here today with John, who is the most lovely blind gentleman. He has a history of retinoblastoma. Now, because of his history of retinoblastoma, this may mean that these bumps are more than just a benign growth. So today, I decided that it would be best for me to really tackle one of the bigger ones and see what's under there, see what's going on, if this looks like something really dangerous or suspicious, and also just see how he handles the surgery.
We have regular fat here. Let's see if we have a lipoma.
This is not so bad. This looks like a very typical lipoma. It's not super firm or hard. It doesn't appear to have scarring, no funny textures or colors. But the thing is that it is tough in the sense that it is really caught up in here. It's really tethered in this fine, fibrous netting.
It definitely is not one like full sac, actually. It is kind of wound in with other regular fat. So as you can see, it's like in these little fibrous like net. It's like in this like netting, you know?
Right.
So I'm just trying to free it from there, and I'm also double checking, making sure none of that netting is anything that I, make sure I want to cut. A little bit of pulling and stuff here. You okay?
Yeah.
I'm just pushing. I just don't want to push on your chest too hard.
I'll let you know.
Okay,
Don't worry,
please
Doc.
do.
Oh, this is good. This is good stuff. That thing is awesome.
There you go.
John,
So your heart is on your chest now, for real.
Look at
Getting
the
out on
size
that
of
side.
that thing.
John might have a pretty hairy chest, but he also has this netting of almost hair underneath his skin. So I was able to free this lipoma from this like fibers that were holding it in.
You know, it's had a lot of years to make it its home,
Yeah,
so.
you're gonna be sad a little bit about it, I'm sure.
No.
No.
It's gone, John.
Yeah,
It's gone.
Let's take a look.
Yes.
I mean, look how small we made that opening. Too.
Oh my goodness.
All right, that made me feel good about this.
It took a little work to get this big bump off of his chest. It was stubborn. It was tough to remove, but I was able to get it off and give his chest a nice, flat, normal contour. So it's really nice that I can take this huge insecurity off his chest.
Almost there.
Goodbye.
The tissue from this growth on his chest, I'm gonna send to the dermatopathologist to have them read it. Let me see whether this is benign or whether it is not, and that will really help me to decide how to proceed properly.
I'm gonna lay a piece of gauze over there to block it if you want to feel.
Holy
Schnikes.
Nikes.
That's his
Holy
word.
rainbow
Oh
cookies.
It's gone. It's unbelievable now to feel the difference in not having this lipoma in me, just taking up so much space. I haven't touched my body being flat like this in forever.
Oh my God, John, this thing is so funky looking.
I mean, I thought I had an idea of just how large it is, but now being able to touch it, it's unbelievable. I can't believe this came out of my body.
I wanna do anything that I can to help John, so I think I'm gonna tackle these other lipomas, and the first one I'm gonna do is this giant one on his shoulder.
Make sure I'm never hurting you, right?
Nope.
Good. Oh, here he comes. You okay?
The first and largest lipoma has been removed. Now I'm gonna tackle the one that's really wrapped around his neck.
It's like a lobster. A piece of like a lobster tail.
It really, yes.
Thankfully, the second lipoma kind of slipped out like a beautiful little lobster tail. And now I'm gonna tackle the third and final lipoma for today on John's forearm.
Oh, there he is.
So now that I've removed 3 more pretty big lipomas, John can go home feeling a little lighter.
I adore you.
Thank you.
You're so much fun. I can't wait to visit you.
The boost that it's going to give me for self-confidence and my self-image can't be spoken, enough.
I'll be talking to you. So nice
Thank
to see
you
you
again.
Can I
Same
give you a
here.
hug?
I'm certainly happy to have had the lipomas removed by Dr. Lee. Am I disappointed that I couldn't get the ones removed from the neck? Yes. But the story's not over, I don't quit.
So I'm gonna do one here first, just to see. You okay?
Even though it's on me, I still don't want it to start squirting everywhere.
I don't want it to squirt either. You've got butter in there. But we're gonna get that little sack out there too. Because they're so oily though, they kind of get like slippery for me. One down.
I would like to see one of them.
Sure, I will show you.
Ew, look like a snake covered out.
Yeah, it's like a little ribbon.
Oh. That
like
was
your reaction.
liquidy. It looks like lotion.
Mm-hmm. Lotion or like some vanilla pudding. Oh, that was a good one. This one's more like linguine.
So far, so good. Lynette is actually enjoying a little bit of what we're doing. I'm removing so many of them so far, and she's kind of maybe enjoying how we're likening them to all different kinds of food. But I still have a lot more to go. I've got a lot of snipping, a lot of undermining, a lot of pulling, and let's hope that I can get all of these popped before I get too pooped.
That's gonna be okay here. Take a look. Obviously, then we're gonna let those little lines heal. That looks good, right? You're
It
seeing
looks
that.
awesome.
We're gonna move to the upper part, okay?
Okay.
That was a cute one. It's like a dressing on a cake.
You wanna watch this last bit? This is the last bit here, okay?
Oh, my. That's a lot in there.
I know, it's like interesting how much is trapped under there. Okay, everything looks great.
Okay, I'm finally finished. I was able to tackle pretty much all of the ones on her abdomen and on her chest. I removed all the sacs. They're not gonna come back, so I'm really pleased about that. Most importantly, I'm so happy that I can give Lynette the confidence back that she was lacking because of these steatocystomas.
Now you can wear that low cut all the way down to your tummy.
Yes, it's awesome.
I've had these bumps on my skin for 10 or more years, and to be able to look at my body and see them gone, it's a sense of relief.
See you later. Thank you.
Thank you, Dr. Lee. I can live a normal life again.
This is exciting.
When I get home, I'm gonna do a shopping spree. I'm gonna wear a two-piece, little halter top, little shorts, and most definitely gonna have this stomach sitting out.
Okay, so I'm gonna put a little numbing here. I just wanna take a peek and see what goes on here on top.
I don't know whether this is a cyst or a lipoma as I begin. And it's in a really delicate area. There's not a lot of room for error. So I'm gonna take a little peek and see if I can discern this early on to help me decide how I'm gonna proceed.
Okay, it's a cyst. How did you have a 30-year cyst here? My goodness, it didn't really change. I know enough not to bet money on these things. This one is porridge.
Cream of wheat, huh? There's a reason I never ate cream of wheat.
Oh, really? I kind of keep everything as pulled far away from your neck as possible. I think it's real close to your important stuff there, and I'm just trying to keep it away while I tease it.
I've drained all the porridge-like contents out of this cyst, and so now I'm just left with an empty sac. So I have to gently tease this really thin, adherent sac away from all of his structures that I want to leave there.
Okay. Looks like I detached it, and I can see the muscles of your neck, but I don't see your windpipe, nor do I want to.
I haven't been able to hit a high G in a while. Did you find it in there?
Jerry's cyst and the sac are out completely. So now I'm gonna stitch him up, and I think he's gonna be really pleased with these results. In fact, I'm hoping he's gonna be so pleased that he's gonna give me a little show outside.
You look like 10 years younger. Ready, look at that. I see you do. Look.
Wow, that's crazy. It feels like 30 years of weight has just been removed. It's just a pretty incredible feeling. This is something that is not only visually, but definitely emotionally life-changing. The next time I go on stage, I will hold my head up high.
My plan today is to attack from the front and move to the back. In the meantime, I want to keep the mood really nice and light for Amy. I know she's anxious, and we've got a few cysts here to tackle. I think that to remove this one on the front of her forehead would be a great way to start, because I feel like if we built up to that, it would make her even more nervous.
That's a nice little pilar cyst. How long have you had this one?
Maybe 6 years? 5 or 6 years?
Well, you had your first baby there.
Oh, well, that first baby cyst came out so easily. I love when that happens, when it just goes bloop. Let's hope this big one here, Donald Jr., the one that I named after her boyfriend, Donald, let's hope it's as nice as this little one was.
Okay, now we're working on the big one, Donald. Let's see if I should squeeze this a little bit. Look, that is ready. Sorry. Okay.
Sometimes I like it when cysts pop out whole, but I equally love it when you can pop and squeeze those contents out. You get to see the fruits of your labor, I suppose. Now I just have to make sure that the entire sac wall is removed in its entirety to make sure that this does not come back.
Donald. It's good. Go, Donald. There's Donald. Well, that one was nice because Donald was well behaved and he came out whole.
Yay.
Right there. Okay. You must be really happy to have these gone. You've been thinking about them. They've been literally on your mind for a while.
Yeah, I've had these forever.
Looks good. Okay, now we're going to that last one that was the troublesome one, though. See, there's like another part over here, though.
Underneath again.
And there's like scar tissue right here.
So I've tackled the first 3 cysts. Everything's come along smashingly well. But now I'm tackling the 4th cyst, and this is the one that has a little bit of a history. It has been damaged before, it has ruptured under the skin, so I'm suspecting that this one's gonna be the troublemaker. Oof. I'm sorry.
Yeah, that hurt.
I'm so sorry, it's the edge of it. Let me put some more numbing right there. Oof. I'm sorry, that's numbing. It's like I think it got damaged and it sort of grew back in pieces. You have a litter over here. It's like buckshot here.
Opening up this last cyst for Amy is like opening Amy's Pandora's box. I mean, there are multiple little cysts balled in there, like quintuplets or sextuplets.
That one was a little harder to navigate. There was like a litter.
But it is really nice to stitch up this last cyst because her scalp is gonna be nice and smooth. Even mini Donald is gone, so now she can be left with her lovely, sweet Donald by her side. The Donald.
All right. You want to reach up and feel those back ones? Just make sure they're gone. It's like a magic trick.
Oh my gosh, that's so flat.
Yes. It took 1 inch off of you.
That's crazy.
You're gonna be a little shorter.
Touching my head for the first time and the bumps aren't there, it's life-changing. So weird.
We took off a little extra skin, that curly skin, and here it is.
That's huge.
Right?
Dr. Lee has helped change my life today by just helping free me, honestly, of all this worry and fear, and I feel like I can pretty much do anything now.
We kind of did a little funny thing. Because that one looks so much like your hair.
My doppelganger.
So one little pinch here, okay?
Cylindromas are dome-shaped tumors. It may look a lot like a cyst that you would see me remove commonly, but there's nothing to pop. It's just solid mass.
I need to make sure I can control the bleeding, so I might try to do this one first.
I really want to get this area flush to Elizabeth's scalp, but they're right on top of each other. I have to really delineate each individual stalk and try to remove each stalk one by one. The scalp is very vascular. It likes to bleed very easily, so the foremost thing in my mind is controlling the bleeding.
Okay, let me know if anything hurts. Okay?
Okay.
Yeah, it's so thick right here. Super dense. I can't see under there to be able to get to the whole thing.
The first cylindroma that I want to tackle is right on top of her ear. It really is tightly stuck to her. Like, it's so stuck I can't lift up and see under it.
I'm just gonna try to debulk this a little bit because I won't be able to see what's going on under there.
It's as if Elizabeth has a whole head of cauliflower stuck to her scalp. And so the first thing I'm gonna do is debulk it to be able to see what's going on underneath.
It's very vascular here. The nice thing about using this tool is that it cauterizes at the same time to help minimize bleeding, but it does like to ooze still. Wonder hand.
Oh, did he have wonder hands?
No.
I'm gonna try to shave this down as flush to the skin as possible, but I'm really concerned about the bleeding, and that could really cause some problems.
What I'll do is I'll try to, let me get around here and take this part off here. Let me try to pull down myself here. Bring down here.
Quite a production, though, this one. Removing that first cylindroma was definitely not easy. And if all of these cylindromas are going to be like this, this is going to certainly take more than one visit. But could I just cut this whole thing off with one quick thing? Because I do see that it's not attached too fiercely to the base here, or too widely to the base. I'm gonna try to lift this up, and I'm gonna try to go from this way, I think. Okay, so, okay. Make sure nothing hurts. The next one appears to be more pedunculated, meaning it's attached by a smaller stalk. It hopefully will make it easier to remove. Going for a bigger one here. I'm gonna try to do it quick. So hard to get under there. I did not mess around with that one. I'll tell you that. Let's see. All right. Hold that pressure until you think if I took that away, it's gonna ooze, maybe?
Yeah, when you move this gauze, it starts to want to bleed again.
Yeah, let me buzz it a little more. Yeah, I agree. I agree. All right, just a cute little nubbin left. I think we need to see how these two do here, because they wanted to bleed a lot. How the second one was better. That I didn't take all of it off because it really started to bleed, and I can see some of these they're bluish, so they're filled with some blood vessels. I think I'm gonna stop for now, but I am really proud of how well Elizabeth has endured this. The next 24 hours is actually where it's the most important. When some of this numbing medication wears off, it's not uncommon for people to really start bleeding. I want to show you, actually. Straighten your
Ay, doctora Lee, gracias.
Yeah, a lot of it is better, huh? Because that's going to hide in the back.
Ay, gracias,
That's going to be much better.
Yes. Cuando la vi que terminó la cirugía, no podía creer que me hubiera quitado tanto. Quería que me hubiera quitado más porque me sentía muy bien. Pero si ella dice que no, pues se respeta. Thank you, Dr. Lee. Thank you so much.
Mucho gracias. No, that's not what I say. De nada. Yes, I said the right thing. Okay. After a few months, Elizabeth's initial wounds healed up really nicely and didn't bleed too much. So I brought her back to the office to remove more of those big cylindromas.
Other?
Okay, how about the next one? The second procedure went really smoothly, and I think when these spots heal, Elizabeth is gonna have a really nice improvement. Uno, dos, tres. Much better.
Thank you.
A little baby pinch here, okay? Because I'm not really sure exactly what's going on Jamal's tush, I'm going to use the tumescent anesthesia technique. This is where I inject a dilute numbing solution under there, and that's gonna help create a cushion or a little space potentially between this growth and any of the other deeper important structures so that I can separate it from his real tush. I hope that when I make my first incision, it looks like a standard lipoma. I don't want it to be any strange colors. I don't want it to be any strange textures. All right, let's take this booty off your booty.
Yeah.
Let me just take a little peek first, just to see what you got here. Well, it is definitely fat. Looks like a lipoma, looks like a pretty normal lipoma. Just a very septated lipoma. As you saw, you know, how it had these little dimples in it. Can you squeeze that and just pop it out?
I wish.
Right? It's almost.
Mm-hmm.
It's
not gonna budge, yeah.
It's like a sea anemone. Anemone. You got a beautiful butt flower going on right here.
My butt's very romantic.
Yeah. Yes, your butt is romantic. I don't say that very often, you know. That's a compliment. You can take it. Why don't you take it from me? Thank you. Well, the bulk of it is gone. Okay, well, this does look like a good typical lipoma, so that's the great news. But I do not want this thing to grow back. He doesn't want this thing to grow back. I'm trying to clear out the whole lipoma so I don't leave anything behind in Jamal's behind.
I think that it came out really well. It just was really tethered in there, but we got it. I don't know why the 9-year-old thing happened. I feel like it might be independent of what this is, but maybe.
It looks like I was able to successfully remove this lipoma. I'm certainly gonna send a sample of this to confirm that it's a lipoma and that it's not something more concerning, but I can't wait to show him his new booty.
All right, it's looking good. Okay.
Oh, wow. Never been so happy to have a flat butt.
Oh my God. I feel amazing. I feel like a huge weight has been taken off of me.
Here's a little bit of skin we took off.
Whoa.
Your booty has never been this close to your face.
I don't know, after 24 years of dealing with this, I feel like a piece of me is now missing, but like a piece that I don't mind is missing. Ooh.
Yeah, you feel good.
I like that.
Yeah.
I actually
How we
feel-
take things for granted. We can't just sit normally, huh?
I actually feel like my back
It's
feels
already
better.
straighter. You're gonna stand a little taller no matter what. It was really a pleasure. I adore you, okay? And take care of that booty, okay?
Yes,
It's
I will.
a good looking booty.
Thank you. Dr. Lee, she has an amazing spirit. She made me feel really comfortable. And I'm really grateful for her that she was able to remove the lipoma. Now that this lump is gone, I'm gonna be able to be in the studio all the time, sitting all day, making music comfortably. Thank you very much.
Okay, do you wanna take a look now?
Yes, I'm excited.
Right there, can you see that with my hand there? Okay, that one was oily.
This program examines dermatological conditions and the procedures involved with treating them. Due to the graphic nature, viewer discretion is advised.
Okay, so you shouldn't feel anything other than us touching you, okay?
Okay.
We have a lovely man here, Kenny, who has Gardner's syndrome. This is a congenital condition that can create a lot of bumps on the body and within the body. I'm gonna try to address his back first. It's going to be a very daunting task, but the most important task is just calming his nerves.
Make sure I'm not hurting you at all. I'm not gonna torture you in any way.
My voice is very relaxing. The only person that feels it grates is my husband. I'm using my best calming tactics with Kenny. We have a lot of work ahead of us because in Gardner's syndrome, you can have a lot of different kinds of growth. So Kenny's back could really be filled with a lot of different surprises, and I don't like surprises.
Okay, we know we have cysts here. So just for us here, Christy, there's obviously some fluid in here. Get some gauze out here, okay? Might make a little bit of a wet mess. Like mashed potatoes. Actually, you know what? It kind of looks like German chocolate cake frosting.
I was thinking
In
like
the middle
lemon
of it.
frosting, like a lemon curd or something.
Yeah, like well, you know how like German chocolate cake has that layer that has that kind of,
Yes.
like coconut or something in there?
It's something like that, yeah.
So far, so good. Kenny's first bump is indeed an epidermoid cyst, and the contents look a lot like grits with a little sprinkling of a split pea soup.
Okay, let me look at those. You know what? I think there's another cyst right there. Like lift it up there and then push it. Yeah, you see that? How you feel like two of them right there? Let me feel that again. There's definitely one right here, right where my fingers. Yeah, I'm seeing a bunch of other cysts. They're all butted up against this sac wall. It's like you have like little landmines under there. Landmines of cysts, I'm trying to get around them.
I'm trying to remove the entire sac of this cyst, and it's really kind of stuck up against other bumps that I feel under there. So I feel that there's a bunch of other cysts under there, really like these sort of landmines. I'm going to need to try not to rupture any of the other sacs, because if I do, that means that I need to chase that entire sac, and I don't want to leave a portion of a sac just under there. That would extend the scar line. There's more risk of an infection. This could be a lot of trouble.
Let me start moving on this, otherwise we'll be here all day.
So are they underneath it then?
Right, underneath it.
And around it too, like surrounding.
Yeah, it's like all around it. I'm like going between cysts.
Yeah.
It is, it's like a minefield here. How am I gonna get this off? I should have started with your forehead. I think those would have been easier, actually.
Yeah.
This is gonna take me a little bit. I'm so sorry.
You're fine. I don't have any, hot dates tonight or anything, so I'll be good.
Kenny's being a real trooper here. I mean, this is very time-consuming. I've got to be really detail-oriented. This is like being a minesweeper. You don't want a minesweeper that is really sloppy and just goes trudging through the land. You want them to, every step that they take, and think about what the consequences are. And that's exactly what I'm doing here. I'm trying to intricately and very precisely remove the sac wall with a landmine of cysts around me. Sorry, that's numbing. You okay?
Yeah.
Every time I go in one place, I'm gonna put more numbing there.
I'll never complain about numbing.
There is such thing as over-numbing, though. We can put unsafe levels of numbing.
I'm using a lot of numbing, and that is another issue that I have to consider, too. If you use too much numbing, that is too high a level. It can really actually affect your heart.
Yeah, I'm sorry.
No, they're fine.
Or like at the bottom of it, right, Christy? Mm-hmm. No, it's just attached by a little strand. Come on, Sandra, let's do this. We got it.
Got it?
That was probably one of the more complicated cysts that I've had to remove because it was surrounded by the guardians of the cyst.
So what are you thinking? We're gonna be able to do anything else?
I mean, I'm hoping that we tackled the most complicated first, but that took us longer than I expected, and we can't do all of them in one day. The numbing, that's too much numbing in one 24-hour period.
So Dr. Lee, what's the plan? What do you think we're gonna do?
So I think that we're gonna have him come back.
I think it's best that I stop here. I feel pretty confident that I've gotten all the cyst wall contents out and I haven't disrupted any of the other cysts in the area. And I want to see how he tolerates this.
This is called the chalazion clamp. It's actually for the eye. It's like a barbaric device if you think about that. But what we can do is we can put that area right between here and kind of tighten it so that it won't want to ooze so much. But I'm just gonna grab that area.
I'm here with Angelica, who has a pyogenic granuloma. I'm going to use a device called the chalazion clamp. And this really allows me to grab that slippery lip, but also puts pressure on the edges so that it won't bleed as profusely.
Oh, I'm so serious in here now. Doing great. Just put a little light dab on there.
I've gotten most of the growth off, and now I'm going to remove the chalazion clamp so I can really see how the lips look in a natural position.
You guys okay? Are you okay, Hubby?
I'm doing okay.
You sure?
Yeah, I turned away a little bit. We're okay.
Oh, goodness. Okay, now you're gonna hear a little buzzing noise. Make sure you don't feel anything. You okay?
Mm-hmm. I'm using my cautery to seal those little superficial blood vessels. If this was actually involving the skin of the lip, I probably would stitch at least part of it up. But because this only involves her mucous membrane, we do not need to stitch this up. Mucous membranes heal really quickly, and so that is really the best option here.
This will cauterize the blood vessels so it won't ooze, but also potentially if there's any more of the cells that could grow, we're gonna make sure they don't come back. Can you see that? It looks pretty normal now, huh?
Yeah.
The lip? The contour in that lip looks really good.
The lip is gonna take a little while to heal, but I do think with a little bit of time, it's going to heal really great, and Angelica's gonna be really happy.
It's still a little swollen, and it's like a little charred a little bit on the center, okay?
Oh, it's gone.
I'm looking in the mirror, and I can't believe it's off my lip. I don't have to hide anymore. I don't have to worry about people saying something. It's finally over.
And here's your little friend. Right there.
Wow. I have no words to describe Dr. Lee.
She's amazing.
Knowing that there are still doctors that will take the time to figure out somebody's struggle and fix it is comforting.
Thank you so much.
Oh, give her a little smooch. Come on. Oh. All right, troublemaker. You stay out of trouble. You keep running the ship.
Thank you.
Bye-bye.
Bye-bye. Happy?
Very happy. Very, very happy.
Can we get out of here now so we can go make out?
Yeah.
Yeah.
We're gonna do something where we give a little vibration here.
You feel it?
See your little vibrating right there? Isn't
Do you
that
feel the
awesome?
vibration?
Yeah, you
Focus on the vibration.
You just stay still, and we'll be done.
Point your brain to that vibration.
Oh,
Do you like
he's
it?
smiling. He likes it.
Do we need to get one of those?
Yeah.
Looks like you do.
I've decided to use a buzzing device. This is like a vibrating wand that I've cooled, and it really introduces another sensation for the patient to think about, and I think it's working.
Okay, we're done.
Hi.
Hello. Oh. Okay, you're not gonna feel it. I'm just gonna take that off, but you're numb, okay?
All right.
So just hang out with me for a moment here. You're gonna do great.
Just rolled off like a little rock.
Uh-huh.
You're already looking so handsome.
Oh, wow.
I'm gonna go to the other side so she can do the other side of your nose.
Okay.
Almost there. Close those eyes. I want to stick my finger in your eye. These are like special serrated scissors, so they can grab a little bit more.
Oh, wow.
Okay, that's it. That's it for that. You shouldn't feel this, okay? Just me touching you. Close those eyes again, okay? You okay?
Heck yeah.
Good.
These are the last bumps I'm snipping off. These are the ones that have the highest chance of getting caught on things, of bleeding easily, maybe leading to infection. He doesn't exactly love being cauterized, but he's doing a really good job at staying still.
Let's just show you. Can you hold the mirror? So you see that there are like little spots there, but they're flat. They'll heal up.
Yeah.
There you are.
I wasn't really sure what would happen when we got here, but I'm very relieved. I'm very happy. There will be less bleeding, and I'm not as worried about his infection as I was before. How do you feel about your bumps being gone?
Good.
Yeah?
I feel great.
You feel great. All right.
And here's Mama. Hi, Mama.
We've been through a lot, but Dr. Lee really took time to go slow and work with Jordan. Not all doctors in the past have been as patient. They haven't been as understanding. Dr. Lee is very loving and very caring, and somebody might have a crush on her.
I'm gonna numb Jackie using the tumescent technique. Tumescence can help in the shoulder area because it's really pulling this growth away from important nerves and structures. It can make an area twice the size or more, so I don't want her to really look over her shoulder and freak out and see this bump like the size of her head for real now.
You shouldn't feel anything other than us touching you, okay? You okay?
I feel like you can almost take a nap. Take a nap. Take a nap.
No.
Yeah.
I guess Jacqueline's okay because now I just sliced her open and she seems to be pretty calm and chill about this. So thank goodness that relaxing medication worked. Now I just gotta scoop this big bump out of there as quick as I can.
Just removing, there's some like little fibrous bands that are keeping this in place. So I'm just trying to like tease them away gently and safely. It's gonna squeeze you, because sometimes I try to not use anything sharp and try to squeeze things out. Popping it out is much safer because then I'm not gonna shear any vessels or anything.
Right.
So I gotta use my brute strength here.
Okay.
He's coming, he's coming. Come this way. It's just stuck in there.
Yeah.
Come on, little baby. Come on. Come to Mama.
Oh, it's such a weird thing.
This lipoma, it really just keeps coming and coming. I hope I can get this all out before the relaxing medication wears off. Honestly, though, I don't think Jackie's gonna care any which way at this point. I mean, I think she's feeling pretty good.
Last little bit is the underside, and so I'm very gentle with that part because I don't want to pull on you. We want to leave the things that we want to leave there. Just take the lipoma, nothing else. Sorry, dear, there's like one last little bit. I just want to make sure that all this looks clear before I snip that area. All right. Guess what? It's gone.
That was pretty heavy.
Success, the mega bump, gone, out of there. Now my task is to sew up this really long incision and make Jacqueline's arm as pretty as she is.
Done. So let me grab you a mirror, okay? See that arm right there?
Oh my gosh.
Right? This is all fluid.
Wow. Wow, yeah, I'm so excited. I feel like a different person right now. It's almost like you want to go run on top of the buildings and just start hollering and feel like you're not being a freak, you know, like because you're happy.
I know that was really hard for you to get over out of your mind. You know what I mean?
Yeah, I did not feel a thing.
Oh, really?
I didn't feel a thing.
That's great. That's great.
Dr. Lee was able to keep me in a calm state. My fears were really senseless.
Hey, you take care, all right?
Yes, thank you.
Bye-bye.
Now that this lump is gone, I'm a stronger person. I can do what I want and be me.
So you shouldn't feel anything other than us touching you. Pulling down on your eye, okay? Sorry about that.
First, what I do is I debulk the tumor. You might think that that's me just removing the skin cancer, but no, that's me removing the top of the cupcake. Now I need to remove that entire cupcake that is in the mold, but doing it really thinly. I just want to take out the skin cancer, and that's it.
A little buzzing sound you're gonna hear. Just a cautery that stops little baby blood vessels from oozing. Let me process this, so we'll look at it under the microscope. It's gonna take a little bit. I say it's a lot of hurry up and wait.
Okay.
Okay, you did okay though, huh?
Yes, thanks,
Okay.
Dr. Lee.
Wow.
It's really important for me to make a map of this tissue so that I know how it was placed on his skin, so that if an edge happens to still be positive, I can go right back to that specific edge and remove just a little more from that place.
It might wanna easily, you know, break apart there. Okay.
The next step is to take this tissue to my Mohs technician, Rachel. She's going to freeze it so that it's more solid, so that you can cut through this in very thin slices so that we can put it on a microscope slide. I'm gonna look at this piece of tissue under the microscope to see whether there's still some cancer that remains.
What I do is when I look under the microscope, I'm checking to make sure I have skin edges, and I can see where my markings are, like the colors of the nicks of the tissue. Now when I'm looking in the microscope, I see some positive edges, and I'm gonna mark that where I see it. So we have to do another layer here.
It looks like there's still some skin cancer cells present, and this always makes me concerned, especially when we're coming up close to its structure, like his eye. There are certain areas that this can progress to, like if this affects his eyelid, then that's really an area that I would refer this to somebody else. So we might not even be able to complete the surgery if it progresses too far.
Okay, just a little bit more from one little edge here, okay?
All right.
Then let me make sure. You okay, yeah? So keep your fingers crossed here. This one looks pretty good.
All right.
I'm feeling better about this round of tissue. Hopefully this will mean that this next round is clear. It certainly was deeper than I expected, and you know, the deeper or the wider that we go, the more complicated this is gonna be.
Those flaps of skin were bigger than I expected her to take off.
Oh my God.
All right. So you're clear.
Got it.
When I look at it in the microscope, I don't see any more skin cancer cells.
Nice.
I'll go ahead, I'm gonna send this to pathology, but we got it.
Big sense of relief after she said she got it.
If I felt like I could exhale, I had been holding my breath the entire time.
You're almost done. This is our last step here. The creative part of all of this comes out when we're doing the reconstruction. James has a circular defect here. So if we close this side to side and I pull it this way, that's gonna pull down on your eye. So instead of pulling this up and down, I could really redirect this tissue in this direction. So I'm pulling it closed now and the tension is now this way, and so now I'm not going to pull down on his eye. Okay, so let me put a stitch in. It's gonna feel a little tight because we're pulling something from side to side, but we can see here how we've gotten this tissue all ready to pull, and we've got some nice movement there.
I can't believe it's gone.
It's good. You were dealing with that for a while. It's probably something you've thought about all the time. It only took 3 hours and several Mohs layers, but we finally got him clear, and I'm really pretty pleased with the results. I think he's gonna be really happy as this heals up. And I mean, he's still gonna be able to sleep well at night and close his eyes. So you can take a look. It's gonna be funny looking and bumpy, okay?
All right, Dr. Lee.
There you go. There you go.
Nice. After 2.5 years of dealing with this on my face, just real ecstatic to see it gone. It was just unbelievable.
Okay. You're okay, right?
I am okay.
Okay, good. Trying to take as little bit as I can. Almost got it all. Just trying to get that off. There we go. We've taken it off, but let's take a look at this area now, too. I'm really happy that I was able to remove the bulk of the really ugly, really noticeable part of Michaela's nevus, but there is still a little part of it that I see here trailing on the side. I don't know whether I'm gonna be able to attack that because the tension on this skin wound is at its highest, and that tension is causing me tension.
Is it looking like you might be able to just pull the skin?
I don't know. Let's just see what we got. I'm pretty happy that I was successful in removing a good amount of this nevus that she has, but I need to make a decision. I need to decide whether I can try to remove a little bit more, or is this gonna risk maintaining enough laxity in the wound edges to be able to pull this together? I wanna go below the hair follicles so I don't destroy the hair follicles. And I'm also going to the level of the fat because I can more easily loosen that skin underneath there and pull it together. Phew. That looks better. Okay, great. I've got enough skin now. This should close up nicely. So the scalp is pretty tight. For me to be able to close this wound side to side, I have to do something called undermining, which is when you really try to release some of the tissue so that you can take advantage of some of its stretch. And you do this by freeing it up from the skull and go under the hair follicles and really not destroy them so that the hair will still grow. I am not able to remove all of the bumps. I have to leave a smaller row of this nevus or this birthmark to get another day because I really need the skin to be able to be pulled together side to side, and this does not prevent her from coming back another day once it's healed. So take a look here, okay? Wow. Yeah, it looks good. So I'm just gonna numb this side first. I wanna remove this big cluster of cysts that Joe has, and I'm gonna start with the one that is lowest, and this is a very vascular area. It's a good strategy for me to remove the lowest one first so that the blood from it, if it's dripping, doesn't drip into other cysts and kind of obscure my vision. Chloe's getting lessons that are not even in the textbook. This is cyst smarts. Let's do that big mama here first. Did you wanna see too?
Yes, I was.
Oh, you do? Look, she's like, before you even finish answering that question. We're really trying to remove the areas that have less hair because it's stretched. You hear me here moving around. Gonna hear a buzzing sound, but you shouldn't feel anything other than us touching you here, okay? The bleeding with this big cyst is not as bad as I was expecting, and I do really enjoy popping them out intact. But sometimes when the cyst is older, they are often really stuck to the scalp at a wider base, and I don't like to just cut underneath there blindly. So in this case, I decided to really make an incision and pop some of the contents out. Chloe's lucky because I don't think I learned any of these until I was on the job myself.
It's just got a lot of sludge in it. Cement. Ooh, splash there. Okay, let's do a little scooparoo. Careful there. Okay, under there. That was it. That was the squeeze part. So, Chloe, so you can see the deflated balloon here.
It's like she's taking out a piece of your brain.
Now, let's do that second one there.
I'm moving on to the next closest cyst, and this one is smaller, so in my book, that probably means that it's younger, so hopefully it really hasn't planted its feet into the scalp.
Just pushing against you. That's it, that's all.
It's out. Not fully,
That
but...
was like you having a baby.
Yep.
Oh my
There's your little
gosh.
kidney bean.
The second cyst came out pretty easily, so hopefully I'll be able to move on and get rid of all of his cysts and not have too much of a problem.
So I'm just gonna see whether it's liquid in there actually first, so.
This is an older cyst, I suspect, and it feels like it's under pressure. If I were to cut this open, it could really make a big old mess. So I'm going to release the cyst. By doing this, I'm showing Chloe a really important lesson: how not to get hit.
Ooh, that looks like brown sludge.
Yeah.
All right. Just beware, you can get squirted here.
This old cyst is doing exactly as I hoped it wouldn't, but kind of expected, bleeding really well from a nice big vessel there. So I really had to take my time and find it. Got to hemostat that and get a good grip on it, because if this takes me a long time, I'm not gonna be able to remove the other cysts.
Let me see, is it oozing under there? Yeah, it wants to ooze on me. Oh my gosh.
I'm trying to remove his oldest cyst here, and this one is proving to be a little bit more of a problem. It likes to bleed a lot. So this is a really good lesson for Chloe, because she can see that not all these cysts are so easy, and some of them are fighters.
I'm just trying to get him without having any oozers too much.
This guy was maybe
like
the
today.
worst.
Okay, let's take a look at that whole thing. That's number 3. 10 hours later.
I removed the third cyst, and interestingly, he's got a couple little satellite cysts, and they were hiding under there. I'm gonna use the existing incision and just pop it out from the edge.
It's almost like two giant tonsil stones.
Oh, wow.
Oh, that's a cute one. And since he's a oozer. All right, they're all gone.
Wow, Chloe really got to see the full range of what we see in cyst removals, especially pilar cysts. You got to see a really perfect one that I had to really fight with, one that was filled with liquid, one that was bleeding a lot. This was really a masterclass in cyst extraction.
Okay, let's take a look at your head.
Well,
It is bumpy.
it's nowhere near as bumpy as it was.
Did great. I'll go ahead, I'm gonna send this to pathology. Make sure we're not hurting you. All right, you're okay? Mm-hmm. You got a little egg in here. It's like a little quail egg. You okay?
Yes.
Okay, so after all this drama, here I go removing this perfect little epidermoid cyst on his brow. And Cedric, he seems to be comfortable and he looks great.
It's a little bumpy right now.
Oh, man. Well, I ain't seen it like this in years. Looking in the mirror for the first time, I can't believe what I'm seeing. I never thought I'd be looking this way again.
So I think you did so well with this. Let's try to get rid of that other bump on you, okay?
Yes, ma'am.
Cedric did really well, so now I'm gonna turn my attention to this big goose egg more on the back of his neck. This is an area that bleeds easily, so I never know what exactly to expect. And because of his condition, I'm always on high alert.
Let's see if we can't take this out nice and simply. Make sure there's nothing sharp. And it's a lipoma.
Okay, so this is a lipoma, not a giant cyst, unfortunately. They can be challenging when they're stuck on or like they're a little bit more stubborn, but hopefully I can pop this out very simply. That will certainly make him happy and it will make me really happy.
See if this thing will ease out of here. Okay, a little squeeze here.
I think it's just barely hanging on, huh?
Got it. Got a good looking back here, Cedric.
This was a tough journey for Cedric, but he's gonna get to go home bumpless and hopefully with some newfound motivation to really take care of his health.
Hi.
Oh, hi. How you doing? Oh, wow, Daddy, look.
Yeah.
It looks good.
Yeah, it
Dad.
does. He was such a good patient. Hold this for me.
Oh, my God.
It's not even that swollen.
No, man. I ain't looked like this in years.
Like a new man.
I really thank you. I really, from the bottom of my heart.
I mean, you gotta thank your daughter, though, too. She's the one that helped this happen.
If it weren't for her, I wouldn't be here.
Right. Right.
Oh.
It's true. You're a lucky man and you're a lucky woman, you know what I mean?
Yeah.
Thank you, thank you, thank you, Lord, thank you.
You're so welcome.
I'm just really happy. Really relieved. He don't have to go through this anymore. He can actually live a regular life now and be normal. And the fact that I was able to do this and help him out, it means a lot to me.
I can't believe it's finally happened.
And it almost felt like it wasn't gonna happen, huh?
Yeah,
You came
yes,
out that
ma'am,
first
'cause
time.
I ran out of all options. I didn't know where to go. Didn't know who to turn to.
Yeah. We're really happy we can help you.
My daughter being here with me is, and words can't explain it. She is so special, so one of a kind. Without her, I wouldn't be here.
I adore you. You're the best. Can I have a hug?
Oh, yes, ma'am. Thank you. I
You're the
love you.
best.
Thank you.
Oh, I love you too. Take care, all right?
All
Thank
right,
you so much,
you.
Dr. Lee. Thank you so much, hon.
Thank you.
Of course.
I really appreciate Dr. Lee. She was heaven sent. What she did for me, that's the motivation I need. Now I can see if I can get back to work.
I think it's just make sure I'm not hurting you, okay?
Mm-hmm.
You doing all right, right?
Mhm.
Okay, good. So are we. Just kind of right over it. Just trying to be a little tentative with what we do. It's like a little calcium deposit almost. Maybe a calcified cyst.
Every now and then, a cyst ends up being more complicated, and I'm starting to suspect that this might be the case with Juka. It seems to be very intercalated or attached to the surrounding tissue.
I'm just gonna squeeze this here for a moment. You know what I think this is? I think this is a pilomatricoma. Dab that again. Am I hurting you by pinching?
No.
Okay, I'm gonna squeeze you a little bit harder here just to see if I can't squeeze this out. This is a pilomatricoma. Looks like a little cat or something on you, actually.
It's a pilomatricoma, which is a different kind of cyst, not as commonly seen, but has this sort of cakey, almost like dried up toothpaste, firm, rocky texture or feel. And they're more rare to see, but my whole concern now is being able to detach this without having any big issues.
Let's see if I can get this off now. hold that gauze under there, please? Let me just let me take this off real quick here, okay? Get that, hold that gauze under there. Okay, go. We got it out. I'm gonna go ahead and send this to pathology. There's this one little baby blood vessel oozing. Let me get it. Can you get that hook there so you can grab the side back?
Of course, this whole thing couldn't be easy. As I feared, there's a pretty feisty blood vessel. In these instances, I have to move really fast because the more blood that comes out of it, the harder it is for me to see. Any false move by myself or any false move from Juka, and I could poke his eye out.
Where is this thing? Hold that pressure until I grab my cautery here. There's like one little baby blood vessel that wants to ooze on us. You okay, huh?
Yeah.
Okay, I think I got it. Let me stitch you up.
There was a really oozing blood vessel there, but I was able to clamp that off without really damaging any surrounding muscles or nerves, or so it seems. Thankfully, I was able to remove this without any huge incident. And I think I still maintain my perfect Pimple Popper pilomatricoma score.
You can't see anything yet. We would give you the special treat of being the first to see him. He hasn't even seen himself, okay?
Mm-hmm. Oh, he back.
Uh-oh,
He
that's
back.
trouble. Trouble's back. Take a look here. It's just a little puffy, as you know, as I've told you.
Wow.
Right?
Yeah.
Much better.
All right, what's next? I feel different. I feel like a new man right now.
Raise your eyebrows up and down. Still works.
It's almost like a Juka that I don't even remember before the bump. It affected me more than I ever gave it credit for.
Here's your friend.
Wowzers. Like a little organ.
Can you get another perf for Eric if he wants to hold it?
No, it's all right. You can keep
Oh,
those.
come on. Aren't you guys close?
Problem, you keep those gloves.
Here, put this one on.
You gotta do it, bro. You gotta do it.
Okay. It's like cold, right?
Catch, bro.
Hey, bro. No, bro. Oh, it is like cold. Yeah, I'm good.
You're okay.
I'm good.
Okay, so I'm gonna cut through it, all right?
All right.
So the white areas there, I think, are a little calcium.
Oh, shoot.
Yeah.
Fragments
Wow.
kind of
It's literally like little teeth in there.
Yeah, almost.
Crazy.
Anyway, let me tell you, you look 100% better, I will say. Think of all the ladies, that could be a deal breaker.
Deals have been broken.
Seriously, yeah.
Right?
Deals have been broken.
I mean, look at him, he looks great.
Now that I got this freak alien out of my eye, I'm definitely excited to get out and step up to social life. I'm absolutely super thankful that I came out here to see Dr. Lee. Amazed. She did a great job. She's an artist. She's awesome. Life-changing experience, and I'm sure it will continue to change.
Thank
Stay
you
out
so
of
much.
trouble.
No problem. Nice
See you
meeting
guys.
I want it back.
No, stop it.
I miss it.
Okay, let's start with this cute one here on your butt. I'm just gonna put some numbing here, okay? A little baby pinch here, okay? Baby pinch. Kind of close to the limit of the number we can remove here safely with the numbing medicine we're using.
There is a limited amount of numbing that I can administer to a patient, and it's because if you have too high doses, it can really be toxic to your heart. So these are all things that I need to keep in mind when I numb her up to make sure it's properly numb, but that I don't have an unsafe level of lidocaine.
Okay. You shouldn't feel anything other than us touching you. Let's try to take this off as evenly as we can without it being bumpy or anything. And let's... Oh, I'm sorry.
Oops, maybe not quite enough numbing. Maybe it's a little too dilute.
Numbing here a little bit. Just kind of doing it gingerly, making sure there's nothing under here that I don't want to wield around. Looks good so far. Okay. Sorry, this is a big... Oh, okay. I'm sorry. There's that piece here. Now we want to try to make this as flat as we can. Oh, sorry.
So I've gotten the majority of this NF bump off the surface of the skin, but I can see that there's still some iceberg underneath that skin, and so I need to try to remove this completely so that it doesn't really simply just herniate back out again. I'm not sure whether this dilute solution is helping me be able to get this done because it's just not numb enough. Okay, the last bit that I'm taking off here.
Ow.
Oh, I'm sorry. I need to get Talina through this last bit of stitching before I turn her over and address her stomach. But I think in that instance, when I address that, I'm gonna use a higher concentration of numbing. Okay. That looks nice. Ooh, that's a cute tush, girl. Looks good. Hey, Christy, can I get one like half syringe or full if that's all you have of regular numbing? The solution that I usually use is more dilute so that I can apply a higher volume of numbing to an area, but this wasn't very successful. So when I address her stomach, I'm gonna use a stronger concentration of numbing. I really hope this works because I want to give her everything that she's hoping for. All right, so let's start with the bigger one here. That's next to your belly button. Here we go, okay? Make sure you're not hurting. So this one rubs against your pants.
Yeah, because I wear the high-waisted jeans.
Yes, the mom jeans.
Yes.
This one's way easier than that one on your tush.
Well, that one was like 3 times bigger.
So I don't want to jinx myself, but it looks like she's much more comfortable when I'm using the stronger solution to remove these on her stomach. Let's get this one because it rubs up against her bra. Done. All right.
Oh,
sorry.
That hurt worse than my nipples.
Your nipples?
I had my nipples feet.
I didn't do anything to your nipples, so I don't know. I'm not responsible for that. But I kind of got to think that a nipple piercing is going to feel a lot worse than any of these things that I've done here today. But I wouldn't know. Okay, last one on your side. Alrighty. Make sure that nothing hurts, okay? Must have been that numbing. Guess what? He's gone. Thanks to the numbing gods, we were able to remove all of the bumps that Talina was really concerned with. All I have to do now is stitch her up, and by the grace of the cis gods, we will all rejoice. Okay. Can you see your tummy here?
Mm-hmm.
Okay, so that looks really good.
Getting this done changes everything for me. I feel relieved the bumps are off me and I don't have to worry about them growing back. Makes me feel more comfortable to wear shorts or be who I am.
And then let's take a look at your tush here. That looks good. It actually falls down really nice and it's just puffy because you put numbing under it, but I think that's gonna look pretty symmetric.
It's a big deal for me to be a good mom and a good role model. Thanks to Dr. Lee, I'm gonna be the best mom I can be without the bumps. They get the mom they wish they always had. They don't have to walk behind me, they can walk beside me now. They don't have to worry about tucking in my bump. They can be normal kids when they're around me.
Let me take out these first few and just get a feel of everything here. Okay, do you want to take a look now?
Yes, I'm excited.
Right there, can you see that with my hand there? Okay, that one was oily.
Oh my goodness.
There's another one right next to it. Okay, you can take a look again.
Oh my goodness.
So there's the oil there too.
That is a lot.
The butter, oh, there's more. Where the cluster is. Sometimes these same areas, you gotta come back and do it again because there's other ones. Like almost like a cluster of grapes, like that's what it's like.
Oh, can I see the sack?
Sure.
Oh my goodness.
Here, there's a sack. Not very impressive. I mean, you know, you don't have an impressive sack, sorry. Don't be insulted.
I'm good.
Okay. Doing great. And this is gonna be my process for the next several hours. It's a lot of pop and squeeze.
Oh, shoot.
A lot of tweeze and snip the sack. seal up with skin glue some of these little incisions that we made, or for the bigger ones, stitch them up. Let's see how many of these we can get done.
Is this like cathartic? It's better than massage?
I love it. We got a lot, huh?
Some of them have doubles in them.
Mm-hmm.
Look, all these
Oh
here,
my
right?
God, they just keep
Right, you
coming.
think like we're doing such a good job, and we are, but like there's so
like
many
never
hidden.
ending.
Right. I mean, I'm gonna try to get as many
That
as I
might take
can.
up the whole session, huh? That alone.
I mean, there could be like 30 right in here. It starts to shake here because I'm squeezing so hard. Oh, well, there's still so many left.
Now it's a race against my hand strength. When I look back and see how many I removed, it doesn't even look like I've removed that much, but it's really double or triple the amount than it appears because they're just layers of steatocystomas under there. This is really taxing, but I really want to try to get as many as I can here.
All right, I'm starting to lose my squeeze muscle now. Okay, I'm reaching max capacity. We're getting there.
I just ripped my skin off. Let's just do that.
All right, I'm starting to lose my squeeze muscle now. Okay, I'm reaching max capacity. We're getting
I just ripped my skin off. Let's just do that.
But you see this definition now. It's coming out, right?
Yes.
But yes, it's not so easy.
I'm here with Brittany and I'm tackling these steatocystomas on her chest. I did not expect them to be so densely packed in her upper chest area, and it's taking me a lot longer than I expected, and it's also taking up a lot of my hand strength. So I'm not really sure whether I'm going to be able to proceed and address all the ones that I promised her.
That's what's so aggravating
That
about
looks
it.
so much better.
But it does, huh? When you look beyond all that, look at that beautiful definition. It is flat, it looks beautiful. Hold on, let me just put a stitch right here. And then I think I'm at max capacity, but I do think that we've done enough.
Great job.
I do think this looks really good.
Even though we removed so many of her bumps today, and especially these big clusters that were on her upper chest, I really feel bad that I wasn't able to address all of the ones that she wanted today.
The most important is that you can appreciate the change. We did a lot here.
Did.
And we got so much of this down.
I hate to leave a job partially undone, but it's out of my hands, really. If she heals up okay, maybe we can do some more in the future.
The next time you're gonna be like, can you do these so that I can show the side boob?
Right.
I am extremely thankful for Dr. Lee. Removing these bumps is not easy. I am so happy that Dr. Lee was able to get this amount of work done in such a short amount of time.
I adore you. You're the best.
You're the best.
No, you're the best.
I can actually feel sexy and confident again. And moving forward, I can get them removed. That part right there is just a blessing because I thought that there was nothing I can do. I had no control over it when I do have control. I have all the control in the world.
We're in business, baby.
I'm gonna start on this side. Close your eyes, keep your eyes closed, but let me know if anything hurts.
I'm gonna do electrosurgery on John. This is where I use an electric loop. It is really a current that is going through this loop that allows me to cut and cauterize the tissue at the same time, which is key. Cauterizing is a medical term, essentially burning the flesh, really. And here, in these instances, I'm trying to really seal blood vessels and prevent them from bleeding. But in this case, I'm also using the cut function where we're really just trying to surgically excise the area as well. The goal is to really try to remove all this rhinophymatous tissue and leave your normal nose intact. And a lot of times I have to take thin little slices like you would of a gyro, but I'm just trying to remove it evenly because if I take too much, you can regret it. I can't just put it back. This person's gonna have a different shaped nose. And just like a great gyro chef, every piece means something.
You okay?
Yeah.
I feel like are you wincing because it really hurts?
Not gonna really hurt. I mean, I can feel it, but it don't really hurt.
Let me get the edge here. Close those eyes. You okay here?
Yeah.
I already see your nostril opening up.
Oh, really?
Yep, I do.
Oh, this is good because I'm taking huge chunks off of John's nose, and this is really gonna help him to breathe better. I just hope that he allows me to keep going. We still have some work to do, and he lets me dig deep here.
Courtney, I mean, he looks like he's okay. I was kind of concerned about him. Okay.
He's not a complainer.
Right, he's not a complainer. That's what I'm worried about. You okay?
I see that John is getting uncomfortable, and I've used a good amount of numbing. So this is really when I start to have concern about how much numbing solution I'm using and the safety of the patient. I mean, if they have heart conditions, if they are at a more advanced age, these are all things that I consider that really can increase your risk of having problems or complications with numbing solution. If I can't get John completely comfortable, I mean, I'm gonna have to stop. I can't do that to somebody.
Does that hurt?
Well, like I said, it's more of a burn than it is a hurt, you know?
A burn is a hurt. I don't know, the numbing's not doing so good on you.
Oh, my Lord.
Oh, I'm sorry. Hold on. Sorry. Okay. We're getting to halfway, okay? I'm gonna go to the other side. You gotta move that hose to the other side without knocking this off the thing.
I'm here with John, who has rhinophyma, and I'm trying to remove all the rhinophyma that I can on his nose. I've moved to the other nostril. You know, he is starting to feel uncomfortable, and I'm starting to get concerned about the amount of numbing that I'm giving him, that could cause some heart issues. Hopefully, I'm gonna be able to finish.
I think what happens is you have these oil pockets in here, and they get heated up, and so that probably transmits that heat to you.
Yeah.
With rhinophyma, there's not only thickening of the tissue, but there is a lot of oil, a lot of sebum that is built up within these pores. So you can find these big pockets of custard, essentially. I mean, these can be fun and really satisfying to pop, but I do think that this cautery that generates heat can really heat up those little oil pockets and really kind of cause more transfer of pain. I mean, imagine if you stuck a bowl of custard into the microwave and you heat it up. If it touches your skin after that, it's gonna burn. And imagine this is what I'm doing here. I'm heating up this custard or this oil within his nose, and that's probably causing him some discomfort.
All right, hold on. There's a little bit of oil in here. Let me see if I can squeeze that out. That makes it smaller already. We're so close. Remember, we've done most of the areas here. I just got to clean them up a little bit, okay?
Okay.
It's like sometimes I don't want to take it too much on one side because then that means I have to take it that same on the other side. I want it to be nice and even.
One of the toughest things about rhinophyma surgery is knowing when to quit because it can look very deceiving right afterwards. It's really swollen, it's really inflamed, it's really red. The patient might also look at it and think, wow, this doesn't look like anything was really done. But it takes some experience doing this procedure and the knowledge that you know that it's more swollen, you know that it's angry, you know that the area is numb and the patient is feeling numb, so it feels like this area is huge. But sometimes it's best to stop, let the healing begin, let the inflammation go down, and then reassess it at that point.
Yeah, it looks great. It looks pretty good. No, I see the potential because it's all swollen right now. So you can turn that off. How you doing?
I'm doing good.
That was pretty bad though, huh?
No, it wasn't that bad. Really wasn't.
Let me sit you up so you can breathe a little better first.
Well, that was a tricky procedure, but John really powered through that, even despite this sort of feeling of hot custard just dripping from your nose, really. So hopefully we'll get him back to that dashing man that we see of yesteryear.
His nose is so tight right now because we got so much numbing in it.
Good.
But you see it, right? His nose is coming back.
It's a huge difference.
So I'm gonna show you the prosciutto we took off, the bacon bits.
Wow.
See the cheese that kind of came out of there too?
Oh, my God.
You see that?
Yeah.
That was a tough one, I will tell you. You did really good. It's gonna still look funny right now. It's still super swollen. Hold this mirror. Can you see it or do you need your glasses?
No, I can see it. Oh, my God, it's ugly.
Yes, it is, but it's prettier than it was before.
Yeah. When Dr. Lee finished with the surgery and brought the mirror and showed me my nose, the first thing that went to my mind was, holy but my hoping is it looks perfect, which I think it will.
when it heals. I appreciate you very much,
You did awesome. It's gonna look really great.
John is the reason that I do what I do. And after years of searching for a doctor for his rhinophyma, I think I found the best person that could perform that procedure for John.
All right, we'll put a nice bandage on you.
Thank you.
And I know your nose still looks big, but it's coming down.
That's fine.
I'm very excited about my future. My hopes are when my nose heals, I'll look like I did 20 years ago, and look like the old John. Old John knows old man's face.
My biggest concern with this lipoma is its size and the hardness to this. I am going to use the tumescent numbing technique because I do think that that's going to allow me to properly numb this larger area, but also it's going to help to pull away this growth and this boniness away from his regular tissue.
Yeah, hopefully this will be the last time I see it.
Okay. Kind of changing the direction of this a little bit just because I think this will make it better for me to avoid that kind of bigger vein there. I use a lot of my fingers actually because it helps me to feel where this is, but also doesn't traumatize the tissue.
Don't let it roll on the floor.
Yeah, it's 5-second rule. If it goes on the floor, it's
Yeah,
okay.
right. 5-second rule.
Still good. Oh my gosh. Look, that is ready. It's so heavy, it doesn't want to lift up. I have to like put my fingers on it like a bowling ball.
Wow. Get a strike.
Here's that hard part. I can feel it.
Does it look different than the rest of it?
There's like layers of it, it looks like.
Really? Huh.
Okay, hold on. Okay, now, how do I get this off here? This is like where all its blood supply is coming from. Well, that was good while it lasted. I was able to get out the really bony area and the lipoma, but underneath I see just a maze of larger veins and vessels. I have to really be precise and make sure that none of these vessels under here are bleeding because once we sew them up, if this area starts bleeding again, that can cause a lot of trouble. Okay. Okay, so if I remove this, that should conceivably not lose it. It might lose a little bit just because there's a little blood right there. Okay, but we're getting it there. We made some headway right there.
Nice.
Guess what? He's gone.
How heavy do you think that is?
Maybe 5 pounds.
That's it?
I don't know. Maybe
Not
maybe
impressive.
more. But it's like it's deceiving sometimes, I feel like. It doesn't even fit in the tray.
So I was able to buzz all those deeper blood vessels underneath. So this should really heal up nicely. And hopefully I've helped Mike to close a chapter in his life so that he can start a whole new one. You want to hold that mirror here?
Oh, yeah.
See? You can't really see behind you.
Oh, yeah, look at that. Wow, that looks amazing.
It was such a relief. You know, all these years I've carried it, now it's not here, it's there.
So, you ready?
Oh my God, look at that.
Yeah.
It looks bigger than it, wow.
So Dr. Lee pulls it out, and it looks like a meaty loaf of bread.
Don't drop it.
I won't. All right, here it goes.
Because we're freaks. 5 pounds.
5.38.
That's pretty good. That's a baby.
Yeah. I feel amazing. I feel 5.4 pounds lighter. And I can lose even more weight because now I have the ability to exercise a lot more.
Okay, take care, all right? We'll see you again soon.
All right.
Thank you.
Given my religion, there was a part of me that thought, you know, I would never get rid of it, but now that I've made that progress, it's a great feeling to change, to evolve yourself. You know, I'm moving towards the person that I'm supposed to be.
You gonna numb me up good, right?
I bet, of course I will.
All right.
Do you remember a Mr. Babcock?
Yep.
Mr. Babcock was my homeroom teacher.
Yeah, remember Mr. Yamamoto?
Yes, science.
Yep.
It's really wild to meet somebody randomly that shares a lot of the same memories that you have from way back. It's really taking me back. Do you know the house that has like the turret, like it looks kind of like a castle? It has like a rock. That's my house. That's where I grew up.
Really?
Yeah, you
I
like
spent my
live-
whole childhood
Oh my God, we were just
Up in
hanging
there.
out right
Yep,
next
right
to each
there.
other. And then remember there was a monkey on baseline? Remember you drive down going towards Claremont
yeah.
and there was a monkey
Yep.
in a cage?
While we've been chatting, I've been really numbing up the area very well because I do know that because this has been traumatized and there's potentially scar tissue there, that can really be more difficult to numb up. And I really need to numb this up well because there's probably gonna be a lot of scraping going on.
Okay, so let's see here. You have a lot of stuff inside there. Not hurting you, right?
No.
Good. That wasn't a really convincing. No, your
No,
voice got a
I'm
little
all right.
higher. We're just trying to clean up this little mess you made here first. Let's see, it's all like in kind of dried up pieces here. I'm just gonna tug on you a little bit. You shouldn't. Let me see if I can just squeeze it a little bit here. You like stored a bunch of stuff in here. Christy, I need like a big curette, something that's gonna scratch it a little bit.
Right away, I can tell that this cyst is gonna be a tough one. I mean, I have to really scrape a lot of these contents out, and even the surface of the skin is really damaged. It's thin, it's friable, and I think that a lot of that skin is at a loss. I'm gonna have to really remove a lot of that.
Ow.
Am I pinching you?
Yeah.
I'm sorry.
That one is like
What?
pulling off a scab or something.
It is. It's pretty stuck on you. I gotta like work on it a little, figure out my angle here. Oh, sorry.
Ow.
Oh gosh.
That one you got.
I am so sorry.
Uh-huh.
The scar tissue that's present is really making it difficult for me to numb this up properly because you really can't get a lot of liquid in something that is really tightly packed.
I don't usually pinch people like this. I couldn't get the numbing right there. Sorry.
Ow.
And take out all this material underneath here that has cyst in it, and then try to make sure it sticks back together so you don't have a whole like little bird bath up here for people. Almost flipped some of your cyst on me. Nasty.
You wouldn't be the first person.
Yeah? Who else has flipped it?
I'm scraping off some of the cyst pieces, and it's kind of like crumbled concrete that you're trying to scrape off. You know, I think I'm making progress here, but it's really hard to figure out if I'm getting it all or not.
This is a tough one, actually. Let me tell you, this has a higher chance of coming back because of the fact that it's kind of all like scarred down and damaged there. I'm just kind of, I know this sounds gross, but scraping it all out of there.
Oh, yeah.
You knew that, huh?
Exactly.
Okay, I think I got out as much of this cyst as I could. Because it was coming out in fragments, I think there's a higher chance of recurrence here. I do think that Shad's gonna be pretty pleased with what we've done here. I think it's gonna look a lot better than it did. I mean, I gotta make sure that I do a good job here because Shad knows where I live.
All right, so here's some parts of it because it was all peeling out and it all came out in pieces. Look at it.
Oh.
So you can feel back here. It'll be a little bumpy.
Yeah.
After 10 years, my chat is gone. Oh, I feel fantastic. Dr. Lee did an amazing job.
I got a hat for you.
Okay, perfect.
At least something, right?
Yeah.
That's when you can get all dirty.
Dr. Lee, I'm very grateful for you taking your time out to take care of my bump on my head. In all seriousness, I know we joked around a lot. Thank you very much.
I think I need a picture of you like that. Smile.
Not too bad for a couple kids from Upland.
Just gonna wiggle you here a little bit, and you might feel one little bit pinch. This is the thinnest skin on the whole body, so very, very difficult to get just above it.
I can tell that Ebony does not like this. So I definitely have to keep that in mind as I'm proceeding here.
That's it, just like that. That should be the worst of it, okay?
Now it's my turn to really try to take these out completely, and they're really evasive. It's like, you know, when you pop balloons and then you have to try to find all the little pieces on the floor. And it's really important to try to remove every little shred of that balloon or that cyst to be able to make sure it doesn't come back.
The last time you did it, did you feel a lot of it?
It was traumatizing.
Oh, I'm sorry. Well, I don't want it to be traumatizing this time. Okay, I'm gonna just use 2 Q-tips and try to see if I can squeeze it now. Nope, I still can't, not yet. You know, my favorite cysts to pop are the pilar cysts that just pop out whole, like a nice little garbanzo bean or an olive. These are really difficult. They're not satisfying to remove because you are never really sure that you get it all. It's such a small little cyst that's filled with water. There's not even any color to it. And then you have this really flimsy cyst wall that just disappears once you pop it. See how it's like a milky liquid almost? Yeah. There's multiple little loculations, so that is also what makes it a little difficult to remove. I am quickly discovering that there is a cluster of hydrocystomas hiding behind that one on top. It's like baby clusters of grapes. This is as challenging as a giant lipoma. Plus, every time I try to do something, I feel like she's on the edge of flinching. And a little buzzing noise here, like that. You okay? Mm-hmm. I'm cauterizing what I think is the root of this cluster in the hopes that it will seal this off and that these won't reform again. But you know what? It's difficult in this really small space to be able to see exactly what you're cauterizing, so it is something that you have to really hold still for. Okay, sorry. Let's try to get those other 2 here. Okay, sorry. Pinch,
I burned a little bit.
Okay, I'm sorry. Ebony is absolutely uncomfortable. I mean, this is a really difficult process, but I do feel like neither of us wants to give up yet. So it's really a tightrope walk, me being able to get as many as I can with her remaining comfortable. Okay.
Are you all right?
Yes, I'm okay. I think that one pinched a little more.
Yes, it's kind of frightening. Seeing the scaffold close to her eyeball. Anything make your wife uncomfortable hurts real bad.
That little one hurt.
I'm sorry. Now it's come to this point where every little move that I make, every little numbing, every little cautery, every little poke with the blade makes her flinch. So we might not even be able to complete the surgery. Dang it. Let's see if we can't do some kind of measures that are gonna make this better. And let's see if I can't find someone like an eye doctor that specializes in these more so. Because I do think you're gonna need multiple treatments. I don't think she can tolerate it anymore. So I think now is the time to quit. She's really uncomfortable here, and there's some really tough corners like the medial canthus, the lateral canthus to really get to. Maybe she would consider doing this under general anesthesia. And I'm really gonna try to find a great oculoplastic surgeon or ophthalmologist in her area who can really take care of more of these. But let's wrap up what we have going on here. Okay, that does look a lot better.
Yeah, a lot better.
Yeah.
She got to be
Presentable now.
Yes.
I do think we did some good work today. I think I was able to tackle Ebony's most prominent hydrocystomas, and I'm really excited to show her her results. Take a look and see.
Oh my.
Yeah?
Yes. Thank you so much. This is life-changing for me because when I look at myself, I don't see them big bumps. So I'm happy. I'm very happy.
I think that what you should do is oculoplastics, or somebody that specializes in the eye will have the right equipment to get the other little ones. We'll try to find you somebody that's really nice and gentle.
Okay, thank you so much.
Okay? Yeah. So cute. Oh, I adore you. Thank you.
Dr. Lee is so informative. I now have a better understanding of my condition.
She's gonna leave the shades behind.
I'm not gonna wear my sunglasses inside no more, but they still cute. When I go to the beach, I still put them on.
You might just feel me putting a little baby pinch on your skin here, just a little baby pinch. How was that? Was that terrible?
No.
I heard you screaming on the inside. No. You doing okay?
Uh-huh.
I'm numbing up Ralph's back really well to make sure that I can remove probably about 5 cysts. I'm gonna start with the Bermuda Triangle, and after that, time permitting, I'm gonna jump on some of these blackheads. Make sure I'm not hurting you, like I said. Are you ready for a squeeze?
Yes.
You want to stand up for that one?
Yes, please.
You got a little hard-boiled egg in here.
Really? There's that golden cheese.
Oh.
It's like dried cheese, cream cheese has been sitting in the fridge too long.
That's a description. Okay, I'm gonna loosen this sack wall from here. If I'm pulling or anything pinches, you tell me, okay? I'm trying to loosen it. There's scar tissue here. I try to get the whole sack out intact because that'll tell me that I got it all, right? Oh, scar tissue here. 1 down, 1 million to go.
All right.
How many times do you think it's been inflamed before?
I gave up counting.
I'm gonna squeeze you again, okay?
Okay.
It's been stuck in here for a while. What do you want me to do?
That was a good one.
It's kind of dried up and crusty.
Yeah.
Oh, wow.
That's a lot of me is dried up and crusty.
That's what I wasn't gonna say that. You said it for me. They're so hard to kind of work at. We're just on our second one, so.
His back could keep you busy for a while, couldn't it?
And then number 3, the other hard one. Let's see how that one goes. Let's see. I think that one's gonna have some scars in it too. I'm gonna squeeze. Hopefully those other 2 are smaller and may be more agreeable. See, it's like burrowing down into this area right here. All right, I need you to lean a little more forward. Is it like uncomfortable for you to, you want me to get you a little stretch a little bit?
It's the shoulder.
You want to lie down on your tummy all the way?
Well, we can try that, sure.
Ralph has done great so far, but I really need Ralph to roll over so that I can get better access, a better angle to remove this last cyst. But this might be where I push him too far.
Oh, there you go. Oh, you okay? Can you lower this here? Thank you. Getting pretty tired?
No, I have to pee.
Oh, you have to pee. Okay, let me just quickly put a little stitch in here.
Okay, so Ralph has to pee.
Yeah, your feet are gonna come right down. There you go, there's your foot.
There you go.
This is a long procedure, so of course I understand if he has to take a little bit of a break. So I'm gonna send him to the bathroom, and when he comes back, we'll see how he's managing things.
Careful. I'll be right here if you need me, okay?
All right.
Because Ralph is older and diabetic, it is really important that he has enough energy to endure this, that he has enough food and water in his system.
We gotta get some food in you, okay?
Maybe while he's doing this, it's a great opportunity for me to work on some of these less invasive blackheads on his back.
Now, let me get a couple of the blackheads, I guess, while you're here.
Oh, that's a good one.
Hey, look how much it extends right there.
It's amazing how deep they go.
You okay? You're kind of trembling. Are you cold?
A little bit. That's partly because I'm just recovering from lying on my stomach.
I didn't realize that Ralph is shivering. Obviously, his body is giving me cues that he's still out of sorts.
I'm gonna make a little executive decision here. I mean, you're shivering here a little, you're tired and you're tough. I know that, but you know what I mean?
Yeah.
It's been a really long day for Ralph. He's been tough. It's been a long journey for him. But I think it's time to make that call.
You're tough, you don't want to admit it, but you've had enough, I think. And I know you're gonna deny that, but your daughter's here with me and it's 2 against 1.
She didn't stop because he was tired. She stopped because she didn't want to put him through any more stress because he was getting the shakes. He's diabetic.
And she's very meticulous in her actions and very honest in her approach. I can't say enough nice things about her.
So your back looks really good.
Oh, okay. Oh.
See from the side here? Those bumps are gone. They're nice and flat, right?
Okay.
We got a lot of those cute little blackheads right there.
Cute, yes, aren't they?
Aren't they adorable?
I've been fiddling with these things for about 30 years, and finally, I feel so relieved and so happy that we came down here and had this done. When she says it doesn't hurt, it doesn't hurt.
Just a little tightness, maybe. This is the numbing going in.
Any growth that is large, there are more things that I have to watch out for. One is bleeding and protecting deeper structures. This is why I'm gonna use a tumescent technique here. This allows me to really infuse saline in there with the numbing solution and allow this to pull away from deeper structures while also helping with bleeding. But also, if there's a very noticeable superficial dilated vein, I kind of try to trace over it. Just it helps me a little bit, especially when you hit it and it bleeds a little bit more in that area, you know that it's that vein and not to worry about it so much because you can control that bleeding. I really hope this works because I want to give her everything that she's hoping for. All right, so let me just take a little peek and see what we have here, see what this is.
Oh, I hope it's lipoma and not a cyst.
Oh, you do? Me too. Okay. Right here, we took a little peek, about an inch exposure, and it looks like a lipoma.
Okay.
And it looks like it's ready to pop. The good news is that this seems to be a pretty nice, benign-looking, smooth lipoma. I'm gonna just try to start removing it, and maybe this is gonna be a lot easier than I thought. Let's see if I can squeeze it out. I got half of them. Let's see if I can convince the rest to join it. Stuck right here, that's all. I think this is the oldest part of it, maybe. So I'm just gently trying to tugging loose. Okay, I guess I spoke too soon because the oldest part of it, or what I perceive to be the oldest part, is really kind of twisted and wound down onto her shoulder. And I could see that it sort of has these lipoma arms that have it's almost like they've reached out and they've gripped her shoulder to hold on, making it very difficult for me to remove this. I think we can pretty much forget a nice clean pop at this point. I just hope that I can get all of it. It's a troubled child right here. Dang it. Yeah, let me just try to trim this away because it's just taking us a long time to fiddle with that and I can't see that well. Ready to catch it here? All right, we got most of it off. There's still a little bit here, but because there's one little slowish oozing vessel that I need to tie off. It's just a little vein, because you can see it compresses. See, there's a valve, watch, when I go like this. And it's a valve right here, because it flushes back in. I've removed the smooth part of the lipoma, the top of the lipoma, so I could really see what's going on underneath here. It's like you working on a car and you lift up the hood to be able to see what all these other mechanical things are that go on underneath the hood there. And one of the things I'm having trouble with is there's a pretty dilated vein here that just really wants to ooze, and that can be a big problem. You don't want there to be bleeding under this once you close it up because you can get a large hematoma or sometimes it just won't stop bleeding at all. And so it's important that I tie this vein off. Oh, I think that's gonna be okay. Now that I've handled this vein, I can just move around with my blunt fingers and really try to pull out the rest of this mushy lipoma fingers that are extending towards the shoulder joint. Okay, let's do it. Let's get this last little bit here. Woo, okay. I was able to wrench every last piece of that lipoma out, and I was really able to avoid that pretty threatening dilated vein on the surface. So I feel pretty good about this. Time to stitch Kelly up. Do you want to feel how flat it is?
Yeah.
With your hand?
Oh my gosh, it's gone.
Yes. So I'm gonna put one little baby pinch here, just on the surface here. How many years would you say you've had it here then?
About 45 years.
Girl, you look good.
Thank you.
I hope this was in the anti-aging button. I've numbed up Erica really well, and I'm gonna be very gentle here and just make a very superficial, simple incision. And I'm just expecting maybe a little bit of blood here. So I'm just gonna make a little nick in the skin, okay? You shouldn't feel, I'm gonna test it.
Okay.
Let's see what we have here. You okay, yeah?
I am. I don't feel anything.
Huh, this is weird. Look at that little blue color right there.
Oh, wow.
It's like paint.
That's incredible.
This is definitely not blood. I've never seen blood this color. I don't really know exactly what's going on here, but it's definitely a weird gray, kind of muddy look to it. So I am not sure what is going on in Erica's hand. I think there might be a little bit more.
Oh.
What in the world is that?
So fascinating. Look how much more is still in there.
Oh my gosh.
Yeah. What the heck is that? So fascinating though. See how it's stained? I feel like it's like dissolved graphite. Look.
That's unbelievable, Dr. Lee.
Wow, that's a whole nother person in your hand.
More and more of these oily black drops come out of this area, along with a lump of tissue that is stained this color. So now I'm thinking that perhaps there was pencil lead in this area, and the body sort of walled this off because it's a little foreign body reaction. I have never seen this in my entire life.
I feel like this is still something here too. I just need to get my bearings and see what the heck is going on under here.
Gotta be kidding me.
Oh, my.
Look.
Oh, she got it.
Yeah. This is definitely the lead. That is just
Unbelievable.
crazy to see.
Unbelievable.
That's the tissue that walled it off, that was stained that.
That was the cocoon.
A little splinter almost of the pen. Oh, that's like the wood.
Yeah.
Okay, well now I've seen it all. I mean, this is crazy talk. This is crazy stuff. I mean, what's going on here? How could she have pencil lead that is stuck in her palm for the last 45 years? And her body has sort of walled off and protected this portion of her hand just to make sure that, you know, we don't have any problems with that area. Kind of walled it off and put it in its little place like it was in solitary confinement right there in her palm. And now we've unearthed it. Of pencil lead, you see the taper. You see that it was probably recently sharpened. This is one for the books. One for the books.
Oh my goodness.
All of that was in your hand.
That's
girl.
unbelievable. 45 years of having a foreign object in your hand and now it's out. Amazing is the word for the day.
I'm a little sad. My girlfriend is gone.
Okay, little baby pinch here. Okay, little baby pinch. So the scalp likes to sometimes just ooze a little bit more because there's so much good vasculature there supplying our what's underneath there and our hair and all this kind of stuff. Let us know if you feel, you know, anything
Okay.
lightheaded.
Oh, I
don't
absolutely
like
will.
Yeah, I don't like to have more than one patient at a time. You'll feel me pushing on you. That's all normal, okay?
Okay.
You doing, and you can kind of hear me, sorry. That's why I jabber away, because hair follicles make noises, sort of.
Yeah,
They talk to us.
I'm seeing her run the scalpel along his bump. I'm feeling nervous because based on what I'm seeing, it looks scary.
Hold this gauze underneath there. You're gonna also hear a buzzing noise. No shock, okay, good. You're doing great. Let me see what we have here. We're just right on top of it. Just take my time in the beginning just to make sure everything looks good. And try to keep it out nice and cleanly that I can see, and just kind of a little meticulous in the beginning. Right there, thank you, because it was just pulling too much on this side. Let me try to see.
It's really hard for me to find where this blood is coming out from this blood vessel, and I really might have to extend the length of the wound to be able to really properly see into this deep area. I also hear Tania behind me, who is having a tough time watching this procedure. I need to make sure she doesn't become a patient too.
Annoying little baby vessels just not making it easy for me to see over here. Okay, can you do this for me here then? I can't seem to see it here. Thank you. It's like you're having a little baby. You could say you had your first baby together. Are you guys practicing, you said?
Oh, yeah. We're having a baby in April.
Oh, you are?
Yeah.
Congratulations.
Thank you.
She's giggling. Okay, I've calmed Tania down, and so now I can really kind of address this bloody lipoma.
I think I have a clamp over it. Let me see if I can tie that. Got a little pest of a vessel there, a little one. You doing okay?
I'm still in awe of what I'm looking at.
Oh,
When I
really? You can look at it though, huh?
I
It's
can
okay?
look at it,
Okay,
so
good.
that's nice.
that side. It's fine.
Well, I've successfully tied off this really annoying blood vessel. Now I can try to work on removing this lipoma.
I'm gonna squeeze you here, okay? Let's see if this comes out. Right.
I think this is the part I probably shouldn't watch.
Oh yeah, you don't have to watch it. You okay?
Just the pulling.
Yeah, just it's pinching. I got a really good pinch muscle. It's like having a baby. I think he's gonna be better at having babies than you. Might not be that easy with you.
Oh my gosh, that's very interesting to see.
Yeah, we almost got it.
That's crazy. It's really cool, Michael.
Guess what? It's out. You had a little baby girl.
This one I don't want to take home, though.
Well, we'll send him home. Let's put some stitches there.
Even though that blood vessel gave me some initial kind of pause or some trouble, we were able to get this out in one piece. Mike and Tania did really well. I'm really proud of them. And I'm really proud of myself because I got to deliver their first baby.
Oh my God, that's crazy.
It's like a little brain.
Yeah.
Right?
Isn't that crazy?
That's so weird.
Here's a mirror. And you can kind of, but I'll also show you a mirror so
wow.
you can see it.
That's crazy.
Right? You can kind of see that.
I feel good. I feel happy. It's crazy. It's not there anymore. It's literally a weight off my head knowing that this is just a lipoma and I could have and should have dealt with this a long time ago.
I'm really proud of you.
Thank you so
guys,
much.
Congratulations.
Thank you.
I'm glad I was like the first delivery on your side, right?
Yeah.
You guys take care and congrats,
Thank you so
okay?
much.
Thank
you. I'm so happy. I know that he's gonna feel much more confident at our wedding now, and I'm also looking forward to our photos because that's a really big deal to me.
Now I don't have to wear a hat.
I know, now you don't have to wear a hat to our wedding.
Yeah, serious. I'm not gonna throw all my hats away, but I won't wear one at the wedding.
Fair enough.
Baby pinch. You okay right there? Did you feel that? Oh, okay.
During the surgery, if I tend to pull or cauterize a particular area, if that elicits more pain, it could be that has some connection to some deeper structure that is really kind of causing discomfort. And I don't want to do something that causes permanent and consistent pain in that area.
So like I said, make sure nothing hurts, okay?
Oh yeah, I felt that right there.
I'm sorry. Right there on that edge, huh? Okay.
Plexiform neurofibromas have a distinct sort of appearance. When you lay them flat, they just kind of flatten out. I mean, I don't know what I'm gonna see under there. I'm gonna just be really as cautious as I can, try to go really circumscribe this area with my blade, and let's see what we can take off.
It's just kind of like a challenge because when I lay flat, it like lays flat. And so I want to lift it up but not take off too much. So I'm just trying to find the right angle to do this. It's like removing like eyelid skin. It's very flimsy and moves around a lot. It's like a giant piece of eyelid skin.
Grabbing something like this is like grabbing a rotten peach that, you grab it and the skin kind of almost falls away from it. Meanwhile, I'm trying to keep Amanda as calm as possible while I'm removing this, and this growth is just not cooperating.
Buzzing again.
Ooh, I feel that a lot.
I'm sorry. A lot? I'm
Yeah.
sorry. I'm sorry.
I can't get a good grip on this loose skin. It keeps trying to get away. I don't want to cut too deep because I don't want to go and probe for any of these neurofibroma cells that might be wrapped around important structures down deep.
You okay, huh? Okay. Just let me know again. Yeah, you okay? You okay?
Yeah.
Got it off. Okay, let's put some stitches in now. It looks pretty flat right there, but we gotta be able to pull that together.
So I got the part off that was hanging, but not disrupting any deeper components. And I think, that will make Amanda really happy. Now is the time to stitch this up, and hopefully this will relieve a lot of Amanda's symptoms.
Everything looks good. As I've told you, I can't get around this whole thing. That's too large of an area. So we're making it flat, and then hopefully that's gonna help to diminish the discomfort. Okay, did you wanna see your neurofibroma on the tray?
Oh, definitely.
It looks like a hamburger patty.
Oh, wow, it does. That's crazy. It didn't even look like that on my back.
Take a look at the undersurface there too.
Oh, wow.
So see that middle, the yellow part, that's like fat, but see all the edges, how it's sort of clearish? That's more neurofibroma, you know?
I never would have thought it looked like that.
Looks like when you peel up pizza.
That's insane.
Cheese pizza.
I've been told by so many doctors this can't be done over and over again that it made me lose a lot of faith that this was ever gonna happen. I'm just really, really happy that it finally did. I'm really happy that Dr. Lee was able to help me. I really wanna go back to the previous doctors, all of them, and say, look, you know, you were wrong. It could be done, and it was done.
Did you wanna see it?
Yeah, let's take a look with you.
Oh, yeah. A lot better.
Yes, a
Thank
lot
you.
better. Okay?
Looks like a different back.
Yes, it looks like a regular back.
Yeah, thank you.
I really feel like this has changed my life for the better, so I can just be myself again, just be happy again, and hopefully be pain-free.
I think it looks really good. I'm pretty pleased with that, and we'll see about the pain. I hope it helps that. Okay, but you did great. You're
Well,
such
thank
a
you
pro.
so much.
Thank you. You're such a sweetheart.
I'm really looking forward to Tyler seeing like the old me, maybe seeing how confident I used to be and outgoing that I used to be. I really want to give Dr. Lee a big hug and just tell her how much this means to me. I don't think she knows, like, you know, how big this really is.
I'm 100% serious when I tell you that popping a loved one's cyst is probably the most romantic, the most endearing thing that you could do for somebody. Okay, so there you go. Ready? Okay. Oh, here she goes. Here she goes.
Oh, it feels so nice.
Yeah, doesn't it?
Yes.
Just go around it a little bit.
This program examines dermatological conditions and the procedures involved with treating them. Due to the graphic nature, viewer discretion is advised.
So I'm gonna put some numbing there. You might feel a pinch on the surface, but the area will kind of get bigger because it's gonna get filled with a little fluid there.
Okay.
Knowing that Terry is experiencing some pretty severe pain in this area makes me proceed with caution. Tumescent anesthesia is key here. We're really going to flood that area with numbing to really try to lift this growth up and separate it because I think it's pretty inherent to his muscle and bigger nerves underneath there. And when I'm making an incision, I'm looking for big blood vessels, potentially nerve fibers. I want to make sure this is not intertwined within his muscles and potentially kind of impinging on some of the bigger nerves that are really important to his functioning of his leg. Let's see whether this is something I can remove. I'm gonna just be a little bit more timid, more conservative, and just kind of take a peek and see what we have going on here.
Okay.
It looks like a lipoma. And it's a lipoma.
So I think we can remove it, okay? Thankfully, I was afraid I was gonna have to give you bad news. Okay, I'm gonna give it a squeeze. That might pop out.
Doctor, what kind of concerns do you have with the pain that he's been experiencing?
I'm treating this very conservatively and timidly. I'm trying to see if I can pop this out whole. I mean, and that would be nice, because then we know we got it all. And certainly I don't want to disrupt anything underneath. Hopefully this will get rid of his pain, but I don't want to anger that nerve either so that it's always firing and causing pain. So just, sorry, making that noise, but I'm not trying to have a bowel movement or anything. I'm just trying to squeeze this. This is actually pretty tucked under here.
The good news is that this looks like a pretty benign appearing lipoma, but part of it is still adherent. If this lipoma is intertwined with some really big vessels and nerves under the skin, I'm not gonna be able to proceed. It's over. It's like coiled in there. It's like twisted in there. Oh my gosh. Just have to be gentle. That's what it is. Be even extra gentle right there. Look at that. It's pretty heavy. Make sure I don't tug on you and pull on those nerves, or we don't want to get angry. But I'm close here now. Just the last little bit that's almost there. All right. Let me just check it out now. We got it all off.
I'm ready now. Stitch me up, I'm ready to go.
You gotta rest a little bit.
I know, I'm just happy.
I'm just checking whether I see any, like, nerves that might have gotten irritated by this.
Thing looks pretty good. The giant lipoma has really been causing Terry a lot of pain. Hopefully, I've been able to get it all out and not disrupted any of the nerves around the area. So hopefully he can get back to a much more normal life now. All right. I think a mirror might be easier for you to see. It's a little bit like filled with fluid still, but But look at that good-looking hip now.
Oh, wow, that's neat. Now that this bump is gone, I'm excited because I can buy new clothes and I can just go be in public. I ain't got to worry about my job. I can go through security without being scrutinized, worried about if I'm stealing something or what I got. It's a different chapter now.
You were fantastic, and I'm so lucky to know you.
I'm just so happy that you were able to help me.
I know, it's gonna look great. It must be so relief. Oh my God, I bet you're such a tough guy. You never do that, so I feel honored.
It's just a relief.
Yeah, you did so good too. I adore you, okay? We'll put a little bandage on you, okay? Thank you.
I've been carrying this around for so long. When I looked at it, I was overcome with emotion to actually see my leg looking normal again, back to where my leg was before this bump, because I didn't really believe it was gonna ever be like that again until now.
What do you think it's gonna weigh?
3 pounds.
3 pounds, okay. Yep, 1.54. Typical man, always think it's bigger than it is. Feel that, that's got some weight to it.
I want to say thank you, Dr. Lee. You have made a major difference in my life. I get to live my life again. I get to live a normal life. All I ask for. Thank you.
Put some numbing right here. I still think it's probably a cyst. The only way we can get rid of it is to not just squeeze it, but like to actually remove the sac wall. And hopefully these are gonna come out nice and easy. I'm here with James, who has a doctor that previously told him he has 2 lipomas on his upper back. I don't think they're lipomas. I suspect that they are cysts. One of them is overlying his spine, so of course there's a little area that I don't want to go in. I don't want to delve too deeply, but I always proceed with caution because there's a lot of important structures around that are threatening, like his spinal cord. Let's see what we have here. I think cyst. I have been proven wrong before, so let's see what goes on. Gonna be a little timid. I feel even there was like a little punctum or a little kind of opening right there, so make sure I'm not hurting you. I'm just gonna lightly, you wanna be gentle with the cyst too because you don't wanna squeeze and there's an opening and it kind of gets you. It ruins your day, Janet. Yeah, I think, see, look, there's a cyst. It's a cyst.
All right.
So I was right this time. I like being right. Not right that often. So now let's try to squeeze out all the cheese from the cyst. And maybe Tara wants to see that squeeze part.
Yeah, I do.
You do? Okay, here.
Oh, my.
So we got some mashed potatoes in there, grits. Isn't that lovely? Mm-hmm. You okay? Sorry, squeeze kind of hard.
That's good.
That's our little grits there. You've been saving those grits for something. This one didn't pop out whole. Unfortunately, I had to rupture the sac and kind of squeeze the contents out because the sac wall was kind of thin and pretty adherent to his regular tissue. So I really had to gently try to scrape that out, obviously still remaining conscious that these look like they go pretty deep, and I'm aware that there's a spinal cord under there. Oh, sorry. Ay, sorry. The little buzzing sound you're gonna hear. Oh, sorry. There's just one little baby vessel that's oozing on us, that's all. So things aren't going quite as smoothly as a cyst removal should go. He is experiencing some pain here. He does have a little bleeder that I need to tie off. And so I just have to really manage him and his comfort levels while I'm trying to really effectively and completely remove the sac wall. The sac was a little stuck, but I think I'm gonna be able to get it all. All right. Okay, on to number 2. I'm just trying to tease a little bit around it. I don't feel like I should give it a squeeze. I feel like I should take it out. Let me see, because I feel like I could get it out whole, and that is also equally amazing. I love that so much better because it doesn't make a little bit of a mess here. This cyst seems to be less adherent to the skin, and it really kind of moves around, kind of like a ball bearing. So this makes me think that maybe I can get this one out whole if it cooperates. It's like an egg, huh?
Wow.
Yeah, it's not messing around, is it? Sometimes it's deceiving how big it is until you get it loosened up. You just gotta have enough time for me to scare you completely. There we go. Isn't that one nicer? I feel like I could charge for admission for that one. Actually, I could charge for admission for both.
Both cysts are out. I'm happy that we didn't go anywhere near his spine and disrupt any of those really important nerves there that are consistent with life. I think that we got rid of the demons on his back, though. That's great.
Your back is completely flat.
Yeah, it looks good. Those will look really good when they heal up here. You can see that, right?
They're gone.
That is amazing. That is freaking awesome. Once I seen in the mirror, it didn't have them demons on my back no more. It was just pure ecstasy. My back looks flat now, like it should. I can be myself again, finally.
Okay, so we prepared them in 2 different ways to your liking.
Wow. You gonna deep batter them?
Yeah, one is sous vide, and the other one is like scrambled, like grits or something. I don't know. That's like egg salad.
I could have made breakfast out of that.
Yeah. He's like, I'm out. That was enough.
I'm so excited to get my best friend back and to be able to experience life with him. We're going to the beach, and I'm gonna make him take his shirt off this time.
You're not gonna have to make me take it off. I'll be doing it as happy, with a smile on my face.
So let me have you climb up, because I'm already thinking about your position to be in. And then you're going to come, I thought it's the other way. Yeah, turn this way. Cover him with that blue towel, too, that blue one over there. So hold on, yeah, I think that, yep. I think that's, now scoot your butt back so you're all the way against there. Yeah. That will work there. It actually makes it really nice and perfectly exposed here. Yeah, that might work out. He's like really a very good patient because you really get in the right position right away. I like that.
Okay, well, Kevin is the right guy to have a bump in the spot. He sure is flexible, and he's not shy. I think that this is a lipoma, but it could just be herniated fat. At worst, it could be a arteriovenous malformation. Could this be filled with blood vessels? And that would not be a good thing. I think that it's a lipoma, though, so I'm gonna proceed with caution. I'm gonna numb the area, and I'm always gonna take a conservative little peekaboo look.
All right, so you shouldn't feel anything other than us touching you, okay? Nothing should be sharp and uncomfortable. Okay, we're about to start here, and I was a little more hesitant when we were outside because when you were bending over like that, it looked like it was really in a tough spot and very tight, but looks like a lipoma. It looks like I can remove this, so I'm gonna give it a try, okay?
Yeah, let's do this.
Have you always been this like happy-go-lucky? You really are like a very
I'm always positive, I'm always happy.
Yes, I like that. Just wants to use a little bit more. He's got a lot of nice little, because he's got a nice tush, I guess. He's got like a good blood supply there. Like, I don't want to see you mad, because then you're probably, people are like, oh my God, what's going on now? I'm gonna buzz, make sure, is he touching anything metal? No. Okay, good. I'm gonna buzz you here, you shouldn't feel anything. Let's see if I can get it out with not too much problems here. Let's see, it likes to ooze on us.
Fresh out of the gates, I see some pretty consistent and persistent bleeding, and I really want to take my time and cauterize these areas. I want to try to nip any of these bleeders in the bud before things get out of control.
Hopefully it's not attached to the muscle.
Yes. It feels pretty good right now. I'm gonna loosen it up soon and then try to dab right there again. That's the little blood vessel there. I can see it right there. It's connected to him. Come on. I'm gonna tie it off more right there. Just trying to help this little annoying vessel right here so we can pull this off.
I do see that there's definitely a bleeder here, and I really need to get it. This is a really mobile area. He's gonna stand up and sit down and squat. It is already prone to bleed on its own with movement here. And so if I have a bleeder there that is not controlled, he's just gonna have essentially a bag of clotted blood in the area, like Jell-O. You don't wanna have a third butt of blood. I finally feel comfortable with the control of the blood vessels. There doesn't seem to be any active bleeding now, and so now I need to tackle the lipoma. I don't think it's gonna pop out so nice and easy. Come on. It's like a baby that's crying. There we go. Did you feel that release?
Yes. Woo.
Let me see if I can't tease that out now. Gently on him. I've been able to express the majority of Kevin's lipoma here, but it's just kind of holding on by some bare fibrous tissue here. So I just gotta snip that last bit off. It's right up against your edge of your leg, and I'm trying to pull it away without pulling too hard. You okay?
I'm okay.
Good. We're almost done here, actually. Go. Got it out. So I'm just gonna buzz you now and close you up, okay? Gonna have to try to minimize movements here, but obviously whenever you sit and move around, you know what I mean? This area gets stretched. I am stitching up this incision really nicely just so it's hidden out under the crease of his booty cheek. I'm gonna put in more stitches because I do think that these little gaps here can cause it to ooze a little bit more too from these gaps, so. I'm taking some extra care, putting in some extra deep sutures because this is an area under a lot of tension and I don't want him to bend over and pop out those sutures. So important in the next 24 hours because that's when you can bleed more. Kevin's got his booty back and I can't wait to show him his results. Okay, it looks really good. Just a little bit puffy, which is normal. Can you see that?
Oh, yeah, I can.
See how it's a little, right, and when you're standing, it'll be flattened like this.
When Dr. Lee handed me the mirror, it was very surprising and shocking. My heart was pounding out of excitement. There's no bump there. I just saw flat with stitches. I wish I could get off the chair and just celebrate and run all up on the street because it's a celebration for me, living lipoma free.
See that part right there?
It was this.
That's probably the part that was in the end. You know how it was bulging out?
I will be very careful in the next coming days, weeks, to not mess this thing up. I'm gonna be very happy coaching, exercise. This lump was getting me stressed every day. Now I can live life like a normal human being. I'm very excited. I can't even talk right now.
Close your eyes just so I don't stick my finger in your eye. Great. Maybe pinch. Whenever I plan an incision on the face, I'm always trying to hide the scar as much as possible. And one of the most common ways to do this is to hide them in resting skin tension lines. And in this case, on the forehead, that would be along our forehead lines. The other thing that I'm aware of is trying to keep an incision as small as possible. I'm not 100% sure what this is. I don't really know what to expect yet, and I won't know until I get started. Okay. This might kind of squirt at us here. Okay. I think it's open a little here on this side, yeah. Sorry, it spit at us a little bit. There's it is a cyst.
It is a cyst?
Yeah. Gonna squeeze it. Sorry, I'm squeezing it out of you. Just nothing using sharp, you know what I mean? So that I don't traumatize or cause any other issues, but I just wanna squeeze a lot of it out so that I can numb underneath it. Because of the size of this growth and the fact that it's filled with contents that are under pressure, I really need to squeeze the contents out first because it's gonna allow me to see what's going on underneath. I mean, this big balloon is just in the way. We're just trying to take our time here and, okay, here, getting underneath it, so just wanna kind of tease around it. I'm trying to get under the sac and really try to scrape the sac well off of her skull, but I'm also concerned that this is gonna start to get uncomfortable for Crystal. I know that Crystal is hearing things, so I just really need to try to make her as comfortable as possible. So what do you like to do for fun?
I am a practicing witch.
A practicing witch?
Yes.
Do you think that witchcraft caused this? And
I feel as though my spiritual side is pushing out the things that I don't need anymore.
I've never thought about it, but maybe cysts and lipomas are just this bad spiritual energy that's just trying to get out of you. Just keep it like that. The other theories could be benign fatty tissue and old skin cells.
Like having it get so much bigger, it had become difficult to really have like my third eye be clear.
I agree with that.
I'm just trying to get around it. It's like kind of stuck to you at the base, so I'm trying to get around it without it causing too much oozing here. It really is wanting to stick to you, I'll tell you that. This is unusual that it takes me this long to get this off. Okay, well, I gotta back up here a little. I think you're right. I feel weird vibes from this thing. You okay? We have like energies in here that are not. Maybe this thing is getting mad at you and doesn't want us to take it off. Did you see that? His camera almost popped out of his hand.
Oh my goodness.
Okay.
I'm relieved to finally have this procedure over. I was able to make the incision nice and small. I think I was able to remove the cyst entirely. Now I think I need to burn some sage.
Why don't you hold this? Okay. See the L? Oh
my God. Oh, I can't believe it's going.
Yes, it's gonna look really good. It's just bumpy now. Oh. It was like so much pain and like up, I feel like all the negativity was in there.
I'm looking in the mirror for the first time, and it's almost, I don't even believe it, And me. Dr. Lee, seriously, she is an amazing soul, and I can see so many more possibilities in my life because of her.
You look great. You're so beautiful. And you're amazing.
I think that now I'll be unstoppable on TikTok because there's nothing holding me back anymore. People will know me for me and my voice and not my bump.
Thank you for coming into my life.
Thank you. I have not seen my face like this in 25 years, and I'm finally fully myself.
Sorry, a little wet here. I'm sorry. What do you feel there that makes you?
I'm just scared.
Oh.
I know you're not going to hurt me. You're doing
Yeah,
everything
no,
right.
I'm not trying to hurt you at all.
JFab is absolutely adorable, but man, is she freaking out. And I really have to be very careful with this type of person because I've got sharp objects in my hand. I don't want somebody flipping out and making some quick movements. It's just as important as making sure that this is a painless and comfortable procedure to make sure that I have calmed her nerves and that she feels in control. I'm about to start with my first incision with my scalpel, and if she moves quickly in any way, this is gonna be a different kind of situation.
I do think it's a lipoma now, and that it's above the muscle. This looks like a lipoma. Let's see if I can...
Oh my God, thank you.
Oh my goodness, I've never had... You were so scared it wasn't going to be a lipoma?
Yes.
Goodness sakes.
I actually didn't realize how many emotions were tied into this procedure. It's more than just removing this lipoma. This signifies something very big to her. Now that she seems to be a little bit more calm and relieved, I really hope that this lipoma is gonna pop out really nicely and smoothly, because if I have any problems or she gets stressed out again, this is not gonna be any kind of fabulous party. Dang it.
Sometimes they're really kind of wrapped around your regular tissue, and I don't think it's gonna come out easily. Ay, ay, ay. It's not gonna be an easy one, of course. I think I'm gonna take it out in pieces.
My mind's thinking that the new growth is on top, and it just wants to hang on.
You have a mind that does some sneaky things to you.
I have a big imagination.
You do? Let's talk about something else then.
Oh, no, it's okay.
She gets too much in her mind thinking the worst case scenario when I talk about anything. So I'm gonna talk about anything else other than this lipoma that I'm taking out little piece by little piece.
How many people do you have out there today?
4.
I mean, do you think your friends are nervous for you out there?
I think they're so supportive that I'm the one that's nerve-wracked.
That's good tequila.
Oh, all of it? We're sure.
Okay, I'm gonna play this one. Okay, you guys know it. Ready?
Yeah, well, hopefully they're enjoying themselves being together. Oh, they're having fun.
Oh, good.
I want to massage it because there's like little maybe pebbles of this here, and I'm just seeing if I can massage any of it out. Come on, little pebble things here. Yeah, yours is taking me a little while here, Missy. I can hear them.
As I am painstakingly pulling out every last bit of JFab's lipoma, I'm really trying not to be distracted by this party that's obviously going on in my waiting room by the Dura Dura gang. I mean, this is the first time I've ever had a party out there that I haven't arranged.
Yes, we're all good now. I think I'm gonna start sewing you up now.
Wow! Finally, we got all of it, so now she can go back and be fabulous.
You can reach back and feel this area.
Oh my God.
It's all flat.
I feel so amazing. I am so excited now that people are just gonna look at me and not anything on my back. I'm gonna feel so much more me without the bump.
You have such wonderful friends who've been here the whole time.
Yes.
And let's go out together and we'll meet them.
I'm gonna have to go crash this party. I mean, it's my waiting room.
Ta-da!
What a gorgeous group of wonderful people we have here. And JFab is clearly not the only one that likes animal prints.
Time for some shots.
But of course, I'm on duty, so I gotta pass on the shot, unfortunately. But cheers to the DDG gang.
All right, here's your shots. Here's your servings recovery.
I'm feeling right now that I have the next chapter in my life to be the better version of me. I can do anything. I'm ready.
I'm here with the gentle giant, Dan, and his lovely wife, Elise. He does tell me that he's had a history of fainting, and some people pass out from the thought of having a surgery or even the sight of blood. And I mean, that's because all the blood sort of rushes away from your head and you get lightheaded and you can momentarily pass out. And I'm always really cautious about that. In particular, a person who's as large as he is, because if he were to faint on us and keel over, he could really knock his head and do some serious damage.
If you ever feel lightheaded, or you know how you feel when you start to feel, make sure you get some good oxygen. In fact, I'm gonna let you take this thing off so you get good oxygen. How's that?
Oh, thank you.
It's time to remove these cysts. I'm gonna start with the two on the top of his head. They've been removed before. I expect scar tissue to be present, so you never know how long those are gonna take. Hopefully I'll have time to do the last one.
Okay, so I don't know if these are combined or not. Maybe they are. Are you ready? I actually opened the smallest one, the oldest one, but I'm trying to now tease it away from your skin.
That sounds like a pair of scissors.
Just this one's stuck to you a little bit because it's the oldest. I gotta tease it. I'm very conscious about you and your low pain threshold. I think there's still a little left.
Are you calling me a wussy?
No, so you did that, not me.
I got the first one down. That one was tough. Now I'm gonna tackle the next one, which is right next to it. Hopefully it won't be as difficult as the first one.
We're all in the splash zone over here, so we're all a little conscious of this. Oh, he's got real, like, cream curd butter here.
Oh, gross.
Yeah, we should make that into bar of soap for him.
That's so bad. That's disgusting.
Oh, you love it.
No, I don't.
I guess I kind of misread Dan because he's super squeamish too. He doesn't want to see the beautiful buttery contents of his cyst, and that's weird.
Wow.
All I can feel is tugging.
Yeah, good. I am going to see if there's any fluid in here.
Now I've got to tackle this bigger one that is a little bit virginal and untouched, so hopefully it's gonna behave more than those two smaller, difficult little twins up there.
Let me see if there's not some little fluid in here in case it wants to ooze or something.
This bigger one feels a little bit more water-filled and soft and wobbly, so I really think, let me just aspirate some of the contents. Let me shrink that down because I feel like if I pop that, it's gonna make a big old mess.
Got a straw?
Just a lot of liquid in that.
Yeah, it's
That's
okay.
gross.
Yeah, it's an old one.
An old sis.
Old as him.
Almost as old
Yeah,
as me.
you've had that one for a long time.
Of course, yours is not gonna be so easy. I gotta trim this little sucker. He's too big for me to see around. Okay.
Another.
Yes, another one.
Thank goodness we removed the final cyst, and I know this gentle giant is gonna love his new noggin.
So, you know, this is gonna look bumpy here still.
Oh yeah, look at that. I feel amazing because I wasn't sure I was gonna get these lumps off of my head, and here we are.
I think I took an inch off of you at least.
6'5" now.
Yes.
It's going to be nice to not have to worry about what other people think about me. I do just want to thank Dr. Lee.
Thank you so much for fixing my husband's head.
She's not a shrink.
How you feel?
Short.
I see that they're all kind of mounded right on top of your really nice quad here, your
Thank you.
muscle. So on this side, you have a little more, it looks
Yeah.
like, right?
Alonzo's got a lot of lipomas here, and I really want to make him happy, but I really have to strategize this. There has to be a good plan of action if I want to be able to take off enough of these to make sure that he's happy.
So I think that it would be great for us to focus on your thighs, certainly,
Okay.
right? There is certain things I have to pay attention to, which is like the amount of lidocaine, the amount of numbing that we can put on you safely. And also, my hands can only handle so much squeezing before they start to give out. So what we're gonna do today, if this is okay, is let's try to target the leg that when I first saw you, it was much more noticeable.
Right.
And let's take it from there. Let's see how that goes, and then we'll proceed as we need to.
All right, thank you.
Of course.
My pinch game is pretty strong, but I really do have to use some special muscles to be able to remove these efficiently. My plan of action here is to really start on his right leg first. Try to get off the ones that really bother him, and then let's see how much energy I have left to go on to the next one.
Let's start with these two here on your upper right leg. Make sure never hurting you, like I said. Doing okay. Just squeeze it, okay? That is ready. You okay, right?
Yes, ma'am. It's crazy. I can't feel anything.
Yeah, I know. Isn't that good? It's a good thing. See, there's your little lobe.
Yeah, it's just so weird seeing them out of me.
I know. We're gonna put them where the pictures are, and then you can see the final artwork. That one came out really nice, so hopefully that means they're all gonna be like that. See a little, it's like a little pancake in there. Let me see, they are just popping out. This is where my squeeze muscle gets sore though, too, Look at those two things. Aren't they cute? They're like little brains or something. That's the thigh here. Okay, let's get your lower right thigh now. Is that chair still here? Maybe I could use that. That'd be nice. I'm gonna sit down here first, so it saves my back too. Too early to have issues.
Your back?
Yeah, me leaning over like this.
I'm about halfway through here with his right leg, but my back and my hands are starting to kill me. I'm really hoping to get through both legs today, but at this point, I'm just happy to get through one.
Oh my gosh, he's almost there. There you go. Phew. Look at that. Okay, they're all like sitting on the surface now. Like we're serving them up. Here's one. There. There's a little side piece. This one has a side piece. Okay, last one from this cluster. Slowly kind of shift your whole onto that hip a little bit. Yeah, yeah, there you go. Okay. Good. I think that's it.
All right, now we're gonna just stitch all these up. I was finally able to remove all of the lipomas that I can on Alonzo's right leg, and I'm really proud of the amount we were able to remove.
Okay, so you did really great with those. They popped out really well, really straightforward, so that was great. That really tells me that we can do the other side here.
You know, my back and my hands hurt, but his legs are too nice for me not to finish them. So I think I have a way of winning the war against Alonzo's lipomas and still leaving him with these Schwarzenegger legs.
Alrighty, here we go. Make sure I'm not hurting you like we did last time. You're such a pro at this.
It's really daunting to remove this many lipomas in one sitting. It's very tiring. So I think what I'm gonna try to do is recruit one of my physician assistants, Shannon, to help with this, because I think with the two of us together, we can potentially double the amount of lipomas that I remove.
Oh, those look beautiful.
Alonzo's Schwarzenegger thighs are looking so nice and smooth now, and his lipomas, they won't be back.
Okay. We did both sides, and look at that nice little flexion here, right? Before it was really noticeable. I mean, even in your clothes, you could see little bumps there. So they look great.
Looking down and seeing like the shape of my legs without all these bumps, it's really cool. I mean, like, they're legs now. And I work really hard for these muscles, you know, and now I can see them the way that they're supposed to be seen.
So we got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 22, 23, 24, 25, 26, 27. Yes, I'm so glad I got to meet you. And thank goodness Shannon was also here. That also allowed us to go faster and get some more off.
Appreciate both of you. Thank you so much. Dr. Lee changed my life. You know, I finally have the confidence myself that I'm trying to instill in other people. I feel like my body can finally be my business card, you know, hopefully a good one.
Nice to see you.
Thank you so much.
Thank you, okay?
Thank you.
And I'm glad to take 27 parts of you.
I can't wait to get back into the gym for leg day, you know, wear my short shorts, show off my quads. Ladies, watch out.
So a little pinch right here, okay? Is that really bad?
No.
Not too bad? Okay.
This area was just recently inflamed. In fact, it leaked last night. So I think there could be some liquid in here. So I'm gonna relieve some of that liquid by aspirating, because I do think that if I were to really make an incision, there could be quite an explosion.
I'm gonna see if I can't pull some of that fluid out so that it won't explode on us. Some of these, like when they're tight like that, they can explode on us. So we don't want that to happen, obviously. Yeah, look at that. There's a lot of liquid in there. You okay?
Yes, ma'am.
Not hurting you, right?
No.
I might need another syringe there. That will help us to take this out nice and cleanly, I think. Do you have a nickname for this thing here?
Yes, ma'am. You know what I'm saying? My daughters gave it today, Larry.
Oh, are they gonna miss Larry?
No, I don't think so.
You're like, Larry's got to go.
Yes.
We took off like almost 20 cc's of your liquid gold, I guess we could say, or something. I don't know what to call it.
Now that a lot of the pressure is gone and Jeffrey's cyst looks like a deflated basketball, I can open the top of it and see how the cyst contents appear.
It's been here for a while. It's a little thickened and scarred down here. It's like tough skin you got here.
This is probably my hardest task of all right now, is to try to get out all these cyst contents, and they're really hard to fight with. Normal skin, my surgical instruments and my scalpel will go through it like butter, no problem. But this skin is really tough, it's really thickened, it's really scarred down, so I'm not sure I'm gonna be able to get through all of this.
This one could give us a little run. I already know that. What I'm gonna do to get this to come down here and come off easily. We're gonna just get to know each other, because I gotta peel this off here, I think, little bit by bit. It's so stiff, like it's, Do you remember the old school, like they were like coin purses that you would just squeeze?
It's like a little
plastic. You push, yeah, to open up, the mouth would open. It's kind of like that. If you squeeze it, it'll just pop right back into the shape. It's like this. It's like the cyst wall is causing it. And I don't know if I can get that off that easily. I might just have to kind of scrape a little on where I can, and then just have us pull that out.
Thankfully, I'm noticing as I'm peeling off that sack wall, it is making his skin a little bit more pliable, a little bit more easy to work with, and I'm very thankful for that. And hopefully this means that I'm gonna be able to remove the sack completely and there's not gonna be any errant remnants left. This is much more complicated than your average cyst that might just kind of grow up from scratch, because things get kind of mad or irritated, they get a little more sticky to you. And I've gotta like peel the whole thing off of you. Let's scoop it up in here too. Now, look at that. We got it all. Much better. I was finally able to remove all of Jeffrey's cysts, and let me tell you, that was probably the most ornery cyst that I've ever come across. It was not fun to slowly pick out little pieces of this deflated basketball of a cyst. Now I can close this wound really nice and properly, and I think it's gonna look great. So I'm gonna show this to you.
Okay.
You wanna take that? At least you know where it used to pop out, or do you want to give you the mirror? Sorry.
I'm really happy right now. I feel great, man. It's like a burden has been lifted, man. A 15-year-old burden. The burden of not going out, the burden of staying in the house, the burden of not feeling comfortable. All that I have been dealing with all these years, I feel like it's behind me now, and I can move forward.
This is that stuff the fluid that we collected. See all that here?
Oh, wow.
Like this.
So Dr. Lee is amazing. She very much put me at ease.
Take care.
Yes, ma'am. Thank you so much, man.
Thank you.
So I want to be able to just do the things that I haven't been able to do. You know, so go to my kids' school and go places with them without being looked at. I'm just happy. I'm so happy. I'm happy, man. I really thank y'all. You just don't know how grateful I am. I really, truly am. The joy, and it kind of teared me up. It kind of brought me to tears because this has been a struggle.
Okay, let me see now. Over here, you can see your hairline is right here, and it sort of stretched that out. Okay. I'm really planning out how I'm going to remove this lipoma here. The good news is we should be able to avoid the facial nerve, especially if I use blunt instruments and take a lot of care in that area. So the bad news is Robert can't sit still, and I haven't even really quite begun yet. Okay, let me know if anything hurts you. You okay there?
Yes, ma'am.
Let's see what we have here. You may not know this, but I use my fingers here to try to like tease away things because it's much safer. You okay, huh?
Yeah, I'm sorry.
You can't sit still, huh?
I'm ADHD, yes, ma'am, I can.
Uh-oh.
Got the wiggles.
Yes, he does, but not hurting you, right?
No, ma'am.
Okay, good. But definitely a lipoma, and it looks like it might pop out, which would be great, but I don't have a little big enough opening yet. You like to move.
I'm sorry.
I'm gonna have to strap your head down here.
Yeah, I'm sorry.
I thought it was just anxiety, but you know, Robert really cannot sit still, and that is concerning to me. It's not just a linear excision. This is something that really needs to turn corners because I want to try to mimic his natural hairline. So this movement is really going to mess this all up.
I feel so weird.
Well, because it's numb.
Yeah. Oh, yeah, hold on. This is giving me the weird feeling.
What weird feeling?
I don't know.
Do you want me to cut them in half?
Sure, flatter. Okay, hey, we gotta finish this here. You gotta let me get this done, okay? Cadre.
Hold on, I gotta move my head. But it's okay. Hold on, go. Okay, there. Go ahead.
Okay, hold still. You could never have a baby, man, because I don't know what you're gonna do. Thank goodness.
No, I'm a man.
You wouldn't, well, yeah, but you know, like, you could never handle it.
No, I don't think I could, no.
No, well, at least you know that. That's the first step, I guess, is admitting. I've been able to distract Robert, thankfully, while I'm making as big an incision as I can to be able to try to squeeze this lipoma out. But these lipomas on the forehead are usually pretty adherent at a wide base to the galea. So with Robert's fidgeting, I'm concerned because I'm probably gonna have to pull out my scalpel again. Just gonna pull on you here. I might be able to pop this out. Oh, wouldn't that be nice? Just gonna pull on you. Weird feeling, I know, I'm sorry. Just pushing on you and squeezing with my hands. Nothing sharp or anything, okay?
Well.
Almost have it all out. You need to move around a little bit?
You're good. Do what you gotta do.
Okay, it's just stuck right here. So
Sorry about the weird sound. You okay? Guess what? You had a little boy.
It's out.
Yes.
It's a little brain.
For real?
Yeah.
Thank you so much, man.
Well, let's fix you up first.
Robert thankfully allowed me to remove this lipoma, but I'm not done yet. Now I have to remove the excess skin so that I can leave him with a normal looking hairline and the area lies flat against his head.
It'd be all right if you spoke a little bit about what you're thinking as you're stitching him off.
All right, now I'm trying to put some stitches in here. I'm trying to preserve his hairline, that's the whole key. And he wants to move around a little bit, and so I want to just obviously be safe, but I still think it's gonna look fantastic. Okay.
All right, thank goodness we made it. I mean, he looks great. I was able to create this beautiful scar that's hidden in his hairline, and I think he's gonna be really happy about this. I'm really happy about it.
I'm gonna show you. You ready? You wanna hold your mirror?
What?
Hold your mirror.
Man, thank you so much, man.
You look so handsome.
I hadn't seen myself in the mirror like that without that tumor for over 8 years. I see me.
Yeah, I see you too. I see you too.
I know I'll get a job. I know all my problems are gonna be over. I guarantee it. Thank you so much, man. I feel ecstatic. Now that I got this lump off of my head, I'll be able to go back to work. I can't wait to get home, start my life all over again.
First one to get close to kiss the area here.
Thank you so much, man. I am so grateful for Dr. Lee for taking this tumor out. If it wasn't for her taking care of this procedure, I'd probably be going home to nothing. Now that it's out, I'm just so excited. I know when somebody looks at me, they're not looking at nothing else but me. And I'm grateful for that.
Christina certainly has some very unique and very large hydrocystomas. It's really a miracle that they've gotten such a large size here because that skin is really thin. And it's like walking around with a water balloon around your face and never popping. I'm gonna try to target the much larger veined and clear one first. Then I'm gonna try to kind of get to that purplish one on her left side. But of course, this is very close to the eye. There are very important muscles and nerves, and the eye socket, the eyeball is there. I'm gonna be very careful.
I'm not gonna do anything without telling you, okay?
Okay, thank you. It's just a fear.
I
like,
get it.
of
You know,
feeling
anticipation.
it,
Is it gonna happen,
Yeah.
right? So close to your eye, too. Look, that is ready.
What you have trapped inside there, it's sweat.
Was that it popping?
Yeah, I just felt that. You had some pent-up sweat in there. Now it's like a little raisin here.
That's amazing.
It's deflated, but let's take off that little extra skin she has there.
Now that I've drained 7 years of sweat that was contained in this hydrocystoma, I really got to figure out a way to remove all this excess skin so that I can take a look at what's going on underneath to try to ensure that I remove this cyst completely.
See, this is the inside of the hydrocystoma there. You hold it like this too, so I can pull that apart. I think I can take off that very fine layer of cyst wall. Potentially, let's see. At least try to get as much of it as I can.
So this sac wall is extremely tiny, extremely thin, and I'm trying to remove this entire sac wall completely because I know that if I'm not able to do that, there's a higher chance that this can come back. It's always difficult because you can't really see the sweat gland that this comes out of. You can just try to see as much of the sac wall as you can and try to remove that as delicately as possible.
All right, let me see what we're gonna do here now. Let's see if I can buzz a little bit lightly. This is gonna work, I think. A little buzzing sound you're gonna hear. That's what the sound is. It's a cautery that stops little baby blood vessels. I'm trying to give it extra buzzing just in case maybe I can destroy the cyst wall or seal it somehow. Because I think that if I do this, there's a chance I cannot have this come back. Yes, Christine. it out. I think that's gonna be okay.
So I'm using electrocautery here, and I think that that really helps because I can try to cauterize any cyst fragments so that no new material can be released and a new one can't form. I'm gonna put some sutures in this eye to really close that area as best as I can, and then I'm gonna move over to the left eye. This one's obviously filled with some venous fluid, or some of the sweat gland was sort of tainted with blood. So we'll see what we have here. It might be harder to even see because it might be a different color in there.
It's spitting at us, yeah. Oh gosh. Okay.
Sorry. That one pinched a little?
A little bit.
There's a little bit of old blood in here. Mystery solved. I mean, this is also indeed a hydrocystoma. It's somewhat common to get a little bit of blood that extravasates into the cyst wall here, and since it's so filled with clear fluid, you can easily see that. Now it's time to remove this sac, cauterize it really well, and stitch it all up. I think I've really done some great preventative measures to ensure this doesn't come back. Do you want to take a look and see?
Yeah.
Oh, look at how beautiful your eyes are. Gorgeous eyes. So,
I forgot how green they were.
Yeah.
I feel fantastic. I mean, these bumps are gone, and I don't want to look away. Who's that girl? It feels like it's, you know, my face and not a monstrous circle of crap.
You know what? You are so sweet.
You are
and you
too.
deserved this, really. You guys did.
Finally got my little girl back. I'm excited for her.
I am just totally on top of the world because I'm gonna have my confidence back. I'm gonna be able to be a youth counselor. Nothing's gonna be able to hold me back now. World better watch out.
That's awesome, honey.
I kind of just traced out where the little veins are, because sometimes if it loses a little bit, I'll be like, oh yeah, well that's because that vein's there.
Okay.
It might just look like I'm doodling on her shoulder, just drawing a cartoon there, but I'm really planning out my surgery. There are blood vessels here. They're right underneath this. There's a firmer, deeper component here. So don't go beyond this. Okay. You okay?
I'm great.
Good. You can see that it's in these little fibrous bands. It's kind of caught up in this little net here. It's really kind of wound around your regular fat. Just taking a good look at it, making sure it doesn't look like it's any vessel or any nerve or anything like that. And it breaks up, so that also makes it not want to pop out easily. I was worried that Debbie's lipoma would be difficult to remove, and it is. I mean, it's a triple threat, really. There are blood vessels that I have to really steer around. There is a deeper, firmer component that I can't seem to really identify, and it's coming out in pieces. Why? It's sort of like one of those, you know, have you ever bought like one of those mattresses? It's all vacuum sealed.
Yes.
And then you unseal it and it kind of like makes it bigger. That's what this kind of does too. It's like smushed in there.
I'm on a diet. I've been on Weight Watchers for years. Maybe I can hit my goal weight after this comes off.
We're getting there. Definitely making progress. The evacuation of Debbie's lipoma is truly proving to be quite a feat here. The firm area that I was very concerned about, I can't even find that yet. I mean, I have to really just try to get through all of this fat here. So far, so good. Need to snip this off and put part of it away. What are you going to do? You're going to have all these new outfits to wear?
No, and I'm going on a cruise in a couple of months. Yeah. We've gone on cruises before, and we've zip-lined and jumped out of parachutes.
So you're an adventurer.
Yeah.
All right, we're like so close, but just that last little bit is not coming out without a fight. There's a piece underneath there. I feel like this piece was like the part underneath that maybe was firmer. I think that that tends to be like the older fat. Finally, I was able to identify the more firm or the harder area of Debbie's lipoma, and I was able to remove that. It just looks like maybe a little bit older lipoma material because it was just really packed very tightly in the arm there, but it looks just like regular lipoma.
You know, we've got excursions picked out. If you say it's okay that I can zip
Well,
line.
what is this? Oh, I think you're fine to zip line.
Good.
With a little bit of time and a little bit of patience, I was able to remove this lipoma entirely. And the best news here is that Debbie has this beautiful shoulder again, and she and Jack can go on all the wild adventures they want. You want to hold this so you can see the general idea of...
Oh, yeah, that looks great.
But you can see it's a little bumpy here, so that should flatten down and be a regular contour.
Great.
Okay, that's gonna look really good.
I feel amazing right now. She was able to remove it all and to know that I won't have it the day that I die. It's just a great relief.
Jack,
Hi.
she's still doing all right. Still your woman here.
Still my one.
Yes,
You take care
come
of her?
in. You're doing okay. I'm gonna show it to you. You're not gonna feel lightheaded or anything, right? You're breathing. I'm woman-splaining right now.
Yeah. Okay. Is that what it feels like?
Okay, so we have
that
our
wasn't
arm-
bad.
Yeah.
Wow.
Now I get to get back to all the things I love, like skydiving and zip line. I don't want to ever do anything boring again. I'm so grateful to Dr. Lee. She's definitely changed my life, and for so much better than I could have ever imagined.
Nothing should hurt, okay? You're doing great. I hope this thing doesn't squirt at me. I'm here with Justin, who has 3 cysts that I need to work on today. First one I'm gonna target is likely inflamed because of how red it is. It's really quite a nasty, angry cyst. She's got the best seat in the house.
Yes, I do.
This young lady here.
Yeah,
You've
she
been
tried to
storing
squeeze
some
it
mashed
through, huh?
potatoes in here, yeah.
Oh, really?
It's like almost there's 2 because there's a different color over here on this side.
Yeah.
Maybe that side got a little bit more inflamed. This inflamed cyst has sort of broken off and created another cyst. And they really are kind of separate entities, since one is sort of like cement, the internal contents, and the other one is like smooth, like custard. It's not unusual to see variations in cysts, but this is the most different innards of cysts next to each other that I've ever seen. And no matter what it looks like, I mean, Elise is really enjoying this because the messier, the better, apparently.
What do you see, at least?
Well, it's all out in front of me.
Almost all out. There's a little piece over here.
Oh, it came
But
out
I
in
saw a big
pieces.
chunk.
Yeah, this one was broken up. Because there's a little bit right here in the corner. I gotta get that still stuck to you. Thank you. Looks good there. Got it all. Time to stitch this one up. Luckily, I was able to convince the cyst to leave the party. And the second one is coming out with a nice clean pop. 2 down and 1 to go. And now maybe I'll get Elise involved a little bit. Do you mind if your fiance helps to squeeze the next one?
Girlfriend.
Girlfriend, I'm sorry. No wonder he didn't answer. Oops. I'm 100% serious when I tell you that popping a loved one's cyst is probably the most romantic, the most endearing thing that you could do for somebody. Okay, so there you go. Ready? Okay. Oh, here she goes. Here she goes. Okay, now push the. Oh, there it goes.
Oh, it feels so nice.
Yeah, doesn't it?
Yes.
Just go around it a little bit. It's like a big tick. There you go.
It is.
Isn't that a pretty one?
Yeah, that one's even prettier.
Almost done just putting stitches there. Justin did so well. I mean, the first one was kind of a headache, but the rest of them were so well behaved. I know that he's gonna heal nicely and he's gonna feel so much more confident without all those bumps.
This first one?
Mm-hmm.
Yeah.
It was.
Where
Okay.
it was, yeah, wow, it's so different already.
Yeah, good.
Touching my head for the first time was really strange because I felt like I had a normal head. So I'm just filled with hope, relief, and numbing agent.
This is the first time I've seen Justin without his bumps.
My face has changed though. Do you still like it?
Yes, I do.
Yeah.
I love your face.
I think we're all done.
Oh, wow.
Yeah.
Actually, I think I could cut your hair.
Oh, no.
I brought my shears and my clippers.
Of course you did.
You want to cut it, huh?
Because when we first met, it was shorter.
We're not shaving my head. Shaving my head?
I mean,
You've got to be kidding me.
We were just playing with
Okay. We can take a couple inches off for whatever you want to do there.
Okay.
Yeah, let's try it.
let's do it.
When those clippers came out, I almost bolted out of that room.
Are you good?
Yep.
We're not even engaged yet, and I thought you were gonna divorce me.
Yeah. It was close.
You wanna see how much I'm taking off?
No. That sounds terrible.
Knowing that the bumps are gone and he's healthy is exciting for one thing, but just already seeing his confidence and it's not even healed yet is amazing.
I mean, if I'm confident in this, I'm pretty. We're on a good track, right?
Well,
Thanks for squeezing this out of my head.
Thanks.
Love you. Thank you.
All right, let's see if he comes out nice and easy here, okay? Let's see what we have here. Make sure I'm not hurting you. This is a lipoma. You're doing great. I'm just trying to really gently tease this away, and there's a lot of fluid underneath there that I put numbing, and I just want to make sure that everything is obviously
No worries.
not oozing a lot. Just
Yeah,
so that
blunt
you might want to
dissection
tear that
is one of my
easily.
favorite
Oh,
moves.
it is?
Blunt dissection.
Dr. Jess is right. Blunt dissection is certainly the way to go here. I need to use my fingers so that I don't really disrupt any of the very, very important structures that are in this area. But I do need to rely on my hemostat clamps so I can really nudge it free from this inner sanctity of his neck, because there are certainly potential minefields all around here.
Do this, and that might help it.
Ow.
Oh, sorry.
Yeah, they're
Good. That was a nerve.
Yeah,
That's why. Yeah, there's just a nerve there, a sensory nerve that's still awake with us. So let me just go around it, and I pinched it with the hemostat. That's all.
Oh, I got you.
It did like to ooze a little bit on us. It's trapped in these little spaces, though. You okay?
Yes.
I'm almost
Yes.
to the lower part of that part in the front, and I'm just being very gentle. You okay here?
Ow, that I'm
Okay,
here.
that's that nerve.
Yeah, that I'm feeling.
Now I see why this old lipoma has been causing us trouble, really diving down deep in his neck. I mean, it's very difficult to navigate this real spider web of nerves in this area.
You okay? Because we're close to the bottom now. I feel like I'm so close, but why is it
Yes,
stuck
we do.
here? Oh,
Ow.
sorry. Oh, I'm sorry. Sorry, hold on, let me put some numbing there. It's probably not fully numb right there, that's why. I'm sorry about that. It's at the bottom. Squeeze, sorry, I'm squeezing your back just to sort of squeeze it
No
out. You
worries.
okay, right?
Yes.
Come on, come this way. There's a little bit left, and I'm just trying to take my time because it's kind of stuck to you, and I gotta be very gentle. This is where your all the deeper structures are that we don't want to deal with. It's not like I had to even sneak attack so much the front. It's more this little nerve that I gotta sneak attack around. Take some of this apart, maybe. That was not easy. Not easy.
I think Chess got pretty lucky today, and I got lucky too. This was certainly not third-year medical school material, but I do think that Jess's previous medical school experience helped him to stay calm and cool and collected while I wrestled with his neck.
So Dr. Lee, on the sutures, inverted mattress, vertical, horizontal? What are you gonna do?
I'm doing a buried vertical mattress stitch. You know what a buried vertical mattress stitch
Oh,
is,
sure.
huh?
Yeah. Vertical versus horizontal, yeah.
Yes. And what stitch gets you going?
Inverted mattress, vertical,
Yes.
or sometimes
You better agree with me.
Oh, yeah.
That looks pretty darn good. So you can see at least from this angle. It's hard for you to see. At least you can see that it's not sticking out, okay?
Oh, geez, that's so nice. Oh, God almighty, that is so nice.
For years, I've had this ball on the side of my neck, and it feels amazing, great lightness on the side of my neck now that it's gone. I can't believe that Dr. Lee got rid of this for me.
Reach back with your left hand.
Oh, Jesus.
It's given me a new lease on life. I don't feel 71, I feel 21.
Unbelievably excellent technique.
Are you talking about me?
Yes.
No.
My most greatest and largest admiration for you
Thank you. You were wonderful because you
Thank
did
you,
really
Dr. Lee,
great.
once again.
Joey, I think you're about to say hi. You want to come on this side first and take a look at your dad?
Oh my God.
Still pretty good. Now it's just
Finally it's
bumpy
done.
and a little bit loose there because
Yeah.
there is a lot of extra tissue.
Yes, that's
and it's also numb.
that'll settle down. I've had this ball for 20 years, and now that it's gone, it makes me a free man. I'm no longer tied to the house. I can talk to people. This makes me a new person. This gives me a new life. This gives me hope. This gives me a future. Super excellent. Couldn't be happier.
I'm not afraid of 70,000 people watching me play, 11 guys on the opposite side, but that little woman scares me.
Hello, you made it in here,
Yes,
huh?
I'm fine.
You made it past the goalie.
I made
You
it.
make it past the. Okay. Marcel's bump is pretty firm. Is it even a lipoma? Is this like a bony growth from his skull? So that's not something that I can remove. That's something that essentially has to be sanded down. And I don't do that. I'm gonna put a little baby pinch, okay? Just a baby pinch. Just like that, that's it.
I'm done.
Oh, I'm making you cry. You're totally giving me, I'm like pinching you.
Oh my God, I'm scared of you.
I made this guy cry. Do you guys have a record of that? Did you see that tear coming down? I can tell that he's a little bit nervous. So I need to make sure that this 350-pound man is as calm as can be because this is an area that has a lot of blood vessels, some very important big arteries. We don't want to change anything on his face. I don't want people to look at him and go, oh, Dr. Pimple Popper was here. You shouldn't feel anything other than us touching you. Yep, it's a lipoma. I see the lipoma and I'm just trying to get to it and I'm trying to keep this area nice and small. Once I start loosening a little bit, I think it'll make it a lot easier for me to take this out. Now, normally on the head, I don't try to pop it out whole at all because I don't want to be making a big old incision. So I try to take it out in little pieces. You feel that pulling maybe? Lower edge. See when I push right there, you can see, can you push like that too? Thank you. Yeah, you got pretty thick skin. I mean, not surprising, you're a big guy. You've been hit a lot of times. The challenge I face here really is to be able to visualize the entire lipoma. There are some really big arteries under here, and I need to also make sure we don't nick any of those because that's really gonna make it very difficult to see what's going on. Gosh, your skin is thick and it's under here. I'm just peeking around edges to see if I can find all the lipoma without having to make a bigger incision. It's very soothing. So have you always liked pimple popping? Like, have you always kind of been interested in it?
This is right up my alley. I enjoy this in every way.
What other football players are big fans of this?
Every money. We live in a nasty world. What is it like?
Are you saying that I live in a nasty world?
I mean, when you see green and all these different
see all this
stuff coming out, and we was like,
Yeah, you're used to that.
God, yeah, we're used to that.
It doesn't bug you so much, right?
Yeah.
That was the last little bit right there. Ready to put stitches in. To make the scar look as small and indistinguishable as possible is really a pro move for me. And the crowd goes wild. Oh, I gotta wipe that stuff off of there.
There you go. I ain't seen him in a while. That is crazy.
Dang, you look good. You can't even see that anything is done.
Yes. I feel amazing. Haven't seen that guy since I was 25 years old, 26 years old. It's pretty crazy. I'm 32 now, 33, and I'm finally getting this taken care of. I'm just too excited, just too happy. I just can't stop smiling, man. It's just crazy.
Unlike you, the lipoma is not gonna be that impressive. It came out in pieces.
There you go.
That little thing was all that caused it for you, but you can see all these little pieces in here.
Look at my little twin that's been sitting in my head.
I know.
It's definitely a testament to Dr. Lee. She kept me calm. She knew exactly how to handle the situation, and it was just perfect. It's pretty crazy, man. To go from a fan to a patient.
So what I'm first gonna do is we're gonna put the numbing in. We're doing this tumescent technique. Maybe it'll lift up even
farther away from muscle. Maybe even pull it out of the muscle a little bit if it's in there, okay? So I'm gonna put one little baby pinch here, okay? Baby pinch here. You okay?
Yep, I'm fine.
Tumescent numbing can really bathe that area in fluid and create like a safety buffer area. But there's still a chance that this lipoma could really snake around and wrap around muscle. If a surgeon were to remove a lipoma that was connected to the muscle and they removed a lot of the muscle too, it would deform the area. You would have muscle loss, and I don't want that. I'm gonna take a little peek here first just to make sure this is a lipoma. For sure lipoma. Now the test is to see whether it'll pop out nice or whether it's stuck to your muscle. It is sort of tangled in here. As you probably saw, it was a little bit bumpy, and I'm trying to stay away from your muscle and just try to like coax it away from it. You know what I mean? I got the top edge out of there. Okay, so right off the bat, this lipoma, it is sort of wrapped around and wound itself around regular tissue. And so it's really hard to pop that out because all of these little fingers have moved in all these different random directions, and to pull those out are very difficult indeed. So I really have to take my time here. I don't want to damage his muscle. There are little pieces in here.
Get out of there.
I know I'm pulling on you a little bit. We definitely have this top end off. Like it looks like the older part too. Looks like the grandpa part.
I've been able to pull out a good portion of this big octopus that is there, but there's all these tentacles left there that I have to pull out individually, and I just have to be very careful here.
Okay, now I'm like kind of close to your muscle. I'm just trying to ease this away from it. Got it?
It's out?
Yes, it is out. I think we got all the lipomas. I don't think it's gonna come back, but I'm sure it was right up against the muscle. I could see some fascia here, so I know it was right up against this muscle. You can see these little tunnels, and we kind of fished it out of there.
In the end, Brent's lipoma was not attached to his muscle, but I could sure see the muscle under there. You could just peer in there and I see where that muscle is, and you always give a little thanks right there that you did not kind of invade that area of the body.
Oh, wow. I'm in a little shock, to be honest. I look almost normal again.
You can see your definition, your deltoid
Right.
there, your tri. Look at this. You can already see the definition.
I got muscle back.
Yeah, look at that. Look at it flexing. He looks good.
Thank you. When I walked in the office, I was nervous, but now I feel amazing. It's gone. She didn't have to take my muscle away. I'm excited, super excited. I'm glad for it to be gone. Wow.
There you go.
That's disgusting.
This was the top of it.
Okay.
This was that bottom part that was really heavy.
Right, okay.
Yeah.
Once it finally came out, the relief factor of not having that thing attached to my muscle, I don't have to lose mobility. I get to still work. It's no longer a part of me.
Well, there's a little pus in there. We got it. But I'm just trying to see if there was a sac or anything, and like there's no sac wall. See, it's like an acne cyst.
I'm here with Jeb, who has epidermoid cysts, but also cystic acne. And the first bump that I've tackled here was actually an acne cyst. Now I'm taking a look at this one that's near his eye, and I think this one is gonna be epidermoid cyst.
Yeah, it's like a little cyst. Some of them are cysts, like this one. That one on your beard area is more like a cystic acne. Just trying to get the whole sac wall out here. I almost have it all.
The second one was more like a traditional cyst, which is great because it means that I can remove the entire sac wall and this is not gonna come back.
Here we go, take a look. So you see those bumps? We got rid of them. See that one all nice and flat?
No, it does look, it looks better.
All right, so now let's put a bandage on there so we can flip you over.
Now I'm gonna move on to Jeb's back, and he's got a lot of different things here. I'm gonna really try to target the areas that I think are epidermoid cysts, but I think a lot of these are acne bumps. And so if I inject a little corticosteroid in them, especially if they're red and angry, it can help to shrink them a little bit. And then for his blackheads, I'm going to extract those. You see a lot more going on than what I'm attacking. And it's because there's a lot of areas of old acne inflammation, and they leave a little bit of darkening in the area that can take some months or even some years sometimes to fade away completely.
If you want to open that other 11 blade, you can probably do that and make it that same way that I did. You okay there?
Mm-hmm.
Sometimes people find this relaxing.
Yeah,
Not so
it's
much.
better than the alternative.
This one has a sac, so that means it's an epidermoid cyst. One down and many more to go.
A little baby pinch maybe here. A lot of these are just sitting out waiting for us to pull them out. As you know, they'll just fill up again. Because you got those scars from previous breakout, and so there's like a little holes almost, right? So that's what's filling up.
Okay, how about that one that bothers you the most? Let's do that one. Okay, this one looks like it's a cyst.
Okay? You know, that one's a little bit tense because it was a little red, but we at least got it flat and trying to get out the whole cyst and the whole sac wall so that it will hopefully not come back. Okay, we flattened one really nice there.
So I'm gonna stop for today, but I wanna talk to Jeb about the real thing that's gonna help him. You did really great, though, and I really think we started things with you.
Okay.
My main concern is stopping the process that's causing this.
Yeah.
There is a medication called isotretinoin. That is the thing that might make a significant difference in a couple of months. And then we're gonna get a blood test so that we can make sure your lab tests are okay, that we could start you on isotretinoin. So we'll be in touch.
Okay. Much more hope than I came in with.
Oh, good.
Yeah.
I'm very excited that I finally found someone that could address it. And the fact that I have a long-term plan rather than a short-term plan is the most exciting part of this. Not only do I want them to go away, I don't want them to come back. If I stick to her plan, I should be in good shape.
I look forward to checking back in with you. Probably we'll be talking the next month.
Okay. Well, great. Thank you so much.
Oh, you're so sweet.
I'm gonna be excited to be able to go back to the beach, see some of my friends, and that'll be a nice change to get back to the way that I used to live my life and the way I enjoy it.
I'm here with Jeffrey. He's a pretty big guy who has this big bump on his back. He's pretty scared. He's pretty panicked. And I think the biggest challenge here is really gonna be calming his fears while I'm trying to remove this. Okay, you shouldn't feel anything other than us touching you, all right? Okay?
Mm-hmm.
I can see that it's a lipoma.
Sometimes they're stuck under here. But he is tethered in there, your friends. You have all these fibrous bands in here that it's like an animal that's like caught in a net, you know?
Okay, this is exactly what I'm not looking for. This lipoma is buried in a nest of fibrous tissue. And because the skin itself there is so thick, it's like I have to go quite deep to get to this lipoma. I don't like to go in there and just snip inadvertently in areas because there are blood vessels. There could be a lot of bleeding there that you can't really even track. And it just becomes a mess.
It is really weird that I just wrestle with them like these.
That sounded like it was a good one.
So something came out there, yeah. Just again stuck in this net. It's like a fishing line that's tangled. Come on, little friend. I know you want to.
It's like taunting you right there.
Right,
Just
he's
staring
right
at you.
here.
Come on.
It's fighting back. It's resisting.
You got it.
Yeah, I hope so. I'm getting it. I'm right here. They're just tangled in multiple places. This is not coming out without a fight.
You know when sometimes you order like a steak and it has a lot of sinew in it and you're trying to slice through it and you just get caught up in all the sinew and you can't get nice little succulent pieces of the meat out? Similarly here, it is just so intertwined in his regular fibrous tissue, it's really difficult to pull out each little piece that is really wedged in between this thick fibrous band of tissue.
All right, things are starting to behave. I feel like it's starting to turn around now in our favor. We started to get the upper hand here. Back to you again. Because there's such little pieces that are just coming out. Yeah. Look at that, looks great on this side.
Yeah.
Wow, what is this? Look, it's still coming a little bit. Like, I'm like, that was the end of it. And you're like, nope. Wow, I fought for that piece. I love you, but your lipoma is an I think we've reached the end here. I really can't dig much deeper without getting into some trouble here. There might be parts of this that I can't really get, but that's the part that wasn't growing.
It feels a lot better.
Oh, yes.
Yeah, just
It
like coming
definitely
back
feels
to
better.
it.
I don't know, do you think he's like the hardest that we've had or one of the hardest? Certainly one of the hardest. I just can't tease out all these small little finger-like projections of lipoma. It's just impossible for me to. So at this point, I do think we improved it a good amount, but I couldn't get it all out. I hate it. I don't like it when this happens, and it happens very rarely, but like it happens. But pretty soon, once that swelling settles down, it will look a lot better. It is swollen right now. There's definitely numbing in there that makes it look fuller, but it was really hard to get off the deeper component. I flattened it a good degree, but down underneath, there were like all these little fingers projecting, like, and that's really hard for me to pull up because they were like wedged in there. So we're crossing our fingers. I think it's gonna get smaller than this, but I hope it doesn't come back. That's the whole goal here.
Oh, man.
It is better.
It's a lot better.
Still see a bump, but it looks...
Yeah, it's a lot smaller than it once was. Right now, my back look amazing. I didn't see my back this way for 10 years, so I feel amazing right now. And now that my bump is gone, it's a new chapter to my life. There's gonna be a lot of changes inside of my life once I get home.
You're awesome.
Thank you.
I'll be checking on you, and it was so nice to meet you. Take care, okay? We'll be in touch. Thank you.
I feel really good right now, and I thank Dr. Lee for all the hard work that she put in. I know it was a really tough procedure for me, but she was able to make me calm, and 80 to 90% that she was able to get out, you know, it's a lot smaller than what it once was. I'm happy with that.